Welcome back, Deep Divers. Today we're going deep into abdominal trauma.
Oh, yeah, this will be good.
We've got a chapter from a paramedic textbook
Okay.
and a couple of real-life case studies
Hmm.
to really see how these injuries are managed out in the field, when every second counts.
Right.
You'll learn how something that seems like a minor injury can actually have huge consequences,
Yeah,
and how paramedics use vital signs to figure out what's really going on inside, even when the injury isn't obvious.
exactly. It's a tricky area, abdominal trauma. The abdomen's vulnerable, even though it's protecting all those vital organs.
So let's start there. What makes the abdomen so vulnerable? I mean, yeah, it holds most of our vital organs, but is there something more to it?
It's more than just the number of organs in there. Think of it as a really packed space, not a lot of room to spare. So even a small impact can cause a cascade of problems. Organs can get bruised, torn, or even ruptured, and that leads to internal bleeding, which, as you can imagine, isn't always obvious right away.
So it's like a hidden enemy, unlike, say, a broken bone where you can, see the damage.
Yeah, exactly. And that's what makes it so challenging for paramedics. They can't just rely on what they see on the outside. They have to be like detectives,
hmm
looking for subtle clues that could mean there's a serious internal injury.
Now, the textbook uses the term hypovolemia. Sounds serious. What does that mean exactly?
It is serious. Hypovolemia just means a decrease in blood volume. It's essentially uh, losing blood, often internally. Imagine losing a liter of blood. It's a lot, and your body reacts in all sorts of ways you might not expect.
So even if someone seems okay after an abdominal injury, paramedics are trained to look for those early signs of shock, the things we might not notice.
Exactly. One of the first things they'll see is a rapid pulse. Your heart's working harder to pump the remaining blood around. You might also see cool, clammy skin as your body tries to conserve heat. And then, if the blood loss keeps going, mental state can change, confusion, disorientation.
So even if we're not paramedics, knowing these signs could be the difference between thinking, oh, it's just a little bump, and realizing, hey, this could be serious.
Yeah,
Yeah.
absolutely. Recognizing those signs could be crucial in an emergency, like knowing that even what seems like a minor fall could be a much bigger deal for a kid. Knowing when to get help for yourself or for someone else could literally save a life.
Right. Okay, let's get into the first case study. This one takes us to Harbor Grace, Newfoundland. Picture this. It's 2:15 in the morning, and there's a young man lying by the curb holding his stomach. He's been attacked, stabbed while trying to protect his wallet.
Classic penetrating abdominal injury. And the details here really show how important those subtle clues are, like we were just talking about.
Right, so there's a cut on his lower left abdomen, his shirt soaked in blood, and he's conscious, but his pulse is racing. That's
Huh.
a shock sign, right? But here's the thing. His blood pressure is normal.
That's what throws people off. You'd think with blood loss, pressure would drop. But especially early on, the body compensates by constricting blood vessels, speeding up the heart rate. It's like the body's trying to buy time, keep blood flowing to the important stuff.
So the normal blood pressure is a bit of a trick. It doesn't mean everything's fine.
Nope, it's a temporary fix. If the bleeding isn't stopped, that pressure's going to drop and things get a lot worse. That's why paramedics are trained to look deeper, see the whole picture.
So what happens next? What do they do for him?
The case study talks about oxygen, dressing the wound, careful positioning to minimize further injury. All pretty standard stuff, but the reasoning behind it is key.
So it's not just about stopping the bleeding, getting him to a hospital. There's more to it.
You got to understand what's happening inside the body. The oxygen helps his tissues get what they need, even with the blood loss. The dressing isn't just about the bleeding, it's also about preventing infection, which, with abdominal trauma, can be deadly.
And the positioning, why is that so important?
It minimizes movement, less chance of more internal bleeding. Think about it. Every time he moves, those injured organs are getting jostled around, maybe making things worse. And there's another risk mentioned in the case: evisceration.
Evisceration. Wow. Okay. That sounds intense.
Yeah, it means the internal organs are pushing out through the wound. It's rare, thankfully, but it's a serious complication. Needs surgery right away.
Okay, so we've got our stabbing case. High stakes, definitely, and a lot to learn about how the body responds to trauma. Those subtle clues paramedics are trained to spot, but let's switch gears now and look at something completely different. This time, we've got a 6-year-old boy, Henry, out riding his bike, takes a spill, lands right on the handlebars.
Oof, that's gotta hurt. And yeah, that kind of direct blow to the abdomen, that's always worrisome, especially with a kid.
And here's the thing. Unlike our first case, there's no blood, no open wound, just a little guy complaining of a tummy ache. Easy to brush off, right?
Not so fast. External injuries, they can be scary looking, but they don't always tell the whole story. Remember, we're talking about a packed space full of vital organs. And with Henry, no obvious trauma, it makes it even trickier to figure out what's going on.
So what were the paramedics looking for? What were the warning signs, so to speak?
Well, Henry's symptoms were subtle, but they were definitely cause for concern. He had abdominal pain, and it was getting worse. His abdomen was distended, meaning swollen, and it felt firm to the touch. And when they gently pressed on his belly, it hurt.
Pain on palpation, as they say. What does that actually tell us? I mean, any bruise hurts when you press on it, right?
Sure, but in this case, pain on palpation, it suggests that there's inflammation or even injury to the organs inside. Think of it like this: pressing on a sore muscle versus pressing on a broken bone. Different kind of pain, right? Tells you something different is happening.
So even though we can't see an injury, these signs are telling the paramedics that something could be seriously wrong inside.
Exactly. And this is where knowing the differences between kids and adults is so important. The textbook really hammers this point home.
What do you mean by pediatric differences? Do children experience abdominal injuries differently than adults?
In a lot of ways, yes. Children's organs, they're bigger proportionally, and they're closer together. So more likely to be injured by blunt force. Imagine trying to fit the same number of puzzle pieces into a smaller box. Less room for error,
Yeah.
right? And their abdominal muscles, they're not as developed, so less protection.
So a fall that might just bruise an adult could actually cause some serious internal damage in a child.
Exactly. And kids, they can't always explain their pain as well as adults. So paramedics have to be even more careful in their assessments, relying on those subtle clues to guide their decisions.
It sounds like a real challenge, like solving a puzzle with some pieces missing.
That's a great way to put it. Now, in Henry's case, his abdomen wasn't just distended, it was also firm. And that's a big deal because it suggests internal bleeding.
So even though we can't see blood, the paramedics are using these clues, like the firmness of the abdomen, to try and figure out what's happening inside.
Exactly. And that's why it's so important for paramedics to really understand anatomy and physiology, the mechanisms of injury. They need to be able to connect the dots, even when those dots are, well, subtle and hidden.
Okay, so we've seen two very different cases of abdominal trauma. A stabbing with a clear external injury and a bike accident with no visible wounds at all. What's the connection here? What's the takeaway? It seems like early recognition is key in both cases, wouldn't you say?
Oh, absolutely. Stabbing, handlebar injury, doesn't matter.
Yeah.
Recognizing the possibility of internal bleeding, acting fast, that's what makes the difference in abdominal trauma.
Because the sooner they can do something, the better the outcome.
Exactly.
Right.
Untreated abdominal trauma. That can lead to all sorts of long-term problems: organ damage, infection, even death.
Right, so this is serious stuff. It's not just about patching someone up and sending them home. These are potentially life-saving interventions.
You got it. And, we've been focusing on paramedics, but these lessons apply to everyone. Knowing the signs of abdominal trauma that can help you make better decisions in an emergency, even if it's just knowing when to call for help.
That's a good point. Even without medical training, we can still make a difference. Now, there was something in the textbook that really caught my eye. It said that kids are more prone to splenic injuries than adults. The spleen, that organ tucked up under the ribs, apparently it's pretty vulnerable, especially in kids. Any idea why that is? What makes their spleens so susceptible?
That's a great question. It's what we always say here on the Deep Dive: stay curious. The textbook gives us the basics, but it doesn't always tell us why. And that's where the real learning happens.
So you're throwing down a challenge for our listeners. I like it.
Exactly. Think about what we learned about kids' anatomy. Their organs are bigger, proportionally closer together, and those abdominal muscles, not as strong, not as much protection. Do those things play a role in the spleen's vulnerability? It's a fascinating question. I bet our listeners have some great ideas.
Maybe we'll even bring it up in a future deep dive. Share some of those listener theories. Who knows? But for now, I think we've given everyone a solid understanding of abdominal trauma. They've got the knowledge, they're asking the right questions, and they're ready for whatever comes their way, whether it's a medical emergency or just a better understanding of how their bodies work.
Couldn't have said it better myself. That's what the Deep Dive is all about. taking complex information, breaking it down, making it fun and engaging, giving our listeners knowledge they can use in their lives.
And this is just the beginning. We've got tons of exciting deep dives planned. We'll be exploring everything from the human brain to the latest in space exploration.
So stay curious, keep exploring, and join us next time as we take on another fascinating topic.
Until then, happy diving, everyone. All right, so today we're going to be doing a deep dive on burn cases.
Oh, cool.
Yeah.
I love this stuff.
Yeah, and this is, I was looking over the trauma guide that you gave me, and
Oh,
this section is really intense.
yeah.
Like, I'm not...
It's pretty heavy stuff.
Yeah.
Yeah. So,
Sticks with you.
yeah.
For sure.
And I think what I really want to kind of focus on today is like not just the, listing the facts about burns,
Right.
but really trying to get into like the decision-making
Yeah,
process for treating them,
absolutely.
because I think that's where it gets really interesting.
Yeah, you really have to understand the whole picture, right? You have to understand the type of burn, the severity, the patient's medical history.
Yeah.
All of that goes into how you treat the burn.
Yeah, and how like all those different things interrelate too.
Exactly.
And how like maybe one, aspect of their medical history might
Yes.
influence how you would treat a certain type of burn.
100%. Yeah.
Yeah. So, and we've got some crazy cases here.
Yeah.
Oh, yeah.
Like we've got, kid in a house fire.
All right.
We've got a guy who falls into a bonfire.
Oh, wow.
Yeah. And I think even a workplace accident with some pretty nasty chemicals.
It's amazing how each one is so different,
Yeah.
and
Yeah.
it's never the same.
So let's just jump right into the first case.
Okay.
So this one is the 10-year-old girl in the house fire.
Oh, geez.
So picture this, right? It's late at night.
Oh, okay.
House is on fire. Firefighters pull this girl out of a closet.
Oh, no.
She's got soot around her mouth and nose.
Right away, that's a big red flag.
Right.
Soot means she's probably inhaled a lot of smoke.
Yeah. And she's having trouble breathing.
Right. That's a huge concern because smoke inhalation can be deadly.
Yeah.
Plus, if there are burns on her face and neck, her airway could be closing up.
And she has second-degree burns on her face and neck.
Oh, man.
Yeah. So things aren't looking good.
No, they aren't.
And then they find out she has a history of asthma and epilepsy.
Oh, wow.
And she's on medication.
Okay, so now we're adding another layer to the puzzle.
Right. Like, how does that change things?
Well, for starters, asthma means her lungs are already sensitive, so that smoke inhalation could hit her even harder.
I see.
And the medications, you always have to know what a patient is taking because some drugs can interact with burn treatments.
Oh, that makes sense.
You don't want to accidentally make things worse.
So right away, they start treatment.
Good.
They get her oxygen. They're monitoring her vitals very closely.
Of course.
And then they use this thing called the rule of nines
Oh, yeah.
to figure out how much of her body's burned.
Yeah, the rule of nines, it's a fast way to estimate the percentage of body surface area with burns.
Okay.
Basically, they divide the body into sections that represent 9% or multiples of 9.
And how does that work in this case?
So they determine she has second-degree burns on her entire chest, abdomen, and both arms,
Okay.
which totals up to about 19.5% of her body's surface area.
19.5%. So that's pretty severe.
Definitely, especially for a child.
Right, because kids are more delicate, right?
Yeah, they have thinner skin and a larger body surface area compared to their weight.
I see.
So burns can affect them more seriously.
Right.
More vulnerable to fluid loss, temperature regulation problems, infections, you name it.
Oh, wow. Okay.
Yeah.
So, and then to make matters worse, she has a seizure while they're rushing her to the hospital.
Yeah. No.
And remember, she has epilepsy.
Right.
Right.
This is intense.
A seizure on top of everything else is a major concern. It could be from lack of oxygen to the brain, a complication from her epilepsy, or even a reaction to medication.
Gosh, so they had a lot to figure out.
They do, and fast.
All right, so that one was a lot.
Yeah, it was.
Let's move on to case number 2.
Okay,
This one is, it's pretty dramatic.
let's hear it.
This guy falls into a bonfire.
Oh my gosh.
Yeah. And to make matters worse, he was intoxicated.
Oh no.
Yeah. When they found him, he was confused, strong smell of alcohol on his breath.
Okay, so right away, the alcohol intoxication complicates things.
Well, first of all, impaired judgment probably played a role in him falling into the fire.
Makes sense.
But alcohol also affects pain perception, so it can be hard to tell how badly he's actually injured.
I see.
Plus, alcohol interacts with a lot of medications, so that's another thing to consider.
Right, right.
Yeah.
And he's burns all over face, arms, chest, stomach.
Oh, that's terrible.
Yeah, really bad.
Wow.
But there's this detail in the notes about his rings.
His rings.
Yeah, like they were really focused on getting those off his fingers.
Oh, I see.
Why is that such a big deal?
Well, think about it. Burns cause massive swelling, right?
Right.
So those rings could basically become tourniquets, cutting off blood flow to his fingers.
Oh, wow. I didn't think of that.
Yeah, and with burns, you're always racing against the clock, trying to prevent further damage.
Makes sense.
So getting that jewelry off, especially rings, is absolutely crucial.
Wow. So every little detail matters.
It really does.
Yeah.
And burn care, every second counts. It's incredible, isn't it?
It makes you wonder how they even get them off.
With all the swelling.
Oh, yeah. It can be tricky. Sometimes they have these special tools,
I bet.
but you got to get it done fast.
Yeah, to save those fingers.
Exactly.
So it turns out this guy, he's not just dealing with the burns.
Uh-oh. What else is going on?
He's got a history of alcohol dependence,
Oh, wow.
and he's taking this medication, Antabuse. Antabuse. Okay, that's disulfiram,
Yeah.
and that causes some serious problems when mixed with alcohol.
Like what kind of problems?
We're talking intense nausea, vomiting, even heart problems.
So how does that affect his burn treatment?
It makes everything more complicated.
Like what specifically?
Well, for one thing, pain management.
Oh.
You have to be really careful with what medications you give him.
Right, because of the interaction with the Antabuse.
Exactly.
And then there's the fluid resuscitation.
That's another big one.
Wait, what is fluid resuscitation?
Ours. It's basically giving the patient IV fluids to replace what they've lost because of the burns,
Because they get dehydrated.
right? Severe burns make your skin lose its ability to hold fluid.
So they need extra fluids.
Exactly. It helps maintain blood pressure, prevents shock, supports organ function.
But with this guy,
You have to be super cautious because giving him too much fluid could overload his system.
especially with the alcohol and the Antabuse,
Right. It's a delicate balance.
it's like walking a tightrope.
It is.
Mm.
You have to consider all these different factors and how they interact.
It really shows how important that medical history is.
It's crucial, even when the patient isn't fully coherent. You never know what kind of hidden dangers might be there.
That's a good point. Okay, so are you ready for something completely different?
Yeah, bring it on.
Okay, this next case takes us out of the ER and into the workplace.
Interesting.
This guy, Hunter, he's working with this chemical phenol. Yeah, and he spills it on himself.
Oh no, that's bad news.
Before we get into the details, can you explain what phenol is and why it's so dangerous?
Sure, phenol is this corrosive acid that's used in a lot of industrial processes. It can cause some serious burns on contact.
Like, how serious are we talking?
We're talking deep tissue damage.
Yikes.
It can even get into your body and cause even more problems.
So what do you do if you spill it on yourself?
Well, the first thing is to act fast.
Okay.
Time is of the essence.
Right.
Luckily, this guy, Hunter, he was thinking quickly and used isopropyl alcohol to decontaminate the area.
Isopropyl alcohol.
Yeah, it can actually neutralize phenol to some extent.
Oh, wow. I didn't know that.
But the key is to keep flushing the area with tons of water.
Water.
Yeah, to remove any remaining chemical.
Okay, so lots of water.
Lots and lots of water.
And what about clothing?
Oh yeah, gotta get those contaminated clothes off immediately.
Right, so the first responders did that right away.
Good, they kept flushing his burns with water.
You said that's essential for chemical burns.
It is.
It's interesting how the type of burn dictates the initial treatment.
Absolutely. Knowing what specific chemical is involved is vital.
So they were able to stabilize Hunter, and thankfully, his vitals remain stable.
That's good news.
But he's definitely going to need ongoing pain management
Of course.
and close monitoring for potential complications.
Absolutely.
What are some of the long-term effects someone might face after a chemical burn?
Oh, there could be a lot. Scarring contractures.
Contraction.
That's where the skin tightens and restricts movement.
Oh, wow.
And even functional impairment, depending on where the burn is and how bad it is.
So Hunter might need skin grafts, physical therapy,
Possibly.
and ongoing medical care.
It's a long road to recovery.
It's a good reminder that the impact of a burn goes way beyond just the initial injury.
Absolutely. There's a whole lot to think about.
Okay, so we've covered 3 very different cases, each with its own unique challenges and critical decisions.
It's been quite a journey.
It has. What are some of the key takeaways you hope our listener is walking away with?
Well, I think these cases really highlight how complex and individualized burn treatment is.
No one-size-fits-all approach.
Exactly. We saw how factors like age, pre-existing conditions, the circumstances of the burn, even something as simple as wearing a ring,
Right.
it can all have a huge impact on how you manage the case.
It's like each case is a puzzle with all these interconnected pieces.
I like that analogy.
And getting it right requires not just the textbook knowledge, but also,
Thinking on your feet.
yeah, and understanding how the body responds to trauma.
Exactly.
Yeah.
It's about seeing those connections, recognizing patterns, making informed decisions that can really make a difference.
It's pretty incredible stuff.
Yeah.
Yeah, it really is amazing stuff. Makes you appreciate the people who do this every day.
Oh, yeah, for sure.
So for our listener out there who, might not be a doctor or a nurse or anything,
Right.
what can they take away from all of this? Like, even if we're not, facing these exact situations,
That's a great question.
are there any takeaways, for just everyday life?
Yeah, definitely.
Okay.
Like, I think everyone should know basic first aid for minor burns at least.
Okay, like what kind of stuff?
Well, the classic example is running cool water over the burn.
Oh, yeah, right.
That can really help minimize the damage.
Okay, so cool water, not ice water.
Right, exactly. Cool water for like 10 to 15 minutes.
Okay, good to know.
Yeah. And, of course, being aware of potential fire hazards in your home and workplace.
Right, prevention is key.
Always.
It's like we focus so much on the treatment, but really preventing these things from happening in the first place is so important.
You're absolutely right.
And it's not just physical safety either, right?
No, right.
Like these cases, they also kind of remind us about mental health and well-being.
Yeah, absolutely.
Like we saw how alcohol abuse played a role in one of the cases.
Right. That highlights the need for support and resources for people struggling with addiction.
For sure. And the emotional trauma that burn victims experience.
Oh, yeah, that's huge.
Can't forget about that.
It's a long road to recovery, both physically and mentally.
So it's like healthcare goes beyond just treating the physical injuries. It's about the whole person, right?
It's about the whole person, their mental and emotional needs, too.
Yeah. I think that's a really important takeaway from all of this.
Me too.
Whether you're a medical professional or just someone trying to live a healthier life,
Right.
Understanding that connection between our physical and mental well-being.
It's crucial.
It is. Yeah. Wow. Well, I don't know about you, but I am definitely walking away from this deep dive with a whole new appreciation for
Same here.
the complexity of burn care.
It's amazing.
And just the resilience of the human body.
The human body can endure so much.
It really can. And for our listener out there, we hope this has, piqued your interest.
Yeah.
Maybe inspired you to learn a little bit more.
For sure.
There's always more to learn.
Absolutely.
And who knows, maybe you'll uncover something that we didn't even talk about today.
That's the beauty of learning.
It is. Thanks for joining us on this deep dive.
It was my pleasure.
Welcome to our deep dive today. We're going to be talking about recognizing and responding to anaphylaxis.
Oh, very important stuff.
It is, and we've got a great chapter from a medical textbook. It even has 2 real-world case studies.
That's fantastic.
Yeah. So we'll really break down, what anaphylaxis is, why it's so dangerous.
All right.
And of course, what to do, how to act fast in an emergency.
Because it is an emergency.
Absolutely. To help us break down this very important topic, we've got our expert.
Happy to be here. I think these case studies are really powerful in understanding how this all unfolds.
Yeah.
Really, what's at stake?
Okay. So let's start with, I guess, the basics. Like, what exactly is going on in the body when someone goes into anaphylaxis?
So you can think of it almost like an allergic reaction on overdrive. It's not just like a runny nose or itchy eyes.
Yeah.
This is where your immune system is triggering a chain reaction. That can affect your whole body, and it can happen in minutes.
Wow.
So it's like your body's hitting the panic button, and it can be life-threatening.
Wow. That sounds terrifying. And I know in the textbook it was talking about, like, the airways constricting, blood vessels widening, blood pressure plummeting.
Right.
What is happening?
Yeah. So you can kind of think of it as your body going into this emergency mode.
Okay.
Your airways tighten up, which makes it hard to breathe, of course.
Right.
And then blood vessels widen. And that leads to that sudden drop in blood pressure.
Oh, okay.
So that can cause dizziness, weakness, even loss of consciousness.
Oh, wow.
It's like this cascade of events.
So it's not just about treating symptoms, it's about stopping this whole cascade.
Exactly. You got to hit the brakes on that runaway train.
Yeah. And I know that epinephrine, is that like the go-to treatment?
Yes, it is.
So can you explain why it's so crucial and how it works so fast?
So epinephrine, it's a powerful medication,
Yeah.
and it directly counteracts all of those changes that we just talked about.
Wow.
It opens up the airways.
Oh, okay.
It constricts those blood vessels. It helps stabilize blood pressure. So it's essentially reversing those life-threatening effects.
It's like an instant reset button?
Pretty much, yes.
Wow. Let's dive into our first case study and see how this all kind of plays out.
Okay.
The textbook introduces us to Brianna. She was a young woman who went to the dentist.
Yeah, routine appointment.
It seemed pretty routine at the time.
You would think.
She got a local anesthetic injection,
Right.
and that's when things took a turn.
That's when things went south.
The textbook talks about how she suddenly developed difficulty breathing,
Mm-hmm.
preatness in her chest, even some swelling of her tongue.
Yeah, so these are all classic signs of anaphylaxis starting to take hold.
Okay.
Her body was reacting to something in that injection,
Uh-huh.
and it was escalating really rapidly.
Wow. It's like her body just went haywire. What were the immediate priorities when treating Brianna, and why?
So always the first priority
Mm.
in any anaphylactic situation
Mm-hmm.
is making sure that the person can breathe.
Yeah.
So they give her oxygen right away
Okay, that makes sense.
to support her lungs. They were
Yeah.
struggling.
Yeah. Now, the textbook also talked about the importance of epinephrine.
Absolutely.
So they gave her that too.
Oh, for sure.
Yeah.
I mean, in a situation like that, every second counts.
Right.
Epinephrine is the fastest and most effective way to counteract that cascade.
Right. It's like you said before, hitting the brakes on that runaway train.
Exactly.
Did she respond well to the treatment?
Thankfully, yes. The textbook says after about 20 minutes, her breathing started to improve
Oh, good.
and her blood pressure stabilized.
Oh, wow.
So really just a testament to how quickly epinephrine works.
That's a relief. But this makes me think, if epinephrine acts that fast, why not just give her more of the local anesthetic, the xylocaine, to counteract the reaction?
That's a really good question.
Yeah.
And it highlights why understanding how anaphylaxis works is so important.
Yeah.
Xylocaine, it numbs the nerves, but it does nothing to address the underlying immune response.
Right.
That's driving the anaphylaxis.
Hmm.
So epinephrine is the only effective treatment in this situation.
So it's like trying to put out a fire with, I don't know, like a garden hose.
Right, exactly.
You need the right tool for the job.
You need the right tool.
Yeah.
Now, this brings us to our second case study,
Okay.
which shows how diverse these triggers can be
Yeah.
and how anaphylaxis presents.
Yay.
So this case study is about Ralph.
Ralph, okay. And from what I remember, Ralph had a bit of a different story.
He did, yeah.
It wasn't a dentist appointment?
No, this all started with a fall
Okay.
from a ladder.
Oh,
Yeah.
very good.
And initially, it seemed like a straightforward case.
Mhm.
You know, he fractured his wrist and his femur,
Oh, wow.
but then things took an unexpected turn.
I'm guessing the fall wasn't the only problem.
No, it was not. After they did their initial assessment, Ralph started having trouble breathing.
Oh, no.
He developed what we call stridor, which is kind of this high-pitched whistling sound when you breathe in.
Okay.
And he even started to show signs of hives.
Ooh, okay. So those are some familiar symptoms. Are we thinking anaphylaxis here too?
It certainly raised suspicions, and the textbook mentions this really crucial detail: the possibility of a wasp sting.
Oh, so maybe when he fell off the ladder, he disturbed a wasp nest or something?
Exactly. And, you know, maybe that sting went unnoticed at first,
Oh, wow.
but then that could have been what triggered the anaphylactic reaction.
So two completely different scenarios, yet both potentially leading to the same life-threatening condition.
It is. And it just reinforces how important it is to be aware of it no matter what the situation is.
Yeah.
Even seemingly unrelated events can mask the true culprit.
I'm really curious to hear more about Ralph's case, especially how they managed his treatment because he was already dealing with these injuries from the fall.
Absolutely. There are some fascinating insights there, and we'll delve into that right after this.
Great. Okay, so we left off with Ralph, our ladder faller,
Yeah.
who may or may not have gotten into it with a wasp.
Right.
So what happened next? Was his treatment as straightforward as Brianna's?
Not quite. You see, Ralph's case, it had this added challenge because unlike Brianna, Ralph had a history of coronary artery disease.
Oh, some heart problems.
Yeah.
Okay, that complicates things.
It does.
I bet that gave the medical team some pause
Right.
when considering epinephrine.
Absolutely, yeah.
Yeah.
The textbook actually brings up this very question
Uh-huh.
because epinephrine, while it's life-saving in anaphylaxis, it can also increase heart rate and blood pressure,
Right.
which could be really dangerous for someone with a pre-existing heart condition.
So they're in a really tough spot.
Yeah.
Treat the anaphylaxis and risk, making his heart condition worse, or hold back and risk, well, something worse.
Right.
So what did they do?
Well, this is where medical judgment And a deep understanding of both conditions is so important.
Yeah.
In Ralph's case, the potential benefits of epinephrine, even with those risks,
Uh-huh.
outweighed the potential consequences of not giving it to him.
So they went for it. Did it work? And more importantly, was Ralph okay?
They did, and thankfully, yeah, Ralph responded well.
Oh, good.
The epinephrine helped stabilize his condition, and they were able to carefully monitor his heart rate and blood pressure
Wow.
the whole time. So it's a reminder that even in these really complex medical situations,
Yeah.
there's often a path forward, but it requires, careful consideration and taking a little bit of a calculated risk.
That makes me think back to something we were talking about earlier with the xylocaine not working for anaphylaxis because it targets the nerves, not the immune system.
Right.
It seems like understanding how a medication works is just as critical as knowing what it's supposed to treat.
I couldn't agree more. And that actually brings us to a fundamental concept in healthcare, especially in emergency situations. The 6 rights of medication administration.
Oh, yes. The textbook touched on this, and it really struck me as, pretty simple but powerful framework
Yeah.
for making sure everything is safe for the patient.
Yeah. Absolutely. So the 6 rights are all about making sure the right medication is given to the right patient at the right dose at the right time,
Okay.
via the right route with the right documentation.
It seems straightforward, but I can imagine, in the heat of the moment, with lives on the line, it's easy to miss something.
Well, for sure.
So how do these 6 rights play out in a chaotic situation like anaphylaxis?
Well, that's where training and protocols are super important.
Yeah.
So let's think back to Brianna's case.
Okay.
The medical team, they had to confirm her identity, verify the correct medication and dosage for the epinephrine,
Yeah.
administer it right away in the right way, and document everything.
Yeah.
Every step was crucial to her safety and the positive outcome.
And even with Ralph, where the decision was a bit more nuanced because of his heart, those 6 rights still guided everything.
Yeah.
They had to, weigh the risks, choose the appropriate dose, constantly monitor his response, and document everything.
Exactly.
Wow.
The 6 rights aren't just this checklist.
Yeah.
They're a framework for critical thinking and decision-making, especially when time is of the essence.
Right.
They help ensure that even under pressure,
Yeah.
medical professionals can provide safe and effective care.
It's amazing how something so seemingly simple can have such a big impact on a patient.
For sure.
It highlights how in medicine, it's not just about knowing the science, but applying it correctly and safely in every situation.
You hit the nail on the head.
Yeah.
Understanding those mechanisms, recognizing those signs, and acting fast with those right treatments are all crucial.
I think what's really resonated with me throughout this whole deep dive is just the idea that knowledge is power, especially with something like anaphylaxis.
I couldn't agree more.
Oh.
The more we understand about anaphylaxis, the better we are to identify it,
Right.
respond appropriately, and potentially save lives.
And we've covered a lot of ground today from like the cellular level to real world application, but there's always more to explore.
Yeah.
I think we've given our listeners a really good foundation for understanding this complex and potentially life-threatening condition.
I hope so. If there's one thing I want listeners to take away from this deep dive,
Yeah.
it's don't underestimate the seriousness of allergies.
Yeah.
They can manifest in really unexpected ways.
Right.
Knowing the signs and acting quickly can make all the difference.
Absolutely. It's like having a secret weapon in your back pocket.
Yeah.
You might not need it every day, but when you do, it could be a lifesaver.
Well said.
So where do we go from here? What are some of the big questions that still need answers when it comes to anaphylaxis? Yeah, that's a really good question, and it's one that researchers are,
Trying to figure out.
all over the world are trying to figure out. So think about it this way.
Yeah.
We've been talking about how epinephrine is like hitting the brakes on a runaway train.
Right.
But wouldn't it be amazing if we could like prevent the train from running away in the first place?
I mean, that's the ultimate goal, right? Not just treating it, but preventing it from even happening.
Yeah.
And that means going deeper, understanding the immune system, why some people have these really severe allergies
Yeah.
and others don't, and how can we retrain the immune system to tolerate those allergens.
So instead of just reacting to the problem, we're trying to get ahead of it.
Exactly, yeah. And there's a lot of really promising research out there
Yeah.
looking at things like immunotherapy,
Okay.
which involves gradually exposing people to small amounts of the allergen
Uh-huh.
to build up that tolerance.
Oh, okay.
There's also research into new medications that could block the pathways that lead to anaphylaxis,
Wow.
so preventing that cascade before it even starts.
So it sounds like we're really on the cusp of some major breakthroughs in this field.
I think so. And as we continue to learn more about those mechanisms,
Yeah.
I'm hopeful we'll be able to offer more targeted and effective treatments
Right.
and ultimately find ways to uh, prevent it from impacting people's lives.
That's a great note to end on. A note of hope and a glimpse into the future.
A little bit of hope.
Yeah, but before we wrap up completely, I want to leave our listeners with something to think about.
Okay.
So we talked about how vasodilation and bronchoconstriction are, key players in anaphylaxis.
Right.
Knowing what we know now, how could we use that knowledge to develop new treatments or even like preventative measures?
That is a fantastic question to consider. Maybe by understanding the specific molecules involved in those processes, we could develop drugs that, block them or even reverse them.
Right.
Or maybe find ways to strengthen the body's natural defenses against those reactions.
Yeah.
I mean,
Yeah.
the possibilities are really endless, and I think continued research will lead to some really groundbreaking discoveries in the future.
Yeah, it's exciting to think about all the potential solutions out there.
It is.
Just waiting to be discovered.
Mm-hmm.
And it just shows how important, curiosity and critical thinking are.
Absolutely.
And being willing to challenge the status quo when it comes to medical advancements.
Couldn't agree more.
Well, a huge thank you to our expert for sharing all your knowledge and insights with us today.
Oh, it was my pleasure.
And to all our listeners, thank you for joining us on this deep dive into the world of allergies and anaphylaxis.
Yeah, thanks for listening.
Remember, knowledge is power, and being aware of those signs and symptoms and understanding the importance of a quick response could really make all the difference in an emergency.
It really could.
Stay curious, stay informed, and keep diving deep. Welcome to our deep dive today. We're tackling a tough topic: how to recognize abuse and assault. We'll be looking at it through the lens of paramedics. They're often the first to encounter these situations. You may not be answering 911 calls, but what we discussed today applies to everyone who wants to understand these issues better. We've got 2 cases from our source material to examine, one with a child, one with an elderly man.
It is interesting how paramedics are trained to be so observant. They can pick up on really small things that suggest the situation is more complicated.
Absolutely. Our first case really shows this. It seems simple at first. A father brings his 8-year-old son to the ER, possible fractured arm. The dad says the boy tripped and fell, but when we look closer, some red flags pop up.
The source material mentions the child has tender right lower ribs with blush and purple bruising. That injury doesn't seem to fit the father's story of just a trip and fall.
Yeah, good point. Makes you think. Why wouldn't the father mention those rib injuries? And it's not just the physical injuries. The source material also talks about how important the child's behavior is. The boy is hesitant to talk about what happened. What does that tell us?
Well, hesitation like that can be a big sign of possible abuse. Children who've experienced trauma, especially from someone they trust, they often become withdrawn and scared. They might not make eye contact or hesitate to answer questions, maybe even change their story if you ask them a few times. It's really sad. But it's a crucial detail for paramedics to notice.
It's almost like they're trying to protect themselves, even if they don't fully grasp what's going on. The source material throws a real curveball. It asks, based on the color of Adam's bruises, how old might they be? I was stumped by that one. How can you tell how old a bruise is?
Ah, that's where the science of bruise dating comes in. It's been really important in lots of legal cases. You see, bruises actually change color as they heal. Fresh ones are usually red or purple. Then they turn green, yellow, and finally brown. A trained medical professional can look at these colors and how the bruise feels and estimate its age.
So if the color of the bruise doesn't match the father's story, that's a huge warning sign that something worse might be happening.
Right. And this is where understanding typical patterns of abuse is so important. The source material mentions that bruises on the back, buttocks, or any unusual areas are especially suspicious in children.
Okay, let's say the paramedic or anyone really sees these warning signs. What then? What should someone do if they suspect child abuse?
That can be tricky. Some professionals, like paramedics, teachers, social workers, are called mandatory reporters. That means they're legally required to report any suspicion of child abuse, even if it just seems possible. Think of it as a way to protect children.
That makes sense. But what about someone who's not a mandatory reporter? Like, what if I see something concerning at the park?
Even if you're not legally required to report it, I think you have a moral obligation to act. You don't have to be absolutely sure abuse is happening. By contacting Child Protective Services or the police, you let trained professionals investigate. Your concern could be the difference maker.
So it sounds like documentation is really important here.
Absolutely. Paramedics are trained to document everything in detail. How the child looks, how they're acting, what the caregiver says, any inconsistencies. This record can become vital evidence if a case of abuse is investigated.
Let's move on to our second case now. It involves an elderly man found in a troubling situation.
Yes, the source describes an 85-year-old man. He's in a messy apartment, weak, looks neglected. His daughter is there, but doesn't want the paramedics to examine him. Says he hasn't been eating or drinking. But like our last case, things aren't so simple.
What details stand out in this case? What would set off alarm bells for experienced paramedics?
Several things. The man's overall condition, weakness, not eating, found in urine-stained pajamas. Those point towards possible neglect. Then there's the daughter not wanting the paramedics to examine him. That's suspicious right away.
I see the source material also mentions the man has pressure sores. Are those a serious sign of neglect?
Definitely. Pressure sores or bed sores usually happen when someone can't move for long periods and isn't cared for properly. They suggest a lack of basic hygiene and attention to the man's needs.
Looks like we're seeing a pattern, just like with the child abuse case, putting small details together to get a clearer picture.
You got it. And this case goes even further. The source material asks, based on your partner's assessment of the patient's room, why is there a distinct possibility of elder abuse? It's almost like a detective case.
Okay, you've got me hooked. What's so concerning about the man's apartment?
The paramedics notice a few alarming things. First, the door is locked from the outside. So is the man being kept inside against his will. Then, there's a lack of basic things. Food, water, clean clothes. And finally, the whole apartment is messy and dirty, suggesting neglect that's been going on for a while.
That paints a disturbing picture, a stark reminder that elder abuse is a serious problem that often goes unnoticed.
It is. And sadly, it's more common than people think. Elder abuse often happens behind closed doors, making it hard to detect. That's why it's so important for everyone to know the signs and what to do if something feels wrong.
The source material mentions some medications found in the apartment: Ritalin, Restoril, and Sulindac. Is that significant?
The presence of those medications raises some concerns, especially considering the possibility of elder abuse. Medication mismanagement is, unfortunately, another form of abuse, and it can have terrible effects on seniors.
So it's not just whether the medications themselves are bad, but how they're being used or misused.
Exactly. Mismanagement can be many things. Giving too much medication, not enough, not following the prescription, even using medication to sedate or control an elderly person. These are all forms of abuse. In this case, the specific medications Ritalin for ADHD, Restoril for sleep, and Sulindac, an anti-inflammatory, could have serious side effects for an elderly person, especially if they're already weak and dehydrated. And the fact that Ritalin, usually for ADHD, is in the home of an 85-year-old man raises questions about possible misuse.
It's incredible how much paramedics can figure out from little details. It really shows how important they are in protecting vulnerable people.
You're right. And although we may not all be paramedics, I think there's a valuable lesson here for everyone. It's about being observant, paying attention to the details, trusting your gut feeling when something doesn't seem right.
I agree completely. It's about recognizing that even the most vulnerable people in our society deserve our attention and protection.
Absolutely. And we've just scratched the surface of this complex issue. There's much more to explore.
And we will. In the next part of our deep dive, we'll go deeper into different forms of abuse, the terrible consequences, and most importantly, what we can all do to prevent it.
You know, it's easy to feel kind of overwhelmed by all this, but we're not powerless. There's actually a lot we can do to stop abuse before it even starts.
That's good to hear. I have to admit, after those two cases, I'm feeling a little down. So what can we do to prevent abuse? Where do we even begin?
Well, education is really important. Think about those programs that teach parents how to discipline in a positive way, manage stress, and communicate better. Those can make a huge difference.
Right, giving people the tools they need to handle tough situations. It's about getting to the root of the problem.
Exactly. Abuse often comes from not knowing how to cope, being super stressed, or having unresolved trauma. If we can support families, especially those struggling, we can prevent abuse.
What kind of support are we talking about?
Think about affordable childcare, access to mental health services, strong social support networks. These things can help families deal with stress and prevent abuse.
So it's about creating a safety net, making sure families have what they need to thrive.
Exactly. But prevention goes beyond individual families, too. We need to look at society as a whole and challenge those cultural norms that say violence is okay, or that minimize it.
Can you explain that a bit more? What are some examples of those norms?
Think about how aggression is often shown in movies and TV,
Mm.
or the harmful stereotypes about men and women that still exist. Even the way we talk about discipline can contribute to a culture where abuse is more likely to happen.
So we need to create a culture of respect, empathy, and nonviolence. That's a huge job, but it seems crucial.
It is a big job, but there are some encouraging signs. For example, the way we talk about consent has changed in a positive way. The hashtag #MeToo movement really brought this issue to light, and now there's more emphasis on respecting boundaries and understanding consent in all areas of life, not just in sexual situations.
That's really important. We need to teach kids from a young age that they have the right to say no, to set boundaries, and to be treated with respect.
Absolutely. It's about empowering people and challenging those power imbalances that can lead to abuse.
Mm.
We need a culture where everyone feels safe to speak up and knows their voice will be heard.
It's good to see those conversations happening more openly and that there's more awareness about consent now.
There's also more awareness of domestic violence.
Mhm.
It used to be something people didn't talk about, but now there are more public campaigns,
Mhm.
more resources for victims, and more people willing to speak out against it.
That's so important. The more we talk about these issues, less stigma and shame there will be, and more people will feel comfortable seeking help.
I agree. It's about creating an environment where abuse is not tolerated and is addressed quickly and effectively.
So preventing abuse is the ultimate goal, but we also need to talk about what happens after abuse occurs. What about the victims? What support is there for them?
That's a key question. Healing from abuse can be a long and difficult process. It often requires specialized help. Thankfully, there are many resources available, depending on the type of abuse and the individual's needs.
What kind of resources are we talking about?
Therapy and counseling specifically for trauma survivors are essential. Support groups can also be helpful. They allow survivors to connect with others who understand what they've been through, which can be very validating and empowering. And there are organizations that provide practical help, like legal aid and housing assistance.
So even though we're talking about some very difficult topics, it's encouraging to know that there are people and organizations dedicated to helping survivors heal and rebuild their lives.
It really is. And it's important to remember that healing is possible. With the right support, survivors can find hope and resilience.
That's a powerful message. It's easy to feel hopeless when facing these issues, but knowing that help is available makes a big difference. It's a reminder that even in the darkest times, there's always light and hope for a better future.
And speaking of hope, it's important to recognize that the fight against abuse is something we all need to be part of. It requires awareness, knowledge, and active involvement from everyone.
You're right. The problem may seem huge, but even small actions can have an impact, whether it's educating ourselves, speaking out against abuse, supporting organizations that help survivors, or just being kind and compassionate to the people around us. We can all contribute to creating a safer and more just world. As we've been talking, it occurs to me that recognizing abuse isn't just about seeing the obvious signs. It's about understanding the subtle ways it can show up too, especially in different cultures.
That's really important. Abuse have many forms, and what's seen as abusive in one culture might not be in another. We have to be sensitive to those differences and not make judgments based on our own cultural biases.
Can you give an example? I'm having trouble picturing how cultural differences could affect how we see abuse.
Well, think about disciplining children. In some cultures, it's considered okay to use physical discipline. In others, it's completely forbidden. We need to understand those differences. Approach each situation with an open mind. Try to understand the context before judging.
So it's not about forcing our own values on others, right? It's about recognizing that cultures have different norms and beliefs. That makes sense, but it seems complicated. How do we deal with that? How can we recognize abuse in a culture different from our own?
It takes a combination of things: cultural sensitivity, careful observation, a willingness to ask questions. It's important to build relationships with people from different cultures, learn about their customs and beliefs, and be respectful of their points of view.
So open communication and genuinely wanting to understand are key.
Absolutely. And I think it's just as important to be aware of our own biases. We all have them, even if we don't realize it. We need to be mindful of those biases and challenge them whenever we can.
That's a great point. It reminds me of that quote, "We don't see the world as it is, we see it as we are." Our own experiences and perspectives shape how we interpret things.
Exactly. And when we're dealing with something as sensitive as abuse, we need to be extra careful not to let our biases affect our judgment. We have to approach each situation with empathy and a willingness to learn.
This connects back to what we discussed earlier about education and prevention. The more we know about different cultures, the better we can recognize and address abuse in all its forms.
Exactly. It's about creating a world where everyone feels safe and respected, no matter their cultural background. That's the kind of world I want to live in.
Me too. And that's a perfect way to wrap up our deep dive today. We've explored a lot, from the subtle signs of abuse to the impact of cultural differences. It's been a tough but important conversation.
It really has. I hope our listeners feel empowered to act in their own communities, to speak up for those who can't, to work towards a world where abuse is no longer tolerated.
Well said. Remember, knowledge is power, and together we can make a real difference. Thanks for joining us on this deep dive. Until next time, stay curious, stay informed, and stay engaged. Welcome to the deep dive. Today, we're going behind the scenes of emergency medicine.
Oh, okay.
Yeah, exploring the world of behavioral disorders from a paramedic's perspective.
Interesting.
We've got some fascinating case studies and test questions
Oh, wow.
taken straight from a paramedic textbook. The kind of stuff that really makes you think.
Yeah, these aren't just abstract medical scenarios.
Right.
We're talking about real-life situations that paramedics encounter every day.
Yeah.
Situations where understanding human behavior can be just as crucial as knowing medical procedures.
Exactly. And
Yeah.
you'll see how the lines can blur when it comes to behavioral emergencies.
For sure.
We're going to delve into cases involving potential suicide. Okay, extreme agitation.
Yeah.
Even situations where restraint becomes necessary.
Restraint. Yeah, that's always
Yeah.
a tough one.
That is.
What's fascinating is that each case presents unique challenges, ethical dilemmas,
Right.
and opportunities to learn.
Yeah.
It's about more than just treating symptoms. It's about understanding the whole person in crisis.
Yeah, let's start with a case that really highlights the complexities of scene assessment.
Okay.
Imagine this.
Okay.
A 16-year-old boy
Okay.
found by his father hanging in his closet.
Oh, gosh. It's a scene filled with chaos and grief.
Right?
The boy is unconscious. His skin is turning blue,
Oh, wow.
and there are fluids on his chest and abdomen.
Oh, my God.
The father, who's already started CPR, tells the paramedics he found his son with padding under the tie around his neck.
That detail about the padding, it immediately raises questions, doesn't it?
It does.
In a situation that seems like a clear-cut suicide attempt, that one detail throws everything into question.
It does, and it forces paramedics to consider a difficult possibility.
Okay.
Autoerotic asphyxiation.
Oh.
It's a phenomenon where individuals accidentally die during solitary sexual acts that involve intentionally restricting oxygen flow to the brain.
Wow.
The presence of padding suggests this might be the case rather than a deliberate attempt to end his life.
That's such a sensitive and often misunderstood topic.
Yeah.
I imagine it takes a lot of training and experience for paramedics to even consider that possibility,
It does.
especially in the midst of such a charged situation.
It does, and they have to balance their investigation with incredible sensitivity towards the grieving father.
Right.
Can you imagine the guilt and confusion he must be
I
experiencing?
can't even imagine.
Paramedics need to be careful not to add to that burden by jumping to conclusions.
Absolutely. It's about gathering all the information,
Yeah.
considering every angle, but
Yeah.
also treating everyone involved with compassion and respect.
Right now, in this case, they learned the boy had a history of asthma
Okay.
and was on medication.
Okay, so that adds another...
That adds another layer of complexity.
Could an asthma attack have somehow mimicked the symptoms of hanging?
Yeah, it's a question that highlights the importance of differential diagnosis.
That's where paramedics have to become medical detectives,
Yeah.
right? They have to look beyond the most obvious explanation and consider all the potential factors at play.
Precisely. They have to connect the dots, considering the boy's medical history,
Uh-huh.
the specific details of the scene,
Yeah.
and all the possible explanations for his condition.
And in this case, they also had the boy's ECG readings to consider.
Right.
Initially, it showed pulseless electrical activity,
Oh,
or PEA.
PEA.
Can you explain what that means for those of us who aren't medical professionals?
Sure, think of it this way. His heart was essentially quivering,
Okay.
not pumping blood effectively.
Wow.
It's a very serious condition.
Yeah.
Later, his ECG progressed to asystole,
Okay.
which is essentially a flat line,
Right.
no electrical activity at all.
So they're dealing with a young patient, a potential hanging,
Right.
A distraught father
Yeah.
and a complex medical situation all at the same time.
Yeah.
It really emphasizes the weight of responsibility these paramedics carry.
It does. And that was just our first case.
Oh my gosh.
Ready to move on to a scenario that's completely different.
Absolutely. What do we have next?
This time we're called to a scene where police have restrained a 48-year-old man who is manic and aggressive.
Okay.
He's exhibiting erratic behavior, struggling against the restraints,
Oh, wow.
and lashing out verbally at anyone who comes near.
That sounds incredibly intense, even dangerous.
Yeah,
I can only imagine how challenging it is for paramedics to approach a scene like that.
it is, and it presents a whole different set of challenges compared to our first case.
Right.
When a patient is already restrained by police, paramedics have to be extremely cautious.
Yeah.
The risk of injury is high,
Yeah.
both for the patient and the responders.
Right, because you're walking into a situation that's already highly charged.
Yeah,
De-escalation must become the top priority.
it is, but at the same time, paramedics need to quickly assess the situation
Okay.
and determine the root cause of the behavior.
Right.
Is it stemming from a medical condition, a psychiatric condition,
Yeah.
or a combination of both?
It's like trying to solve a puzzle while also managing a potentially volatile situation.
Yeah.
What was this man's background? Do they know anything about his medical history?
They did. He had a known history of bipolar disorder
Okay.
and was on medication.
So, judging by his behavior,
Yeah,
it seems likely he was in a manic state at that moment.
it seems that way.
Is there a way for paramedics to confirm that suspicion quickly,
Yeah.
even in such a chaotic environment?
There are certain physical signs that can point to mania.
Okay.
In this case, his vital signs were telling
Okay.
elevated blood pressure
Uh-huh.
and rapid pulse indicated a heightened state of arousal.
Okay.
His dilated pupils and sweaty skin were further signs of his agitated state.
So even in a situation where the patient isn't communicating clearly,
Right.
their body is sending signals that paramedics can interpret.
Exactly. It's about being attuned to those subtle cues,
Mm-hmm.
reading the situation,
Yeah.
and responding appropriately.
So how did they approach treating him? What's the best course of action when you're dealing with a patient who's already restrained
Yeah.
and exhibiting such extreme behavior?
The restraints were already in place,
Okay.
which helps ensure everyone's safety.
Mm-hmm.
But verbal de-escalation techniques are also crucial in these situations.
Okay.
Speaking calmly, validating the patient's feelings, and explaining what's happening can go a long way in reducing agitation.
It's almost like a delicate dance, isn't it?
It is.
Balancing the need for control with the need for compassion.
It is. And in some cases, medication might be necessary to help calm the patient down.
Okay.
But it's not a decision to be taken lightly.
Right, because you have to weigh the potential benefits against the potential side effects and the patient's right to autonomy.
Exactly. It's a complex ethical dilemma that paramedics often have to grapple with in the field.
Now, before we move on to our final case for today,
Okay.
I want to touch on something you mentioned earlier,
Sure.
the cyclical nature of bipolar disorder. What does that mean for paramedics who might encounter the same patient again in the future?
That's a great question.
Mm-hmm.
It's important to remember that bipolar disorder isn't a static condition.
Okay.
Even if this patient is stabilized and seems cooperative now, he could experience another manic episode
Mm-hmm.
or swing into a deep depression down the road.
So it's not just about addressing the immediate crisis, but also understanding the long-term trajectory of the illness
Right.
and the ongoing challenges the patient might face.
Exactly. It's about seeing the patient as a whole person, not just a collection of symptoms.
With that in mind,
Yeah.
let's delve into our final case.
Okay.
One that raises some serious questions about the way individuals with behavioral disorders are sometimes handled.
Okay.
We're talking about a 34-year-old man who was subdued by police after acting bizarrely and aggressively.
Okay.
When paramedics arrive,
Yeah.
he's unconscious, has abrasions, and his skin is showing signs of cyanosis,
Oh.
that bluish tint that indicates a lack of oxygen.
This case is particularly tragic because it highlights the potential for harm when restraint practices are misused and misunderstood.
Yeah.
The fact that this man was found lying face down immediately raises red flags.
Because that position can restrict breathing
Exactly.
and potentially lead to positional asphyxia,
Yes.
which can be fatal.
Exactly. It's a risk that paramedics are acutely aware of,
Right.
especially when dealing with patients who have been restrained.
Uh-huh.
Unfortunately, there's a dark history associated with restraining people face down,
Okay.
particularly a practice called hog tying,
Right?
which thankfully is avoided in modern emergency medicine due to its extreme dangers.
It's disturbing to think that such a dangerous practice was ever considered acceptable.
I know.
What are the preferred methods for restraining a patient safely and humanely?
It's all about minimizing the risk of harm while ensuring everyone's safety.
Okay.
Soft restraints applied to the wrists and ankles are generally considered safer,
Yeah.
and the patient should never be placed in a face-down position.
Makes
Constant monitoring is essential to ensure their airway remains open and that they're not experiencing any distress.
So back to this specific case.
Okay.
What else did the paramedics know about this man's background?
He had a history of schizophrenia,
Okay.
a complex mental disorder that can involve a range of symptoms,
Mm.
including hallucinations,
Uh-huh.
delusions, disorganized thinking, and social withdrawal.
Wow.
It's important to note that not everyone with schizophrenia experiences the same symptoms or severity of symptoms.
So there's no one-size-fits-all approach to caring for these patients.
Exactly.
Each encounter requires a personalized assessment and response.
Exactly. And in this case, it was crucial for the paramedics to understand his specific presentation,
Uh-huh.
his medical history,
Yeah.
and the medications he was on. He was taking Risperdal and Zyprexa,
Uh-huh.
both antipsychotic medications,
Okay.
and CNO, an anticonvulsant, sometimes used to manage agitation. These medications can have side effects, so it's important for paramedics to be aware of potential drug interactions or complications.
Now, his ECG readings also revealed some concerning information.
Oh.
Initially, he presented with PEA,
Okay.
similar to the first case we discussed.
Mm-hmm.
But after resuscitation efforts, it progressed to normal sinus rhythm,
Good.
or NSR,
And
with PACs, which are premature atrial contractions.
Cox, can you break that down for us? What does it all mean?
The initial PEA is a serious sign indicating that his heart wasn't pumping blood effectively.
Wow.
It's likely this was brought on by the positional asphyxia he experienced while restrained.
Right.
The fact that his heart rhythm returned to normal after resuscitation is a positive sign.
Okay, good.
But the presence of those PACs, those extra beats, suggests there might be some underlying cardiac irritability.
So even though he was revived, it doesn't mean he's out of the woods.
Right.
There could be lingering effects from that period of oxygen deprivation. Precisely. And it underscores the need for thorough post-resuscitation care and ongoing monitoring.
Right.
These patients require careful observation to ensure they don't experience further complications.
We've covered a lot of ground with these three cases,
We have.
each one highlighting a different facet of behavioral emergencies.
Yeah.
What are some of the key takeaways we should keep in mind?
I think the overarching theme is that behavioral emergencies are complex,
Yeah.
multifaceted situations.
Right.
They demand not only medical expertise, but also a deep understanding of human behavior,
Uh-huh.
empathy,
Yeah.
and a commitment to providing ethical, compassionate care.
It's about recognizing that these aren't just medical cases. These are real people in crisis,
Yeah,
each with their own unique story and set of challenges.
absolutely. And paramedics are often the first line of support for these individuals. They need the training, the resources, and understanding to navigate these challenging situations and provide the best possible care.
We've just scratched the surface of these cases,
We have.
and I'm sure you're eager to hear more about their implications and the lessons they hold.
I am. So let's revisit that first case, the 16-year-old boy found hanging.
Okay.
The textbook asks a pointed question
Okay.
that really gets to the heart of this case. What was significant about the patient's positioning, the padding under the tie around his neck?
Yeah, the padding stands out as a really unusual detail.
Right.
It's something you wouldn't expect to see in a typical suicide scenario.
Exactly. And that's why it's so crucial for paramedics to pay attention to those seemingly small details.
Right.
The presence of padding along with the specific positioning could suggest autoerotic asphyxiation,
Right.
where the goal isn't suicide,
Hmm.
but to heighten sexual pleasure through oxygen deprivation.
It's a difficult concept to grasp, especially in such a tragic context.
Yeah.
And I imagine it adds another layer of complexity for the paramedics who are trying to determine what happened.
They have to consider all possibilities while remaining incredibly sensitive to the family's grief.
Right.
Imagine trying to explain this delicate concept to a father who just found his son.
Yeah.
It requires a level of empathy and communication skills that goes beyond just medical knowledge.
Absolutely. It's about acknowledging the human element in all of this, not just focusing on the technical aspects of the case.
Right now, the textbook also challenges us to think about the differential diagnosis in this case.
Okay.
What else could have caused the boy's condition besides hanging or autoerotic asphyxiation?
His history of asthma immediately comes to mind.
Okay.
Could an asthma attack have led to a loss of consciousness and eventually cardiac arrest?
That's a possibility the paramedics have to consider. Asthma attacks can be severe, especially if they're not managed properly.
Right.
And the symptoms, difficulty breathing, turning blue, can overlap with what we see in a hanging scenario.
So even in a situation that seems straightforward at first glance, there's a lot of detective work involved.
Exactly. Paramedics are trained to look for those subtle clues,
Yeah.
to consider all the potential factors, and to never jump to conclusions.
Let's move on to our second case. The 48-year-old man exhibiting manic behavior who was restrained by police.
Right.
This one raises some interesting questions about how to manage a patient who's already in a highly agitated state.
It's a high-stakes scenario, for
Mhm.
sure. The textbook asks a very direct question: why is the patient presenting with aggression and bizarre behavior?
Well, his diagnosis of bipolar disorder certainly seems relevant here. Could you explain how bipolar disorder can manifest in such extreme behavior?
Bipolar disorder is characterized by those extreme shifts in mood, from mania to depression.
Right.
During a manic episode, individuals can experience racing thoughts,
Okay.
heightened energy,
Hmm.
impulsivity,
Yeah.
and even psychosis, which can explain the bizarre behavior and aggression we see in this case.
So it's not simply a matter of someone being difficult or uncooperative.
So,
There's a biological basis for their behavior, a chemical imbalance in the brain.
precisely. And it's essential for paramedics to understand that context when they're approaching a patient like this.
Mm.
They need to recognize that the behavior isn't intentional or malicious. It's a symptom of a complex neurological condition.
Now, the textbook also asks about the best approaches for dealing with a manic patient versus a depressed patient. It seems like those would require very different strategies.
Absolutely, when dealing with a manic patient like the man. In this case, the priority is de-escalation.
Oh, okay.
Speaking calmly, validating their feelings, and avoiding confrontation can help reduce agitation.
But wouldn't that be challenging when the patient is already restrained and potentially struggling against those restraints?
It can be,
Yeah.
and it requires a delicate balance of ensuring safety while also respecting the patient's dignity.
Right.
Sometimes simply acknowledging their distress and explaining what's happening can make a difference.
What about medication? Would that be a consideration in this situation?
It could be if the patient is a danger to themselves or others, or if their mania is so severe that it's preventing them from receiving necessary care. Medication might be administered, but it's not a decision to be taken lightly.
Right, because medication can have side effects, and you have to consider the patient's autonomy as well.
Exactly. It's a complex ethical dilemma that paramedics often face in the field.
Right.
They have to weigh the potential benefits of medication against the potential risks and the patient's right to refuse treatment.
Now, you mentioned earlier that bipolar disorder is cyclical,
Yes.
meaning that manic episodes can be followed by depressive episodes.
Right.
How does that impact the way paramedics approach a patient with bipolar disorder?
It means they need to be aware that the patient's presentation can change dramatically from one encounter to the next.
Right.
Someone who is manic and agitated today could be withdrawn and lethargic tomorrow.
So it's not just about addressing the immediate crisis, but also recognizing that this is a long-term condition that requires ongoing care and support.
Precisely. And it underscores the need for communication and collaboration between paramedics, mental health professionals, and other support systems in the community.
Let's move on to our final case. The 34-year-old man with schizophrenia who was found unconscious after being subdued by police.
Okay.
This one raises some serious concerns about the use of restraints and the potential for harm.
This case is a stark reminder of the responsibility that comes with restraining a person, especially someone experiencing a mental health crisis.
Yeah.
The textbook asks a very pointed question: should hog tying be utilized in the field for patient restraint?
Okay.
And the answer is a resounding no.
That seems pretty definitive of what makes hog tying so dangerous.
Hog tying involves binding a person's hands and feet together behind their back,
Yeah.
often in a face-down position.
Right.
It severely restricts breathing and can quickly lead to positional asphyxia, which is exactly what happened in this case.
It's disturbing to think that such a dangerous practice was ever used.
Yeah.
What are the preferred methods for restraining a patient safely?
It's all about minimizing the risk of harm, while ensuring everyone's safety soft restraints applied to the wrists and ankles are generally considered safer, and the patient should never be placed in a face-down position.
That makes sense. It's about finding that balance between protecting the patient and protecting those around them.
Exactly, and constant monitoring is crucial. Paramedics need to constantly assess the patient's breathing circulation and overall well-being to ensure the restraints aren't causing any harm.
So in this case, the patient had a history of schizophrenia. Could you explain a bit more about that condition and how it might have contributed to his behavior?
Schizophrenia is a complex mental disorder characterized by a range of symptoms, including hallucinations, delusions, disorganized thinking, and social withdrawal. It's important to remember that not everyone with schizophrenia experiences the same symptoms or severity of symptoms.
So there's no one-size-fits-all approach to caring for a patient with schizophrenia.
Exactly. Each encounter requires a personalized assessment based on the individual's specific presentation and needs. In this case, the paramedics needed to understand the man's history, the medications he was on, and the specific triggers that might have led to his crisis.
His medications included Risperdal and Zyprexa, which are antipsychotics, and CNO, which is sometimes used to manage agitation. What should paramedics know about these medications when they're treating a patient with schizophrenia?
It's essential to understand that these medications can have side effects, and some can interact with other drugs. Paramedics need to be aware of those potential interactions and be prepared to manage any complications that might arise.
Now, his ECG readings also painted a rather complex picture. He initially presented with PEA, which we discussed earlier, then progressed to a normal sinus rhythm with PACS after resuscitation. What can we learn from that?
The initial PEA is a serious sign indicating that his heart wasn't pumping effectively. It's likely this was a result of the positional asphyxia he experienced. While restrained, the fact that his heart rhythm returned to normal after resuscitation is a positive sign. But the presence of those packs, those extra beats, suggests there might be some underlying cardiac irritability.
So even though his heart rhythm stabilized, it doesn't mean he's out of danger. There could be lingering effects from that period of oxygen deprivation.
Precisely. It highlights the importance of thorough post-resuscitation care and ongoing monitoring. These patients need close observation to ensure they don't experience further complications.
We've explored these three cases in depth, uncovering the layers of complexity that paramedics face when responding to behavioral emergencies. As we move into the final part of our deep dive, what are some key themes that have emerged from these discussions?
I think the overarching message is that behavioral emergencies are rarely straightforward. They demand a unique blend of medical knowledge, compassion, and critical thinking skills.
It's not just about treating the symptoms, it's about understanding the person behind the crisis.
Absolutely. And as we delve deeper into the questions posed by the textbook and explore the broader societal context, we'll see how these themes play out on a larger scale.
We've laid the groundwork with these cases, and now it's time to expand our perspective and explore the bigger picture. Stay tuned for the final part of our deep dive. So we've explored the medical complexities of these cases, the diagnostic challenges, and the ethical considerations. But now I want to shift our focus to the human element, to the individuals behind the diagnoses. These aren't just textbook examples. These are real people experiencing real crises.
Yeah, it's so easy to get caught up in the technical details and forget that we're dealing with human beings who are often scared, confused, and in desperate need of understanding.
The textbook we've been using really emphasizes that point by asking questions that go beyond the purely medical. For example, in the case of the 16-year-old boy found hanging it asks, what is this act of self-gratification commonly labeled by law enforcement agencies?
And the answer can be quite jarring. Autoerotic asphyxiation is often misconstrued as suicide or even homicide without clear evidence to the contrary. Law enforcement might jump to conclusions that further traumatize the family and misrepresent what truly occurred.
It's a stark reminder that assumptions can be dangerous, especially in these sensitive situations. It highlights the need for thorough investigation, open communication, and a willingness to consider all possibilities.
Absolutely, and the textbook also delves into the emotional impact on those involved, particularly the father who found his son, it asks. What is difficult for the father and others affected by this incident?
I can only imagine the guilt, the confusion, the grief compounded by the social stigma surrounding such a death.
It's a heavy burden to carry, and paramedics, who are often the first to arrive on the scene, play a crucial role in providing support that goes beyond medical.
It's about recognizing the emotional turmoil the family is going through, acknowledging their loss, and offering a sense of humanity amidst the chaos.
Exactly. It's about treating them with dignity and respect, even in the midst of a difficult investigation.
Now, the second case, involving the man with bipolar disorder, also prompts us to think about the long-term management of this condition, the textbook asks. What are the classifications of the patient's medications? What are the best approaches for dealing with a manic patient versus a depressed patient?
Yeah, it's emphasizing that this isn't just a one-time encounter. Paramedics might encounter this individual again, perhaps during a depressive episode, which presents a whole different set of challenges.
So it's not just about addressing the immediate crisis, but also recognizing that bipolar disorder is a chronic condition that requires ongoing care and understanding.
Precisely, and the approach to a manic patient who might be agitated and unpredictable will differ significantly from the approach to a depressed patient who might be withdrawn and lethargic.
It underscores the need for paramedics to be adaptable, to tailor their responses to the specific needs of each patient at each encounter.
And to recognize that mental health is a spectrum, not a fixed point. People can move along that spectrum, and their needs will change over time.
Finally, the case of the man with schizophrenia who is restrained face down raises some broader societal questions. The textbook asks, what is agitated delirium? What is schizophrenia? Should hog tying be utilized?
It's prompting us to examine how we as a society respond to individuals experiencing mental health crises. Agitated delirium, characterized by extreme agitation and often aggression, can be incredibly frightening for both the individual and those around them. But the use of excessive force or dangerous restraints like hog tying is never the answer.
It speaks to the need for better training for law enforcement and first responders training that emphasizes de-escalation techniques, mental health awareness, and the appropriate use of restraints.
We need to shift from a culture of control to a culture of care when it comes to interacting with individuals with mental health challenges. This includes recognizing the signs of a crisis, understanding how to communicate effectively, and knowing when to call for medical assistance.
We've covered a lot of ground in this deep dive. We've explored the medical intricacies of behavioral emergencies, delved into the ethical dilemmas faced by paramedics, and examined the broader societal context of mental health care. What's the lasting message you hope our listeners take away from this?
I think it boils down to this. We need to approach behavioral emergencies with both our heads and our hearts. We need to be clinically competent, of course, but we also need to be compassionate, understanding, and truly present for those in crisis. We need to see beyond the diagnosis and recognize the individual human being who deserves our care and respect.
That's a powerful call to action. We can all play a role in creating a more supportive and empathetic world for those struggling with mental health challenges. Thanks for joining us for this insightful deep dive, and until next time, keep those minds curious and those hearts open. All right, let's jump into it. Today, we're tackling emergency cardiology.
Oh yeah, those high-stakes calls.
You got it. Using what we have here, 4 case studies from a medical textbook.
That's right, those tricky scenarios paramedics face.
Yeah, and we'll unpack how they make those tough decisions, out in the field with limited info.
Yeah, limited info, ticking clock, life or death.
Absolutely. So let's dive right into the first one.
Okay.
This one puts us right into a nursing home.
Right.
Freezing January morning. You arrive and find an elderly woman, she's in her 70s, struggling to breathe.
Oh, that's rough.
She's conscious, but it's not looking good. Shallow breaths, you can hear crackles in her lungs, pale, sweating profusely.
Okay, so right away you're thinking respiratory distress.
Right.
What's causing it? Cardiac event? Maybe,
Could be.
but always got to keep an open mind, right?
Yeah.
Pneumonia, something else.
So many possibilities.
Yeah.
And adding to that, she's got a history of congestive heart failure.
Oh, okay, so that's a big piece of the puzzle.
Big piece. And she's on a bunch of meds.
What's like?
Lasix, a diuretic, and digoxin for her heart rhythm.
Okay, so her meds give us some hints right
Right.
there. Lasix, that means she's probably dealing with fluid buildup. Maybe her heart's not pumping as well as it should.
Mm.
And then the digoxin, that often means the heart needs a little help to keep a steady beat.
So we've got respiratory distress, history of CHF, meds hinting at underlying heart issues. And then you check her vitals, blood pressure sky high, 200 over a 160.
Whoa.
Pulse is racing at 150 and irregular, and her oxygen saturation is dipping down to 88%.
Yeah, this is all pointing towards a serious cardiac event.
It really is. And think about what's happening inside her body.
Yeah.
Her heart's struggling to keep up, like a pump that's failing.
Exactly. That's why you see that high blood pressure, that rapid pulse.
And the fluid building up in her lungs, making it harder and harder to breathe, hence the low O2 sat. So what's the first thing a paramedic does? Every second counts in this situation, right?
Absolutely. Immediate priority is oxygen. Get that into her system.
Okay.
And then address that potential heart failure and the fluid in her lungs.
Okay.
The source material mentions starting an IV and giving nitroglycerin.
Oh, nitroglycerin.
Yep, that helps dilate those blood vessels.
Like widening the pipes to ease the pressure.
Exactly. Improve blood flow to the heart.
But then the textbook mentions something interesting.
What's that?
Transporting her in a semi-Fowler's position.
Ah, sitting her up at a 45-degree angle.
Why is that so important? Wouldn't you want to keep her lying down and still?
You'd think so, right?
Huh?
But think about it. When she's lying flat, gravity is working against her.
Okay.
It's harder for her diaphragm to expand, for her lungs to fill up with air.
Hmm.
But sitting her up helps her breathe a little easier, reduces the workload on that already strained heart.
So a simple change in position can make a big difference.
Huge difference. It's all about those little details. In this case, really shows how paramedics got to think critically and consider everything when they're making those decisions out there.
Okay, let's move on to case 12.2.
All right, what do we got?
Dinner time. You're called to a busy restaurant.
Oh, yeah?
You find a woman in her late 50s. She's just fainted.
Oh, man.
She's conscious, but she's confused, pale, sweating, struggling to catch her breath.
All right, so what caused her to faint? That's the first thing you're thinking. But there's this key detail. The source mentions her symptoms started right after she ate.
So could there be a connection between her dinner and the fainting?
Definitely something to think about.
Definitely.
Now, she does have a history of a heart attack, hypertension, and diabetes.
Oh, wow.
And she's on a bunch of meds, too.
So are those medications part of the puzzle, too?
They absolutely could be.
Right.
She's got an NTG patch for angina, Cardizem for blood pressure, Paxil for anxiety, and others.
Wow, that's a lot.
We got to think about side effects, interactions.
Oh, yeah.
Could any of these be contributing?
Okay, so complex medical history, a list of meds to consider. What do her vitals tell us?
Blood pressure's low, 80/60, and her pulse is regular at 84, but it's weak.
Okay.
Now, given her history, these findings could point to a few things.
Like what?
Could be related to her heart, a complication from her diabetes, even a side effect from one of her meds.
It's like a web, trying to figure out what's connected.
Exactly.
So what are the first steps to treat her?
Source material mentions oxygen and stabilizing that blood pressure.
Okay.
But there's a big caveat here. They specifically say no aspirin.
Why not? Isn't aspirin usually given when you suspect a heart attack?
Usually, yes, but her low blood pressure makes it risky.
Oh, okay.
Aspirin thins the blood, and giving it to someone with low blood pressure could make it even lower, lead to more problems.
So even though aspirin is usually a good thing in these situations, it's not a one-size-fits-all?
Definitely not. Good reminder that paramedics have to consider everything: medical history, symptoms, vital signs, the whole picture.
Absolutely. All right, ready for case 12.3.
Hit me with it.
This time you're called to a home where a 72-year-old man is having chest pain
All right.
right after breakfast.
Interesting. That timing, right after a meal,
Right.
could be something simple like indigestion,
Could be.
or something more serious like angina.
Right.
What else do we know?
He's conscious, alert, sweating, but his radial pulse is strong.
Okay, good sign.
And he has a history of hypertension, diabetes, arthritis, and a previous hernia repair.
So we're dealing with a few pre-existing conditions here.
We are.
Could complicate things.
Definitely. And his vitals show elevated blood pressure 132/90,
Okay.
rapid pulse at 170, but regular.
Those vitals with the chest pain, that's a red flag.
Definitely.
Makes you think about heart attack.
Right, and the EKG adds another layer.
What's it showing?
Initial reading shows a rapid heart rate.
Okay.
But as things progress, it starts to show some worrying changes.
Not good.
And then things get really intense.
Oh.
The source material says he starts vomiting and then loses consciousness.
Whoa, rapid decline. What's going on in his body?
Sounds like his condition's deteriorating fast.
Yeah.
Vomiting could be from the pain.
Okay.
Loss of consciousness probably means blood flow to the brain is compromised.
Right. Likely due to a major cardiac event.
So what's the plan of action here?
Priorities are oxygen, aspirin, nitroglycerin, and getting ready for a potential cardiac arrest.
So it's a race against time.
Absolutely. Gotta move fast.
This case really shows how a stable situation can turn critical in an instant.
It does.
Importance of early intervention, recognizing those subtle signs that something is seriously wrong.
Yeah, you gotta be on your toes.
Okay, on to our final case for this part of our deep dive, case 12.4.
Right, bring it on.
Warm night. You're called to a house.
Okay.
55-year-old man complaining of sharp, really bad chest pain that radiates to his back.
Oh, that radiating pain, that's a big clue.
It is.
Often means we're dealing with something more than just muscle or bone pain.
And the pain started suddenly as he was getting ready to go to the bathroom.
That sudden onset, the specific timing, those are crucial pieces of information.
They are.
Suggest a sudden event, not a gradual buildup.
Right, like something just happened.
Exactly.
We also find out he has a history of hypertension and a heart attack 3 years ago.
Okay, so he's already vulnerable to heart problems.
He is, and he's currently taking Sectrol, that's a beta blocker for his blood pressure,
Yep.
and some other meds for pain and anxiety.
Got it.
Vitals are troubling, blood pressure is low, 70/60, pulse is weak and slow at 38.
Uh-oh.
And the source material mentions poor circulation, mottled appearance in his lower extremities.
Those are really concerning findings.
They are.
Low blood pressure, the mottled skin, suggests his tissues aren't getting enough oxygen.
Right, like his body's struggling to circulate blood properly.
Exactly.
And his EKG, what does that show?
Shows a dangerous heart rhythm called ventricular tachycardia.
What does that mean?
Means his heart's beating too fast for the ventricles to fill up with blood properly, so his circulation's compromised.
Oh, wow.
Yeah, not good.
So, putting it all together, what's the likely diagnosis here?
Based on everything. The pain, the low blood pressure, the circulation problems, the EKG, the source material points to a potential aortic dissection.
Aortic dissection, so a tear in the aorta, the main artery.
That's it. And if that tear gets bigger, it could be catastrophic.
Oh, wow. So what are the treatment priorities here?
Oxygen right away, get an IV line in, and transport. Get him to the hospital ASCP.
But there's a caution about giving a fluid bolus, right? Why is that?
Yeah, a fluid bolus is usually used to raise blood pressure, but with a suspected aortic dissection, it's risky.
How so? Wouldn't you want to raise his blood pressure if it's low?
You would think so, but think about that tear in the aorta.
Okay.
If we suddenly increase his blood volume and pressure, we could actually make the tear worse, even cause a rupture.
So it's about weighing the benefits against the risks.
Exactly. And in this case, less is more. Stabilize him, get him to the hospital fast, let the surgeons handle it.
It's all about getting him to the right place for the right care.
It's exactly. Welcome back to our deep dive,
Yeah.
to emergency cardiology.
We've covered some pretty intense stuff already, but we're really trying to learn from these cases.
Absolutely.
So let's go back to that first one, the elderly woman in respiratory distress at the nursing home.
Okay.
One thing that really stuck with me was her history of congestive heart failure.
Yeah, CHF, it's common, especially in older adults,
Right,
but it can be tough to manage.
for sure.
In fact, the textbook asks, what are the telltale signs and symptoms of CHF?
It's a good question because those signs can be pretty subtle, especially at first.
Exactly. It can sneak up on you.
Right.
The textbook highlights shortness of breath, especially when lying down.
Okay.
Persistent cough or wheezing, swelling in the legs and ankles, fatigue, rapid or irregular heartbeat, difficulty exercising.
Wow, so it can really affect the whole body.
It does. It's like a domino effect.
Right, the heart's not pumping, right?
Yeah.
Fluid starts to back up,
Mhm.
and then all these other systems start to struggle.
Exactly. The body's working overtime.
The textbook also asks this interesting question. Why do episodes of CHF often happen in the early morning hours?
Oh, that's a good one. Have you ever noticed that?
Now that you mention it, yeah, I think I have.
It's those natural body rhythms.
Okay.
During sleep, heart rate and blood pressure naturally go down.
Right.
But with CHF, that weakened heart, it might struggle to adapt. Leads to fluid buildup in the lungs overnight.
So they wake up feeling worse.
Exactly. Shortness of breath, all those
As
symptoms,
if their body's working against them while they sleep.
pretty much.
The textbook also dives into her medications.
Okay, yeah, she was on a few.
Right, like Lasix, the diuretic, and digoxin for her heart rhythm.
Right, right.
So how do those meds fit into the overall picture?
Well, Lasix helps get rid of that excess fluid, ease the strain on the heart.
Okay.
But diuretics can also mess with electrolytes,
Oh, right.
which can then affect heart rhythm.
So a med meant to help could actually backfire.
It can. That's why monitoring is so important.
Right, and then there's digoxin.
Yeah, digoxin.
It can help regulate the heart rhythm,
You can.
but it can also have side effects.
Yeah, especially if the dosage isn't right.
It's like a constant balancing act with these medications.
It really is finding that sweet spot.
The textbook also asks about positioning.
Mm-hmm.
Why should this patient not be placed flat on her back during transport?
Another good question. You'd think lying down would be best.
Right. Keep them still.
But remember, she's having trouble breathing.
Okay.
Lying flat can actually make that worse.
Why is that?
Think about it. Her lungs are already full of fluid.
Right.
When she's flat, gravity pulls everything down, puts more pressure on her diaphragm, makes it harder to breathe.
Makes sense.
Sitting her up, that semi-Fowler's position, helps reduce that pressure.
So it's all about those little details, like positioning.
Absolutely can make a big difference.
Okay, let's move on to case 12.2, the woman who fainted at the diner.
Oh, yeah, that one.
I remember one interesting detail from the source material.
What's that?
She was pretty argumentative when the paramedics arrived.
Oh, that can be tough.
It can.
But got to remember, their behavior,
Yeah.
it's often influenced by things beyond their control.
Like what?
Think about it. She just fainted in public,
Yeah.
probably embarrassed, confused, maybe even scared.
Yeah, I can see that.
All those emotions, they could lead to agitation.
Makes sense. Good reminder to approach every patient with empathy.
For sure.
The textbook also asks about her medications.
She was on a few.
An NTG patch for angina, cardizem for blood pressure, Paxil for anxiety.
Right.
So could those meds be contributing to her fainting?
Well, both NTG and cardizem can lower blood pressure,
Okay.
which is what they're supposed to do, but sometimes it can cause a sudden drop, leading to fainting.
So the intended effect could actually be a problem in this case.
Exactly.
And what about the Paxil anxiety meds? Can they affect blood pressure too?
Paxil itself doesn't directly lower blood pressure,
Okay.
but anxiety itself can sometimes cause a temporary drop, leading to lightheadedness or fainting.
It's like everything's connected.
It really is mind to body.
The textbook also asks a very practical question.
Oh, yeah.
What's the best way to move this patient from her chair to a stretcher?
Good question. You got to think about that.
What would you recommend?
Well, she's weak, having trouble breathing, so we want to minimize any extra movement or strain.
Right.
The textbook recommends a direct lift, at least 3 rescuers.
Teamwork makes the dream work.
Exactly. Got to communicate clearly and make sure the patient feels safe.
The textbook also throws out a few possible diagnoses:
Okay, like what?
cardiac insufficiency, acute myocardial infarction.
So heart failure or a heart attack?
Yeah, both serious possibilities.
They are.
Heart failure could explain the low blood pressure, the breathing problems,
Right.
and a heart attack, well, that could be triggered by the stress of the situation, especially with her history.
Makes sense.
So it's like solving a puzzle, trying to put all those clues together.
Exactly. What's the underlying cause?
And sometimes you need more info, like tests at the hospital, to get a definitive answer.
Absolutely. Sometimes the picture isn't clear right away.
Okay, let's move on to case 12.3, the 72-year-old man with chest pain after breakfast.
Yeah, that one.
One thing that stood out to me in this case was the use of aspirin.
Oh, yeah.
The textbook asks, why is aspirin included in the treatment of this patient?
Aspirin, it's a workhorse in emergency medicine,
It is.
especially when we suspect a heart attack.
Right.
It stops those blood platelets from clumping together, forming clots.
So it's keeping those arteries open, blood flowing to the heart muscle.
Exactly. Time is muscle when it comes to a heart attack.
Right. The faster you restore blood flow, the less damage.
Exactly.
The textbook also asks about his medications.
Right. He was on quite a few.
Plendil for blood pressure, glucotrol for diabetes, Dilantin for seizures, naproxen for pain and inflammation.
Wow. That's a lot to keep track of.
It is, and some of those meds, like the naproxen, can actually increase the risk of heart problems.
Oh, interesting. So his meds could be part of the problem.
Wow.
And the solution.
That's a good way to put it. It's a delicate balance.
It is managing multiple conditions,
Yeah.
meds with overlapping effects, sometimes even conflicting.
The textbook also highlights this question: what is the benefit of morphine in treating this patient?
Morphine, that's a strong pain reliever.
Right. Essential in a heart attack.
Absolutely. But it does more than just manage pain.
Yeah.
It's also a vasodilator.
So it widens those blood vessels, improves blood flow.
Exactly. Gives the heart a little break, reduces its workload.
Smart.
I remember the source material also talks about assessing his skin.
They do. They ask, what should a paramedic look for in reference to the skin?
Right, skin can tell you a lot.
Why is skin assessment so important in these situations?
It gives you a quick snapshot of circulation, overall health.
Okay.
We look for changes in color, temperature, moisture, and terroir.
Okay, break that down for me. What does abnormal skin color tell you?
Well, pale or mottled skin, that could mean poor perfusion.
Meaning?
The tissues aren't getting enough oxygen.
And temperature.
Cool or clammy skin, that can also be poor perfusion.
Okay.
Warm, flushed skin could mean fever or infection.
Got it. What about moisture?
Excessive sweating, that can be a sign of shock or a cardiac event.
Okay, and turgor. What's that?
Turgor is the skin's elasticity.
Okay.
You pinch the skin, if it doesn't spring back quickly, could be dehydration.
It's amazing how much you can learn just by looking at someone's skin.
It is. It's a powerful tool.
The source material also throws in some practical questions about equipment.
Like what?
What is the proper placement for defibrillator pads?
Defibrillation placement is key.
It is.
One pad goes on the right side of the upper chest, below the clavicle.
Right.
The other pad goes on the left side, along the mid-axillary line, basically down from the armpit.
So it's not just about slapping those pads on anywhere.
Nope. Got to be precise.
It's about making sure that electrical current goes right through the heart.
Exactly. Restore that normal rhythm.
The textbook also mentions confirming endotracheal tube placement.
Oh, yeah. Got to make sure that tube's in the right spot.
It is
What techniques do they describe?
auscultation.
So listening for breath sounds.
Yeah, you want to hear those sounds on both sides of the chest.
Right. Equal breath sounds means the tubes in the trachea, the windpipe.
And what if you hear those sounds in the stomach?
Uh-oh, that's bad news.
Bad news.
Means the tube went down the esophagus, not the trachea. Patient's not getting air.
So what are some other ways to confirm placement?
They mention watching for chest rise and fall.
Okay, make sure those lungs are inflating.
Exactly. And they also talk about capnography.
What's that?
It measures carbon dioxide levels in the breath.
Okay.
A high reading means the tube's in the right place.
So multiple ways to double check, make sure the patient's getting air.
Exactly. Gotta be thorough.
Thorough. All right, let's wrap up this part by revisiting case 12.4, the man with the sudden severe chest pain.
Yeah, that's suspected aortic dissection.
Right, the textbook asks, what cardiac rhythm is the patient presenting with?
He was in ventricular tachycardia, or VTach.
VTach.
Yeah, life-threatening rhythm.
Dangerous stuff.
It is. His heart was beating too fast for the ventricles to fill up with blood properly.
So his circulation was compromised.
Exactly.
The textbook also asks why he had poor circulation and that mottled appearance in his legs.
Right, that's connected to the aortic dissection.
How so?
Well, the aorta, it's the main highway for blood from the heart.
Right.
When there's a tear, it can disrupt blood flow, especially to areas farther away, like the legs.
So the tear is like a detour in the circulatory system.
Exactly, and that's why you see those signs, the weak pulses, the mottled skin, the paleness.
But a sign those tissues aren't getting enough oxygen.
Right, they're being starved of blood.
The textbook also wants us to look back at his meds.
Cool.
He was taking Sextrol for blood pressure, Tylenol, #3 for pain, and a couple of others.
Right, quite a few.
Do any of those raise any red flags in this situation?
The Sextrol, the beta blocker, that's an interesting one.
How so?
Beta blockers, they're usually helpful for blood pressure, heart conditions.
Right.
But with an aortic dissection, they can sometimes mask the symptoms.
So the medication could be hiding the problem.
It's possible, which is why getting a complete medical history is so important.
Makes sense. You need all the information to make the right call.
Absolutely.
The textbook also digs into the decision to give a fluid bolus.
Oh, yeah, that's a tricky one.
They ask, why should you be cautious regarding the administration of a fluid bolus with this patient?
A fluid bolus, it's usually used to raise blood pressure.
Right, which seems like it would be a good thing in this case.
You'd think so, but with a suspected aortic dissection, it can backfire.
Okay, I'm seeing a pattern here. Why is that?
Remember, there's a tear in the aorta.
Right.
If you suddenly increase blood volume and pressure, you could make the tear worse, maybe even cause a rupture.
So it's a judgment call, weighing the risks and benefits.
Exactly. In this case, the priority is getting him to surgery, ASAP.
Where they can repair that tear.
Exactly.
Welcome back to the final part of our deep dive. It's been a wild ride through emergency cardiology.
It has been. So many twists and turns, but always something new to learn, especially when it comes to the heart, right?
Absolutely, so vital. And these cases really show how much paramedics need to know to make the right call in those intense moments.
Yeah, they're like walking encyclopedias of emergency medicine.
They really are. So let's revisit that last case, the man with the suspected aortic dissection.
Okay, the one where every second counted.
Right. The source material asks a great question about aortic aneurysms.
Interesting.
What are the typical signs and symptoms?
Good question, because while aneurysms are different from dissections, they can be just as dangerous.
Right. Can you remind us what an aneurysm is again?
Think of it as a weak spot in the aorta, that main artery.
Okay.
That weak spot, it bulges out, kind of like a balloon, and if it pops, massive internal bleeding.
Oh, wow. That's scary.
It is, so paramedics need to be on the lookout for any signs.
So what are some red flags? What should they be looking for?
The textbook mentions a few things.
Okay.
One is a pulsating sensation in the abdomen.
So like feeling a heartbeat in their stomach?
Exactly. That's a pretty specific sign.
Wow. Well,
Sudden severe pain in the chest, back, or abdomen, often described as sharp, tearing, ripping.
like the pain our patient was having.
Yeah, the pain patterns can be similar, which is why a good assessment is so important.
They'd tell the difference.
Exactly. You got to rule things out.
Any other symptoms to be aware of?
Dizziness, nausea, vomiting, shortness of breath, sweating, clammy skin, all of those can be associated with an aneurysm.
So a lot of different things to consider.
Yeah, it can be tricky, and the textbook makes a point of differentiating between a dissection and an aneurysm.
Right. We've been talking about both, but they're not the same.
Definitely not. So think of a dissection as a tear in the lining of the aorta.
Okay.
Blood can then seep between the layers,
Oh, I see.
and that weakens the aorta, makes it bulge, which could lead to a rupture.
So the dissection is the tear, the aneurysm is the bulge.
That's it. And an aneurysm, it can develop gradually, over time, because of things like high blood pressure or hardening of the arteries.
Okay.
But a dissection, that's usually a sudden event, triggered by a spike in blood pressure.
So it can happen out of the blue?
It can, yeah. That's why knowing the signs is so important.
Absolutely. The textbook also asks about the causes of aortic aneurysms.
Right. What puts people at risk?
So what are some of the risk factors?
Atherosclerosis, that buildup of plaque in the arteries. That's a big one.
Makes sense.
High blood pressure is another, puts stress on those artery walls.
Right. Anything else? Like lifestyle factors?
Oh yeah, smoking's a big one.
Of course.
Damages the blood vessels, increases the risk of atherosclerosis and high blood pressure.
Double whammy.
Exactly. And genetics can play a role too.
Okay.
Some people are just more prone to aneurysms, especially those with certain connective tissue disorders.
Like Marfan syndrome.
Exactly, that's one of them.
The source material also mentions IV access.
Yeah, that's always important in these situations.
They ask, why should a large bore 5E catheter be used?
Good question. The size of the catheter, it matters because of potential fluid loss.
Okay.
If that aneurysm bursts, the patient can bleed out fast.
That's terrifying.
It is. So a larger catheter, it allows you to get fluids and blood into the system much quicker.
So it's a matter of time.
Absolutely. Every second counts.
Got to be prepared for anything.
Always.
This case really highlights how important it is to recognize the signs and to understand why we do what we do.
It's not just about memorizing protocols.
Right. It's about understanding the reasoning behind those actions.
Exactly. So you can adapt and make good decisions in tough situations.
Well, I think we've successfully dissected these 4 cases,
We did it.
uncovered some amazing insights along the way.
It's been quite a journey.
What really stood out to you?
I think, for me, it's how every single detail matters.
It all adds up.
It does. Patient history, meds, vitals, even their position. It all helps you understand what's going on.
And it's incredible how paramedics can process all that information so quickly under pressure.
It's amazing. They're true heroes.
Absolutely. And to our listeners, we hope this deep dive gave you a glimpse into the world of emergency cardiology.
And maybe a new appreciation for those amazing paramedics out there.
Absolutely. Thanks for joining us on this incredible journey. Until next time, stay curious and keep learning. Welcome to another deep dive. Today we have a medical mystery that's going to make you think twice about those DIY projects.
Oh yeah, definitely.
You sent us this case study about a guy trapped under a collapsed wall out at his hunting cabin.
Yeah.
And it's pretty intense. So get this. He was trying to reinforce the wall when it came down on him.
The report says he was pinned from the waist down. Conscious when help arrived, but confused
Oh.
and excruciating pain in his lower legs, but no feeling in his feet.
So, like, right away, something is really wrong here. Beyond just being trapped, obviously.
Yeah, big red flag for sure.
What were the first responders dealing with when they actually got to him?
Okay, so they found a 45-year-old male,
Okay.
conscious but disoriented,
Mm-hmm.
strong radial pulse, and normal breathing.
Okay.
His skin looked okay where they could see it,
Right.
but obviously his legs were pinned.
Yeah.
So a full assessment wasn't possible yet.
The source material mentions he had a whole list of medications that he takes regularly.
Yeah,
Does that complicate things at this stage?
it definitely adds another layer to consider. So he was on aspirin,
Okay.
probably for pain or heart health, Synthroid for hypothyroidism,
Mm.
2 antidepressants, fluoxetine and amitriptyline,
Wow, that's a lot.
and Tylenol 3, another pain medication.
Wow.
Knowing all this helps the medical team anticipate, potential drug interactions and adjust treatment accordingly.
Right.
Like, for example, aspirin could increase his risk of bleeding, which is obviously a major concern with any injury.
It's like they're playing medical chess,
Yeah.
trying to anticipate like several moves ahead.
Exactly.
What else did they find once they were actually able to get a better look at him?
Well, once they got the wall off of him,
Yeah.
it was clear his legs took the brunt of the force.
Oh, yeah.
The report notes more swelling in his right hand than his left.
Interesting.
It's hard to say for sure without more information,
Right.
but it could mean his right hand was either more directly compressed
Okay.
or positioned in a way that cut off blood flow more severely.
Okay, so we've got the initial scene, the medications, the crush injury to his legs. Where do they go from here?
So they did a full assessment once they could,
Yeah.
checking his head, neck, chest, abdomen back,
Yeah.
all of which were unremarkable.
Okay.
His upper extremities were stable, but of course, they still couldn't fully assess his lower limbs.
And I'm guessing his vitals become even more important at this point,
Absolutely.
since they can't see everything that's going on.
Exactly.
Yeah.
His blood pressure was 127/86,
Mhm.
pulse 60, and regular respirations, 14 pupils, equal and reactive to light.
Okay.
Blood sugar was a bit high at 146,
Mm.
but that's not uncommon in a stressful situation like this.
Yeah, makes sense.
Oxygen saturation was excellent at 98%,
Mm-hmm.
and his skin was warm and dry, indicating decent circulation for the moment.
Okay.
But the real concern is the potential for internal bleeding
Right.
and the effects of that prolonged crushing force on his legs.
The report says he described the pain in his legs as quote-unquote crushing,
Yeah.
which sadly makes sense. He also reported numbness, but couldn't rate the pain on a scale, which, I mean,
Is understandable given what he just went through.
Mhm.
What's striking is that he'd been enduring this for an hour
Wow.
by the time they could assess him. An hour.
That's a long time
Yeah,
to be in that kind of pain,
I can't even imagine.
and it really underscores the urgency of the situation.
Right.
This brings us to the diagnosis of compartment syndrome.
Okay.
Have you ever heard of that?
I've heard the term, but to be honest, I wouldn't be able to explain it to anyone.
Yeah,
I bet a lot of our listeners are in the same boat.
probably.
Break it down for us. What exactly is going on here?
Okay, so imagine your muscles are all bundled up in these tough, fibrous casings
Okay.
called fascia.
Okay.
Almost like each muscle group has its own little compartment
Hmm.
when there's an injury, like a crush injury in this case. It can cause bleeding and swelling inside these compartments.
So the pressure builds up like a
Mhm.
balloon that's about to burst.
Exactly. And that increased pressure starts to restrict blood flow to the muscles and nerves trapped inside.
Oh, that's what causes the intense pain numbness. And if it's not treated, eventually tissue damage.
So in our patient's case, the crushing weight of that wall triggered this whole chain reaction in his legs.
That's the most likely scenario.
Okay.
Yeah, the prolonged pressure and the trauma itself could have led to bleeding and swelling in his lower leg compartments,
Okay.
setting off the compartment syndrome.
What are the telltale signs,
Okay.
aside from the pain and numbness he was already experiencing?
So one major red flag is pain. That's way worse than what you'd expect from the visible injury.
Okay.
You also look for numbness or tingling, weakness in the affected limb, swelling and tightness in the compartment, and weakened pulses.
So our patient was already showing several of these, and how quickly can this become a serious problem?
Compartment syndrome can progress rapidly, sometimes within hours.
Oh, wow.
That's why immediate action is crucial.
Yeah.
Luckily, in this case, they were able to lift the wall and free him after about 25 minutes.
Okay.
But that's just the first step in a long road to recovery.
So freeing him from the wall is just the beginning.
Yeah.
This is where it gets really interesting, right? What happens next?
You're right. It does get interesting. Freeing him was critical, obviously.
Right.
But the real work begins once he's out from under that wall.
Right. So what were the immediate next steps? The source material mentions they got him on a backboard, rushed him to the hospital.
Exactly. The backboard's standard procedure
Mhm.
for, potential spinal injuries.
Right.
And getting him to the hospital quickly is crucial.
Of course.
During transport, they likely started 5E fluids to counteract shock and keep his blood pressure stable.
Okay.
That's especially important with crush injuries because of the potential for widespread tissue damage and fluid loss.
Okay, so they're stabilizing him. But what about treating the compartment syndrome itself? Is that something they can address right there in the ambulance?
Not quite. Managing compartment syndrome often requires a surgical procedure
Okay.
called a fasciotomy.
Fasciotomy.
Yeah, sounds intimidating.
It does.
But it's basically a way to relieve the dangerous pressure building up in those muscle compartments.
Okay.
The surgeon makes incisions in the fascia, those tough casings around the muscles,
Right.
to allow the tissues to swell outward instead of being constricted.
Got it.
It's like giving them space to breathe.
I see. So it's not just about getting the weight off his legs, it's about addressing the internal pressure that's already built up. Is a fasciotomy always necessary?
It depends on the severity.
Okay.
In milder cases, they might try less invasive approaches first,
Okay.
like elevation and pain management.
Right.
But in a situation like this,
Mm-hmm.
where there's been prolonged compression and clear signs of compromised blood flow,
Yeah.
a fasciotomy is often the best way to save the limb.
Makes sense.
Remember, Time is muscle when it comes to compartment syndrome.
Oh, wow.
The longer those tissues are deprived of oxygen, the greater the risk of permanent damage.
Speaking of time, the source material mentioned something kind of interesting about using a tourniquet if they couldn't do a fluid bolus. Why would they do that? Right.
It seems counterintuitive to cut off blood flow even more.
It does seem counterintuitive, but there's a good reason for it.
Okay.
If they can't give IV fluids to support his circulation, a tourniquet applied before releasing the pressure from his legs can actually help prevent something called reperfusion injury.
Reperfusion injury.
What's that? Think of it this way. When blood flow is suddenly restored to tissues that have been starved of oxygen for a while,
Yeah.
it can be like a shock to the system.
Okay.
It causes this rush of harmful substances that actually further damage the tissues.
Wow.
The tourniquet helps control that rush of blood, minimizing the potential harm until his body can handle it.
That's fascinating. It's like a delicate balancing act, trying to restore blood flow, but not too quickly.
Yeah,
It really highlights how complex these situations can be. The source material keeps mentioning acute traumatic ischemia,
right.
or ATI. What is that exactly, and how does it relate to all of this?
You're right to bring that up. It's important to remember that the focus should always be on the underlying injury.
Which in this case is the crush injury itself.
Right.
Compartment syndrome is a consequence of that.
Okay.
ATI refers to the severe lack of blood flow to the tissues
Okay.
caused by that crushing force.
It's the root of the problem. And treating the compartment syndrome is part of managing the overall ATI.
So it's like treating both the cause and the effect.
Exactly.
You need to address both to have the best chance of a positive outcome.
Exactly. And another piece of the puzzle here is his ECG,
Okay.
which showed a junctional escape rhythm.
Okay, you lost me there. Junctional what now?
Think of it like the heart's backup pacemaker kicking in,
Okay.
because the regular rhythm is disrupted.
Okay.
It can be caused by various things,
Right.
including medications and trauma.
Okay.
In his case, it's not necessarily a crisis in itself, but it does need to be carefully monitored,
Mm.
especially given all the medications he's on.
Right. Let's circle back to those medications for a minute.
Yeah.
He was on aspirin, synthroid, fluoxetine, amitriptyline, and Tylenol 3. How might those affect his treatment and recovery? It's a bit of a juggling act.
Yeah.
Some medications might need to be adjusted or temporarily stopped, while others are essential for his overall health.
Right.
We already mentioned the aspirin and its potential to increase bleeding. The antidepressants, fluoxetine and amitriptyline, can interact with certain pain medications.
Yeah.
So the medical team has to be very careful there.
Of course.
And the Synthroid, for his hypothyroidism, will need to be continued to manage that condition effectively.
So on top of everything else,
Yeah.
managing his medications is another layer of complexity in this whole medical mystery.
Absolutely. It's like a puzzle where each piece has to fit just right.
Yeah.
They have to weigh the benefits and risks of each medication in his current situation
Right.
and make adjustments as needed. This is where a deep understanding of his medical history and how different drugs interact becomes really crucial.
It's incredible how a seemingly straightforward injury,
Right.
like being trapped under a wall, can snowball into such a complex medical situation.
Yeah, it is.
What are some of the key takeaways for our listeners so far? What are the aha moments that we should all be paying attention to?
Well, for me, it's a stark reminder of how crucial early recognition is
Right.
and timely intervention when it comes to compartment syndrome. The sooner it's addressed, the better the chances of a positive outcome.
Absolutely.
If it's left untreated,
Yeah.
it can have devastating consequences,
Yeah.
leading to permanent muscle damage, nerve damage,
Yeah.
and even amputation in severe cases.
This case also really highlights the incredible skill
Oh, yeah,
and quick thinking of the first responders and the medical team.
for sure.
They recognized the potential seriousness of the situation right away, acted quickly to stabilize him and get him the care he needed.
Yeah, their actions likely played a huge role in preventing further complications
Right.
and improving his chances of a full recovery.
I completely agree. Their coordinated efforts and expertise were essential in this case. It underscores the importance of having well-trained professionals who can assess, stabilize, and transport patients effectively in these kinds of emergency situations.
Absolutely.
And it emphasizes the need for continuous medical education,
Yeah.
staying up to date on best practices. The medical field is constantly evolving. There's
Yeah.
always something new to learn.
Exactly.
You've definitely given us a lot to think about today.
That has been interesting.
We've learned about compartment syndrome, crush injuries, and the intricate world of emergency medical care.
It's been a pleasure unraveling this case with you.
Yeah.
I always find it fascinating to explore these real-world scenarios
Yeah, me too.
and discover the hidden lessons they hold.
Absolutely.
It's a reminder that we can all benefit from expanding our knowledge of medical conditions,
Right.
even if we're not healthcare professionals ourselves.
Absolutely. You never know when that knowledge might come in handy,
Right.
whether for ourselves or for someone we care about. It's about being empowered to make informed decisions and advocate for our own health and well-being.
Speaking of advocating for our well-being,
Yeah.
this case brings up a point that we haven't touched on yet.
Okay.
We've discussed the physical impact of compartment syndrome,
Mm-hmm.
but what about the psychological effects? Imagine the trauma of being trapped, the fear, the intense pain.
Right.
How might that impact someone's recovery, both physically and emotionally?
That's a really important point. It highlights the need for a holistic approach to healthcare.
Absolutely.
We can't just focus on the physical injuries. We need to consider the emotional and psychological well-being of the patient as well.
Right.
True healing involves the mind, body, and spirit.
Well said. It's been a fascinating deep dive, and I hope our listeners found it as insightful as I have.
Until next time, stay curious and take care. All right, let's jump into a deep dive today into the world of gastroenterology. We're going to crack open some really fascinating case studies. And luckily, I'm joined by an expert to help us sort of decipher all the clues and understand what makes these cases so intriguing. And, think of this as a medical detective show, but for your gut.
Yeah, I'm really excited to dive in. You know, one of the most compelling things about these cases is that they really highlight how important it is to look at the whole picture. When it comes to diagnosing GI issues, it's about connecting all the dots, understanding the patient's history, their lifestyle, their social context.
Okay, so let's jump right in. Case number 1, 16.1, the pizza puzzle. Okay, imagine this. You get called to a scene, middle-aged woman, clearly in a lot of pain, and what's she surrounded by? Empty pizza boxes. And she's complaining of really intense upper epigastric pain. She says it's the worst she's ever experienced. So what's going through your mind right now?
Well, the first thing that jumps out at me is the sudden onset and the severity of the pain, particularly in the right upper quadrant. That's a big red flag right there.
And then you learn she has a history of GERD, duodenal ulcers, and a medicine cabinet full of medications like Anacil HC, Rolaids Refluxamine, famotidine, metoclopramide, Gaviscon. It seems like she's been battling some GI issues for a while.
Yeah, absolutely. And that past history is such a crucial piece of information. And in the exam, we find that she's guarding her abdomen. And there's that increased pain in that same right upper quadrant when you palpate the area.
Okay, so we've got intense pain, a history of GI problems, tenderness in the right upper quadrant. Could this be just a really bad case of heartburn, or are we thinking something else?
Well, while heartburn is a possibility, the location and severity of the pain combined with her history makes me lean towards something a bit more serious. Cholecystitis or inflammation of the gallbladder is pretty high on my list of possibilities.
Interesting. Now those pizza boxes are looking a lot more relevant.
Right, exactly. A fatty meal, like, you might get with multiple pizzas, can actually trigger a gallbladder attack. So the pizza isn't just a random detail. It could be a key piece of the puzzle here.
Wow, so seemingly insignificant details can actually be pretty important clues. All right, are you ready to tackle the next case?
Absolutely, bring it on.
All right, case number 2, 16.2, the peanut butter problem. So we have a teenage boy complaining of abdominal pain and vomiting after lunch, but he mentions that he's had similar discomfort before. What's different about this case compared to our pizza-loving lady?
Well, in this case, the onset of pain is gradual, not sudden. So that's an immediate differentiator. It kind of shifts our thinking a little bit.
And get this, his lunch was a peanut butter and jelly sandwich. Do you think that's a clue, or are we reading too much into it?
Well, you never know with GI cases. Even the most seemingly innocent foods can sometimes cause problems, especially if there's a sensitivity or intolerance there. So we always want to consider the patient's dietary history.
Okay, good point. So during the exam, the doctor notes visceral tenderness, which means pain when pressing on the abdomen over the affected organ, and rebound tenderness, which means the pain increases when the pressure is released. In the right lower quadrant, what's the likely diagnosis here?
Well, based on this presentation, appendicitis is a strong contender. And you remember how the location of the pain during palpation was different in that first case? That's one way we can start to distinguish between cholecystitis and appendicitis.
So 2 cases, 2 very different presentations. but both involving pain in the abdomen. It really highlights how crucial it is to pay attention to those nuances.
Absolutely. Every detail matters.
All right, get ready for a more challenging one. Case 16.3. Disturbing.
Well, the alcohol abuse history definitely stands out to me. Alcohol abuse can lead to a variety of gastrointestinal problems, and the chest pain, combined with his history and current symptoms, makes me concerned about esophageal varices.
No, you're going to have to explain that one. I'm not familiar with that condition.
Sure, esophageal varices are essentially enlarged veins in the esophagus, similar to varicose veins you might see in the legs. But these veins are fragile and prone to bleeding, especially in someone with a history of alcohol abuse. Long-term alcohol use can damage the liver, leading to a condition called cirrhosis, which increases pressure in these veins, making them even more likely to rupture.
So we're talking about a potentially life-threatening situation here. It's amazing how something like alcohol abuse can have such a ripple effect on the body, even leading to a condition like this.
It really is a stark reminder of how interconnected our bodies are, and how lifestyle choices can have far-reaching consequences.
All right, on to our final case for this part of the deep dive, case 16.4, the high-stress weekend. This one involves a businessman who's experiencing intense abdominal pain, but with the twist.
The twist being black tarry stools, a classic sign of a serious gastrointestinal bleed. This is a significant finding that really changes the urgency of the situation.
And it turns out this businessman had a very eventful weekend. He was dealing with a lot of anxieties, barely slept, and had more than a few drinks to cope with the stress. It's making me wonder if his lifestyle played a role in this.
It's definitely a factor worth considering. Stress, alcohol use, lack of sleep can all wreak havoc on the digestive system. They can exacerbate existing conditions like ulcers or gastritis, and even contribute to the development of new problems.
So we're looking at a possible ulcer gastritis, or even those esophageal varices again. It seems like stress really is a silent killer in a way.
It can certainly contribute to a wide range of health issues, including gastrointestinal problems. It's crucial to understand how stress impacts our bodies and to find healthy ways to manage it.
Wow, what a whirlwind of cases. We've got pizza, peanut butter alcohol, and stress all playing a part in these gastrointestinal mysteries.
It's fascinating, isn't it? It's like putting together a puzzle, considering all the pieces to get a complete picture.
Exactly. But before we try to solve the whole puzzle, I want to take a closer look at the diagnostic process itself. How do doctors narrow down the possibilities and arrive at a diagnosis?
Well, it all starts with gathering information. A thorough patient history is absolutely essential. We need to know about their symptoms, their past medical history, their medications, their lifestyle habits, even their social situation. All of these factors can provide valuable clues.
And then there's the physical exam, right? We've talked about palpation, but what else are doctors looking for?
Well, observation is key. We'll assess the patient's overall appearance. Are they in obvious distress? Are they pale or sweating? These can provide immediate clues about the severity of the situation. We'll also check their vital signs: heart rate, blood pressure, respiratory rate, and temperature. These can indicate how stable the patient is and whether there's an underlying infection or other systemic issues.
So it's about piecing together all these clues, like a detective, looking for patterns and consistencies, anything that might point to a diagnosis.
Exactly. And sometimes we need additional tools to help us see that bigger picture. Blood tests, imaging studies like ultrasounds or CT scans, and even endoscopies can provide more detailed information about what's going on inside the body.
Speaking of endoscopies, that reminds me of our patient with the suspected esophageal varices. That seems a pretty serious condition that might require immediate intervention.
You're right. Esophageal varices, as we discussed, are those fragile, enlarged veins in the esophagus that can rupture and bleed profusely. It's a life-threatening emergency. That often requires an endoscopy to assess the severity and potentially stop the bleeding.
And it often stems from chronic alcohol abuse, which brings us back to the idea that our lifestyle choices can have a profound impact on our health, sometimes in ways we might not even realize.
Absolutely. Our habits and behaviors play a significant role in shaping our overall well-being, and that includes our digestive health.
That's a powerful message. It seems like we're starting to see some common threads emerge from these cases: the importance of a holistic approach, the role of lifestyle factors, and the interconnectedness of our physical and mental health.
I'm glad you're picking up on the themes. They're really essential for understanding not just these specific cases, but the broader picture of gastrointestinal health.
All right, before I move on, I want to circle back to something you mentioned earlier, the social determinants of health. You alluded to this when discussing the patient found in his apartment. Can you elaborate on how social factors can impact gastrointestinal health?
Certainly. Social determinants of health encompass a wide range of factors, including socioeconomic status, access to
Hmm.
healthcare education, neighborhood environment, and even social support networks. All of these elements can influence a person's health outcomes, including their digestive health.
Can you give us some specific examples of how those social factors might play out in the context of gastrointestinal health?
Absolutely. For instance, someone living in a food desert with limited access to fresh, healthy foods may be more likely to develop nutritional deficiencies or experience digestive problems related to a poor diet.
That makes sense. If you don't have access to fresh fruits and vegetables and whole grains, it's going to be difficult to maintain a healthy gut microbiome.
Exactly. And then there's the issue of access to health care. If someone lacks health insurance or can't afford to see a doctor regularly, they might delay seeking treatment for digestive symptoms, allowing a condition to worsen over time.
So it's not just about individual choices, it's about the systems and structures that create barriers to good health.
Precisely. We need to acknowledge that not everyone has an equal opportunity to achieve good health. The playing field isn't level.
It's a complex issue, but it's one we can't ignore. So what can be done to address these social determinants of health and create a more equitable healthcare system?
Well, it requires a multi-pronged approach. We need policies that promote economic opportunity, affordable housing, quality education, and access to healthcare for all. We also need to invest in community-based programs that address the specific needs of underserved populations.
It sounds like it's going to take a collective effort from policymakers, healthcare providers, and community organizations.
Absolutely. It's a societal issue that requires a societal solution.
Well said. So we've covered a lot of ground already, from pizza-induced gallbladder attacks to the social determinants of health. And we've only just begun.
There's so much more to explore in the world of gastroenterology. We'll be delving deeper into these cases, discussing treatment options, and exploring the latest research in upcoming parts of this deep dive.
I'm already fascinated to hear more. It's amazing how much we can learn from just a few cases.
It's true. Each case is a window into the complexity of the human body and the intricate interplay of factors that influence our health.
Well, on that note, let's take a short break, and we'll be back soon with more insights and analysis.
These cases really highlight how interconnected everything is, when it comes to our health. Sometimes the most unexpected things can impact our digestive system.
Absolutely. It makes you realize just how much is going on beneath the surface, so to speak. But let's zoom back in on one particular element we've touched on a few times: stress. You mentioned how stress played a role in case 16.4, but I think it deserves a bit more attention.
Yeah, I agree. Stress is often an overlooked factor in gastrointestinal health. We tend to think of stress as a mental or emotional issue, but it has very real physical consequences, especially for our digestive system.
Can you break down that connection for us a little bit? What's actually happening in the body when we're stressed that can lead to digestive problems?
Well, imagine this. You're faced with a stressful situation. Maybe you're about to give a big presentation, or you're stuck in traffic. Your body kicks into that fight or flight mode, releasing hormones like cortisol and adrenaline. These hormones prepare your body to deal with the threat, but they also have a number of effects on your digestive system.
So it's like our body is prioritizing survival over digestion when we're under stress.
Exactly. One of the things that happens is that blood flow is diverted away from the digestive system and towards the muscles and brain. This can slow down digestion and lead to problems like indigestion, bloating, and constipation.
Makes sense.
You know,
If you're running from a tiger, you don't really need to be digesting your lunch at that moment.
right? Stress can also increase inflammation in the gut, making existing conditions like irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD, even worse. And here's the really interesting part. Stress can actually alter the composition of our gut microbiome.
Wait, you're saying stress can change the bacteria that live in our gut?
That's exactly what the research is showing. The gut microbiome is this complex ecosystem of trillions of bacteria that play a crucial role in digestion, immunity, and even mental health. When we're stressed, the balance of these bacteria can be disrupted, leading to a whole host of problems.
Wow, it's incredible how much we're learning about the gut microbiome these days. It seems like it's involved in everything.
It really is a fascinating area of research, and it's changing the way we think about health and disease. The more we understand about the gut-brain connection, the more we realize how important it is to manage stress, not just for our mental well-being, but for our digestive health as well.
So what are some effective strategies for managing stress, especially when it comes to protecting our gut? I've heard things like yoga and meditation can be helpful.
Those are definitely great options. Exercise in general is fantastic for stress reduction. Even something as simple as a brisk walk can make a difference. Mindfulness practices like meditation and deep breathing can also help calm the nervous system and reduce the production of those stress hormones.
It seems like it's about finding activities that help us relax and de-stress.
Exactly. And it's important to find what works for you. Some people find solace in spending time in nature, while others might prefer listening to music or spending time with loved ones. The key is to identify activities that help you feel calm and grounded.
So it's about incorporating those stress management techniques into our daily lives, not just as a quick fix when we're feeling overwhelmed.
Precisely. It's about creating a lifestyle that supports both our mental and physical health. And remember, getting enough sleep is crucial too. When we're sleep deprived, our stress levels tend to skyrocket, which can trigger that whole cascade of negative effects on our gut.
It seems like we keep circling back to this idea of a holistic approach. Taking care of our gut isn't just about what we eat. It's about how we manage stress, how much we sleep, and even the social connections we have in our lives.
Exactly. It's about seeing the bigger picture and understanding how all these different aspects of our lives influence our overall health and well-being.
That's a powerful message. It really makes you stop and think about the choices you're making and how they might be impacting your gut health.
And that's ultimately the goal, isn't it? To empower people with knowledge so they can make informed choices that support their health.
Absolutely. Now, before we wrap up this deep dive, I want to shift gears a bit and talk about the social determinants of health. We've touched on this throughout the episode, but I think it deserves a dedicated conversation.
I agree. Social determinants of health are a crucial piece of the puzzle when it comes to understanding health inequities.
Can you remind us what exactly falls under the umbrella of social determinants of health?
Well, it's a broad term. That encompasses the conditions in which people are born, grow, live, work, and age. These conditions are shaped by the distribution of money, power, and resources at global, national, and local levels.
So we're talking about factors like income, education, housing, access to health care, and even neighborhood safety.
Exactly. These factors can have a profound impact on a person's health, including their digestive health.
Can you give us some specific examples of how social determinants of health might affect someone's risk of developing a gastrointestinal condition?
Certainly. Let's consider access to healthy food. If someone lives in a food desert, an area with limited access to affordable and nutritious food, they might be more likely to rely on processed foods, fast food, or convenience stores, which can contribute to a number of digestive problems.
That makes sense. If you don't have access to fresh fruits, vegetables, and whole grains, it's going to be difficult to maintain a healthy gut microbiome.
Exactly. And then there's the issue of access to health care. If someone lacks health insurance
Right.
or can't afford to see a doctor regularly, they might delay seeking treatment for digestive symptoms,
Yeah.
allowing a condition to worsen over time.
So it's not just about individual choices. It's about the systems and structures that create barriers to good health.
Precisely. We need to acknowledge that not everyone has an equal opportunity to achieve good health. The playing field isn't level.
It's a complex issue, but it's one we can't ignore. So what can be done to address these social determinants of health and create a more equitable healthcare system?
Well, it requires a multi-pronged approach. We need policies that promote economic opportunity, affordable housing, quality education, and access to health care for all. We also need to invest in community-based programs that address the specific needs of underserved populations.
It sounds like it's going to take a collective effort from policymakers, healthcare providers, and community organizations.
Absolutely. It's a societal issue that requires a societal solution.
Well said. So we've covered a lot of ground in this deep dive, from the intricate workings of the digestive system to the broader social factors that influence health outcomes. What's the one key takeaway you want our listeners to leave with?
I think the most important message is that our digestive health is intricately connected to our overall well-being. Taking care of our gut means taking care of our entire selves, mind, body, and spirit. It means making healthy lifestyle choices, managing stress effectively, and advocating for policies that promote health equity for all.
That's a powerful message. It's a reminder that health is a multifaceted and interconnected concept. It's not just about what we eat or how much we exercise. It's about the environments we live in, the resources we have access to, and the social connections we cultivate.
Exactly. It's about seeing the bigger picture and understanding that health is a collective responsibility.
Well said. I think we've given our listeners a lot to think about.
I hope so. And I hope this deep dive has sparked a curiosity about the fascinating world of gastroenterology and the importance of prioritizing gut health.
All right, we're going to take a short break, and we'll be back soon to wrap up this deep dive with some final thoughts and insights. Welcome back to our deep dive into gastroenterology. I don't know about you, but I'm feeling a lot more aware of what's going on in my gut. After all these cases and insights, it's amazing how much we take our digestive system for granted until something goes wrong.
It's true. We often only start paying attention to our gut when we're experiencing, discomfort or symptoms. But as we've seen, there's so much more to digestive health than just the absence of pain.
Exactly. It's about understanding that complex interplay of factors that contribute to a healthy gut. From the food we eat, to the stress we experience, to the social environment we live in.
And it's about recognizing that our digestive health is so intricately linked to our overall well-being. When our gut is healthy, we tend to feel better both physically and mentally.
Speaking of feeling better, I'm curious to hear your thoughts on treatment options for some of the conditions we've discussed. What are some of the approaches doctors take to address these gastrointestinal problems?
Well, the treatment approach really depends on the specific condition and the individual patient. For some conditions like GERD or IBS, lifestyle modifications can be very effective. Things like dietary changes, stress management techniques, and regular exercise can make a big difference.
So it's often about empowering patients to take control of their health and make sustainable changes.
Exactly. But of course, there are times when medications or even surgery are necessary. For example, in the case of esophageal varices, where there's a risk of life-threatening bleeding, medical intervention is critical.
It's about finding the right balance between lifestyle modifications and medical interventions, tailoring the approach to the individual's needs and circumstances.
Precisely. And it's important to have open communication with your healthcare provider, discussing your symptoms, your concerns, and your treatment preferences.
It's about being an active participant in your own healthcare journey.
Absolutely. Now, I know we've been focusing a lot on the challenges and complexities of gastrointestinal health, but I also want to emphasize that there's a lot of exciting research happening in this field.
Oh, tell me more. I'm always fascinated by the latest scientific discoveries. What are some of the areas that are particularly promising right now?
Well, as we touched on earlier, the gut microbiome is a hotbed of research activity. Scientists are uncovering more and more about the role these trillions of bacteria play in our overall health. And they're developing new therapies that target the microbiome to treat a variety of conditions.
So we might be seeing a whole new wave of treatments that focus on manipulating the gut microbiome to improve digestive health and even overall well-being.
That's the hope. There are also promising advances in areas like personalized medicine, where treatments are tailored to an individual's genetic makeup and specific needs. And there's a growing understanding of the gut-brain connection, leading to new approaches for addressing the link between digestive health and mental health.
It sounds like there's a lot to be optimistic about when it comes to the future of gastroenterology.
There certainly is. We're making significant strides in our understanding of the digestive system and how to keep it healthy.
Well, I don't know about you, but I'm feeling a lot more knowledgeable about my gut after this deep dive. I've learned so much about the different conditions, the diagnostic process, the treatment options, and even the exciting research that's on the horizon.
I'm glad to hear that. Knowledge is power, especially when it comes to our health.
And hopefully this knowledge will empower our listeners to take better care of their digestive health and advocate for a more equitable healthcare system that addresses the social determinants of health.
That's my hope as well.
Well, I think we've covered just about everything we set out to explore in this deep dive. Any final thoughts you'd like to leave our listeners with?
Just this. Listen to your gut. It's trying to tell you something. Pay attention to your body's signals. Seek help when you need it, and don't be afraid to ask questions.
Great advice.
Well,
And remember, even small changes in your diet, your stress management techniques, or lifestyle habits can make a big difference in your digestive health. All right, folks, that's a wrap on our deep dive into the fascinating world of gastroenterology. We hope you've enjoyed the journey and learned something new along the way. Until next time, stay curious, stay healthy, and keep exploring. All right, strap in, everyone, because today we're diving headfirst into the world of head and neck trauma.
buckle up.
We're going to be dissecting
That's right.
some real-life medical cases straight from a trauma textbook that you've been poring over.
I have.
And we're talking Chapter 7 here.
The good stuff.
Trust me, this is not your everyday bumps and bruises.
Okay.
with expert speaker here.
Here I am.
To guide us, we're going way beyond textbook definitions.
Way beyond.
We're going to really understand what makes these injuries so critical and how the pros, the medical pros,
the folks in the field,
make those split-second life or death decisions out there in the field.
It's all about those subtle clues, you know, those little things that can really reveal a whole lot about how serious a head or neck injury actually is.
Okay, so let's just jump right in. Both of these cases we're looking at today involve patients with significant trauma to the head and neck.
Head and neck,
but in very different ways. We've got a young woman ejected from a rollover car accident and a young man found unconscious on a university campus. What fascinates me is how these medical professionals use every single piece of information they can gather, from the vital signs to the position of the patient, to really paint a picture of what's happening.
Like putting a puzzle together.
Inside the body.
Exactly. Every piece matters.
Right.
Take vital signs, for example.
Okay.
Most people, they know the basics. Blood pressure, pulse, respiration.
Sure.
But in trauma care, those numbers, they tell a much deeper story.
So it's not just about whether the numbers are quote-unquote good or quote-unquote bad. It's about how they relate to the injury.
The specific injury.
And how they change over time.
That's it.
Exactly.
Let's look at that case of the woman in the rollover accident. Now, initially, her vitals were relatively stable, which you know, might seem reassuring at first. But you got to consider the mechanism of the injury here. She was ejected.
Thrown from a
rolling vehicle. You got to anticipate the potential for some serious internal injuries. Especially to the head and spine.
So even if those initial vital signs seem okay,
they might look good on paper.
The context of the accident tells a very different story. And that's where that concept of ongoing assessment comes in. We can't just rely on that initial snapshot. The patient's condition can change so rapidly. Oh, wow.
So constant vigilance is key.
Makes me think about that second case. The young man found unconscious. His vitals were much more alarming. Right from the start.
Right away.
Slow, irregular pulse, shallow breathing. That paints a much different picture.
Very different. Absolutely. Those vital signs immediately raise those red flags, suggesting a potentially life-threatening situation. And then you add in the fact that he was incontinent.
Oh, wow.
Which can indicate a loss of control of bodily functions due to brain or spinal cord damage. You get a very high-stakes scenario.
It's amazing how much those vital signs can reveal, especially when considered alongside other observations. Speaking of observation.
In the textbook, there's a question about the first case. What is significant about the patient's position when you arrive on scene? Seems like such a simple question.
Simple, but
I bet there's more to it.
Oh, there always is.
Than meets the eye.
Always more than meets the eye in trauma care. In this case, the fact that the woman was ejected from the vehicle and found a significant distance away tells us a lot about the force involved. The farther she was thrown, the higher the likelihood of severe injuries.
So even something as simple as the patient's position can provide valuable clues about the mechanism of injury and the potential for internal damage.
It highlights the importance of that detective work.
Piecing it all together.
Piecing it all together.
Now, in both of these cases, there's a big question mark. What's going on?
Inside the skull.
Inside the skull. We've talked about the vital signs and external clues. But how do those medical professionals assess the brain itself?
Assess the brain,
That's where some of those more specialized assessments come in.
Like
checking pupillary response.
Pupillary response.
Remember, the pupils are those black circles in the center of your eyes. They can tell us a lot about brain function.
Oh, right. I remember learning about
Yeah.
film pupils in first aid class.
Ah, yes.
If they're dilated and don't react to light,
Right.
that's a bad sign.
It can be.
Oh,
It
yeah,
suggests
yeah.
pressure on the
Yes.
oculomotor nerve,
Right.
which could be caused by
Yeah.
bleeding or swelling inside the skull.
Oh.
And then there are those
Yeah.
specific patterns
Mhm.
of vital signs, like
Okay.
Cushing's reflex.
Hold on. Cushing's reflex.
Yes.
Can we unpack that a bit?
Sure.
I'm not sure
Yeah.
I fully grasp.
Okay, so what that means.
I think of it as the body's way
Right.
of trying to protect the brain
Mm-hmm.
when pressure is building up inside the skull.
Okay.
Essentially, the blood pressure increases
Right.
and the heart rate slows down
Right.
to try and maintain blood flow to the brain.
So it's like the body is
Yeah.
trying to compensate for the injury.
Right.
But that itself
That in itself
is
is
a sign of a serious problem.
of a very serious problem.
Exactly. And that's why
That's
recognizing these patterns
Yes.
is so crucial.
crucial.
They give us a glimpse
They do.
into what's happening deep inside the skull.
Even before we
Yeah.
can do any advanced imaging.
It's exactly
It's like having a
Putting a
secret window
a secret window
into the brain. That's a great way to put it.
But even with all these clues,
Mm-hmm.
it sounds like
Yeah.
head trauma is still
It is, in a
check
way.
your history.
The
Yeah.
brain is an incredibly complex organ.
Right.
Every injury is unique.
Okay.
But by understanding those mechanisms of injury, recognizing those subtle signs,
All right.
and constantly reassessing
Okay.
the patient's condition,
Yeah.
we can significantly improve
Right.
their chances of survival and recovery.
And that's where
That-
the real expertise comes in.
It does.
Right. It's
Yeah.
not just about
It's not just about memorizing film.
memorizing the textbook.
It's about knowing how
It's
to
about
interpret them,
and apply that knowledge
applying that knowledge
in those high pressure situations.
in those high-pressure situations.
Absolutely.
It's about thinking critically.
Connecting the dots
Yeah.
and anticipating those potential complications
Wow.
before they even arise.
And
Even
sometimes
if it's knowing,
when to step back
stepping back.
and asking for help.
That's a good reminder for all of us.
It is a good
Just like
reminder.
experts
Even experts need
Extra-
support
sometimes.
at times.
Speaking of support, I'm curious about the
Yeah.
psychological impact
That's
of these injuries.
a big one.
We've talked a lot about the
Yeah.
physical aspects,
Yes.
but these are incredibly
Yeah.
traumatic events,
Mhm.
both for the patients
Absolutely.
and the people around them.
The families, the loved ones.
Right. Yeah.
You're absolutely right.
Yeah.
The psychological effects of head and neck trauma
Yeah.
can be just as profound
Wow.
as the physical ones.
Okay.
About anxiety, depression,
Post-traumatic stress disorder,
PTSD. Yeah.
and even cognitive impairments
Oh, wow.
that can affect memory,
Okay.
attention,
Uh-huh.
and decision-making.
So it's not just about
It's not just about
healing the body.
healing the body.
It's about healing
It's about healing the mind as well.
the mind as well.
Absolutely.
That adds another layer
It's-
of complexity.
It certainly does
And
these
it's not
days, and it
absolute-
highlights
Yeah.
the need for a holistic approach to care,
Okay.
one that addresses not only
Mm-hmm.
that immediate medical crisis,
Right.
but also the long-term physical and psychological
Mhm.
needs of the patient.
I'm realizing that we've
It's
only
just
just scratched the surface.
Scratch the surface.
There's so much more.
There's so much more to explore when it comes to understanding the nuances
Yeah.
of
head and neck trauma.
head and neck trauma.
But before we dive deeper,
Okay.
let's take a moment to recap what we've learned so far.
Good idea.
Mm.
So far, we've established that
Mhm.
head and neck injuries
Mm.
are way more complex than they
Mhm.
might seem
Yeah.
on the surface.
It's more than a
We've talked about
vital SNE.
vital signs, yeah.
Yeah.
The patient's position at the scene,
Mm-hmm.
specialized assessments like pupillary response and
Oh.
Cushing's reflex.
Mm-hmm.
But
Yeah.
this is really just the tip of the iceberg,
It's like we've zoomed in on
Uh,
that initial assessment,
initial assessment.
but now we need to kind of
When you
widen
wind the lens,
Yeah.
look at the bigger
Yeah.
picture.
the bigger picture of what happens next.
Yeah.
Exactly.
I'm thinking about those
Very
potential
sure.
long-term complications.
Yeah, you mentioned both
Physical
and psychological.
Where do we even begin?
Or to unpack all of that.
Begin to unpack all of that.
It's a lot.
It is a lot.
Well, let's start.
Well, we got to start with the immediate concern,
Yeah.
making sure that brain
Yeah.
gets the oxygen
The oxygen in
it
yeah,
needs,
yeah.
right?
Yeah.
Remember, the brain,
Yeah.
incredibly sensitive to oxygen deprivation.
Oh, wow.
And even a brief interruption in blood flow
Right.
can have devastating consequences.
So what are some of the things that can
What if
Disrupt that blood flow?
they can interrupt that blood
After
flow
a head injury?
after a head
What
injury?
can go wrong there?
Well, one of the most common culprits
Okay.
is swelling,
Okay.
also known as cerebral edema.
Oh, right.
When the brain swells,
Yeah.
it increases the pressure inside the skull,
Oh,
which
wow.
can compress blood vessels
Okay.
and restrict blood flow.
So the swelling itself.
Think of it like a garden hose.
Oh, okay.
If you step on it,
Yeah.
the water flow decreases.
So the swelling can actually worsen the injury.
Exactly.
Right.
And then there's the risk of bleeding,
Okay.
either within the brain tissue itself
Right.
or between the brain
Right.
and the skull,
Uh-huh.
like a subdural hematoma.
Subdural hematoma.
These bleeds
Okay.
can further increase that pressure
Mm-hmm.
and disrupt blood flow,
Okay.
leading to even more damage.
It sounds like a vicious cycle.
Vicious cycle, yeah.
Injury, swelling,
Swelling,
more injury.
more injury, like
The brain's under attack.
under attack from multiple forces.
From multiple forces.
That's a good way to put it.
Okay, and this
Underscores the need
is for swift and decisive action
Yeah. Yeah.
to control the bleeding,
Okay.
reduce that swelling,
Mm-hmm.
and maintain adequate blood flow
To that brain.
to the brain.
Yeah.
Absolutely.
This makes me think about those two cases.
Again, in the rollover accident,
Mm-hmm.
there was that strong suspicion of
Yeah.
a possible
A possible
subdural hematoma.
subdural hematoma.
While in the case of the unconscious young man,
Right.
we were kind of left wondering
We were wondering
about the cause
of his unconsciousness
his unconsciousness
and those alarming vital signs.
those alarming vital signs.
Right.
So in both
Some
cases,
cases.
the medical team would be working quickly
Okay.
to stabilize the patient,
Right.
secure the airway,
Mm-hmm.
provide ventilation support if needed,
Yeah.
and initiate transport
Right.
to a facility
Mhm.
equipped to handle these types of injuries.
Get him to the right place.
Time is of the essence.
Time is of the essence.
In these situations,
It's almost like a race against time.
it is a race against time.
To minimize
That secondary damage.
that secondary damage.
Well, what happens once the patient
When that patient arrives at the hospital,
arrives at the hospital?
what are those next steps
What
in the
steps?
treatment process?
Next steps.
Well, once that patient is
Yeah.
in a stable environment,
Mm-hmm.
the focus shifts
Okay.
to a more detailed assessment
Okay.
and targeted interventions.
Right.
This might include imaging studies
Okay.
like CT scans
Mhm.
or MRIs
Okay.
to really get a clear picture
Yes.
of the extent of that injury,
Okay.
monitoring intracranial pressure,
Right.
and potentially even surgery
Oh, wow.
to relieve pressure
Oh.
or remove blood.
Clot.
A multi-pronged approach
It is a multi-pronged approach.
addressing both that immediate crisis
and the potential for
Yeah.
long-term
the
complications.
potential for long-term
Well,
complications.
even with
But even with the best medical care,
the best medical care,
is full recovery always possible
is it always possible
after a head injury?
to bounce back from something like this?
That's a tough question.
It is. Yeah.
And the answer, unfortunately, is not always.
Oh, wow.
The brain
Yeah.
is remarkably resilient,
Okay.
but it's also incredibly vulnerable.
It's both at the same time.
It's both at the same time.
So
The extent of recovery depends on
what determines
so many factors how well someone recovers.
including the severity of that initial injury, the
Right.
location of the
Uh-huh.
damage,
Yeah.
the age and overall health of the patient,
Right.
and the quality of care received.
So it's not just about
It's not just about
surviving that initial trauma.
surviving the initial trauma.
It's about navigating
That's
that
a
long
huge-
road to recovery,
a long road to recovery,
which can be filled
which is often
with
filled
its own challenges.
with its own challenges.
And this is where
those psychological effects
come into play. Effects we talked about earlier come
Yeah.
into play.
Imagine waking up
Imagine waking up
from a coma,
disoriented,
disoriented
come
with
on.
gaps in your memory,
gaps in your memory,
and lingering physical impairments.
yeah, and lingering physical
like
impairment.
daunting experience, to say the least.
It's a daunting experience,
Yeah.
to say the least. And then there are those
And then there are
potential cognitive changes.
potential
Like,
cognitive changes,
it's difficulty with memory,
decision making,
attention, decision making.
Those can have
Yeah, those can have a huge impact
a huge impact on a person's life,
on a person's life.
even
If
their physical injuries,
their physical injuries
have healed.
have healed.
Absolutely.
And it's not just
Yeah.
the patients themselves who are affected.
It's the
Families and caregivers
families. It's
often bear the brunt
caregivers
of these challenges
Yeah.
as they adjust to a new reality.
It sounds
It does.
this ripple effect.
It sounds like the ripple effects
of a head injury
can be far-reaching.
Can be far-reaching. They can't.
And that's why
Yeah.
it's so important
It's so important
to have a strong support system in place,
a good support system.
both for the patients and those who care for them.
Yeah.
Counseling, support groups,
Support groups, right?
rehabilitation programs.
Rehab, yeah.
These resources
Mm-hmm.
can make a world of difference
You really can.
in navigating that long,
It's a long and
arduous journey
journey of recovery.
of recovery.
Exactly.
This makes me think about
Yeah.
those questions
Questions
posed in the textbook
in the textbook.
after each case.
Yeah.
In the first case,
Mm-hmm.
there's a question about
Okay.
the importance of documenting
Right.
the scene. Documenting the scene.
And the patient's position.
And the patient's position.
And in the second case,
Mm-hmm.
there's a question about what might have happened to the young man
To the young man.
with the possibility
With the possibility.
of an assault being
If
raised.
an assault,
These questions seem to point towards
these questions point to something
something bigger
than
just the medical aspects.
the medical aspects of these
look at-
cases.
You're picking up
On
a
a crucial point.
crucial point.
Yeah.
Head and neck trauma cases
Right.
often involve more than just
Right.
those physical injuries.
More than just the physical.
They can raise
Wow.
ethical dilemmas,
It's not just black and white.
legal questions.
It has social issues
Yes.
that require careful consideration.
They do. So it's about approaching these cases.
It's about approaching these cases
thank
with
you.
a broader perspective. A broader perspective.
Yeah. Acknowledging the human story.
The human story behind the medical charts.
There's medical charts.
It's more than a bill.
Exactly. Each patient
Yeah.
brings their own unique set of circumstances and
Mhm.
experiences to the table.
Okay.
And it's our responsibility to treat
Mhm.
them with compassion,
Compassion, yeah.
respect,
hmm
and a commitment
Sure.
to their overall well-being.
It's a reminder that
It is a reminder
every injury,
every injury,
every case
is more
than a collection of symptoms.
and vital signs.
And vital signs.
There's a
There's a human being
human being
at the center of it all.
at the center of it all.
Someone deserving of our best efforts
Our best efforts
and our deepest empathy.
and our deepest empathy.
Yet I said it better myself.
And that brings us to
And that brings us to a crucial concept
A crucial concept
that's often overlooked.
that's often overlooked, yeah.
And discussions of
Head and neck trauma.
head and neck trauma.
Prevention.
Prevention.
I'm intrigued. Tell me more.
While we've been focused on,
Okay.
recognizing the signs
Mhm.
and managing the aftermath
Right.
of these injuries,
Yeah.
it's equally important to
Right.
address the root causes
Those root causes, yeah.
and explore ways
Yeah.
to prevent them from
To
happening.
prevent them
from
ever
happening.
Exactly. So it's not just about
So it's not just about
reacting to trauma.
reacting to trauma,
It's about being proactive,
proactively creating
creating a safer world
a safer world,
where these injuries
where these injuries
are
are
less likely to occur.
less likely to occur. Right, so it's about shifting our mindset
Shifting our mindset
from reaction to prevention.
from reaction to prevention, from damage control.
Yeah, from damage control to
Proactive
proactive measures. And that shift
And that shift
requires a collective effort.
requires a collective effort.
It's not just
We all have a role to play
one person
in creating
Yeah,
a culture of safety.
a culture of safety.
But whether it's big or small,
by speaking up against violence,
yeah.
promoting responsible behavior, or simply being more aware
More aware of our surroundings.
of our surroundings.
Yeah, we all have a part to play.
It's a powerful reminder
It's a powerful reminder.
that we're not just passive
Yeah.
observers in this.
Just passive observers.
We can actively
choose to make a difference.
Absolutely. And sometimes
Those seemingly
small choices.
small choices.
Buckling up,
Hearing
wearing a helmet,
intervening.
intervening when someone's behavior is risky.
And have life-saving consequences.
Life-saving consequences.
It's a call to action.
It is a call to action.
Reminder that
A reminder that
we all have the power
we all have the power
to prevent
to prevent these devastating injuries
these devastating injuries
and create a safer world
and create a safer world
for ourselves
and those around us.
and those around us.
Yeah.
Well said.
I think
And I think that's a great place
That's a great place.
to pause,
Yes, I know.
reflect
Yeah.
on everything we've covered so far. Wow, this deep dive
Yeah, it really has.
is really opened my eyes
My
to
stuff is
just how many different sides
faceted
there are to head and neck trauma.
of head and neck trauma. Yeah.
We've gone from
From examining those vital signs
Those vital signs.
and those subtle clues at the scene,
all
the way to
the long-term, implications and the importance of prevention. It's just been quite a journey.
It has been quite a journey through a really complex and often overlooked area of medicine. But before we wrap up, I think it's worth taking a moment.
Let's do it.
To distill some key takeaways
for listeners
to a few essential points. What would those be? What do you want?
What are those things? I really want the listener
to remember
about head and neck trauma. What are the big ones?
The big ones, yeah.
All right.
First, never underestimate
the seriousness of these injuries. Even seemingly minor
bumps or falls
can have lasting consequences.
They can have
especially when it comes to the brain.
Early recognition and intervention.
So paying attention to those subtle clues, like changes in behavior. Or pupillary response
can make all the difference.
You're getting
timely
medical
attention. Exactly.
And then secondly was number 2.
Remember that ongoing assessment is key. The patient's condition can change so rapidly. And those changes
and they might not always be
obvious. Vigilance is important.
And a deep understanding of the body's responsive
to trauma
are essential
for
both for medical professionals and anyone
who might
encounter these situations.
It's like we've been given
a crash course
in
recognizing those red flags.
And understanding what they might signify. And finally,
all right, what's number 3?
I want to emphasize
that
recovery from
head and neck trauma
is
rarely straightforward.
It's a journey
that often
extends far beyond
that initial injury. It involves not
only physical healing, but also addressing those
psychological
attacks of the
experience. So providing comprehensive support, fostering resilience, and connecting patients and families. With the resources they need. Are all essential aspects
to
the healing process.
Couldn't have put it better myself.
As we've been talking, I've been thinking that this deep dive hasn't just been about.
It's really been about gaining knowledge.
It's really been about shifting.
It's about shifting
perspective.
I'm seeing the world.
You're seeing the world
through a new lens.
One
that recognizes
the
fragility
of the human body
and the importance
of proactive
art of
safety measures. That's the power of knowledge.
It really is,
isn't it?
It expands our
understanding. And empowers us
to make informed choices,
both for ourselves and for those around us.
It's a reminder that even though we can't control every situation, we can control how we prepare for them. And how we respond.
We can control how we prepare and respond.
And sometimes that preparedness can make all the difference.
Whether it's
taking a first aid course, advocating for safety measures, having a conversation
with loved ones
about helmets and seatbelts. Those seemingly small actions can have a ripple effect. Creating a safer world. For everyone. I think that's
a beautiful note to end on.
A
sense of empowerment. A call to action. And a reminder
that knowledge truly is power. Well said.
And to our listener. I hope this deep dive is not only
informative, but also inspiring. Keep asking questions.
Keep asking those questions.
Stay curious. And remember that. Learning is a lifelong journey.
Your lifelong journey.
Exactly.
And until next time. Stay safe out there.
Welcome back, everyone. We're diving into endocrinology today.
Oh, yeah.
But with a bit of a twist.
All right.
We're looking at it through the eyes of paramedics,
I like it.
those folks on the front lines dealing with uh, what the textbook calls endocrine emergencies.
Ah, high stakes stuff.
Exactly. And speaking of the textbook, that's our source material for today.
Oh, cool. What kind of textbook is it?
It's a paramedic textbook, actually.
Makes sense.
And it's packed with these like real life case studies, which is what we're going to dive into.
Oh, case studies are the best.
Right. It really makes it, well, real, you know?
Totally. You can really see how it all plays out in the field.
Yeah, exactly. So before we get into the nitty-gritty of the cases, I think it's worth mentioning that the endocrine system, well, it's complex.
Oh, absolutely. Hormones,
Right.
glands, feedback loops, the whole
But
shebang.
the thing is, it's all about balance, right? Like one hormone goes up, another one goes down. It's all interconnected.
Delicate balance, for sure.
And when that balance gets thrown off, well, that's when things can go wrong. And that's where these endocrine emergencies come in.
Exactly. And I'm guessing a lot of these cases we're going to talk about today probably revolve around diabetes, right?
You guessed it. The textbook really focuses on diabetes mellitus and how it can present in all sorts of ways.
Makes sense. It's
Mhm.
one of the most common endocrine disorders out there.
For sure. And it can be really tricky for paramedics to like diagnose and treat in those emergency situations, you know?
Yeah, totally.
Uh,
Because I can mimic so many other things, right?
Yeah, exactly. So, okay, let's jump into our first case.
Okay, hit me.
This one introduces us to Nancy, a woman in her 60s.
Yeah.
It's a snowy December day.
Brr.
Paramedics get called to her home. Her husband, he's the one who called. He says she's been feeling off for a few days.
Okay.
When the paramedics see her, she's like really lethargic, confused,
Oh.
and she just keeps complaining of being thirsty.
Mm.
And her husband mentions that she has a history of high blood pressure and managed diabetes.
Okay, so there are some pre-existing conditions there.
Just from that initial impression, what are your thoughts? What's going through your head as a paramedic?
Well, already those symptoms like the lethargy and confusion, especially with the diabetes, it makes you think about a possible blood sugar issue,
Yeah.
right?
Right.
And then the thirst, that's a classic sign that something's up with her glucose regulation.
Exactly. So the paramedics, they do what they do best. They take her vitals,
Of course.
and her blood pressure is through the roof. Her heart is racing. Her skin is warm and dry.
Hmm.
But here's the real shocker. Her blood glucose level is 34.0 millimole.
Wow, that is seriously high.
It is, right. I mean, for those listening who might not be familiar with those numbers, what does that actually mean for her body?
Well, it means her body's in a state of crisis.
Okay.
That level of glucose, it's incredibly dangerous.
Oh, wow.
Remember, glucose is like the body's primary fuel, but it needs insulin to get into the cells to be used, right?
Right.
Right. And in her case, it seems like either she's not producing enough insulin or her body's not responding to it properly. You know what I mean?
Okay.
So all that glucose is building up in her bloodstream.
And that's causing all those problems.
You got it.
So paramedics got to act fast, right?
Absolutely.
Oxygen, 5E fluids, close monitoring, the whole 9 yards.
Get her stabilized into the hospital ASAP.
Exactly. But on the way to the hospital, she has a tonic-clonic seizure.
Oh, no. That's not good.
Yeah, it's a serious turn of events.
A seizure, it means the brain's in distress.
Hmm?
In this case, it's most likely from those really high blood sugar levels messing with her brain function, you know.
So based on what we've heard so far, what's your diagnosis? What do you think's going on with Nancy?
Well, putting it all together, her age, the diabetes history, that sky-high blood sugar, and those specific symptoms, it sounds a lot like hyperglycemic, hyperosmolar non-ketotic acidosis.
Whoa, say that again?
Hyperglycemic, hyperosmolar non-ketotic acidosis, or HHNK for short.
HHNK. Got it.
It's a mouthful, I know.
So what is that exactly? Break it down for us.
Well, it's a pretty serious complication of diabetes,
Okay.
usually type 2, and it often affects older adults.
Interesting.
Now, here's the thing. HHNK, it's not as immediately life-threatening as, say, DKA, which is diabetic ketoacidosis.
Okay, so there's a difference.
Big difference.
Yeah.
But HHNK can be a bit more sneaky, you know?
Oh, how so?
Well, those early symptoms, like this increased thirst and fatigue, they can be subtle, especially in older folks,
Ah, I see.
and often get brushed off as just part of getting older.
Right, makes sense.
And that's why it's so important to be aware to catch it early.
Especially if you have diabetes or know someone who does.
Exactly. Early detection is key.
But okay, back to Nancy.
Yeah.
What makes HHNK so dangerous in that moment? Like, what's happening inside her body?
Well, basically, it leads to severe dehydration.
Dehydration.
Yeah, the high blood sugar, it pulls fluid from her body's tissues, including vital organs like the brain.
Oh, wow.
And that leads to a whole cascade of problems.
Like the confusion and lethargy.
Exactly. And in severe cases, it can even lead to seizures and coma.
Scary stuff. And to think it can all start with something as simple as just feeling a little more thirsty.
That's the thing. It can be really subtle at first, which is why recognizing those early warning signs and seeking medical attention is crucial.
Absolutely. Early intervention can make all the difference.
For sure.
Okay, so we've seen how high blood sugar can lead to HHNK.
Right.
Makes sense. But this next case with Dan, it's a total flip. Low blood sugar causing all sorts of chaos, aggression, confusion, the works.
Yeah, hypoglycemia.
Yep.
Tricky one.
So how does that work? Like, how can low blood sugar cause that kind of reaction?
Well, think of it this way. Your brain runs on glucose. It's like its primary fuel source.
Okay, the brain needs sugar.
Big time. And when blood sugar levels drop, the brain basically starts short-circuiting.
Oh, wow.
It can't send signals properly, so you get confusion, irritability, even seizures.
It's like a car sputtering, running out of gas.
Perfect analogy.
Yeah.
Everything just grinds to a halt.
So it's not just feeling a little shaky, it's a complete personality shift.
Exactly. It can be really scary, especially for those witnessing it.
And that's exactly what the paramedics walked into with Dan.
Oh, boy.
This call starts with, actually, the police are already on scene.
Whoa.
They find Dan. He's a 16-year-old, recently diagnosed with diabetes, and he's completely out of control, violent, confused, screaming.
Yikes.
His parents are beside themselves. The police are having a hard time restraining him.
Oh, what a situation.
Total chaos. So what happened? What led to this outburst?
Well, according to his parents, Dan had been playing basketball with friends.
Okay. Active.
Then he came home, ate something, and then, bam, went downhill fast.
So what happened?
Hypoglycemia, low blood sugar.
But he just ate. How's that possible?
That's the thing with diabetes. It's all about balance. The physical exertion from basketball, then the food, it probably threw his insulin-glucose balance way off.
Ah, so it's like a delicate dance.
Exactly. The timing of his insulin, the food, the exercise, it all plays a role.
So the paramedics, they see the classic signs of hypoglycemia, right?
Yep. Pale, sweaty skin, shallow breathing, racing heart,
And his blood glucose.
dangerously low, 2.2 millimole.
Another medical emergency.
Absolutely. This really highlights how crucial that glucose is for the brain.
And even a short period of being that low can have these severe consequences.
You got it. It can disrupt brain function so much that it leads to these extreme behavioral changes. It's a neurological emergency, not just feeling shaky.
And treating someone in that state, I imagine it's incredibly difficult.
You're right. Safety comes first. They might have to restrain him, prevent him from hurting himself or others. Then they need to get that blood sugar up fast, usually with intravenous glucose.
Get that fuel back to the brain.
Exactly. It's all about stabilizing the situation and addressing that underlying cause.
Wow. So we've seen high blood sugar with HHNK, the dangers of low blood sugar with Dan, but what happens when low blood sugar combines with another dangerous complication? That's what we'll explore in our next case.
Oh, sounds intriguing.
It involves an unconscious woman and a bit of a mystery.
I'm all ears.
Picture this. A 45-year-old woman found unconscious on a sidewalk.
Okay, that's not good.
Bystanders call 911.
Of course.
Paramedics arrive. And they find her lying there, unresponsive, but there's this strange fruity odor on her breath.
Fruity odor, huh? That's interesting.
Yeah, before we even get to the medical stuff, that fruity odor, it's a pretty significant clue.
It definitely is. It suggests something specific might be going on metabolically, you know?
Okay, keeping the suspense going. So besides the fruity breath, she's breathing really deeply and rapidly, and she's showing signs of cyanosis, meaning her skin has this bluish tint, lack of oxygen.
Not a good sign.
Definitely not. And she's incontinent of urine.
Okay, things are adding up.
Did they find anything on her that gives them more clues about her history?
Well, they find a few medications in her purse. Cardizem, Tylenol, ibuprofen, the usual suspects. But more importantly, they find a medic alert bracelet. It says she has diabetes and hypertension.
Ah, so diabetes is back in the picture. And when they check her blood glucose,
What's that?
alarmingly low,
Yeah.
just 1 millimole. Another case of hypoglycemia.
Could be. But remember that fruity breath.
Yeah.
That's a classic sign of diabetic ketoacidosis,
DKA.
DKA.
So how is this different from HHNK, which we talked about with Nancy?
Good question. Both are serious complications of diabetes, but there are some key differences. DKA involves ketones in the blood.
Ketones, remind me, what are those again?
So ketones, they're acidic byproducts of fat metabolism.
Okay.
When the body doesn't have enough insulin to use glucose for energy, it starts burning fat instead.
Right, makes sense.
And that process creates ketones.
Gotcha.
And those ketones, they build up in the bloodstream, making the blood acidic.
Okay, so ketones are bad news.
Pretty much. And unfortunately, DKA has a higher mortality rate than HHNK.
Oh, wow, that's serious.
It's a very serious condition.
But why the fruity breath? What's the connection there?
Well, one of the ketones produced is acetone.
Acetone, like nail polish remover.
Exactly. It's got that distinctive fruity smell.
Ah, so that's where the odor comes from?
Yep, that's your ketone signature right there.
And the rapid breathing.
That's the body trying to fight back.
Okay.
Those deep, rapid breaths, we call them Kussmaul respirations.
Poo-small respiration.
They help get rid of carbon dioxide from the lungs.
And why is that important?
It helps raise the pH of the blood, trying to counteract that acidity from the ketones.
Wow, so her body's basically waging a chemical war within itself.
Yeah, it's a desperate attempt to restore balance.
Amazing how the body tries to compensate even when facing such a serious threat.
The human body is pretty incredible.
It is, but in this case, it's not enough.
Nope, she needs medical attention, stat.
So rapid transport to the hospital, DKA is life-threatening.
Absolutely. Every minute counts.
Man, this is heavy stuff. We've covered 3 very different scenarios: HHNK, hypoglycemia, and DKA, each with its own unique challenges and symptoms.
Yeah, it really shows the variety of ways these endocrine emergencies can present.
So what are some key takeaways from these cases that we can apply to a broader understanding of endocrine emergencies?
Well, first of all, it's clear that these emergencies aren't just abstract concepts in a textbook.
Right.
They're real-life situations with real people. And those subtle differences in symptoms, they can make all the difference in the world.
Absolutely. You got to be able to read those clues and make the right call fast.
Exactly. And the textbook really emphasizes that,
Yeah.
Recognizing those specific signs and symptoms, it's crucial.
It's like being a detective, putting those pieces together.
Exactly. Is the patient confused and thirsty, agitated and sweaty, fruity breath? Those are all clues that point us in different directions.
It's fascinating, really.
It is, and it makes you realize the pressure paramedics face.
Oh, yeah, for sure. Split-second decisions that can mean life or death.
The textbook doesn't shy away from that. It really underscores the importance of rapid assessment, accurate diagnosis.
And how it all hinges on recognizing those key symptoms.
You got it.
But there's also another layer to this, right?
Oh, absolutely. There's the immediate emergency, but then there's the bigger picture.
The underlying causes.
Exactly. And often, that leads back to diabetes management.
So we're moving from the acute situation to, like, long-term strategies.
Yeah, the textbook raises this really interesting point. It asks, why are we so focused on reacting to these emergencies rather than trying to prevent them in the first place?
That's a great question. And when you think about it, all 3 of our cases, they all involve diabetes in some way.
Exactly. If we could help people manage their diabetes more effectively, wouldn't that reduce the number of these life-threatening emergencies?
Makes sense to me. But how do we do that? How do we make that shift?
Well, the textbook highlights a few key areas. Education is a big one.
Empowering people with the knowledge to take control of their health.
Exactly. Help them understand their condition, recognize those early warning signs, and manage their blood sugar.
So it's about being proactive, not just reactive.
Exactly. And technology plays a big role here too. We're seeing some incredible advancements in diabetes technology, like continuous glucose monitors.
Those are the ones that give you real-time blood sugar readings, right?
Yeah, those. And insulin pumps that deliver insulin automatically.
It's like having a high-tech support system right there with you.
It is. But technology is only part of the solution, right?
Right. Can't just rely on gadgets.
Access to quality healthcare is crucial too. Regular checkups, early detection of complications, ongoing support from healthcare professionals.
So it's about having a team in your corner guiding you, helping you stay on track.
Exactly. And we also have to think about those broader societal factors that contribute to diabetes in the first place,
Like food insecurity, lack of access to healthy food.
Yep, those are big ones. And promoting healthy lifestyles, making it easier for people to make healthy choices.
It's a reminder that health isn't just about individual responsibility, it's also about creating supportive environments.
Well said. And it all circles back to that initial point. shifting our focus from just reacting to emergencies
Mhm.
to embracing those preventative measures.
It's a big challenge, but it's a worthwhile one.
Absolutely. It has the potential to make a real difference in people's lives.
It's inspiring to think about those possibilities. But before we get too far ahead of ourselves, let's bring it back to those paramedics on the front lines.
Okay, yeah.
What are some of the key skills and knowledge that stand out to you from these cases?
What really strikes me is their ability to stay calm under pressure.
Oh, absolutely.
These are intense, high-stakes situations, but the paramedics in these case studies, they're incredibly composed. They're methodical in their assessments, quick on their feet.
Laser focused on patient care.
Exactly. It's impressive.
It is. And I think it's easy to overlook the mental and emotional toll this job takes, dealing with life and death on a regular basis.
Yeah, it's definitely not easy, and the textbook touches on that too.
Oh, really?
Yeah, it points out that being a paramedic, it's not just about medical knowledge.
What else is there?
It's also about having the resilience, the compassion to handle those tough situations.
So it's a calling, not just a job.
It is a commitment to helping people in their most vulnerable moments.
And that's something worth recognizing and respecting.
Absolutely. These paramedics, they're unsung heroes.
We really are. They're out there every day making those split-second decisions that can literally change the course of someone's life.
Couldn't agree more. Their ability to assess, diagnose, and intervene in these endocrine emergencies, it's a testament to their dedication and expertise.
It is, for sure. Okay, so we've talked about recognizing those specific symptoms, the need for early intervention, the importance of long-term diabetes management in preventing these emergencies. What else stands out to you as a key takeaway from these cases?
One more thing I think is worth highlighting is the incredible resilience of the human body.
Oh, that's an interesting perspective.
Even when faced with these really serious, life-threatening conditions like we saw in these cases, the body has this amazing capacity to fight back, to try and heal.
It's like it has this inner drive to survive.
Exactly. Take Nancy's case. Her body was dealing with sky-high blood sugar, but it was still trying to compensate, to bring things back into balance.
And with the unconscious woman, her body was desperately trying to counteract that acidity caused by DKA.
Exactly. It's a powerful reminder that even in the face of these huge challenges, there's this innate drive within us to survive, to heal, to find a way back to equilibrium.
It's humbling, really, the complexity of the human body and its ability to adapt and persevere.
It is, and I think it's a message of hope. Even when things seem really dire, there's always a chance for recovery, for healing.
That's a beautiful thought.
But that recovery, it often depends on a delicate balance between medical intervention, personal responsibility, and those broader societal supports that we talked about.
It's a collective effort. We all have a role to play in creating a world where these emergencies are less frequent.
And where people living with diabetes have the support and resources they need to thrive.
Absolutely. So, as we wrap up this first part of our deep dive, what's the one message you hope our listeners will take away with them today?
That's a good question. I think the biggest takeaway is this. While these endocrine emergencies are serious and they can be life-threatening, there's also a lot of hope.
I love that. It's not all doom and gloom.
Not at all. There are things we can do, both individually and as a society, to make a real difference.
By staying informed, making healthy choices, advocating for better healthcare, and supporting each other.
Exactly. We can create a brighter future for ourselves and for generations to come.
Well said. And to our listeners, thank you for joining us on this deep dive into the world of endocrinology. We hope you found it informative, thought-provoking, and maybe even a little bit inspiring. Stay tuned for part 2, where we'll explore some of the cutting-edge research and innovations that are shaping the future of diabetes management.
So we're picking up where we left off, right, with that idea of shifting from reaction to prevention when it comes to endocrine emergencies.
Exactly. It's a complex issue, but I think it's a crucial one to address.
Absolutely. And the textbook actually does a good job of laying out some of the challenges and potential solutions.
Okay, so let's dive into those. What are some of the things that researchers and healthcare providers are focusing on when it comes to preventing these emergencies?
Well, one area that's really gaining traction is personalized medicine.
Personalized medicine. Okay, I've heard that term before, but remind me what it means exactly.
Basically, it's about tailoring treatment plans to each individual's unique needs.
So moving away from that one-size-fits-all approach.
Exactly. Because everyone's different, right? Their genetics, their lifestyle, their medical history, all these factors play a role.
So how does personalized medicine apply to preventing endocrine emergencies specifically?
Well, for example, researchers are looking for ways to identify individuals who are at higher risk of developing certain complications, like DKA.
So if you know someone's more likely to have a DKA episode, you can intervene earlier.
Exactly. It's all about early detection and prevention.
That's fascinating. I imagine technology is playing a big role in all this.
Oh, absolutely. We're seeing some incredible advancements in things like artificial intelligence and machine learning.
AI in healthcare. It's like
Yeah,
something out of a sci-fi movie.
I know, right? But it's becoming more and more real, and these technologies are helping us analyze vast amounts of data to identify those patterns that we might not be able to see on our own.
So it's like having this superpowered detective working behind the scenes to uncover those hidden clues.
Exactly. And another area where technology is making a huge impact is in the development of closed-loop insulin delivery systems.
Closed loop. What's that?
It's essentially an artificial pancreas. It combines a continuous glucose monitor with an insulin pump to automatically adjust insulin delivery based on real-time blood sugar readings.
Whoa, so it's like having an autopilot for blood sugar control.
Pretty much. And these systems are getting more sophisticated all the time. Some of the newer models even incorporate algorithms that can predict and prevent hypoglycemic episodes.
That's incredible. It seems like we're on the verge of a real revolution in diabetes management.
I think so too. But as amazing as these technological advancements are, it's important to remember that they're only one piece of the puzzle.
Right. We can't just rely on gadgets to solve this problem.
Exactly. There's also a huge emphasis on lifestyle interventions.
Things like diet and exercise.
Exactly. Research has shown that even small changes in these areas can have a big impact on blood sugar control and overall health.
So it's about empowering people to take ownership of their health through those lifestyle choices.
Absolutely. And this is where education and support come in, helping people understand how their choices affect their health and giving them the tools and resources they need to make positive changes.
And it's not just about individual effort, right? We talked about those broader societal factors too, like food insecurity.
Absolutely. Addressing those social determinants of health is crucial. Ensuring access to affordable, nutritious food, creating safe spaces for physical activity, reducing those systemic barriers that prevent people from achieving optimal health.
It's a reminder that health is this complex tapestry woven together by individual choices, medical advancements, and those broader societal influences.
Well said. And it all comes down to recognizing those interconnected factors and working together to create a healthier future for everyone.
Okay, so we've got personalized medicine, cutting-edge technology, lifestyle interventions, and addressing those broader societal factors. It seems like there's a lot happening in this space. Well, the one message you hope our listeners will take away from this conversation about preventing endocrine emergencies.
I think the biggest takeaway is that while these emergencies are serious and can be life-threatening, there's also so much reason for hope.
I love that. It's not all doom and gloom. There are things we can do both individually and collectively to make a difference.
Absolutely. By staying informed, making healthy choices, advocating for better healthcare, and supporting each other, we can create a brighter future for ourselves and for generations to come.
What an inspiring note to end on. And to our listeners, thank you for joining us on this deep dive into the world of endocrinology. We hope you found it informative, engaging, and maybe even a little bit empowering. Until next time, stay curious, keep exploring, and take good care of yourself.
You know, we've talked a lot about the physical and technological aspects of preventing these emergencies.
Right, like those closed-loop systems and personalized medicine approaches.
But there's another piece of the puzzle that I think is really important to address.
Oh, tell me more.
The psychological impact of living with a chronic condition like diabetes.
Ah, that's a really important point. It's not just about managing the physical symptoms.
Exactly. Imagine the constant vigilance, the worry about those highs and lows, the fear of complications. It can take a huge toll on mental and emotional well-being.
And I imagine that stress can actually make it harder to manage the condition effectively.
Absolutely. Stress hormones can throw off blood sugar levels, making it even more challenging to stay within that target range.
So it's like a vicious cycle.
Exactly. That's why it's crucial to address the psychological aspects of diabetes alongside those physical and technological interventions.
Okay, so how do we do that? What kind of support is available for people struggling with the emotional burden of diabetes?
Well, one of the most important things is simply acknowledging that these challenges exist.
Creating a space where people feel comfortable talking about their experiences?
Exactly. And there are lots of resources out there to help: support groups, therapy counseling, online communities where people can connect with others who understand what they're going through.
It's that sense of community, knowing you're not alone in this.
Absolutely. And beyond that, there are also techniques that people can learn to manage stress and build resilience. Mindfulness, meditation, yoga, these practices can be really helpful in coping with the emotional ups and downs of diabetes.
So it's about equipping people with those coping mechanisms.
Exactly. Giving them the tools to not just manage their physical health,
Mhm.
but also their mental and emotional well-being.
Because ultimately it's all connected, right? A
Yeah.
healthy mind and a healthy body.
Couldn't have said it better myself. And that brings us back to that overarching theme of prevention.
Right. It's not just about reacting to emergencies. It's about creating a holistic approach to diabetes care.
Absolutely. And it's an ongoing journey, a collaboration between individuals, healthcare providers, researchers, and society as a whole.
We all have a role to play in supporting each other and creating a world where people living with diabetes can thrive.
I completely agree.
Mhm.
It's about fostering a sense of empowerment, knowledge, and community.
And ultimately, it's about hope. The hope for a future where these endocrine emergencies become less and less frequent.
A future where people with diabetes can live long, healthy, and fulfilling lives.
Well said. And on that note, I want to thank you for joining us on this deep dive into the world of endocrinology. It's been an incredible journey exploring the complexities of this system and the challenges and triumphs of managing endocrine emergencies.
It's been a pleasure sharing this conversation with you. And to our listeners, we hope you've gained some valuable insights and a renewed sense of hope for a healthier future.
Remember, knowledge is power. The more we understand about our bodies and the resources available to us, the better equipped we are to take control of our health and advocate for ourselves and our loved ones.
So keep learning, keep exploring, and keep those conversations going, because together we can make a real difference.
Until next time, stay curious and take care.
Hey everyone, and welcome to our deep dive into something that's especially relevant for us Canadians,
Oh, yeah.
environmental emergencies.
Yeah.
You know, with our wild and unpredictable landscapes and weather.
Yeah,
It's definitely something we should all be thinking about.
absolutely.
So to guide us through this,
Yeah.
we're using a chapter from an emergency medical services textbook,
Okay.
specifically chapter 20 on environmental emergencies.
That's right.
And the goal here
Yeah.
is to give you the knowledge you need to not just recognize these situations,
Mm-hmm.
but also to know what to do if you ever find yourself in one.
Right.
You know, it's kind of like having a little survival guide
Yeah.
right in your pocket.
Exactly. So,
You know, a lot of people think these emergencies
Mm.
only happen to
Yeah.
hardcore adventurers or like,
like extreme athletes.
yeah, people who are really into the outdoors.
Right, right.
But honestly,
Yeah,
it can happen to anyone.
absolutely.
Like imagine just taking a dip in a lake on a hot day,
Yeah.
or even just going for a hike,
Mm-hmm.
a sudden change in weather,
Right.
or even just pushing yourself a little too hard
Yeah,
can quickly turn a fun outing into a really serious situation.
totally.
So
Yeah.
I actually had a friend who got caught in a sudden downpour while hiking.
Oh, wow.
He wasn't prepared for it at all.
Oh, no.
And he ended up getting pretty chilled.
Yeah.
Luckily, it wasn't anything serious.
Okay.
But it definitely made me realize how quickly things can change,
Right.
even on a seemingly ordinary outing.
Absolutely. And that's why it's so important to be prepared. And, one of the key things that this chapter emphasizes is that the most important thing you can do in an environmental emergency is to remove yourself
Okay.
or the person who's in trouble from that harmful environment as quickly as possible.
Right.
It's like rescue comes first.
Okay.
Get out of that danger zone before
Yeah.
anything else.
Yeah, that makes total sense.
Yeah.
So I know this chapter talks about a whole bunch of different environmental emergencies,
Mhm.
like heat stroke,
Right.
hypothermia,
Right.
even things like decompression sickness.
Oh, wow.
But before we jump into the specifics of each of those,
Yeah.
can you give us like a general overview of what kinds of risks
Yeah.
Canadians face?
Well, think about it. We have incredibly diverse geography in Canada.
Yeah.
Everything from scorching deserts to like freezing Arctic landscapes and
Yeah.
everything in between.
Yeah.
And with that kind of range comes a whole spectrum of potential risks.
Right.
So exposure to extreme temperatures is a major one.
Okay.
Whether it's extreme heat or extreme cold. We also have high altitudes in some parts of the country,
Yeah.
which can pose their own unique set of challenges.
Right.
And then, of course, there's the risks associated with water, whether it's cold water immersion,
Right.
drowning, or even diving accidents.
Okay. So lots to think about.
Lots to think about.
Now, I imagine that recognizing the problem early on is crucial in these situations.
Absolutely.
The textbook mentions the importance of obtaining a thorough patient history.
Right.
But what does that actually mean, like in a practical sense?
That's a great question.
Yeah.
So in a real life situation, it means asking questions and gathering as much information as possible about what happened.
Okay.
So, for example, if someone's showing signs of hypothermia,
Mm.
you'd want to know how long they've been exposed to the cold, what
Okay.
kind of clothing they were wearing,
Mhm.
whether they were wet,
Okay.
and so on.
Yeah.
The same goes for heat stroke.
Right.
Finding out how long they were in the heat,
Oh.
what they were doing,
Oh.
whether they had access to water.
Yeah.
All of that is crucial.
So it's like being a detective,
It is.
piecing together the clues to figure out what happened
Yeah,
and how best to respond.
absolutely.
All right, I think I'm ready to put on my detective hat and dive into some real-life examples.
Yeah, me too.
This chapter features a bunch of case studies
It
that
does.
seem like they'll really bring these concepts to life.
Yeah.
So why don't we start with case 20.1,
Right.
which focuses on the dangers of cold water immersion.
Right.
Now, this is especially relevant for us in Canada
Yeah,
with all of our lakes and rivers.
absolutely.
Okay, so
Case 20.1, bring it on.
picture this. It's early spring.
Okay.
The air temperature is a pleasant 18 degrees Celsius.
Right.
A group of teenagers is hanging out by a lake,
Mm-hmm.
and they decide to go cliff diving.
Okay.
Now, the air might be warm,
Yeah.
but the water
Yeah.
still freezing cold.
Right.
And to make matters worse, they've been sharing a bottle of vodka.
Oh, no. I can already see where this is going.
Yeah,
Alcohol and cold water.
never a good combination.
Never a good combination.
Alcohol impairs judgment,
Mm-hmm.
increases risk-taking,
Yeah.
and delays the body's natural response to cold.
Yeah, okay.
So one of the teenagers, a 19-year-old named Matt, jumps in.
And doesn't come up right away.
Yikes, that's terrifying.
His friends finally manage to pull him out of the water. He's unresponsive,
Oh, no.
barely breathing,
Oh, wow.
with a weak pulse, and his skin is ice cold.
Okay, that sounds really serious.
It is.
What happens next?
So the paramedics arrive, and they immediately prioritize stabilizing Matt's neck
Okay,
because of the risk of a spinal injury from the cliff dive.
right.
So it's called cervical spine control,
Mm-hmm.
and it basically means they're making sure his neck doesn't move to
Uh-huh.
prevent any damage to his spinal cord.
Wow. Never would have thought of that.
Yeah.
It's amazing how much the paramedics have to consider in these situations.
Yeah, they have to think fast and act quickly.
Yeah.
So in Matt's case, they immediately focus on the ABCs,
Okay.
airway, breathing, and circulation.
Mm-hmm.
They give him oxygen
Yeah.
and do everything they can to stabilize him for transport to the hospital.
So even though it sounds obvious, getting someone out of the cold water is just the first step.
Absolutely. Cold water immersion is incredibly dangerous.
Yeah.
You know, your body loses heat much faster in water than it does in air.
Right.
And hypothermia,
Mm-hmm.
which is what happens when your body temperature gets too low,
Yeah.
can set in incredibly quickly,
Wow.
especially in water that's this cold.
And I remember you mentioned earlier that the amount of time someone spends exposed to the cold is a really important factor.
You've got a great memory.
Yeah.
It's absolutely crucial.
Okay.
The longer someone's exposed,
Right.
more serious the situation becomes.
Yeah.
And the cold doesn't just affect your body temperature,
Mhm.
it also impacts your breathing,
Wow.
your heart rate,
Okay.
and even your mental state.
Right.
You can become confused,
Yeah.
disoriented,
Yeah,
and
right.
eventually lose consciousness.
This case study really paints a vivid picture of how dangerous cold water can be.
It is.
It's making me think twice about jumping into any lakes anytime soon.
It's definitely a good reminder to be cautious,
Yeah.
especially in the early spring or late fall,
Right.
when the water temperatures are still very cold.
Okay.
But, you know, it's not just the cold that can be dangerous.
Right.
Let's move on to case 20.2, which focuses on the opposite end of the spectrum.
Okay, from one extreme to the other.
Yes.
I'm ready for case 20.2.
All right.
What's the scenario?
So imagine this.
Okay.
A hiker is out on a long trek on a hot, humid day.
Right.
The sun is beating down.
Yeah.
They're sweating profusely, and they haven't brought enough water.
Oh, no. That's a recipe for disaster.
It is.
I remember one summer I was doing some gardening on a hot day,
Yeah.
and I completely underestimated how much water I needed.
Mm-hmm.
I ended up feeling lightheaded and dizzy.
Oh, wow.
It was a wake-up call for me to pay more attention to hydration.
It is easy to get caught up in the moment and forget about the basics.
Yeah.
But proper hydration is absolutely essential in hot weather,
Right.
especially when you're exerting yourself.
Okay, so what happens to the hiker in this case study?
So after hours of hiking, they start feeling really unwell. They become confused, disoriented, and eventually collapse on the trail.
I'm guessing this is a case of heat stroke.
You got it.
Okay.
When the paramedics arrive,
Yeah.
they find the hiker Semi-conscious.
Okay.
Their skin is burning hot to the touch,
Oh.
and their mouth and tongue are bone dry.
Those are some pretty alarming signs.
They are.
Yeah.
It means that the hiker's body has lost its ability to regulate its internal temperature.
Okay.
Sweating, which is the body's natural way of cooling down,
Right.
has stopped working effectively.
Right.
And the internal temperature has risen to a dangerous level.
So it sounds like heat stroke is a really serious medical emergency.
It absolutely is.
Right.
Heat stroke can cause damage to the brain
Yeah.
and other vital organs, and it can
Mhm.
even be fatal if not treated promptly.
So what do the paramedics do in this situation?
Well, the first priority is to cool the hiker down as quickly as possible. They'll use cool water or ice packs to bring down the body temperature,
Right.
administer 4V fluids to rehydrate them,
Mm-hmm.
and carefully monitor their vital signs,
Okay.
like heart rate and blood pressure.
Yeah.
Time is of the essence in these situations.
So while prevention is obviously the best approach,
Yes.
knowing how to recognize the signs of heat stroke
Mhm.
and respond appropriately
Mm,
is crucial.
absolutely.
Okay, so we've talked about the dangers of both extreme cold and extreme heat.
We have.
What other environmental hazards
Yeah.
do we need to be aware of?
Well, let's shift gears and talk about another environmental hazard
Okay.
that might not be as obvious,
Go ahead.
altitude.
Altitude. Okay.
Many people don't realize that altitude sickness can be a real problem.
I always associate altitude sickness with climbing Mount Everest or something like that. I
Yeah.
didn't realize it could be an issue in Canada.
Yeah. Well, we actually have some pretty high elevations in parts of the country,
Okay.
particularly in the Rocky Mountains. And you don't have to be climbing a mountain to experience altitude sickness.
Okay.
Even hiking at elevations above 2,500 meters
Yeah.
can cause problems for some people.
So what exactly is altitude sickness
Yeah.
and why does it happen?
So altitude sickness, also known as acute mountain sickness,
Mhm.
occurs when your body has trouble adjusting to the lower oxygen levels at higher elevations.
Okay.
As you go higher,
Yeah.
the air pressure decreases
Okay.
and there's less oxygen available for your body to use.
So it's like your body is literally being starved of oxygen.
That's a good way to put it.
Okay.
And when your body doesn't have enough oxygen,
Yeah.
it can lead to a whole cascade of symptoms like
Right.
headache, fatigue, nausea, dizziness, and shortness of breath.
Wow.
In severe cases,
Yeah.
it can even cause fluid to build up in the lungs or brain,
Okay.
which can be life-threatening.
That sounds pretty serious. I had no idea altitude sickness could be so dangerous.
It can be, but the good news is that
Okay.
most cases are mild, and they often resolve on their own if you descend to a lower altitude
Right.
and give your body time to adjust.
So what are some things people could do to prevent altitude sickness?
Well, the best way to prevent it
Yeah.
is to ascend gradually.
Okay.
Don't go from sea level to 3,000 meters in one day.
Right.
Give your body time to acclimatize
Okay.
by spending a couple of days at lower elevations before going higher.
Right.
Also, stay hydrated.
Okay.
Avoid alcohol and caffeine and make sure you're eating enough calories.
Those are great tips.
Yeah,
It sounds like a bit of planning and preparation can go a long way
it does.
in preventing altitude sickness.
Mm-hmm.
But what if someone starts to experience symptoms?
Yeah.
What should they do?
If you start to feel the effects of altitude sickness,
Yeah.
the most important thing is to stop ascending
Okay.
and rest.
Right.
If the symptoms are mild,
Mm-hmm.
you can often manage them by staying hydrated,
Right.
getting some rest, and taking over-the-counter medications like ibuprofen or a acetaminophen for headaches.
Okay.
However, if the symptoms are severe
Right.
or if they don't improve with rest,
Right.
it's essential to descend to a lower altitude as quickly as possible
Okay.
and seek medical attention.
So just like with cold water, immersion, and heat stroke,
Yeah,
early recognition and prompt action are key.
absolutely.
Okay, so we've covered the extremes of hot and cold.
Right.
What about those hazards that are a bit more unique
Yeah.
to Canada's diverse geography?
Okay.
We talked about altitude sickness,
Mm-hmm.
but I'm curious to learn more about
Yeah.
what actually happens in the body when someone experiences it.
Well, you're right. Altitude sickness is something many Canadians might encounter,
Yeah.
especially those living in or visiting mountainous regions.
Mm.
Here's the thing.
Yeah.
As you ascend to higher altitudes,
Right.
the air pressure decreases,
Mhm.
meaning there are fewer oxygen molecules packed into each breath you take.
So even though you're breathing normally, you're not actually getting enough oxygen.
Precisely.
Okay.
Your body starts to feel this oxygen deprivation.
Yeah.
That's what triggers those classic altitude sickness symptoms.
Yeah.
Headaches, nausea, fatigue.
Yeah.
It's like a really bad hangover,
Right.
only without the fun part beforehand.
That sounds awful.
Yeah.
And you mentioned that in severe cases, fluid can build up in the lungs
Yeah.
or even the brain.
It's a scary thought, but it's why taking altitude sickness seriously is so important.
Yeah.
That fluid buildup, it's called edema,
Mm-hmm.
and it can be life-threatening.
Wow.
It's like your body's plumbing system gets overwhelmed, and it can
Hmm.
cause all sorts of problems.
So what can you do if you're experiencing altitude sickness?
The best remedy is actually quite simple.
Okay.
Descend.
Just go down.
Get yourself to a lower altitude as quickly as possible.
Right.
And remember, it's always better to ascend gradually,
Okay.
giving your body time to acclimate to the thinner air.
Mm-hmm.
Think of it like this.
Yeah.
You wouldn't run a marathon without training first, right?
That's a great analogy.
Yeah,
You need to train your body for altitude, just like you would for any other physical challenge.
exactly.
Now, what about diving accidents?
Okay,
We briefly touched on decompression sickness
right.
or the bends,
Yeah.
but I'm curious to learn more about
Yeah.
what actually causes it.
Well, you know how when you open a bottle of soda that's been shaken,
Yeah.
all the bubbles rush to the top?
Yeah.
Decompression sickness is kind of like that.
Okay.
When you're diving,
Mm-hmm.
your body absorbs nitrogen from the air you breathe.
Right.
And the deeper you go, the more nitrogen your body absorbs.
Okay.
It's all about pressure.
Right.
The deeper you dive, the higher the pressure,
Yeah.
and the more nitrogen gets dissolved into your tissues.
Okay.
Now, if you come up too quickly,
Right.
that nitrogen doesn't have time to escape your body safely,
Okay.
and it forms bubbles.
And those bubbles are what cause the problems.
Okay.
Those nitrogen bubbles,
Yeah.
they can block blood vessels,
Right.
damage tissues,
Okay.
and cause all sorts of havoc in your body.
Wow.
That's why it's crucial to ascend slowly from a dive,
Right.
making those safety stops
Mhm.
to let the nitrogen gradually diffuse back out of your system.
So it's not just about holding your breath.
It's not just about holding your breath.
It's about giving your body time to adjust to the changing pressure.
Absolutely.
Now, we can't talk about water safety
Yeah.
without revisiting the topic of drowning.
Right.
I remember you mentioned that it can happen even in shallow water,
It can.
which is
That's a sobering thought.
it's something people often don't realize.
Yeah.
You don't have to be in the middle of the ocean to drown.
Right.
It can happen in a bathtub,
Yeah.
a swimming pool,
Okay.
even a small pond.
So it's not just about the depth of the water. It's about being able to breathe.
Exactly.
Yeah.
Drowning is all about what happens when water blocks your airway and prevents oxygen from getting to your lungs
Yeah.
and brain.
And I remember you said there were actually two types of drowning,
Yes.
wet and dry.
Wet and dry.
Can you explain those a bit more?
Sure.
Yeah.
Wet drowning is what most people think of when they hear the word drowning.
Right.
It's when water enters the lungs,
Mhm,
and it's often accompanied by coughing and sputtering.
So it's pretty obvious when someone is experiencing wet drowning.
Usually, yes,
Okay.
but dry drowning is a bit more subtle.
Right.
It happens when water triggers a spasm in the vocal cords,
Okay.
which closes off the airway.
So even though water isn't entering the lungs, the person still can't breathe.
Exactly.
Yeah.
It's like a reflex that's meant to protect the lungs from aspirating water,
Okay.
but it ends up blocking the airway altogether.
That's terrifying.
Yeah.
So someone experiencing dry drowning might not even be coughing or sputtering.
They might not.
Okay.
They might just look like they're struggling to breathe.
Yeah.
Their chest might be heaving, and they might have a panicked look on their face.
So it's crucial to pay attention to any signs of breathing difficulty,
It is.
even if it doesn't look like the classic drowning scenario.
Absolutely. Early recognition is key in drowning cases.
This has been an incredibly eye-opening discussion so far.
Yeah.
We've covered so much ground,
We have.
and I'm starting to feel like I have a much better understanding
Yeah.
of the different types of environmental emergencies and what
Yeah.
makes them so dangerous.
That's great to hear. And, you know,
Mhm.
even though we've talked about each of these hazards separately, it's important to remember that they can often overlap.
Okay.
For example, someone who's experiencing hypothermia might also be at risk for drowning,
Right.
or someone with heat stroke might become dehydrated and disoriented,
Mhm.
which could lead to other accidents.
That's a really important point.
Yeah.
It's not always a clear-cut,
It's not.
one hazard at a time situation.
It's about understanding the bigger picture
right.
and being aware of how different environmental factors can interact with each other
Yeah.
and with your body's own responses.
So with all this knowledge we've gained,
Mm-hmm.
what can we do to actually apply it in real-life situations?
Yeah.
How can we use this information
Right.
to stay safer and be better prepared?
That's the million-dollar question.
All right.
And it's something we'll delve into in the next part of our deep dive.
Okay.
We'll talk about practical strategies for preventing these emergencies, recognizing the early warning signs,
Right.
and providing basic first aid until help arrives.
Sounds like we're just getting started.
We are.
I'm ready to dive deeper into this fascinating and important topic.
Great, let's continue our exploration of environmental emergencies.
Yeah.
Welcome back to our deep dive into environmental emergencies.
Right.
Before we get into the specifics of treatment,
Yeah.
I want to go back to heat stroke for a second.
Okay.
One question I always had was,
Mhm.
why does sweating actually stop when someone has heat stroke?
Oh, that's a good question.
Like, isn't sweating supposed to cool us down?
Yeah, it seems counterintuitive, right?
Yeah.
Like, shouldn't your body be sweating even more if it's overheating?
You'd think so, but here's what happens.
Okay.
At first, your body tries to fight that rising temperature by
Right.
sweating like crazy. But as your core temperature keeps climbing
Uh-huh.
and you get more and more dehydrated,
Okay.
your body's cooling system just can't keep up.
Right.
It's like your internal air conditioner overloads and shuts down.
So it's not that your body isn't trying to cool down.
Right.
It's just that it's reached its limit.
Exactly.
Okay.
And that's when things get really dangerous.
Right.
Without that cooling mechanism, your core temperature can skyrocket.
Yeah.
And that can lead to serious damage to your organs,
Okay.
especially your brain.
That makes sense.
Yeah.
Now, remember we talked about two types of heat stroke,
Mm-hmm.
classic and exertional.
Yeah,
Can you remind me what the difference is
sure.
and why it matters?
So classic heat stroke usually happens to people who are more vulnerable to heat,
Okay.
like older adults,
Mm.
babies,
Yeah.
or people with certain health conditions.
Right.
Their bodies might not be as efficient at regulating temperature.
So it's not just about being in the heat.
Right.
It's also about how well your body can handle it.
Exactly.
Okay.
And then there's exertional heat stroke,
Mm-hmm.
which is what we saw in that case study with the hiker.
Right.
It happens when you're pushing yourself physically in a hot environment.
Yeah.
Your body is generating its own heat from the exertion,
Right.
and that can overwhelm your cooling system even faster.
So athletes, construction workers, anyone working outside in the heat
Yeah,
would be at higher risk for this type.
exactly. And here's the important thing.
Yeah.
Both types of heat stroke are equally serious.
Okay.
They both mean your body's internal thermostat has gone haywire
Right.
and needs immediate attention.
Got it. So whether you're relaxing on the beach or running a marathon,
Right.
it's crucial to be aware of the signs of heat stroke
Yeah,
and take steps to prevent it.
absolutely.
Now, I know heat exhaustion is often a precursor to heat stroke,
It is.
but people often get those two mixed up.
Yeah.
Can you explain the difference?
Yeah, it's a crucial distinction.
Okay.
Heat exhaustion is like your body's yellow warning light,
Right.
telling you to slow down and cool off.
Right.
You'll feel tired, dizzy, maybe nauseous.
Yeah.
You'll be sweating heavily,
Mm-hmm.
but your core temperature hasn't hit that critical point yet.
So with heat exhaustion, you still have a chance to reverse things
Exactly.
before they get really serious.
Rest, shade, and lots of fluids can usually do the trick.
Okay.
But if you ignore those warning signs
Yeah.
and keep pushing,
Right.
that's when heat exhaustion can escalate into heat stroke,
Got it.
which is the full-blown red alert.
Okay. So pay attention to your body
Yeah,
and don't ignore those early warning signs.
absolutely.
Now let's switch gears and talk about the other end of the temperature spectrum,
Right.
hypothermia.
All right.
I remember the textbook defined it as a core body temperature below 35 degrees Celsius.
Right.
Okay.
And one of the things I find fascinating about hypothermia
Oh,
is
yeah.
that it can sneak up on you,
Okay.
especially in those cold, wet conditions
Right.
we often experience in Canada.
It's like how they say you lose most of your body heat through your head.
Right.
I always make sure to wear a hat when it's cold out.
That's a smart move.
Yeah.
But it's not just your head,
It is
any
not.
exposed skin.
Right.
And when you add wind and moisture to the mix,
Yeah.
it can accelerate heat loss even faster.
Whoa.
That's why it's so important to dress in layers
Yeah.
and stay dry when you're out in cold weather.
So even if the temperature doesn't seem that cold, you can still be at risk for hypothermia
Absolutely.
if you're not dressed properly.
And the tricky thing about hypothermia
Yeah.
is that the symptoms can be pretty subtle at first.
Okay.
You might start shivering, which is your body's way of trying to generate heat.
Oh, yeah. I definitely turn into a human icicle when I get cold.
We've all been there.
Yeah.
But as hypothermia progresses,
Mhm.
those shivers might actually decrease or stop altogether.
Oh, really?
And that's a dangerous sign
Okay.
because it means your body is losing its ability to warm itself up.
That's so counterintuitive.
It is.
I would think that you would just keep shivering more and more as you
Right.
get colder.
But it's like your body's internal furnace is running out of fuel.
Okay.
You'll also start feeling confused and sluggish.
Right.
Your speech might become slurred,
Yeah.
and your movements will become clumsy.
So if you see someone stumbling around and talking gibberish in the cold,
Yeah,
that's a sign to take action.
definitely. It's time to get them out of the cold.
Yeah.
Remove any wet clothing and
Yeah.
start warming them up gradually.
And I remember from the case study that gradual rewarming is key.
Yes.
Right.
It might be tempting to throw someone with hypothermia into a hot bath,
Yeah, I could see that.
but that can actually be dangerous.
Really? Why is that?
Rapid rewarming can shock the system
Okay.
and lead to heart problems.
Got it.
It's much safer to warm someone up slowly
Right.
using blankets or warm compressors.
Okay, so slow and steady wins the race
Exactly.
when it comes to rewarming someone with hypothermia.
Now, as hypothermia progresses to a severe stage, things get even more serious.
Right.
The person might become unconscious.
Right.
Their breathing and heart rate will slow down drastically,
Wow.
and their pupils might become dilated.
So it sounds like recognizing the different stages of hypothermia
It is.
is crucial for determining the right course of action.
Absolutely. Early recognition and treatment are essential
Okay.
for preventing serious complications.
All right, so we've covered the extremes of hot and cold.
We have.
What about those hazards that are a bit more unique
Yeah.
to Canada's diverse geography?
Okay.
We talked about altitude sickness,
Mm-hmm.
but I'm curious to learn more about what actually happens in the body when someone experiences it.
You're right. Altitude sickness is something many Canadians might encounter,
Mhm.
especially those living in or visiting mountainous regions.
Right.
Here's the thing. As you ascend to higher altitudes,
Yeah.
the air pressure decreases,
Right.
meaning there are fewer oxygen molecules packed into each breath you take.
So even though you're breathing normally, you're not actually getting enough oxygen?
Precisely.
Yeah.
Your body starts to feel this oxygen deprivation.
Yeah.
And that's what triggers those classic altitude sickness symptoms.
Okay.
Headaches, nausea, fatigue.
Mm-hmm.
It's like a really bad hangover,
Right.
only without the fun part beforehand.
Yeah, that sounds awful.
It is.
And you mentioned that in severe cases, fluid can build up in the lungs or even the brain.
It's a scary thought, but it's why taking altitude sickness seriously is so important.
Yeah.
That fluid buildup, it's called edema,
Right.
and it can be life-threatening. It's like your body's plumbing system gets overwhelmed,
Okay.
and it can cause all sorts of problems.
So what can you do if you're experiencing altitude sickness?
The best remedy is actually quite simple.
Okay, what's that?
Descend.
Okay,
Get yourself to a lower altitude as quickly as possible.
so just go down.
Yeah, and remember, it's always better to ascend gradually,
Right.
giving your body time to acclimate to the thinner air.
Mm-hmm.
Think of it like this.
Okay.
You wouldn't run a marathon without training first.
That's a great analogy.
Yeah.
You need to train your body for altitude,
Right.
just like you would for any other physical challenge.
Exactly.
Now, what about diving accidents?
Okay.
We briefly touched on decompression sickness, or the bends,
Right.
but I'm curious to learn more about what actually causes it.
Well, you know how when you open a bottle of soda that's been shaken,
Yeah.
all the bubbles rush to the top?
Right.
Decompression sickness is kind of like that.
Okay.
When you're diving, your body absorbs nitrogen from the air you breathe.
Right, and the deeper you go, the more nitrogen your body absorbs, right?
Exactly. It's all about pressure.
Oh,
The deeper you dive,
yeah.
the higher the pressure.
Right.
And the more nitrogen gets dissolved into your tissues.
Okay.
Now, if you come up too quickly,
Yeah.
that nitrogen doesn't have time to escape your body safely,
Mm-hmm.
and it forms bubbles.
And those bubbles are what cause the problems?
Precisely.
Okay.
Those nitrogen bubbles,
Mm.
they can block blood vessels,
Yeah.
damage tissues,
Okay.
and cause all sorts of havoc in your body.
Wow.
That's why it's crucial to ascend slowly from a dive,
Mm.
making those safety stops
Yeah.
to let the nitrogen gradually diffuse back out of your system.
So it's not just about holding your breath.
It's not just about holding your breath, no.
It's about giving your body time to adjust
Yep.
to the changing pressure.
Absolutely.
Yeah.
It's a bit like letting the air out of a balloon slowly,
Okay.
so it doesn't pop.
Right.
You have to be gradual and controlled.
No, we can't talk about water safety
Right.
without revisiting the topic of drowning.
Yeah.
I remember you mentioned that it can happen even in shallow water,
It can.
which is a sobering thought.
It's something people often don't realize. You
Mm.
don't have to be in the middle of the ocean to drown.
Right.
It can happen in a bathtub,
Yeah.
a swimming pool,
Okay.
even a small pond.
So it's not just about the depth of the water, it's about being able to breathe.
Exactly. Drowning is all about what happens when water blocks your airway and
Mhm.
prevents oxygen from getting to your lungs and brain.
And I remember you said there are actually two types of drowning,
Yes.
wet and dry.
Wet and dry. That's right.
Can you explain those a bit more?
Sure. Wet drowning is what most people think of when they hear the word drowning.
Right.
It's when water enters the lungs,
Yeah.
and it's often accompanied by coughing and sputtering.
So it's pretty obvious when someone is experiencing wet drowning.
Usually.
But
Yeah.
dry drowning is a bit more subtle.
Right.
Mm.
It happens when water triggers a spasm in the vocal cords, which closes off the airway.
So even though water isn't entering the lungs,
Yeah.
the person still can't breathe.
Exactly. It's like a reflex
Wow.
that's meant to protect the lungs from aspirating water,
Right.
but it ends up blocking the airway altogether.
That's terrifying. So someone experiencing dry drowning might not even be coughing or sputtering?
They might not.
Okay.
They might just look like they're struggling to breathe.
Mhm.
Their chest might be heaving,
Okay.
and they might have a panicked look on their face.
So it's crucial to pay attention to any signs of breathing difficulty, even if it doesn't look like the classic drowning scenario.
Absolutely. Early recognition is key in drowning cases.
This has been an incredibly eye-opening discussion so far.
Yeah.
We've covered so much ground,
We have.
and I'm starting to feel like I have a much better understanding
Yeah.
of the different types of environmental emergencies
Right.
and
Yeah.
what makes them so dangerous.
That's great to hear.
Yeah.
And, even though we've talked about each of these hazards separately,
Mhm.
it's important to remember that they can often overlap.
Okay.
For example, someone who's experiencing hypothermia
Right.
might also be at risk for drowning.
Right.
Or someone with heat stroke might become dehydrated and disoriented,
Yeah.
which could lead to other accidents.
That's a really important point.
It is.
It's not always a clear-cut, one hazard at a time situation.
It's about understanding the bigger picture and
Yeah.
being aware of how different environmental factors can interact with each other and with your body's own responses.
So with all this knowledge we've gained,
Yeah.
what can we do to actually apply it in real-life situations?
All right.
How can we use this information to stay safer and be better prepared?
That's the million-dollar question.
Yeah.
And it's something we'll delve into in the next part of our deep dive.
Okay.
We'll talk about practical strategies for preventing these emergencies,
Right.
recognizing those early warning signs, and providing basic first aid until help arrives.
Welcome back to our deep dive on environmental emergencies.
It's good to be back.
We've spent the last two parts talking about all the ways things can go wrong
Mm-hmm.
when we're out exploring our amazing Canadian landscape.
Yeah, all the risks out there.
But now, let's flip the script
Right.
and focus on what we can do to stay safe.
That's the empowering part. It's
Yeah.
not just about the doom and gloom.
Exactly.
It's about taking control.
It's all about turning knowledge into action.
Right.
So where do we even start?
Well, the first step is actually pretty simple.
Yeah.
Know your limits.
Okay.
Are you planning a big, challenging hike in the mountains?
Yeah.
A multi-day canoe trip?
Mm-hmm.
A scuba diving adventure?
Okay.
Be honest with yourself about your physical abilities
Right.
and your experience level.
Yeah,
Don't bite off more than you can chew,
it's true.
especially when it comes to dealing with Mother Nature.
That's such good advice.
Yeah.
It's easy to get caught up in the excitement of an adventure and
Yeah.
totally overestimate what we're capable of.
Absolutely. And it's not just about physical limits.
Right.
It's about mental preparedness as well.
Okay.
Anxiety, stress, even fatigue can cloud your judgment
Yeah.
and make you more susceptible to making mistakes.
Right.
So go into any outdoor activity well-rested,
Oh.
mentally prepared,
Mm-hmm.
and with a realistic understanding of the challenges you might face.
So know your limits,
Yeah.
be mentally prepared.
Mm-hmm.
What else can we do to kind of stack the odds in our favor?
This one might sound obvious, but it's
Uh-huh.
worth repeating.
Right.
Check the weather forecast.
Yeah, of course.
And don't just rely on that general overview.
Right.
Dive deeper.
Okay.
Look for specific forecasts for the area that you'll be in, factoring in things like elevation changes and microclimates.
Yeah.
A sunny day at the base of a mountain
Right.
can quickly turn into a blizzard at the summit.
It's true. I've been caught in those sudden mountain weather shifts before.
Yeah.
And it is no joke.
It's amazing how quickly things can change.
It really is.
And once you know what the weather might throw at you,
yeah,
pack accordingly.
right.
Layering your clothing is key.
Okay.
So you can adjust to those temperature fluctuations.
Mm-hmm.
Invest in good quality waterproof and windproof gear,
Yeah,
even if you don't think you'll need it.
right.
You know, it's better to have it and not need it
Yeah.
than need it and not have it.
That's the motto of every seasoned camper I know. Be prepared.
Be prepared.
Speaking of preparedness,
Yeah.
what about essential gear?
Right.
What are some of those must-haves for any outdoor adventure?
Well, a first aid kit is non-negotiable.
Okay.
Make sure it's well stocked with the basics, bandages, antiseptic wipes,
Right.
pain relievers,
Right.
and any personal medications that you might need.
Okay, good point.
A map and compass are also crucial.
Yeah.
Even if you think you're familiar with the area,
Right.
you know, phones die.
Yeah.
GPS signals can be unreliable.
Right.
So having those old school navigation tools can be a real lifesaver.
I'm a bit old school myself when it comes to navigation.
Yeah.
I still love the feeling of, like, orienting myself with a map and compass.
Oh, it's a great skill to have.
It's like a little puzzle to solve.
And don't forget about food and water.
Right, of course.
Packed more than you think you'll need,
Okay.
especially if you're going into more remote areas or if the weather is unpredictable.
Yeah.
You never know when you might get delayed or have to spend an unexpected night outdoors.
Okay, so we've got our gear sorted.
Mm-hmm.
What about specific strategies for dealing with some of the hazards we talked about?
Yeah.
Let's start with cold weather.
Okay.
Any tips for staying warm and preventing hypothermia?
Staying dry is paramount when it comes to cold weather safety.
Go.
Wet clothing loses its insulating properties.
Right.
So if you get wet, change into dry clothes as soon as possible.
Okay.
Keep your head, hands, and feet covered, as those are the areas where you lose heat most rapidly and fuel your internal furnace with regular snacks and warm drinks.
That makes sense.
Yeah.
It's like keeping a fire going. You need to keep feeding it fuel to keep those flames burning.
Exactly. And just like with a fire,
Yeah.
don't let those early warning signs of hypothermia go unnoticed.
Okay.
If you or someone you're with starts shivering uncontrollably,
Mm-hmm.
seems confused or disoriented,
Right.
or has slurred speech,
Okay.
it's time to take action.
Got it.
Get out of the cold,
Mm-hmm.
remove wet clothing,
Okay.
and start that rewarming process gradually.
So stay dry, fuel up.
Yeah.
Pay attention to the warning signs.
Right.
What about heat stroke?
Okay.
How can we stay cool and hydrated in those scorching summer months?
Hydration is key.
Okay.
Drink plenty of water throughout the day, even if you don't feel thirsty.
Okay.
Avoid sugary drinks and alcohol,
Yeah.
as those can actually dehydrate you.
Right.
Dress in loose-fitting, light-colored clothing that allows your body to breathe.
Okay.
Seek out shade whenever possible and take frequent breaks from any strenuous activities.
So it's all about being proactive and listening to your body's cues.
Absolutely. And if you start to feel the effects of heat exhaustion,
Okay.
fatigue, dizziness, nausea, those kinds of things,
Yeah.
don't push through it.
Right.
Rest, rehydrate, and cool down immediately.
Okay.
Remember, heat exhaustion can quickly escalate into heat stroke
Yeah.
if you're not careful.
So heat stroke prevention checklist.
Yeah.
Hydrate.
Hydrate.
Dress smart.
Dress smart.
Find shade.
Fan shade.
Take breaks.
Go to the sea.
Take breaks. Okay.
Any tips for acclimatizing to those thinner air conditions?
As we discussed earlier, ascending gradually is the best way to prevent altitude sickness.
Mm-hmm.
Give your body time to adjust to those lower oxygen levels.
Right?
Stay hydrated.
Mm.
Eat a balanced diet.
Okay.
And avoid alcohol and caffeine, as those can actually worsen symptoms. And if someone does start experiencing altitude sickness,
Yeah.
what's the best course of action?
The most effective treatment is to descend to a lower altitude.
Okay.
It might be disappointing to cut your trip short,
Yeah.
but it's much better to play it safe
Right.
and give your body the time it needs to recover.
So it's all about respecting the power of altitude
Yes.
and not pushing yourself beyond your limits.
Exactly. Now let's talk about water safety.
All right.
We've already covered a lot of ground on drowning prevention.
Yeah.
But what are some key takeaways
Yeah.
for staying safe in and around water?
Well, I know never swimming alone is a big one.
It is.
You know, it's always best to have a buddy system in place.
That's excellent advice.
Yeah.
Never swim alone
Right.
and always supervise children around water.
Of course.
Even if they're strong swimmers,
Hmm.
accidents can happen in an instant,
That's true.
And never overestimate your own swimming abilities.
Okay.
Cold water,
Right.
strong currents, hidden hazards can quickly turn a fun swim into a dangerous situation.
So it's about being aware of the potential risks and not getting complacent even in familiar waters.
Right. And if you're boating or paddling,
Yeah,
always wear a life jacket.
right.
It's the law for a reason.
And even strong swimmers can get into trouble,
Yeah,
especially if they're caught off guard by unexpected conditions.
absolutely. It's about having that extra layer of protection,
Yeah.
just in case.
Okay, so we've covered a lot of ground today.
We have.
We talked about the risks,
Mhm.
the warning signs,
Yeah.
and now we've explored some really practical strategies for staying safe
Right.
in all sorts of environmental conditions.
Absolutely.
This has been an incredible deep dive
Yes.
into a topic that's so relevant to our lives here in Canada.
Yeah, for sure.
It really is.
And it all boils down to this,
Yes.
respecting the power of nature.
Yeah.
Preparing ourselves for the challenges it might throw at us
Uh-huh.
and being aware of our own limitations.
I couldn't have said it better myself.
Yeah,
Knowledge really is power,
it is.
and it comes to environmental safety.
Absolutely.
So thank you so much for joining us
Yeah, thanks for having me.
on this deep dive.
It's been fun.
We hope you found it informative and empowering.
Mm-hmm.
Stay curious.
Stay curious.
Stay prepared.
Stay prepared.
And stay safe out
yeah.
there.
Be safe, everyone.
Welcome to the Deep Dive. Today, we're going to be diving into the world of geriatric care.
Oh, that's fascinating.
We've got a chapter from a medical textbook on
Right.
geriatrics
Huh.
and 2 case studies.
Okay.
And I think it's going to be really interesting to kind of see how
Yeah.
these things work together.
Yeah.
So much of what we talk about on this show is high-level stuff.
Yeah.
But when you get down to the nitty-gritty of
Right.
what healthcare providers are actually dealing with
Yeah.
with patients, it gets really interesting.
Absolutely. I think, what's really interesting about geriatric care is how aging can be so individual.
Yeah.
What might seem like a straightforward issue in a younger person can become like a multi-layered puzzle in an older adult.
That's such a good point.
Yeah.
The textbook actually starts with the line, "The gradual progression of age is a complicated process."
Right.
It's like they knew we were going to be doing a deep dive on this.
Yeah.
And then goes on to talk about how aging itself can actually obscure underlying health problems.
Absolutely.
And then on top of that, medications can have this ripple effect on symptoms.
Right. Right. And that's why, in geriatric care, you can't just treat the most obvious symptom.
Right.
You have to really look at the whole picture. It's kind of like detective work, piecing together all these different factors to get to the root of the problem.
Okay, I'm already hooked. Let's get to the case studies.
Okay.
So the first one is called Clarence,
Okay.
and it paints a really vivid picture. Imagine you're called to help an elderly man who collapsed
Yeah.
while making lunch on a freezing winter day.
Okay.
So you get there,
Yeah.
and Clarence is conscious but weak, a little disoriented.
Often it's these everyday activities that become incredibly risky for older adults, Their bodies just don't have the same reserves they used to.
That's so true.
Just a simple task like making lunch can become dangerous.
And in his
Sure.
case, he's got a pretty packed medical history. He's on nitroglycerin, digoxin, hydrochlorothiazide, a whole bunch of medications.
Wow.
And it turns out that his collapse was probably due to a sudden drop in blood pressure,
Okay.
likely caused by a combination of those medications.
It's a classic example of what we call polypharmacy, when a patient is on multiple medications,
Right.
incredibly common in older adults.
Yeah.
But as Clarence's case shows, it can have some really serious consequences.
This polypharmacy thing sounds like a huge deal.
It is.
And the textbook doesn't really hold back on the potential dangers either. It mentions drug interactions,
Right.
unexpected side effects,
Mm-hmm.
and just the sheer difficulty some patients have keeping track of all those pills and dosages.
You might be surprised to learn that even over-the-counter medications can contribute to dangerous interactions in
Yeah.
older adults. It's not just prescription drugs we need to be aware of.
Wow, I hadn't even considered that.
Yeah.
So regular medication reviews are really crucial for these patients.
Oh, absolutely. It's about finding that balance,
Yeah.
effectively managing their conditions while also minimizing the risks. Sometimes simplifying that medication regimen can make a world of difference.
Yeah, that makes a lot of sense.
Yeah.
Okay, on to case study number 2, the confused woman.
Okay.
This one takes us to a busy shopping mall
Uh-huh.
where an elderly woman is walking in and out of traffic, clearly disoriented.
Oh, wow.
Her blood pressure is high, pulse is racing, but there's no information about her medical history.
So this scenario immediately makes you think about potential cognitive impairment. But
Right.
without that medical history, it's like navigating a maze in the dark.
Right.
You know, you have to be extra cautious.
You're working with limited information.
Right.
So what could be happening here? The case study mentions dementia, delirium,
Yeah.
or even medication-related issues as possibilities.
All on the table, and it's important to tease them apart. Dementia, as the textbook explains, is this long-term progressive decline in cognitive function.
Right.
It's not a normal part of aging.
Right, and it's interesting because they make a distinction between dementia and delirium.
Right.
So dementia is this long-term,
Yeah.
gradual decline.
Right.
But delirium, that's different, right?
Exactly. Delirium comes on quickly,
Okay.
often within hours or days, and it can fluctuate.
Yeah.
It's usually triggered by something specific like an infection, medication side effect, or even just a change in environment. And the good news is
Okay.
it's often reversible if you can pinpoint and address that underlying cause.
I see. So both of these cases really highlight the importance of being super observant,
Absolutely.
especially with those like subtle signs of cognitive impairment, whether
Yeah.
it's dementia or delirium.
A thorough assessment is crucial in geriatric care, considering everything from their medical history and medications
Yeah.
to any recent changes in behavior or environment. It's like putting together a jigsaw puzzle.
Before we jump into the specifics of dementia and delirium, the textbook also talks about how aging impacts the body in general.
Yeah.
I think it'd be helpful to touch on that first.
Yeah, good idea. The textbook explains how aging affects pretty much every system in the body,
Right.
from the cardiovascular system to the way our brains function.
So it's not just about wrinkles and gray hair.
No, these are fundamental changes happening beneath the surface.
Yeah.
For instance, our blood vessels become less elastic as we get older,
Right.
which contributes to higher blood pressure.
Yeah.
And our brains naturally change over time,
Mhm.
sometimes leading to memory problems or difficulty with thinking clearly.
The textbook also emphasizes that medications can affect older adults differently than younger people.
Oh, that's a really important point to remember.
Yeah.
Our bodies process medications differently as we age.
Yeah.
Our organs might not be as efficient at breaking down and eliminating those drugs,
Right.
which can increase the risk of side effects,
Mhm.
even with common medications.
Wow. So it's this delicate balance, between managing their conditions and then also being mindful of how their bodies are processing these medications.
And that's why starting with lower doses and carefully monitoring for any reactions is so important in geriatric care. It's not a one-size-fits-all approach.
This makes me think about how crucial communication is in geriatric care.
Yes.
If a patient is experiencing confusion
Yeah.
or disorientation,
Yeah.
they might not be able to clearly explain
Right.
their symptoms.
Absolutely. It's about building rapport and trust.
Yeah.
So patients feel comfortable sharing what they're experiencing,
Yeah.
even if they can't articulate it perfectly.
Right.
Sometimes observing their behavior and nonverbal cues
Yeah.
can be just as important as what they're able to tell you directly.
It's like you're putting together this puzzle
Yeah.
using every piece of information you can gather.
And that brings us back to those two conditions we were discussing, dementia and delirium.
Right.
These are two diagnoses that often come up in geriatric care. And it's so important to understand how they differ.
Okay, so let's dive into those definitions from the textbook. It says, dementia is a chronic and progressive decline in cognitive function
Yes.
that interferes with daily life.
Right. And delirium is defined as a sudden disturbance in mental abilities
Well,
that results in confused thinking and reduced awareness of the environment.
so dementia is this gradual decline,
Right.
while delirium is more like a sudden
Exactly.
shift in mental state.
If we can figure out what's causing it
Right.
and address that underlying issue.
And the textbook also digs into the potential causes of each condition. It says the most common cause of dementia is Alzheimer's disease,
Right.
but there are other types
Mm-hmm.
like vascular dementia, which happens when there's damage to the blood vessels in the brain.
And with delirium, the triggers can be incredibly diverse. Infections, medication side effects, dehydration, even changes in surroundings can all bring it on.
So it sounds like early recognition is key for both dementia and delirium.
Absolutely.
The sooner you catch it,
Yes.
the better the chances of managing it effectively.
Early detection and intervention can make a huge difference.
Okay, let's do a quick recap.
Mm.
We've talked about the complexities of geriatric care,
Uh-huh.
the importance of a thorough assessment,
Yeah.
and the potential dangers of polypharmacy.
We've also touched on the challenges of communication.
Right.
And the need to be sensitive to the unique needs of older adults.
Yeah.
It's about seeing them as individuals, not just a collection of symptoms.
Before we wrap up this part of our deep dive,
Yeah.
I'd like to revisit those 2 case studies
Okay.
and kind of apply what we've learned about dementia and delirium.
Sounds good.
So let's start with Clarence,
Okay.
the man who collapsed while making lunch. He was on multiple medications,
Yes.
experiencing hypotension.
His case is a perfect example of how polypharmacy can create this cascade of issues, you know?
Yeah.
Those medications might have interacted in a way that caused his blood pressure to drop,
Right.
which in turn could have triggered delirium.
But it's not just the direct effect of the drugs themselves.
Right.
It's how they work together
Yeah.
within his aging body.
It highlights the need for constant vigilance when prescribing medications for older adults, taking into account those potential interactions and side effects.
Now, with the confused woman
Yeah.
who was wandering in the mall,
Yeah.
her case seems to fit the classic picture of delirium, right?
It's just a strong possibility. But remember, we don't have her full medical history.
Right.
It's possible she was experiencing an episode of delirium on top of underlying dementia.
Right.
We simply don't have all the pieces of the puzzle.
Which emphasizes how crucial
Yes.
a comprehensive assessment is.
Absolutely. We need as much information as possible to determine the most likely cause of those symptoms and come up with an effective plan of care.
And that assessment should include everything from their medication history
Right.
to their behavior and environment.
Exactly. You have to look at the big picture,
Yeah.
not just the isolated incident.
Well, that brings us to the end of part 1 of our deep dive into geriatrics and polypharmacy.
Okay.
We've covered a lot of ground,
Yeah.
but there's still much more to explore.
Looking forward to it.
In the next part, we'll delve into strategies for managing polypharmacy,
Okay.
including medication reconciliation
Yes.
and the concept of deprescribing. It's a fascinating area with a lot of potential
Yeah.
to improve patient care.
I'm sure.
Stay tuned. This journey into the world of geriatric care is just beginning.
All right. Welcome back to our deep dive into geriatrics and polypharmacy.
I'm ready for more.
Before we get to those management strategies,
Great.
I think it's worth revisiting a point we made earlier.
Okay.
The way medications can interact in older adults is truly fascinating.
You mean that synergistic effect
Yeah.
where multiple medications can create a much bigger impact than any single drug would on its own?
That's it.
Yeah.
As we age, our bodies become more sensitive to medications,
Right.
and those interactions can become incredibly complex.
Wow.
It's like a domino effect, where one change triggers another,
I see.
which makes diagnosis and treatment that much more challenging.
So it's not just about the sheer number of medications.
Right.
It's about how they work together
Exactly.
and how they impact the aging body as a whole.
The whole picture.
Yeah. There's a lot to keep track of.
It really is.
Wow.
Imagine a patient taking a diuretic for high blood pressure
Okay.
and also an antihistamine for allergies.
Uh-huh.
Individually, these drugs might be fine,
All right.
but together they can significantly increase the risk of dizziness and falls,
Oh, wow.
especially in someone who's already a bit unsteady on their feet.
That's a great example.
Yeah.
It really shows how those seemingly harmless medications
Right.
can have these unexpected consequences when combined.
Absolutely.
It's a reminder that we need to be extremely careful
We do.
when prescribing medications for older adults,
Yeah.
considering not only the intended effects,
Right.
but also those potential interactions and side effects.
You got it.
So how do we manage polypharmacy effectively?
Uh-huh.
Is there like a secret?
It's a multifaceted approach.
Okay, so walk us through it.
Sure.
What are the key strategies?
Well, the first step is what we call medication reconciliation.
Okay,
Essentially, it's a thorough review of all the medications a patient is taking.
got it.
Not just prescription drugs, but over-the-counter medications and even herbal supplements.
Is that everything?
We need the full picture.
Like taking inventory.
Exactly.
Everything that's going into their system.
And during this process,
Yeah.
we're looking for any red flags,
Okay.
potential drug interactions duplications or medications that might not be necessary anymore.
It seems like this would involve a lot of communication,
It does.
not just with the patient,
Right.
but with their family as well.
Absolutely. It's essential to get everyone on the same page,
Yeah.
gathering information about their medication history,
Hmm.
any allergies or past reactions they've had,
Right.
and even their understanding of why they're taking each medication.
So it's a real team effort.
It is. It's a
Yeah.
collaborative effort.
It's not just about checking off boxes.
Yeah.
It's about having these
Right.
meaningful conversations to ensure the patient is informed and involved in their care.
Exactly.
And once we have a clear understanding of their current medication regimen,
Right.
we can move on to the next step,
Yeah.
deprescribing.
Deprescribing.
That sounds a bit counterintuitive.
I know, right?
Yeah.
But it's essentially the process of carefully and thoughtfully reducing or stopping medications that might not be doing any good or
Right.
might even be causing harm.
So it's about finding that balance again,
It is.
making sure they're getting the benefits without unnecessary risk.
You got it.
Yeah.
And deprescribing is a delicate process.
Right.
It requires careful consideration of their individual situation,
Of course.
their medical history, the potential risks and benefits of each medication.
Mhm.
It's not a decision to be made lightly.
I imagine it also takes patience,
It does.
both from the healthcare provider and the patient.
Absolutely. It's not always a quick fix.
Right.
It might involve gradually tapering down doses,
Okay.
monitoring for any changes in symptoms,
Mm-hmm.
and adjusting the plan as needed.
Yeah.
It's an ongoing process.
It sounds like it's all about working together,
It is.
finding the best approach for their individual needs.
That's exactly right. The goal is to optimize their medication therapy
Yeah.
to improve their quality of life while minimizing potential harm.
So we've talked about medication reconciliation and deprescribing.
Right.
What other strategies do you use to manage polypharmacy?
Well, one important aspect is simplifying the medication regimen as much as possible.
Okay.
This might involve using combination pills instead of multiple separate medications,
Right.
choosing medications that can be taken once a day instead of multiple times,
Yeah.
and providing clear, easy-to-understand instructions,
Yeah.
anything that makes it easier for the patient to manage.
It's about setting them up for success.
Exactly.
Yeah, making it as straightforward as possible
Right.
for them to adhere to their medication schedule.
Exactly. And speaking of adherence,
Yeah.
we also need to address any barriers that might be preventing them from taking their medications as prescribed.
What kind of barriers are we talking about?
Oh, it could be anything.
Okay.
From difficulty opening pill bottles
Right.
to cognitive impairment that makes it hard to remember doses,
Mm-hmm.
even financial constraints if they're struggling to afford their prescriptions.
Right.
We need to take all of this into account.
It sounds like it's about being proactive,
It is.
asking the right questions
Yeah,
to understand the challenges they might be facing.
absolutely. And then working with the patient and their family to find solutions,
Mm-hmm.
whether that's using pill organizers, providing reminders, or connecting them with resources to help cover the cost of medications.
It's about meeting them where they are.
It is.
Yeah, it really highlights how important
Yeah,
a holistic approach is in geriatric care.
that's a great point.
Yeah.
We can't just focus on the medical aspects. We
Right.
need to consider the whole person,
The whole person.
their physical, mental, and social well-being.
It's about recognizing that their needs are often complex
They are.
and that it takes a team effort to provide the best possible care.
Exactly.
And that team can include
Oh, it can include physicians, nurses, pharmacists, social workers, physical therapists,
wow,
even family members.
everyone's involved.
Everyone plays a role.
It circles back to that need for empathy and patience that we talked about earlier.
Yes,
It's about approaching geriatric care with a deep understanding
it
of
is.
the unique challenges older adults face.
Couldn't agree more.
Yeah.
And it's about building those strong relationships with our patients. Relationships built on trust, respect, and open communication.
Okay, so we've covered a lot of ground on polypharmacy.
Ye have.
Now, I'd love to revisit Clarence and the confused woman from our case studies
Okay,
and see how these concepts play out in their situations.
let's do it.
So Clarence was on a cocktail of medications,
He was.
including nitroglycerin, digoxin, and hydrochlorothiazide.
Right.
His case was a classic example of how polypharmacy can lead to adverse events like hypotension.
Absolutely. And it underscores the importance of regularly reviewing the medications of older adults,
Right.
considering those potential interactions and side effects.
Hmm.
Something as simple as a medication review could have made a huge difference in his case.
So with Clarence,
Yeah.
a medication reconciliation and deprescribing process might have helped identify any problematic medications
It might have.
and potentially reduce his overall medication burden.
Exactly. It's possible that some of his medications could have been safely discontinued
Okay.
or the dosages adjusted to lower the risk of hypotension. It's about fine-tuning the regimen to meet his individual needs.
And what about the confused woman?
Yeah.
How did these discussions about polypharmacy and cognitive impairment apply to her situation?
Well, we don't have her medication history,
Yep.
so we can't definitively say whether polypharmacy was a factor in her disorientation and confusion.
But it's certainly a possibility,
It is.
especially given that medications can sometimes trigger delirium in older adults.
It's definitely something to consider,
Yeah.
especially when you're dealing with an older patient who is presenting with cognitive impairment. It
Right.
should always be on your radar.
So even though we don't have the complete picture with her,
Right.
it serves as a reminder that polypharmacy is a prevalent issue in geriatric care,
It is.
and it can have a significant impact on cognitive function.
Absolutely.
Yeah.
It really highlights the need for careful medication management in this population.
Mm-hmm.
It's about finding that balance between managing their conditions and minimizing potential harm.
Okay, let's shift gears a bit and delve into the textbook's discussion of dementia and delirium.
Okay.
I think it would be helpful to unpack those definitions in more detail.
Sounds good.
So the textbook defines dementia as a chronic and progressive decline in cognitive function that interferes with daily life.
Right.
It emphasizes that dementia isn't a normal part of aging,
No, it's not.
and it's caused by a variety of factors,
Mm-hmm.
the most common being Alzheimer's disease.
Right?
So it's a gradual decline in cognitive abilities
Yes.
that eventually impacts a person's ability to function independently.
That's right. And the symptoms of dementia can vary widely
Okay.
depending on the underlying cause and the stage of the disease.
What are some of the most common symptoms?
Well,
What should we be looking out for?
in the early stages,
Yeah.
people with dementia might experience memory problems,
Oh.
difficulty finding words,
Mm-hmm.
and changes in mood or personality.
It's interesting.
It's often subtle at first.
And as the disease progresses,
Yeah.
those symptoms become more pronounced.
Exactly. They might have trouble with tasks they used to do easily,
Okay.
like cooking or managing their finances.
Right.
They might get lost in familiar places or
Sure.
have difficulty following conversations.
It's heartbreaking.
It is.
This disease takes such a toll on both the individual and their family.
It does. And while there's no cure for dementia,
Right.
there are medications and therapies that can help manage the symptoms and improve quality of life.
Okay.
Even small improvements can make a big difference.
Okay, now let's talk about delirium.
Sure.
The textbook defines it as a sudden disturbance in mental abilities that results in confused thinking and reduced awareness of the environment.
Right.
So delirium is characterized by its rapid onset
Yes.
and fluctuating course.
Exactly.
Symptoms can come and go throughout the day,
You can.
and the person might seem disoriented and confused one moment
Right.
and then completely lucid the next.
Exactly.
That sounds incredibly frightening,
It can be.
both for the person experiencing it
Yeah.
and for those around them.
People with delirium might have trouble focusing their attention. They might hallucinate,
Wow.
and they might become agitated or restless.
So how is delirium different from dementia?
Okay.
What are the key distinctions?
The main difference is that delirium is usually temporary and reversible,
Okay.
whereas dementia is a progressive and irreversible condition.
But I imagine the symptoms can overlap,
They can.
which could make it difficult to tell them apart.
We're right.
Yeah.
The symptoms can be similar. However, there are a few clues that can help us differentiate between the two.
For example, that
Mm.
sudden onset and fluctuating course of symptoms
Yes.
is more characteristic of delirium.
Exactly. And while dementia typically develops gradually over months or years,
Right.
delirium can come on within hours or days.
Wow. Yeah.
It's much more rapid.
The textbook also mentions that delirium is often triggered by an underlying medical condition or by certain medications.
Absolutely.
So infections, dehydration, electrolyte imbalances,
Yeah.
and medication side effects.
Right.
These are some of the most common culprits.
They are.
So if you can identify and treat the underlying cause,
Mhm.
delirium should clear up.
Precisely.
That's why it's so important to conduct a thorough medical evaluation
It is.
when an older adult presents with cognitive impairment.
Yes.
You have to rule out any potential medical causes.
Yeah, absolutely.
Okay, let's bring this back to our case studies.
Sure.
Do you think Clarence could have been experiencing delirium
It's possible.
in addition to the hypotension?
It's definitely possible.
Yeah.
His disorientation and weakness could have been symptoms of delirium
Right.
triggered by his medications or even by the hypotension itself.
Yeah.
It's hard to say for sure without more information.
And The confused woman,
Yes,
her case seems like a textbook example of delirium.
it does.
The sudden confusion,
Yeah.
disorientation, and
Uh.
wandering behavior, it all fits.
It's a reasonable assumption, but again,
Yeah.
without knowing her medical history,
Right.
we can't rule out the possibility of underlying dementia.
Right.
She could have been experiencing an episode of delirium on top of a pre-existing condition.
Both cases really illustrate how complex can be
They do.
to diagnose and manage cognitive impairment in older adults.
Yes.
It's not always clear-cut.
That's why it's so important to be thorough in our assessments, to consider all the possible causes,
Right.
and to work closely with patients and their families to provide the best possible care.
Well, we've covered a lot of ground in this deep dive.
We have.
We've explored the challenges of polypharmacy and the importance of recognizing and managing cognitive impairment.
Absolutely.
We've also discussed the need for a holistic and empathetic approach to geriatric care.
Yes.
It's about seeing the whole person,
It is.
not just their age or their medical chart.
Couldn't agree more.
Before we wrap up this part, I want to go back to the textbook's discussion of the aging process itself.
Sure.
It emphasized how aging impacts every system in the body,
It does.
making older adults more vulnerable to a wide range of medical conditions.
That's such a crucial point. As
Yeah.
healthcare providers,
Yeah.
we need to have a deep understanding of these age-related changes
Right.
and how they can impact our approach to diagnosis and treatment.
For example, the textbook talked about how the cardiovascular system changes with age,
Yes.
leading to decreased cardiac output and increased blood pressure.
Right. And it also highlighted the changes in the respiratory system that make older adults more susceptible to pneumonia and other infections.
Wow.
Their immune systems just aren't as robust as they used to be.
It also discussed how aging affects the musculoskeletal system,
It does.
leading to decreased bone density and muscle mass, which increases the risk of falls and fractures.
Right.
Those everyday activities can become much more dangerous.
Absolutely. And we can't forget the changes in the genitourinary system,
Right.
which can lead to urinary incontinence and other issues.
It's really about recognizing that aging affects the entire body.
It does.
Yeah.
It's a whole body process.
All of these changes emphasize the need for a comprehensive geriatric assessment.
Yes, they do.
One that takes into account the individual's overall health,
Right.
their functional abilities, and their social support system.
Exactly. We need to look beyond the presenting problem
Right?
and consider the whole person,
The whole person.
recognizing that older adults often have multiple coexisting medical conditions.
And we need to be mindful of the potential for atypical presentations of illness in older adults.
Absolutely.
Yeah.
What might look like a classic heart attack in a younger person
Right.
could manifest as confusion or weakness in an older adult.
Oh,
Their bodies just don't always respond in the same way.
So it's about being aware of those subtle signs and symptoms
It is.
and being proactive in our approach to care.
Exactly. And that includes being vigilant about polypharmacy
Right.
and its potential impact on older adults. It's a thread that runs through so much of geriatric care.
Okay. I think we've covered a lot of important ground,
We have.
but there's one more crucial concept from the textbook that I want to touch on:
Okay.
the ethical considerations in geriatric care.
Uh-huh.
I feel like this is something that often gets overlooked.
It's incredibly important.
Yeah.
The textbook stresses the importance of respecting the autonomy and dignity of older adults and making sure they have a say in their care decisions.
So that means having open and honest conversations with them about their treatment options
Yes, it does.
and ensuring they understand the risks and benefits of each choice.
Right.
It's about empowering them to make informed decisions.
Exactly. And it also means being sensitive to their cultural beliefs and values.
Yeah.
And respecting their right to make decisions that align with their wishes,
Right.
even if those decisions might differ from what we would choose for ourselves.
Yeah. The textbook also discusses the importance of advocating for older adults
It does.
and protecting them from elder abuse and neglect.
Yeah,
That's a heavy but necessary topic.
absolutely. We have a responsibility to ensure that our patients are safe
Right.
and that their basic needs are being met.
Yeah.
If we suspect that an older adult is being mistreated,
Yeah.
we have a legal and ethical obligation to report it to the appropriate authorities.
A tough situation,
It is.
but you have to do the right thing.
We can't turn a blind eye to these situations.
All of these ethical considerations really underscore the importance of treating older adults with compassion, empathy, and respect.
Couldn't agree more.
Yeah.
It's about recognizing their inherent worth and dignity
Hmm.
and ensuring they receive the care and support they deserve.
Absolutely.
They've contributed so much to our society,
Yeah.
and it's our turn to care for them.
Well, I think that brings us to the end of part 2 of our deep dive into geriatrics and polypharmacy.
Okay.
We've covered a lot of ground,
Yeah.
but we're not done yet.
No, we're not.
In the next and final part,
Yes.
we'll wrap up our discussion,
Yep.
focusing on the challenges and rewards of caring for older adults
Sounds good.
and some key takeaways for our listeners.
I'm looking forward to it.
Stay tuned.
Okay.
There's still much more to explore in the fascinating world of geriatric care. Welcome back to the final part of our deep dive into the world of geriatrics and polypharmacy.
Yeah.
We've covered a lot of ground, from those subtle signs of distress to the ethical aspects of caring for older adults.
It's been quite a journey. I hope our listeners are starting to see just how multifaceted geriatric care really is.
I think so. We've talked a lot about the challenges, but I want to shift gears for a moment.
Yeah.
What are the rewards? What makes this field so fulfilling?
That's a question that gets to the heart of why I do what I do.
Yeah.
For me, it's the privilege of working with a population that's often underestimated.
Mm.
Older adults have a lifetime of experiences and wisdom to share, and their resilience is truly inspiring.
I love that. It's not just about treating their medical conditions. It's about honoring their lives and recognizing the value they bring.
Exactly. And there's a deep satisfaction that comes from helping them maintain their independence and quality of life.
Yeah.
Sometimes it's a small victory, like helping someone manage their medications so they can stay in their own home.
Right.
But those small victories can have such a huge impact.
It's about empowering them to live their best lives, even as they face the challenges of aging and illness.
Absolutely. And let's not forget the humor. Older adults often have this incredible wit and perspective on life. It's refreshing and often hilarious.
That's so true. They've seen it all and they don't hold back.
Exactly. So, yes, geriatric care can be challenging, but it's also incredibly rewarding. It's a field that demands a unique blend of medical expertise, compassion, and a good sense of humor.
So as we wrap up,
Mm.
what are the key takeaways for our listeners? What do we want them to walk away with today?
First and foremost, I hope they've gained a deeper appreciation for the complexities of geriatric care. It's not just medicine as usual. It requires a different approach, one that recognizes the interconnectedness of physical, mental, and social factors.
It's about seeing the whole person, not just their age or their medical chart.
Exactly. And I hope they also have a better understanding of polypharmacy and the risks it poses to older adults. It's a serious issue, but it's one that we can address with careful medication management.
What can our listeners do if they're concerned about an older adult in their life who is taking multiple medications?
The best thing they can do is encourage that person to talk to their healthcare provider. Suggest they schedule a medication review to make sure all those medications are truly necessary and that they're being taken safely.
It's never too late to start that conversation.
Absolutely. Even if they've been taking multiple medications for years, a medication review can still be incredibly beneficial.
We've talked about the complexities of geriatric care, the dangers of polypharmacy, and the importance of a holistic approach to treatment. But I think there's one more crucial takeaway: the power of empathy.
That's a great point. Empathy is at the heart of good geriatric care. It's about putting yourself in their shoes, understanding their challenges, and treating them with the respect and dignity they deserve.
It's about recognizing that aging is a natural part of life and that older adults have so much to offer.
And it's about approaching geriatric care with a sense of curiosity and a willingness to learn from our patients. They have so much to teach us.
Here's a final thought-provoking question for our listeners. How would you want to be treated as you age? What kind of care would you hope for?
It's a question we should all ask ourselves. And I hope this deep dive has equipped our listeners with the knowledge and tools they need to advocate for themselves and their loved ones as they navigate the journey of aging.
Thanks for joining us on this exploration of the world of geriatric care. It's a field that's full of challenges, but the rewards are immeasurable. Until next time, keep diving deep. Welcome back, everybody, for another deep dive.
Always exciting to dive into these cases.
Today, we're dissecting two trauma scenarios,
These are good ones.
straight from the pages of a paramedic textbook.
The ones they use to train.
Exactly.
So we're talking musculoskeletal trauma here.
That's right.
Broken bones, dislocations, the whole 9 yards.
We'll see how paramedics assess these situations.
See how they manage them in the field?
Make those critical decisions when time is of the essence.
Every second counts in trauma.
Okay, so first case, picture this.
Okay, I'm picturing.
It's a warm summer day on a farm in Ontario.
Beautiful.
Sun's shining, but inside the tractor cab, it's freezing.
What?
Yeah, the rider's been using it for horseback riding all winter.
Interesting detail.
Our patient, Laura, she's 50 years old.
Okay.
She's been knocked down by the tractor bucket.
Oh, no.
Now when the paramedics arrive, she's conscious and alert,
That's good.
airway's clear, breathing's normal.
Okay, good signs.
Strong pulse in her wrist, they call that a radial pulse.
Yeah, radial pulse, that's a key one.
A bit of blood soaking through her jeans, but honestly, her vitals.
I was going to say, those vitals sound pretty good for a tractor bucket incident.
Right, I mean,
It's deceiving, though.
exactly.
Gotta look deeper. It's like an iceberg.
Okay, so what's lurking beneath the surface?
Well, they discover she's got pain in both her upper legs,
Okay.
and digging into her medical history, she has osteoporosis.
Oh, that makes sense. Weaker bones.
Exactly, increases the risk of fractures.
And she had her gallbladder removed 10 years ago.
Cholecystectomy, they call that.
Okay, now how does that play into this situation?
Well, it might not be directly related to the injuries,
Right.
but it could influence pain management options later on.
Oh, interesting. So many factors to consider.
Trauma is a puzzle.
So the paramedics immobilize her legs.
Standard procedure.
Seems pretty difficult in a cramped tractor cab.
You're right, not the ideal location.
So how do they go about it?
They would try to stabilize her legs as best they can,
Okay.
most likely with a traction splint.
A traction splint.
Yeah, those things designed to stabilize femur fractures.
Oh, I've seen those. The ones that pull on the leg.
Exactly, helps align the bones.
So that's standard for this type of injury.
Well, there's actually some debate about traction splints.
Really?
Yeah, some studies suggest they might not always provide adequate stabilization, especially for certain types of femur fractures.
So choosing the right technique is crucial.
Absolutely crucial.
Now, after they stabilize Laura, her blood pressure and pulse increase.
The body's stress response kicking in.
Yeah, but what's the reason behind that?
Your body's suddenly dealing with injury and potential blood loss.
Even if you don't see a lot of blood.
Exactly, could be internal.
Okay.
So your heart rate increases to circulate blood faster.
To get that oxygen to where it's needed.
Right. And blood pressure rises to maintain blood flow.
To those vital organs.
Exactly, it's like overdrive.
Okay, so Laura's stable for now, but this next case,
Oh boy.
this is a whole different story.
Hit me with...
We're talking about Andre. He's 40 years old,
Okay.
and he's fallen from a drilling platform.
Oof, falls from heights, those are always scary.
And get this, he landed on a pile of his own clothing.
His own clothing.
Yeah, like, could that have actually cushioned his fall?
It's possible, but the height of that platform
Yeah, the height is the real factor.
and how he landed, that's key.
So when the paramedics get to Andre,
Okay.
he's conscious, but he's confused.
Uh-oh. Altered mental status.
That's not a good sign, right?
No, especially after a fall like that.
What does it suggest?
Could be a head injury, could be shock. It's a red flag.
And to make matters worse, he's got pain in his leg,
Okay.
his back, his arm,
Multiple areas.
and the paramedics can't find a pulse in his left wrist.
No radial pulse, that's bad news.
So what does that indicate?
Possible vascular compromise.
Meaning,
The blood flow to his hand is disrupted.
oh no.
Could be a fracture or dislocation pressing on an artery.
So if there's no blood flow,
No oxygen getting to the tissues.
is that like when you have a kink in a garden hose?
Perfect analogy. That's exactly what's happening.
Wow, no wonder that's a serious situation.
And to add another layer of complexity,
Oh, there's more.
Andre's medical history, he's got non-insulin dependent diabetes.
Okay.
He's got sciatica and takes medication for hypertension.
Oh, wow. Okay, back up a second.
Yeah.
That cold tractor cab in the first case,
With Laura.
could that have played a role in her injuries?
It's unlikely to have directly caused the fractures,
Okay.
but exposure to cold can make bones more brittle.
Especially with osteoporosis.
Exactly. Every detail matters in trauma.
I never realized how everything's so connected.
It all ties together.
So back to Andre with his diabetes.
Right.
How does that impact his care in this situation?
Well, you see, when your body goes through trauma,
Yeah.
it releases a bunch of hormones like adrenaline,
Okay.
cortisol, fight or flight.
Right.
Those hormones can raise blood sugar levels.
And that's dangerous for someone with diabetes.
Absolutely. It's a serious complication.
Wow, I never considered that.
Adds another layer of complexity to his care.
So we've got Laura with her potential complications from osteoporosis.
Right.
Andre with his diabetes. A lot to juggle.
And speaking of Andre, his vitals show an elevated heart rate.
Okay.
Elevated breathing, too.
That's just a normal pain response, though, right?
It is, but it's also The body's way of saying, hey, something's wrong.
So those elevated vitals are telling them he's in pain.
And his body's working hard to cope with the stress.
So what are their immediate priorities for treating him?
Where do they even begin?
Yeah, I mean, it seems like a lot going on.
First and foremost, scene safety.
Oh,
Got to make sure they can work safely.
right.
And Andre's not in any immediate danger.
Makes sense. Scene safety first.
Then they'll prioritize stabilizing his spine.
Why the spine?
Any fall from that height, there's a risk of spinal injury.
Oh, right. And that could be devastating.
Exactly, got to protect that spinal cord.
So after immobilizing his spine.
They'll focus on managing his pain
Okay.
and addressing that vascular compromise in his arm.
Getting that blood flow back.
Exactly, and of course they'll be monitoring his vitals.
Especially his blood sugar levels.
Absolutely, can't forget about the diabetes.
They're constantly assessing, reassessing, making adjustments on the fly.
It's a dynamic process.
And that brings up something you mentioned earlier about transport.
The transport decision.
Yeah, not every trauma case goes to the nearest hospital.
Right, got to choose the right facility for the patient's needs.
So they're considering factors like severity of injuries.
The patient's medical history, capabilities of different hospitals.
Like Andre, with his potential spinal and vascular injuries.
He'd likely need to go to a trauma center.
A specialized facility.
Exactly, equipped to handle those complex cases.
Wow, so it's not just patching them up and rushing them to the ER.
No, it's about evaluating, anticipating complications,
Choosing the best course of action.
giving the patient the best chance of recovery.
So we've got Laura with her factors, Andre with his multiple injuries and complex medical history.
Two very different cases.
It seems like every detail matters in these situations.
Every detail.
And the paramedics' knowledge, quick thinking, it can make all the difference.
It's a demanding job, that's for sure.
Well, we've covered a lot of ground already, but there's so much more to explore.
Oh yeah, just getting started.
Stay tuned for part 2 of our deep dive, where we'll take a closer look at those specific techniques and challenges involved in managing musculoskeletal trauma.
Looking forward to it.
So before we went away, we were talking about how paramedics decide where to transport their patients and how every decision is critical. But I'm curious about some of those specific techniques and challenges they face when managing musculoskeletal trauma, like you mentioned, spinal immobilization. How do they determine if that's necessary? It seems like a pretty standard procedure in most trauma cases.
Yeah, spinal immobilization, it's crucial, but it's not automatic. Paramedics consider several factors before making that call. The mechanism of injury, like a fall from a height like Andre or high-speed car accident, plays a big role. They'll also look at the patient's level of consciousness, any neurological symptoms like numbness or tingling, and of course the presence of pain or tenderness along the spine.
So it's a judgment call based on the specific situation. Better be safe than sorry when it comes to the spine. Right. Speaking of judgment calls, you mentioned vascular compromise in Andre's case. I understand that means blood flow is disrupted. But can you break that down in simpler terms for us?
Sure, think of it like a garden hose with a kink in it obstructing the water flow. That's essentially what's happening in Andre's arm. That absent pulse at his wrist suggests a blood vessel, likely an artery, is being compressed, possibly due to a fracture or dislocation.
I get it. So no blood flow means no oxygen getting to the tissues in his hand and forearm. What happens then?
Without adequate blood flow, those tissues can become ischemic, meaning they're deprived of oxygen. And if this isn't addressed quickly, it can lead to permanent damage, even tissue death.
That's pretty scary. Time is of the essence in that situation. What can the paramedics do to address vascular compromise in the field?
Well, they have a few tricks up their sleeve. Sometimes carefully manipulating the limb can restore blood flow. They might also apply traction to try and realign the bones, and pain medication can help relax muscle spasms that could be contributing to the compression.
So it's like they're constantly problem solving, trying to figure out what's going on and how to fix it all while working under immense pressure. It's a lot to juggle.
It certainly is. I remember one case similar to Andre's where the patient had a dislocated shoulder that was compressing a major artery. We tried everything we could think of to restore blood flow, but nothing seemed to work. We were racing against the clock knowing that every minute mattered.
Oh, wow. What happened?
We made the decision to try a procedure called in-field reduction, which basically means putting the shoulder back into place right there on scene. It's a risky maneuver, but in that situation, it was our best option.
Did it work?
It did. We were able to relocate the shoulder, and the pulse returned almost immediately. It was a huge relief, and it reinforced the importance of being adaptable and resourceful in those critical moments.
That's an incredible story. It highlights the quick thinking and decisive action that paramedics need to possess. It's not just about textbook knowledge, is it?
Absolutely not. It's about applying that knowledge in unpredictable situations, thinking outside the box, and sometimes taking calculated risks.
That makes sense.
Yeah.
Okay, so we've talked about spinal immobilization and vascular compromise. Now let's dive into pain management. I noticed both Laura and Andre were in significant pain, but they have very different medical histories. How do paramedics tailor pain relief for each individual's needs?
That's a crucial aspect of pre-hospital care. And it's not as simple as just giving everyone the same pain medication. Paramedics have to consider the patient's medical history, allergies, current medications, and the type and severity of their pain.
So it's not a one-size-fits-all approach.
Exactly.
Yeah.
They also need to consider potential drug interactions and any contraindications.
Contraindications, what does that mean?
It means situations where a particular medication might be harmful to the patient, for example, in Laura's case with her history of osteoporosis and prior surgery. The paramedics might be cautious about using certain pain medications, especially opioids. Opioids, while effective for pain relief, can sometimes have side effects like respiratory depression and constipation, and these risks might be heightened in someone like Laura.
I see. So they have to weigh the benefits of pain relief against the potential risks.
Precisely, they might opt for non-opioid pain relievers or use a combination of medications to manage your pain effectively and safely. It's all about finding the right balance for each individual.
And what about Andre with his diabetes and hypertension? How do those factors play into the pain management equation?
Andre's diabetes can influence his body's response to pain medications, and his hypertension needs careful monitoring the patient. The paramedics would likely monitor his blood pressure closely and adjust his pain medication dosage accordingly. They might also consider using techniques like splinting and positioning to help manage his pain without relying solely on medication.
So it's a complex decision-making process, taking all these factors into account. It's like piecing together a puzzle, isn't it?
It is, and just when you think you've got the puzzle solved, a new piece might appear requiring you to reassess and adjust your approach. That's the nature of pre-hospital care. It's constantly evolving and demanding adaptability.
And that adaptability is what makes those paramedics incredible first responders. They're always on their toes, ready for anything. You mentioned earlier about communication being key.
Yeah.
What kind of information do they relay to the hospital when they're transporting a patient?
Communication is absolutely essential, especially when handing off a patient to the hospital team. The paramedics provide a detailed report starting with the mechanism of injury. They describe what happened, how it happened, the forces involved. They'll also share their assessment findings, including vital signs, level of consciousness, and any obvious injuries.
So they're painting a picture for the receiving team.
Exactly. They'll also detail any treatments they have administered, the patient's response to those treatments, and any relevant medical history and current medications. It's a comprehensive overview of the patient's condition and the care they've received so far.
Wow, that's a lot of information to convey, especially when they're under pressure and probably exhausted from dealing with a traumatic situation.
You're right, it's a testament to their professionalism. And dedication, effective communication can mean the difference between a seamless transition of care and potential delays or misunderstandings that could impact the patient's outcome.
This deep dive has been so eye-opening. It's made me appreciate the complexity and challenges of pre-hospital care in a whole new way.
It's definitely a demanding and rewarding field. Every call is unique, and the paramedics have to be prepared for anything they need. A wide range of skills from medical knowledge and technical expertise to critical thinking, problem solving, and effective communication.
And let's not forget compassion. It takes a special kind of person to do what they do day in and day out. I'm feeling inspired by their dedication and resilience. Before we wrap up part 2, I want to leave our listener with this. Imagine yourself as the paramedic arriving on scene for Laura or Andre. What questions would be going through your mind? What assessments would you prioritize? And how would you balance the need for speed with the importance of accuracy while ensuring the patient's safety and well-being? It's worth thinking about as you continue exploring this fascinating field. Stay tuned for part 3 of our deep dive, where we'll explore some additional resources and insights that can help you solidify your understanding of this crucial topic. So we've really got a sense of what it's like to be a paramedic facing those split-second decisions and the challenges of providing care in the field. But I'm eager to learn more what resources are out there for someone who wants to delve deeper into emergency medicine and trauma care.
Oh, there's a ton of information out there, both online and offline.
Okay.
A great place to start is the American College of Surgeons website. They have a whole section dedicated to trauma care guidelines, best practices, tons of educational materials.
Perfect. We'll check that out. You know, I'm a podcast junkie, And I bet there's some amazing podcasts out there focusing on emergency medicine,
You are absolutely right.
so I can get my fix.
There are tons of podcasts hosted by paramedics, physicians, nurses.
Wow.
They share real-life experiences, insights from the field, discuss the latest advancements in trauma care.
That's awesome. I'll have to add those to my listening list. You know, as we've been dissecting these cases, I've been thinking about something we haven't touched on directly, the psychological impact of trauma,
Oh, yeah.
both on the patient and the first
Mhm.
responders. It's not just about fixing broken bones.
You're right. You hit on a crucial aspect of trauma care.
Yeah.
The emotional and psychological effects can be just as profound and long-lasting as the physical injuries.
Exactly. It's easy to get caught up in the medical procedures and forget there's a human being at the center of it all experiencing fear, pain, and possibly even trauma from the event itself.
Absolutely. And paramedics are trained to address not only the physical injuries, but also to provide emotional support, recognize that trauma can have a significant impact.
Like even just talking to the patient.
Exactly. They might need to calm a frightened patient, reassure worried family members, or even deal with bystanders who are distressed by the situation.
Yeah, it's a very human element that we don't always think about.
Yeah.
And what about the paramedics themselves? They're exposed to these traumatic situations regularly. How do they cope with the emotional burden of their job?
It's an important consideration. Paramedics and other first responders, they often witness suffering death, the aftermath of violence.
Yeah, it's heavy stuff.
They see things that most people will never experience, and that can take a toll.
I can imagine it must be incredibly challenging to process those experiences and still be able to show up and do the job day after day.
It is, and that's why it's crucial they have access to support systems both within their organizations and in their personal lives. Debriefing sessions, counseling services, and peer support groups can be invaluable for helping them cope with that stress.
It's a good reminder that these first responders, they're human beings too, and they deserve our support and recognition for the incredibly difficult work they do.
Absolutely well said. Trauma care. It's a complex and ever-evolving field. As we wrap up this deep dive, remember, keep asking questions, stay curious, and never underestimate the power of knowledge and compassion.
Beautifully put. A huge thank you to you for guiding us through these cases and sharing your insights. And to our listener, thank you for joining us on this deep dive into the world of pre-hospital trauma care. We hope you gained a new appreciation for the challenges and rewards of this vital field. Until next time, stay safe, stay curious, and keep learning. All right, let's jump right into a deep dive into neurology. But we're not cracking open textbooks today. We're going right into the action with paramedics facing those real-life neurological emergencies.
Exactly. Using these really interesting case studies, it'll be like we're right there with them, having to think fast and make critical decisions under pressure.
Exactly. So imagine you're on duty. It's a Sunday morning, kind of chilly, and you get called to a church. An elderly man there suddenly can't speak, and one side of his body has gone weak. Wait, what are you thinking?
Well, those are some major red flags right off the bat. Sudden speech problems and weakness, especially on one side. It's going to make you think stroke.
Makes sense. Every second counts when you're dealing with the brain, right?
Absolutely. You want to limit that brain damage as much as possible.
Now, the report says he's conscious but confused, drooling a bit. His pulse is strong but irregular. And the big thing, he can't speak at all and his awareness is way off.
Okay, so you're on scene. What's the first thing you're doing?
Well, I'm thinking ABCs, right?
Mm-hmm.
Airway, breathing, circulation.
Spot on. Always got to make sure those are good.
And in this case, the source material really emphasizes making sure he's getting enough oxygen, especially since he's not fully aware of what's going on.
Yeah, that makes sense. Brain cells are incredibly sensitive to not having enough oxygen. Even a little bit of time without it, and you can have serious damage.
Now, to add to the stress, his blood pressure is through the roof, 240 over 118.
Whoa. Yeah, that's definitely another piece of the puzzle. High blood pressure or hypertension is a major risk factor for stroke. It can really do a number on those blood vessels in the brain, making them more likely to get blocked or even burst.
Speaking of different types of strokes, the source material asks, what are those two main categories? And what's the go-to treatment if someone have an embolic stroke?
It's all about those blood vessels. Think of it like your brain's plumbing system. You can have a clog, which is an ischemic stroke, or a burst pipe, which is a hemorrhagic stroke.
Oh, so like a plumbing emergency in the brain.
Yeah, pretty much. And for that embolic stroke where a clot travels to the brain, the source talks about clot-busting meds.
So a burst pipe situation, that's got to be a rush to get him to a surgeon, right?
You got it. And with those clot-busting drugs, they only work within a specific time frame. That's why getting a patient to a stroke center fast is so important. They can figure out what kind of stroke it is and give the right treatment, whether it's meds or surgery.
Okay, new scene. We're called to a restaurant. A young woman has just had a seizure.
Witnesses are key here. They can give you so much info about what happened during the seizure.
Right. And this witness says she just looked at them briefly when they called her name loudly and that she peed herself.
Yeah, that's pretty common after a seizure. So you get there, what's your first move?
Well, safety first, always, right? Seizures can be unpredictable. Got to make sure the scene is safe for me and the patient. And then back to the ABCs. Airway, breathing, and circulation.
Exactly. While you're checking that, you also want to get as much info as possible about what happened during the seizure. Like how long did it last? What kind of movements did she have? Does she have a history of seizures? All that's important.
The source material asks about the different phases of a tonic-clonic seizure. You know, what some people call a grand mal seizure.
Right. The one that comes to mind when most people think seizure, loss of consciousness, the whole body convulsing. But it's not just one thing happening. It's not just going on and on. There's that tonic phase where the muscles tense up, then the clonic phase with the rhythmic jerking, and after all that, the postictal phase, where the person might be confused and drowsy.
So there's like a beginning, middle, and end to it.
Exactly. The source also mentions status epilepticus. That's when the seizures last a long time, like more than 5 minutes. Or they happen one after another without the person coming back to normal in between.
That sounds really scary.
It definitely is. It's a real emergency, can be life-threatening. And for adults, the most common cause is people not taking their anti-seizure meds like they're supposed to.
Okay, a good reminder to always follow doctor's orders. All right, case number 3. We're called to a busy shopping mall. This time, it's a woman experiencing dizziness and weakness, but on her left side. And here's the thing. Her eyes are moving back and forth really quickly.
That sounds like nystagmus, involuntary eye movements. Could mean there's a problem in the inner ear or in the parts of the brain that control balance and eye movement.
Now, her medication list is a mile long. Mevacor, Altovin, Celebrex, and Feldene.
So she's dealing with cholesterol, anxiety, and pain. Interesting to think about whether any of those meds, or maybe how they interact with each other, could be causing her symptoms.
And this is where it gets really interesting. The source mentions a possible diagnosis of Wallenberg syndrome.
Wallenberg syndrome, let's see. That's caused by a stroke in a very specific part of the brainstem. The brainstem is that connection between the brain and spinal cord. It's pretty rare, but it can cause dizziness, problem swallowing, that nystagmus we talked about, and weakness or numbness on one side of the body.
The brainstem controls, like, all the important stuff, right? Breathing, heart rate.
It's like the command center. Even a small stroke there can cause a ton of problems.
Okay, last case for this round. We're called to a home where a woman has a really bad headache on the left side of her head, and the report emphasizes that the pain is throbbing.
Throbbing pain, especially on one side, makes you think migraine, right?
Yeah, the classic migraine. But here's a twist. The report also mentions she's been using a Nicoderm patch.
That's interesting. Nicotine withdrawal is a known headache trigger, so maybe it's not a typical migraine after all. Maybe it's related to that.
So it might not be as straightforward as it seemed at first.
Exactly. There could be a lot of factors at play.
And while we're talking about headaches, the source mentions other types to keep in mind, like tension headaches. And those cluster headaches, yikes, those sound awful.
Each type has its own unique characteristics, and they can be caused by different things.
So we've got 4 cases, 4 neurological mysteries to solve, ready to dig in.
Absolutely. Let's break down each case and see what other clues we can find.
Okay, back for more. Let's go back to that first case, the elderly man with the possible stroke. We're thinking stroke, but we got to look closer.
Right. Remember we talked about those 2 main types? Ischemic, like that blocked pipe, and hemorrhagic, like a burst. The source material actually gives us a whole list of stroke symptoms to watch out for.
Okay, so we've got facial drooping, confusion, agitation, trouble speaking, weakness on one side, unsteady walking, and altered consciousness. That's a lot.
Yeah, it is. And the thing is, the specific symptoms can be so different. It all depends on where in the brain that stroke happened and how bad it is.
That makes sense. Now, what about his medical history? The source material gives us a whole rundown of his meds.
Oh yeah, that medication list. It's like a sneak peek into his overall health. You can see what he's dealing with. So he's on meds for hypertension, atrial fibrillation, and diabetes.
Wow, so he's managing high blood pressure and irregular heartbeat and diabetes. Those are all things that make a stroke more likely, right?
Absolutely. Uncontrolled hypertension, atrial fibrillation, and diabetes, those are all big risk factors.
The source material lists a bunch of medications. Atenolol, digoxin, aldactone, Lasix, spironolactone, Humulin N, Humulin R, Tufenil, and Mobic. It's a lot. Do paramedics really need to know what all of them do?
Well, it's like having a cheat sheet, you
Right.
know? It helps you understand the patient's story. Like seeing those insulin names tells you right away, okay, diabetes is part of this.
Now back to the stroke itself. The source material asked about how to treat an embolic stroke, and we talked about clot-busting meds.
Yeah, but remember, it's all about timing. Those meds only work within a certain window. That's why getting them to a stroke center ASAP is so, so important.
So it's a race against time to save that brain tissue.
You got it. The source material also asks about the difference between a stroke and a TIA. A TIA is a transient ischemic attack.
I've heard those called mini strokes.
Yeah, that's a good way to think about it. It's like a temporary interruption in the brain's blood supply. You get those stroke-like symptoms, but they usually go away within 24 hours.
So even though the symptoms go away, it's still a big warning sign, right?
Definitely. It's like a red flag that a full-blown stroke could be on its way, like your body is trying to tell you something.
All right, on to case number 2, the young woman who had a seizure at the restaurant. We know those tonic-clonic seizures have those distinct phases: tonic, clonic, and postictal.
Right, stiffening, jerking, and then that period afterwards where they might be confused and out of it. The source material brings up something called an aura.
An aura, like a warning sign before the seizure.
Exactly. It's a sensory experience some people get before a seizure starts. Could be a weird smell, a strange taste, seeing things that aren't there, even a feeling of deja vu.
So it's like their body's giving a heads up.
Yeah, like something's about to happen. Now, the source material also talks about status epilepticus again. Remember, those are the prolonged or repeating seizures, the ones that are really dangerous.
And we know that for adults, the most common cause is not taking their anti-seizure meds.
That's right. The source material also asks about the different meds paramedics might use for seizures in the field.
I imagine there are a lot, considering how many different types of seizures there are.
Yeah, there are quite a few. Broadly, they fall into categories like barbiturates, hydantoins, benzodiazepines, and others. Each type works a little differently to stop those seizures.
So it's like having a whole toolbox with different tools for different jobs.
Exactly. And choosing the right med depends on what kind of seizure it is, the person's medical history, and other stuff.
Sounds like managing seizures is really individualized.
It definitely is. It's complicated and always changing.
Okay, let's move on to case number 3. Remember the woman at the mall? Dizziness, weakness on her left side, those weird eye movements. The source mentioned Wallenberg's syndrome.
Right, and remember, it's pretty rare. It's caused by a stroke in a very specific spot in the brainstem, that lateral medullary area.
That area must be pretty important.
Super important. It controls things like breathing, heart rate, and how we process sensory information. Even a little stroke there can cause a whole bunch of problems.
No wonder she was having so many different issues. What else might you see with Wallenberg syndrome?
Well, besides what she had, you might see nausea and vomiting, trouble swallowing, maybe hoarseness, problems with balance and coordination, even hiccups.
Hiccups. That's weird.
It might seem strange, but the brainstem actually helps control hiccups, so if there's damage there, it can mess that up. Just goes to show how connected everything is in the body.
Fascinating. The source material also asks about cranial nerves. Can you refresh our memory on those?
Cranial nerves are like direct lines from the brain to different parts of the head and neck. There are 12 pairs, and they're in charge of all sorts of things. Facial sensations, eye movements, taste, hearing, even shrugging your shoulders.
Wow, so they do a lot.
They do. And in Wallenberg syndrome, certain cranial nerves can get affected, like the trigeminal, glossopharyngeal, vagus, and accessory nerves.
So that explains why someone with Wallenberg's might have trouble swallowing or have a hoarse voice. The source material also mentioned another name for this condition.
Oh, right. It's also called lateral medullary plate syndrome. Same thing, different name.
Gotta love those medical terms. Okay, on to our last case. The woman with that intense, throbbing headache. We were thinking migraine, but she was also using that Nicoderm patch.
Right, and we know nicotine withdrawal can trigger headaches, so maybe it's not a classic migraine.
The source material asks what kind of signs you might see if movement makes the headache worse.
Well, she said the pain got worse when she moved, especially when she was up and about working at her computer.
So moving around made the headache worse.
Exactly. And that can be a red flag that something more serious is going on, especially if it's new or if it comes on suddenly.
Definitely something to get checked out. Now, the source material also asked about the types of meds she's on.
So we've got Tylenol, Zoloft, and that Nicodem patch, analgesic for pain, antidepressant, and a smoking cessation aid.
right? It just reminds you that meds can interact with each other, and they can have side effects that might be contributing to what the patient's feeling.
Absolutely. That's why getting a complete medication history is so important. It helps you put the pieces together.
Well, we've gone back through each case and found some more clues. What are your thoughts?
These cases really show how complex neurological conditions can be. Even the ones that seem simple at first glance, it's like a puzzle you got to figure out how all the pieces fit.
All right, final round. We've analyzed symptoms, looked at meds, talked about possible diagnoses. Now it's time to put it all together.
Yeah, like solving a mystery. We've seen how even the little things can be important clues when you're dealing with the brain. So let's go back to those questions from the source material and see what else we can learn.
Sounds good. In our first case, the elderly man with the suspected stroke, the source material asks about what his ECG rhythm looks like.
It's atrial fibrillation. Remember, his medical history included atrial fibrillation, which we know makes a stroke more likely.
Right, atrial fibrillation. Basically, the top chambers of the heart aren't beating right. They're just kind of quivering.
Yeah, that's a good way to put it. And because of that, blood can pool in the heart, which can form clots. And those clots can travel to the brain and cause a stroke.
So it's like a chain reaction, and the end result can be really bad. The source material also throws out this scenario. What if you find a patient unresponsive in bed first thing in the morning and you think it's a stroke? Would you activate a stroke code?
That's a tough one. The source points out that because we don't know when the stroke actually started, that patient wouldn't qualify for treatment under a stroke code. Those codes are all about time. There's a specific window for those interventions to work.
So if you don't know when it started, you can't be sure if those clot-busting drugs would still be effective.
Exactly. It just highlights why knowing the last known well time is so important for stroke patients. It's the last time anyone saw them acting normally, without any symptoms.
Okay, on to case number 2. The young woman with the seizure. The source material asks what kinds of meds paramedics use for seizures out in the field.
Usually benzodiazepines, like diazepam or lorazepam, they work quickly to calm that overactivity in the brain that's causing the seizure.
So like hitting a reset button.
Pretty much. They work by boosting the effects of GABA, a neurotransmitter that helps slow down those nerve impulses in the brain.
Makes sense. The source material also asks why someone might be confused after a seizure.
Could be a few reasons. During a seizure, the brain's going haywire and it needs time to recover to go back to normal. That can cause confusion, what we call the postictal phase.
So like rebooting a computer after it crashes.
Good analogy.
Yeah.
And on top of that, some seizure meds can also cause confusion as a side effect. And of course, if there's an underlying medical reason for the seizure, that could also contribute to confusion.
So lots of possibilities. Okay, let's move on to case 3. The woman at the mall, possible Wallenberg syndrome. The source material wants us to think about what causes this rare condition.
It comes down to a blockage of blood flow to a very specific part of the brainstem. Usually it's a blockage in one of the vertebral arteries or the posterior inferior cerebellar artery. Those are the arteries that supply blood to that area.
So like a traffic jam in the brain's highway system.
Perfect way to think about it. And the source material also reminds us that Wallenberg syndrome has another name.
Right, lateral medullary plate syndrome.
Exactly. Same thing, just a different name. Medical lingo. Gotta love it.
Okay, last case. The woman with that terrible throbbing headache. The source material asks for some typical signs that movement might be making the headache worse.
Well, she said the pain got worse when she moved around, especially when she was at her computer working.
So just the act of moving made the headache worse.
Right. And that can be a sign that something more serious is happening, especially if it's a new symptom or comes on suddenly.
Definitely something to take seriously.
Ah.
And the source material also asks about the different types of meds she's on.
She's taking Tylenol Zoloft and using a Nicoderm patch.
So analgesic for pain, antidepressant, and a smoking cessation aid.
Yep. And it's a good reminder that medications can interact with each other, and they can have side effects that might be adding to what the patient's experiencing.
So it all comes back to that thorough medication history like we've talked about.
Absolutely. It's such an important part of figuring out what's going on with the patient.
Well, we've covered a lot of ground in this neurology deep dive, from strokes and seizures to Wallenberg syndrome and headaches. We've really gotten a glimpse into what paramedics deal with in these real-life situations.
It's been a fascinating journey through the complexities of the brain, and even though we've learned a lot, there's still so much more to discover.
Absolutely. But one thing's for sure, rapid assessment and a good history are crucial when you're dealing with neurological emergencies.
Couldn't agree more. Every little detail matters. from the symptoms and vital signs to their medical history and what meds they're taking.
It's like piecing together a puzzle, and every piece helps you get closer to the answer.
And the more we understand about the brain, the better we can care for our patients.
So next time you come across a neurological case, remember what we've learned from these paramedics. Think critically, gather all the information you can, and don't underestimate the power of connecting the dots.
And keep learning. Neurology is always changing. There's always something new to discover.
That's right. Stay curious, and be sure to join us for our next deep dive, where we'll explore another fascinating area of science and medicine.
Until then, keep those brains engaged. Welcome back, everyone, to the Deep Dive. This time, we're taking a closer look at infectious diseases, but from a pretty unique angle, that of paramedics.
Oh yeah, definitely a crucial perspective.
We've got a textbook chapter here all about these diseases and some real-world case studies. You know, the kind of situations paramedics find themselves in all the time.
Right, right.
So whether you're thinking about a career in medicine or just want to be more aware of, like, health risks, this deep dive's for you.
It's interesting, because most infectious diseases, they aren't really life-threatening,
Right.
but some can be quite serious.
Oh, absolutely.
We're talking about HIV, hepatitis B, bacterial meningitis.
Yeah.
Situations where knowing what to do and knowing it quickly can really make all the difference.
No doubt about it. So, I mean, right away, that raises the stakes. These aren't just, things we read about. They're real-life situations, real consequences.
For sure.
And that kind of leads us to the unique position of paramedics, right?
Right.
They're often the first ones on the scene dealing with these infectious diseases in all sorts of environments.
Yeah, exactly. And that's where the challenge is, right? So imagine being called to a home. Someone's having a seizure.
Oh, wow.
Your mind's racing, trying to figure out what's causing it.
Right.
But also you're thinking, could this be contagious?
Yeah.
How do you balance providing that urgent care while also making sure you and everyone else stay safe?
Yeah. That's a tough one. That's the kind of stuff these case studies really highlight.
They do, yeah.
Speaking of, complex cases,
Yeah.
our first one introduces us to Hatsuyu, a 36-year-old woman.
Okay.
She's had this cough for 3 weeks now, won't go away. It's gotten so bad she's also short of breath and has a fever. So putting yourself in the shoes of the paramedic, what's your gut reaction to this?
Okay, well, the first thing that comes to mind is, some kind of respiratory infection. Seems pretty straightforward. There are a few things that make me pause.
Okay.
Atsuyo traveled to Canada recently, and she was visiting some fish markets.
That's interesting.
That travel history, it makes me think about tuberculosis, TB.
TB. Okay. Now that's not your average cold, right? What makes TB such a concern here?
Well, TB is really contagious, and it can be so hard to treat,
Right?
especially now with, all these antibiotic-resistant strains we hear about.
It's true.
And there's still a lot of stigma around PB, which unfortunately makes some folks hesitant to get help.
Yeah. Makes sense to be cautious then. So the paramedics are thinking TB. What are they looking for in that initial assessment?
Right. They'll check her vitals, of course, temperature, heart rate, all that.
The basics.
Yeah, exactly. And in her case, they found a mild fever, heart rate was a bit high, and her breathing was shallow. Now, those findings, they could fit with a regular respiratory infection, but they don't rule out something more serious, like TB.
So it's a bit of a waiting game at this point until they
Yeah.
can get more info, I mean.
Yeah, in a way. The paramedics, they have to rely on their training and their experience to make judgments in the field. They'll look at everything, the patient's history, the symptoms, the whole picture.
Makes sense. Okay, let's move on to case number 2. This one's pretty different. We've got Sarah, a 5-year-old girl having a seizure, and her mom's not feeling great either.
Yeah.
So what are the challenges when you're dealing with a young child like this?
It's always more emotionally charged when it's a child,
Yeah.
right? And then when the parent's also sick, it just adds another layer of complexity. Immediately makes you think, could this be something they both caught?
Right, yeah. Okay, so the case tells us Sarah had an ear infection last week. She's been really tired, had headaches, and now this seizure. Vitals are mostly normal, just a slightly elevated heart rate.
Yeah.
What jumps out at you from all that?
The ear infection combined with the neurological stuff, especially the seizure, it makes me think about meningitis.
Meningitis.
Yeah. It's an inflammation of the membranes around the brain and spinal cord. It could be caused by bacteria or viruses.
And why is the ear infection important here?
Well, sometimes, particularly in young kids, ear infections can actually lead to bacterial meningitis.
Hmm.
which is, very serious, potentially life-threatening. The inflammation can spread from the ear to those membranes, the meninges, and cause all sorts of neurological problems.
So unlike, a simple cold, meningitis is a much more urgent situation.
Oh, absolutely. Bacterial meningitis, it can progress so quickly. Any delay in treatment, it can have devastating effects.
Wow. This really shows how symptoms that seem totally unrelated, like an ear infection and a seizure, can actually be connected to something much bigger and more serious.
Yeah, it really highlights how important it is to look at the whole picture, not just individual symptoms in isolation.
So we've seen how paramedics approach two very different cases. Now I want to talk about how they keep themselves and their patients safe. What kind of standard procedures are in place?
Well, paramedics follow what are called universal precautions. They're a set of guidelines, basically, to prevent infections from spreading.
Right.
Things like wearing gloves and masks, properly disposing of any contaminated materials, and of course, being really diligent about hand hygiene.
I mean, these precautions, they might seem pretty basic, but they're so important for stopping that chain of infection.
They really are. It's about protecting everyone involved, the paramedics, their patients, other healthcare workers, and the community at large.
So what are some key takeaways for our listeners? What can they do in their everyday lives to stay safe and healthy?
Okay, well, first, it's really important to be aware of your own health and your travel history, too. So if you're going to the doctor, be sure to tell them about any recent illnesses, anything you might have been exposed to, any travel, even if it seems unrelated.
Give them the whole picture so they can make the best decisions for your care.
Exactly. And don't be afraid to ask your doctor about their infection control practices. It's okay to ask about things like hand hygiene protocols, how they sterilize equipment. You have a right to know.
Absolutely. Be an informed patient. Advocate for your own safety.
Right. And never, ever underestimate the power of basic hygiene. Simple things like washing your hands regularly, covering your coughs and sneezes, staying home when you're sick.
It's the basics.
Yeah, those are your first lines of defense. They really can have a huge impact on public health.
All right, so we've talked about the basics of infectious diseases, the challenges that paramedics face. What are your main takeaways so far?
I think what's really struck me is how complex infectious diseases can be. It's rarely a simple diagnosis.
Yeah.
You often need to think like a detective, put all this to pieces together.
And the role of paramedics in this whole process is so crucial. They're often the first contact, and their ability to assess the situation, figure out the priorities, and manage potential infectious diseases, it's really impressive.
They really are like walking encyclopedias of medical knowledge.
Mm.
And their commitment to patient safety is just remarkable.
Before we wrap up this part of our deep dive, I want to leave our listeners with a question to think about. Given what we've learned today, what do you think are the biggest challenges paramedics face when it comes to infectious diseases? What innovations or changes could help them better protect themselves and their patients in the future? We'll dive deeper into those questions in the next part of our deep dive, but for now, I want to leave you with that thought.
It is a great question. Really gets to the heart of some of the big problems in healthcare. Infectious diseases, they're always changing. New threats popping up. So yeah, staying ahead of the curve, that's a major challenge.
It's like a constant race, isn't it? So what are some of the specific hurdles that paramedics might run into, with things changing all the time?
Well, one of the biggest is just the sheer number of different infectious diseases they could encounter.
Right.
I mean, one call could be a common cold, the next something totally rare, something they've never even heard of. And they have to make decisions fast with not a lot to go on.
Yeah, and on top of that, sometimes the symptoms of different diseases, they overlap.
Exactly. Makes it even harder to figure out what you're dealing with.
Yeah, like a puzzle with missing pieces.
It is, yeah. And then there's the risk, right? The risk they take every day. They're right there with patients who could be, coughing, sneezing, bleeding, all of that.
Right.
So that puts them at risk of getting infected themselves, especially if they don't have the right protective gear.
And that risk has got to be even higher in situations where resources are scarce, right? Like in a remote area or during a natural disaster or something.
Oh, absolutely. It really shows you how brave and selfless these first responders are.
It does. And it's not just the physical risks, right? There's the emotional toll, too.
Yeah.
Imagine having to deal with a child with a really contagious disease, maybe even fatal.
Yeah.
That weight of responsibility, the empathy they must feel for their patients, that can't be easy.
It can't. No, you're absolutely right.
And then on top of all of that, there's, constantly having to stay up to date. New treatments, new pathogens, drug resistance patterns changing all the time. It's a lot to keep track of.
It really is. Paramedics have to be like walking medical textbooks, always learning, always adapting. There's no easy feat.
So, given all of those challenges, what are some potential solutions? Things that could help paramedics and improve patient care?
Well, one thing that I think has a lot of potential is rapid diagnostic testing. Imagine having a device, something portable, that can quickly identify the exact germ causing the infection.
Right there on the spot.
Right there. It would be incredible.
It would be a game changer. They could make better decisions about treatment, isolation, all of that right away.
Exactly. Could even prevent unnecessary hospitalizations. And maybe even help slow the spread of infection.
What about improvements to, the protective gear, PPE? Could new technology make that more effective, easier to use?
Oh, for sure. Developing PPE that's lighter, more comfortable,
Yeah.
but still just as effective, that would be huge. Imagine gear that can adapt, adjust to different situations, different levels of risk.
Yeah, that would be amazing. And of course, ongoing training is super important.
Absolutely.
Paramedics need to have the latest knowledge, the latest skills to deal with these ever-changing diseases.
I completely agree. And maybe things like simulations or virtual reality training could play a role. Give them a chance to practice those skills in a safe environment, build their confidence in those tough situations.
I've heard about those simulations. They sound pretty incredible.
They are, yeah.
What about using technology to connect paramedics with, infectious disease specialists, like in real time?
Oh, that's a great idea. Like, imagine a paramedic being able to video chat with a specialist while they're at the scene.
Wow.
It'd be like having that specialist right there with them,
Wow.
giving advice and support, especially in those really complex cases.
That would be amazing. It sounds like there are so many smart people working on some really creative solutions to protect both paramedics and their patients.
There are. And these innovations, they're going to be even more important in the future.
Right.
With climate change, globalization, new drug-resistant pathogens, all of that, it's creating the perfect conditions for infectious diseases to spread.
Yeah, that's a good point.
So the role of paramedics is more important than ever.
Okay, so let's go back to our cases. We have Hatsuyo, who might have tuberculosis.
Right.
And Sarah, who might have meningitis. What happened next?
All right. So with Hatsuyo, her vitals, remember,
Yeah.
mild fever, high heart rate, shallow breathing.
Yeah.
Those fit with a respiratory infection, but they don't necessarily mean it's TB.
Right. Still a bit of a mystery.
Yeah.
So what precautions did they take during transport just in case it was TB?
Well, because they suspected TB, they took extra precautions, wore masks and gloves, and made sure Hatsuyo had a mask on too.
Makes sense. Better safe than sorry.
Exactly. So at the hospital, she had more tests done, a chest x-ray and sputum cultures.
To confirm or rule out TB?
Right, exactly. And what about Sarah? Her case was really concerning with her being so young and the possibility of meningitis.
Yeah, for
Yeah.
sure. So what happened with her?
Well, with those symptoms, she was transported to the hospital right away.
Immediately.
Yeah, bacterial meningitis can be so dangerous, especially for little kids. So every minute counts.
I bet that was a stressful ride for both Sarah and her mom.
Oh, I'm sure it was. And the paramedics had to be extra careful with her. Not jostle her too much, keep things quiet and dim.
Right.
Anything that could make her condition worse. They wanted to create a nice, calm environment, help stabilize her on the way to the hospital.
So it's not just about speed, it's about creating that safe and supportive environment too. What did they do when they got to the hospital?
At the hospital, they did a lumbar puncture. It's also called a spinal tap. Basically, they take a sample of the fluid that surrounds the brain and spinal cord.
To test it.
Yeah, it's the best way to diagnose meningitis. They look for signs of infection in that fluid, and that helps them tell the difference between bacterial and viral meningitis.
Which is important because they're treated differently, right?
That's very important.
So it seems like both Hatsuyo and Sarah's cases really show how important paramedics are. They stabilize the patient and get them to that higher level of care where they can get a diagnosis and be treated.
They do. It's like they're running a relay race, and they're the first runner.
That's a great way to put it.
They hand off the baton to the hospital team.
Right.
But it's more than just transport.
Yeah.
It's assessment, quick thinking, and compassionate care, all in those first few critical moments.
Yeah, absolutely. Okay, so now let's talk a little bit more about tuberculosis and meningitis specifically. Can you explain a little more about TB and why it's such a serious health threat, especially today?
All right, so tuberculosis, or TB, is caused by a bacteria, Mycobacterium tuberculosis. It mainly affects the lungs. And it spreads through the air when an infected person coughs or sneezes. Those bacteria, they can really damage the lungs, maybe get hard to breathe, causing chest pain, even coughing up blood. And in severe cases, it can spread to other parts of the body, like the brain or the spine.
So it's not spread through, like, casual contact, like
Yeah.
shaking hands or something.
No, it has to be through the air. Those tiny droplets that come out when someone with TB coughs or sneezes.
Okay, and you said TB can be fatal if it's not treated. Can you explain why treatment is so difficult?
Well, TB is treatable,
Mm,
but it takes a long time,
right.
usually several months of taking multiple medications.
Wow.
And that can be hard for people to stick with. And if you don't take the medicine consistently, it can actually lead to drug resistance.
Oh, so the bacteria become resistant to the drugs.
Exactly, and then it's much harder to treat. Drug-resistant TB is a big problem worldwide.
So early detection and sticking with the treatment plan are key.
They are, yeah. Okay, so let's switch gears now and talk about meningitis, which is what we thought Sarah might have.
Right.
Can you tell us a bit more about that condition and how it affects the body?
Sure. So meningitis is an inflammation of the meninges,
Uh-huh.
which are the membranes that surround and protect the brain and the spinal cord. That inflammation, it can actually disrupt the flow of cerebrospinal fluid, the fluid that bathes the brain and spinal cord, and that can lead to all sorts of neurological problems.
Okay, so what are some of the typical symptoms of meningitis, and how do they differ from, say, the flu?
Well, meningitis symptoms can range from mild, like flu-like things, to more severe stuff like seizures, even brain damage, in some cases death. But unlike the flu, meningitis often causes a stiff neck and sensitivity to light and mental changes.
Okay, so those are the red flags.
Yeah, those are the things paramedics would be looking out for.
And we mentioned earlier that meningitis can be caused by either bacteria or viruses. What's the difference between those two types, and why is it important to know which one it is? Okay, so bacterial meningitis is generally more serious. It tends to hit harder and faster. Viral meningitis, on the other hand, is usually milder and often goes away on its own without any specific treatment.
So you don't always need antibiotics for viral meningitis.
Right. But for bacterial meningitis, you do. And you need them quickly to prevent those serious complications.
So figuring out which type it is, that's crucial.
It sounds like getting that diagnosis quickly is really important. You mentioned the lumbar puncture, that spinal tap is the best way to diagnose it. Are there any other tests that paramedics can use in the field?
Unfortunately, not really. There aren't many reliable tests for meningitis that can be done right there on scene, so they have to rely a lot on their own judgment,
Right.
looking at the patient's symptoms, their vital signs, their medical history, all of that.
And making that call.
Yeah, that's why their knowledge and experience is so critical.
It's pretty amazing how they have to make these big decisions with limited information and sometimes limited resources.
It's a real testament to their skill and their dedication.
Definitely. They are really on the front lines of healthcare. And their job, it's only getting more complex, more challenging as these infectious diseases keep evolving.
It's incredible, isn't it, how they're constantly adapting, learning, especially with these new diseases popping up. It takes a lot of skill to handle those situations.
Yeah, it really does. It shows how dedicated they are to taking care of their patients, even when things are uncertain. And it's not just about the physical stuff either. It's
Yep.
about understanding the emotional impact of these diseases too.
That's a really good point. We tend to focus on the medical stuff, but, behind every case study, every statistic, there's a person going through something pretty scary.
Exactly.
Yeah.
Imagine being Hatsuyo or Sarah, facing a serious illness, feeling scared, confused. It's a reminder to be compassionate. Empathy is just as important as medical knowledge when you're dealing with infectious diseases.
So true. It's a reminder to all of us to be more understanding and supportive of anyone who's dealing with these kinds of illnesses. Whether it's someone we know or even a stranger, just listening, offering help, it can make a big difference.
And on a bigger scale, knowledge is power. The more we understand about these diseases, the better we can protect ourselves, our families, our communities.
And that's where resources like the textbook we've been talking about and organizations like the WHO and the CDC, they're so important.
Yeah, they're vital.
They give us reliable information, guidance for healthcare workers and for the public.
And they coordinate those global efforts to prevent outbreaks, to detect them, to respond to them. It's a reminder that we're all in this together. We have to work together to deal with these big health challenges.
Absolutely. Collaboration, education, and a lot of empathy. Those seem to be the keys to navigating this whole world of infectious diseases.
Couldn't have said it better myself.
So we've covered a lot today.
We have.
But before we wrap up, I want to leave our listeners with one last thought. We've talked a lot about the challenges that paramedics face, but what about the challenges for the patients themselves? What can we do individually as a society to better support people who are battling these illnesses?
That's a great question. A really important one. It forces us to look beyond the medical aspects and really see the human impact. How can we create a system that's more supportive, more compassionate for people with infectious diseases?
Yeah, it's something to think about. As we've learned today, knowledge is power when it comes to these diseases. The more we know, the better we can protect ourselves, support those who need it, and fight for policies that keep everyone healthy and safe.
I completely agree. Keep learning, keep asking questions, and keep talking about it.
And of course, wash your hands.
Always good advice.
Thanks for joining us on The Deep Dive. We'll see you next time. Stay curious, stay informed, and stay healthy. Happy New Year's Eve, everybody. I know everyone else out there is probably getting ready for tonight's festivities, but we are ending the year a little differently. We're going to be taking a deep dive into the world of hematology. That's right, the study of blood. And you have provided us with some really interesting material to dig into.
Yeah, it's going to be a fascinating deep dive.
Yeah, so we've got a textbook chapter on hematology, and we also have 2 case studies that are really going to make us think, I think.
I think so, too.
So basically, how can we decipher the clues hidden in our blood? You know, that's what we're going to try to figure out today.
Exactly. And it's almost like we're going to be medical detectives in a way, trying to piece together the evidence to solve the mystery of these cases and ultimately try to understand the complexity of blood disorders.
Okay, so let's put on our detective hats then and jump right in. Our first case study throws us right into a sweltering summer day. It's hot, and we've got a 7-year-old boy named Devin. He's outside playing, and suddenly he gets a nosebleed.
Uh-oh.
But this isn't your typical bloody nose.
Right, it just won't stop.
Oh, no.
Yeah, we're talking over an hour of bleeding, even with his mom trying, all the things you usually try.
Oh, well.
And there's an additional clue here. He also has some bruising on his legs.
Okay.
So, bruising, prolonged bleeding. These are looking like some breadcrumbs here, leading us down a particular path. What could be causing this? What should we be most concerned about at this point?
Well, I think first and foremost, you always want to make sure that you can control that bleeding, right? So direct pressure is going to be key, and if that's not working, you might even have to consider an IV.
Oh, wow. Okay.
But the bruising is really what's interesting here, right? Because
Yeah.
it really raises the question of a possible clotting disorder, something like hemophilia.
Hemophilia.
Yeah.
Now, that's a genetic disorder, isn't it? So could this seemingly simple nosebleed actually be a sign of something much more serious? It definitely could be a possibility. So hemophilia, it actually affects the blood's ability to clot properly. And this is all because of a deficiency in specific clotting factors. You got to think of it this way. Imagine you're trying to build a house, a really sturdy house. You need all the right tools and materials.
Right. Otherwise, it's all going to fall apart.
Exactly.
Yeah.
So in hemophilia, those missing clotting factors, it's like missing tools, right? So they prevent the blood from forming a stable clot, which means even a small minor injury could lead to prolonged bleeding.
Wow. Okay. So Devin's case really makes you think twice about what could seem like, just a normal childhood injury.
Absolutely.
You really got to look deeper.
Definitely. But before we get too caught up in this particular case, why don't we shift gears to our next scenario?
Okay.
Okay, so picture this. It's April now, kind of a chilly morning, and we've got a 27-year-old man. He's experiencing some really severe abdominal pain.
This is our second case study, right?
That's right.
And the pain in this case is so severe that it's actually affecting multiple areas. We're talking his lower abdomen, his groin, and even extending to his penis and scrotum.
Wow.
Yeah, and he's also having some wheezing, and his heart rate and blood pressure are through the roof.
That's concerning.
Yeah, so definitely a much different presentation than Devin's case. And those elevated vitals, those are a major red flag.
Right.
So we need to figure out what could be causing this kind of intense and widespread pain.
Yeah, definitely.
Now, based on the information we have in the source material, it seems like sickle cell disease, or SCD, is a possible culprit here. So how is this disorder different from hemophilia? What makes it unique?
Okay, well, you see, with hemophilia, the problem was in the clotting process itself.
Right.
But with sickle cell disease, it actually directly impacts the red blood cells themselves.
Okay.
So instead of being nice and round and flexible like they should be, they actually become sickle-shaped, kind of like a crescent moon, and they get really rigid.
I can't imagine those sickle-shaped cells navigating those tiny blood vessels very easily. It's got to be like trying to fit a square peg into a round hole, right?
Exactly. And that's actually a really good analogy. So this blockage, it's called a vaso-occlusive crisis. And what happens is it deprives the tissues of oxygen. And that's what leads to those extremely painful episodes. And also there's potential for organ damage as well.
Right. And the source material actually painted a pretty grim picture. It said the average person with SCD actually experiences 4 of these severe crises every year. That's not just a medical condition, it's a whole life-altering reality.
Definitely. And it's important to remember it's not just limited to pain. It can actually manifest with a whole range of symptoms. We're talking fatigue, swelling in the hands and feet, eye damage, leg ulcers, and then you also have a higher susceptibility to infections.
So we've got these 2 cases, right? We've got a young boy with a persistent nosebleed, maybe a clotting disorder, and then we've got this young man who's dealing with excruciating pain, possibly caused by sickle cell disease. It seems like we're already starting to see the complexity of hematology and how it can impact people of different ages and just present with completely different symptoms.
It really is fascinating, isn't it? It's almost like we're putting together a puzzle, right? And each case, each symptom, each little detail we uncover in the source material, it helps us build this clearer picture of this diverse world of blood disorders.
Yeah, that's a good analogy. But before we get ahead of ourselves and jump to any conclusions, let's pause for a moment and think about what we've learned so far.
Go ahead.
So what do these cases tell us about the importance of, looking beyond the surface, of considering the underlying causes of symptoms that might seem completely unrelated? It seems like even a simple nosebleed could be a sign of something much more complex going on.
You're absolutely right. It's like being a detective, right? You got to examine every clue carefully to unravel that mystery. And sometimes even the tiniest seemingly insignificant detail can lead to a really major breakthrough.
It's a good reminder that in hematology and medicine in general, we can't just treat the symptoms. We have to understand that root cause.
Exactly. And that's where our source material really comes in handy because it not only gives us these interesting case studies, but it also dives deeper into the science behind these disorders. For example, there's a question in the Test Your Knowledge section about why someone with hemophilia takes longer to stop bleeding. It's really interesting.
Oh, yeah, that's right. And I think it has to do with those missing clotting factors we talked about earlier, right?
Exactly. The source material explained that hemophilia is often due to a deficiency in something called factor VIII or factor IX, and these are absolutely essential for what's called the coagulation cascade.
The coagulation cascade.
Yeah, it's this really intricate chain reaction that ultimately leads to the formation of a clot. But without those factors, that whole process is disrupted, like a domino effect that suddenly stops.
So it's not just that the clot forms slowly, it's that it can't form properly at all.
Right.
Wow. So what are the real-life implications of that? Like, how might a simple injury play out differently for someone who has hemophilia?
Well, even a small cut could bleed for a really long time. And obviously a more serious injury, well, that could be life-threatening. And we also have to worry about internal bleeding, especially into the joints and muscles.
Oh, wow.
Yeah, so that's why early diagnosis and treatment is really critical.
And I remember the source material also mentioned some common signs of hemophilia, like easy bruising, joint pain, and even muscle bleeding. So it sounds like this is something that every healthcare provider should be aware of, right?
Absolutely. And this brings up another really important point, and that's genetic testing.
Okay.
Because for families with a history of bleeding disorders, genetic testing can provide really valuable information for family planning and also for early intervention.
That's a really good point. Speaking of details, I'm curious about those ECG findings that were mentioned in the case study answers.
Right.
I know you mentioned that sinus rhythm is normal, but what about sinus tachycardia? Does that always mean something's wrong?
Well, sinus tachycardia just means that the heart is beating faster than normal, but the rhythm itself is regular. It's often just a normal physiological response to things like, stress, pain, or exercise. But in some cases, yeah, it can be a sign of an underlying medical condition.
So in Devin's case, that tachycardia could just be his body's way of reacting to the prolonged nosebleed and the stress of the situation.
Right.
But in the second case, it's probably more likely related to that severe pain from the vaso-occlusive crisis.
Exactly. It's like our body's internal alarm system,
Right.
letting us know, hey, something needs attention. But we always have to look at the whole picture, not just one isolated finding.
Right. Absolutely. Okay, well, Shifting gears back to sickle cell disease for a minute, what are some other insights that we can get from the source material? It's clear that this disorder is about much more than just pain episodes.
You're absolutely right. The source material really emphasizes the fact that this is a very multifaceted disease. We've already talked about vaso-occlusive crises, but it also mentions dactylitis, which is a very common early symptom, especially in children.
Dactylitis, now I remember that term.
Yeah.
Doesn't that come from the Greek word for finger?
You got it. That's exactly right. And so this swelling, it's actually caused by those sticky sickle cells, and they block blood flow to the small bones in the hands and feet.
Oh, wow.
So this is often one of the first signs that something might be wrong.
It's amazing how this disorder can affect so many different organs and systems, from the eyes and lungs to the spleen and kidneys. It's like no part of the body is immune.
Yeah, and that's actually one of the biggest challenges in managing sickle cell disease. Because it is so systemic, treatment often involves not just addressing the pain, but also preventing and managing those complications that can arise in all these different organs.
So the source material mentions a few different treatment options, including pain management, blood transfusions, and medications to prevent complications. Are there any new breakthroughs or promising research areas in sickle cell treatment that we should be aware of?
That's a great question. And while the source material focuses mainly on the basics, ongoing research is actually exploring some exciting new avenues, like gene therapy and stem cell transplantation. And these therapies are really aiming to correct that underlying genetic defect, so they're offering hope for a potential cure, which is really exciting.
Wow, that is really exciting. It's amazing to see how far medical science has come in understanding and treating these blood disorders. But as we go deeper into this complex world, I'm starting to wonder, are there any common misconceptions about these disorders that we should be aware of?
Oh, definitely. One of the biggest misconceptions is that blood disorders only affect certain ethnic groups.
Right.
And while some disorders might be more prevalent in certain populations because of genetics, it's really important to remember that anybody can be affected.
So ethnicity is not a reliable indicator. We need to be looking for potential symptoms in all individuals.
Exactly. Another big misconception is that all blood disorders are inherited.
Oh, okay.
So while many are genetic, some can actually be acquired later in life. This can be due to things like infections, nutritional deficiencies, or even exposure to certain chemicals.
That's a really good point. It highlights how important it is to consider a person's complete medical history and lifestyle when you're evaluating them for potential blood disorders.
You got it. It's all about connecting the dots and looking at the whole person.
It's like we're detectives, right? We got to gather all the clues.
Exactly.
As we continue this deep dive into hematology, I'm just struck by how much information there is to learn. It can be a little overwhelming at times.
I completely understand. It's like trying to drink from a fire hose.
Right.
But that's why it's so important to break it down into smaller, manageable pieces and focus on those key takeaways.
Right. And I think one of the biggest takeaways for me is that while blood disorders can be serious and complex, they can often be managed effectively with proper medical care.
Absolutely. Early diagnosis and treatment, those are key. And remember, you don't have to go through this alone. Healthcare professionals are there to help guide you, answer your questions, and provide you with the support you need.
That's really reassuring to know that there are resources out there for people who are living with these conditions, and that research is constantly pushing the boundaries of what's possible in terms of treatment.
It's amazing what they're doing, isn't it? And it's a true testament to the dedication and ingenuity of the medical community. They're really dedicated to improving the lives of people who are affected by these blood disorders.
Well, this has been an incredible journey so far. We've learned so much about how our blood works, all the different ways things can go wrong, and the incredible research that's paving the way for new treatments.
It's been an honor to share this knowledge with you and our listeners. And as we approach the end of this New Year's Eve exploration, I want to leave our listeners with one final thought-provoking question. What role does curiosity play in taking control of our health, especially when faced with really complex and potentially scary conditions like blood disorders?
That's a really powerful question to think about as we enter the new year. And on that note, let's take a moment to gather our thoughts, and then we'll wrap up this deep dive into the amazing world of hematology.
It really is. It makes you realize that sometimes you have to look beyond what seems obvious at first.
It really does.
And it reminds us that we need to be thorough in our assessment.
Hmm.
We can't just focus on treating the symptoms. We have to get to the root of the problem.
Exactly. You got to understand the underlying cause, right? And that's where our source material is so helpful because it gives us these really fascinating case studies, but then it also delves into the science behind these disorders, which I think is really helpful for understanding the bigger picture. For example, I remember there's a question in the Test Your Knowledge section about why someone with hemophilia takes longer to stop bleeding.
Oh, right. Yeah.
And I think it has something to do with those clotting factors or the lack of them.
You got it. That's exactly right. The source material explained that hemophilia often results from a deficiency in factor VIII or factor IXs.
Okay.
And these factors, they're essential for something called the coagulation cascade.
The coagulation
Yeah,
cascade.
it's kind of a mouthful, but basically it's this really intricate chain reaction that ultimately leads to the formation of a blood clot.
Okay.
But when you're missing these key factors, that whole process gets disrupted. It's like a domino effect that's been interrupted.
So it's not just that the clot forms slowly, it's that it can't even form properly at all in those cases.
Right.
Wow. So what are the real life implications of that then? Like, if someone has hemophilia, how might a simple injury play out differently?
Well, even a small cut could bleed for an extended period of time.
Yeah.
And obviously, if you have a more serious injury, well, that could be life-threatening.
Hmm.
And then there's also the risk of internal bleeding, which is a major concern, especially bleeding into the joints and muscles.
Wow, that's scary.
Yeah, so that's why getting an early diagnosis and starting treatment as soon as possible is so important for people with hemophilia.
And I remember the source material also talked about some of the common signs of hemophilia, like easy bruising, joint pain, and even muscle bleeding. So it sounds like this is something that healthcare providers should really have on their radar, right?
Absolutely. It's something that we should all be aware of. And this brings up another important point, and that's genetic testing. You know, for families that have a history of bleeding disorders, genetic testing can be so valuable. It can provide information for family planning, and it can also help with early intervention.
That's a really good point. You know, speaking of details, I was thinking about those ECG findings that were mentioned in the case study answers. I know you mentioned that the sinus rhythm is normal, but what about sinus tachycardia? Does that always mean there's a problem?
Well, sinus tachycardia just means the heart is beating faster than normal, but the rhythm itself is still regular. It's often just a normal physiological response to things like stress, pain, or exercise. But, you know, there are cases where it can be a sign of an underlying condition, so it's always something to be aware of.
So, like in Devin's case, that tachycardia could have just been his body's way of reacting to that prolonged nosebleed and the stress of the situation.
Right, exactly.
But in the second case, with the 27-year-old man, it was probably more related to the severe pain he was experiencing from the vaso-occlusive crisis.
Yeah, you're probably right. It's like our body has this built-in alarm system, and it's trying to tell us, hey, pay attention. Something's not quite right here. But it's important to look at the whole picture, not just one single finding in isolation.
That makes sense. Okay, well, let's shift gears back to sickle cell disease for a minute. What other insights can we glean from the source material on this? It's clear that this disorder is about so much more than just those pain episodes.
You're absolutely right. The source material does a really good job of emphasizing just how multifaceted this disorder is. We've already discussed vaso-occlusive crises, but there's also something called dactylitis, which is a really common early symptom, especially in children.
Dactylitis. Now, that's a term I remember.
Yeah.
Doesn't that come from the Greek word for finger?
You got it. You have a good memory.
Yeah.
And this swelling, it's caused by those sticky sickle cells blocking blood flow to the small bones in the hands and feet.
Wow, okay.
So this is often one of the first signs that something might be going on.
It's amazing how this one disorder can affect so many different organs and systems in the body, from the eyes and lungs to the spleen and kidneys. It's like no part of the body is immune to this.
That's true. And that's actually one of the biggest challenges when it comes to managing sickle cell disease.
I'd imagine.
Because it's so systemic, the treatment often involves not just managing the pain, but also trying to prevent and manage all those potential complications that can pop up in all these different organs.
That sounds really challenging. So the source material mentions a few treatment options like pain management, blood transfusions, and medications to prevent complications. But I'm curious, are there any new breakthroughs or promising research areas in sickle cell treatment that we should be aware of?
That's a great question. And while our source material focuses on the basics, there's actually a lot of really exciting research going on right now. They're exploring things like gene therapy and stem cell transplantation.
Wow, that sounds promising.
It really is. These therapies are actually aimed at correcting that underlying genetic defect. So we're talking about a potential cure, which is incredibly exciting.
Wow, that's incredible.
Yeah.
It really is amazing to see how far medical science has come in understanding and treating these blood disorders. But, as we delve deeper into this complex world, I'm starting to wonder if there are any common misconceptions about blood disorders that we should be aware of.
Oh, there are definitely some misconceptions out there. One of the biggest ones is that blood disorders only affect certain ethnic groups.
Right, I've heard that one.
And while it's true that some disorders may be more prevalent in certain populations due to genetic factors, it's really important to remember that anyone can be affected.
So we can't just rely on ethnicity as an indicator. We really need to be vigilant about recognizing potential symptoms in everyone.
Exactly. We can't make assumptions. And another misconception is that all blood disorders are inherited.
Oh, okay, interesting.
While many are genetic, some can actually be acquired later in life due to things like infections, nutritional deficiencies, or even exposure to certain chemicals.
That's a good point. It really highlights the importance of looking at a person's complete medical history and their lifestyle when we're trying to figure out what might be going on.
You got it. It's all about connecting those dots and taking a holistic approach to understanding these conditions.
It's like we're detectives, gathering all the clues we can find.
Exactly.
As we continue this deep dive into hematology, I'm just amazed by how much information there is to absorb. It's a little overwhelming, to be honest.
I know what you mean. Sometimes it feels like we're drinking from a fire hose.
Exactly.
But that's why it's so important to break down the information into smaller, manageable pieces and really try to focus on those key takeaways.
You're right. And one of the biggest takeaways for me has been that while these blood disorders can be really serious and complex, there's a lot we can do to manage them effectively with the right medical care.
I completely agree. Early diagnosis and treatment are absolutely crucial. And it's important to remember that people don't have to go through this alone. Healthcare professionals are there to help guide them, answer their questions, and provide the support they need.
That's really reassuring to know. And it's also encouraging to know that research is constantly moving forward and pushing the boundaries of what's possible when it comes to treatment.
It's amazing what they're doing.
Yeah.
And it really speaks to the dedication and ingenuity of the medical community and their commitment to improving the lives of people who are affected by these disorders.
It's inspiring, for sure. Well, this deep dive has been an incredible journey. We've learned so much about the intricate workings of our blood, the many different ways things can go wrong, and the groundbreaking research that's happening right now to develop new treatments.
It's been an honor to share this knowledge with you and our listeners. And as we approach the end of this New Year's Eve exploration, I want to leave everyone with one final, thought-provoking question to ponder. What role does curiosity play in taking control of our health, especially when we're faced with complex and potentially scary conditions like these blood disorders?
That's a really powerful question to reflect on as we enter a brand new year. And on that note, let's take a moment to gather our thoughts, and then we'll come back and wrap up this deep dive into the fascinating world of hematology. Happy New Year's Eve, everyone. We are back for these final moments of 2024, and wow, what a journey it's been exploring this incredible world of hematitis.
I know, right?
It's just amazing.
We started with what seemed like pretty simple cases, nosebleed, some abdominal pain,
Right?
but we ended up uncovering this whole world of complexity within our blood.
Yeah.
And it really shows just how much we can learn from just a couple of stories.
Yeah, it really does. And I know right before the break, you left us with a really thought-provoking question. You asked, what role does curiosity play in taking control of our health, especially when we're dealing with something as complex as a blood disorder?
Yeah, that's a big one. I think curiosity is really that spark that ignites our desire to understand. When we're curious, we're more likely to ask questions, to seek out information, and most importantly, to advocate for ourselves.
Right.
And that empowers us to make informed decisions about our health.
It's like we've been saying throughout this whole deep dive, knowledge is power. The more we understand about our bodies and how they work, the better equipped we are to navigate the healthcare system and make choices that support our well-being.
Absolutely. And, that knowledge doesn't have to come just from medical professionals, right?
Right.
I mean, we have so many resources at our fingertips these days. There are reputable websites, books, patient support groups. All these things can help us learn more and also connect with others who are going through similar experiences.
Yeah, that sense of community is so powerful. Just knowing that you're not alone when you're facing a health challenge can be incredibly reassuring and motivating.
It really can. It's like building a support network where people can share information, resources, and just offer each other emotional support,
Hmm.
you know? And those connections, they can make a huge difference.
They really can.
Yeah.
As we're talking, I'm thinking about how important it is to really pay attention to those subtle signals that our bodies send us.
Oh, for sure.
We talked about, things like those persistent nosebleeds, the bruising,
Right.
but even small changes like your energy levels, or if you're getting infections more frequently,
Yeah.
or if you're experiencing unexplained pain,
Yeah.
those could be clues that something's not right.
Absolutely. It's all about tuning in, being aware of what your body is telling you, and noticing those patterns.
Right.
Because sometimes those little whispers can be early warning signs that something needs to be checked out.
It's like we're detectives for our own health,
That's a great way to put it.
piecing together the clues to figure out what's really going on.
Yeah.
And that brings us right back to the importance of curiosity.
Exactly.
It's what drives us to ask, why? Why am I feeling this way? What could be causing this? And asking those questions, well, it can lead us down a path of discovery and empower us to be more proactive about our health.
Couldn't have said it better myself.
So as we wrap up this New Year's Eve deep dive, I want to leave our listeners with a sense of hope and empowerment.
We need to.
Because even though blood disorders can be challenging, there's so much we can do to manage these conditions, advocate for ourselves, and connect with others who understand.
Absolutely.
And we've come a long way in understanding hematology, and research is constantly pushing the boundaries of what's possible.
It really is.
So there's every reason to be optimistic about the future of treatment and care for those who are living with blood disorders.
I agree.
So as we raise a glass to ring in the new year, I want to celebrate the resilience of the human spirit,
Yes.
the power of knowledge, and the importance of staying curious about our health.
Here's to a new year filled with discovery, connection, and a commitment to, really embracing the wonder and complexity of our own bodies.
Happy New Year, everyone, and thank you so much for joining us on this deep dive into the fascinating world of hematology.
All right, so today we are going deep into neonatal emergencies.
Buckle up.
Yeah, those critical situations where every second counts, and we're going to be looking at it all through the eyes of paramedics.
First one's on the scene.
Exactly. The first one's on the scene when a baby's life is on the line.
Right.
So to guide our deep dive today, we've got a couple of sources.
2 key sources.
Yeah.
So first off, we're going to be referencing a paramedic textbook
Okay.
to kind of understand the protocols and the procedures.
Makes sense.
But then we're also going to be looking at some real-world case studies.
Oh, nice.
Yeah, to see how these emergencies play out, when the rubber meets the road
Yeah, I like it.
in the field.
So before we get into the really heart-stopping scenarios,
Right.
let's just make sure we're all speaking the same language here.
Yeah,
So when we say neonate, we're talking about...
a newborn baby,
Okay,
specifically from birth to 1 month old.
got it.
And what's so fascinating about neonates is that even though they're so tiny, their physiology is completely different from older children or adults.
So what might seem like a minor issue for us could be life-threatening for a neonate.
Exactly.
Wow.
Their bodies are still developing,
Right.
so they can regulate their temperature or fight off infections as effectively.
So even seemingly simple things can escalate quickly.
Yeah, quickly.
That's a good point.
Which makes the role of paramedics even more critical.
Yeah.
They have to assess the situation fast,
Yeah,
make the right call, even when the symptoms might not be obvious.
you've hit the nail on the head.
That's why I think these case studies are so valuable.
Yeah.
They illustrate not only the medical complexities, but the human element,
Oh, interesting.
the quick thinking,
Right.
the split-second decisions.
I'm ready for some real-life trauma.
Okay, all right.
Hit me with it. What's our first case study?
It's called the cyanosis puzzle.
Ooh, okay.
And it starts with a frantic grandmother calling 911. Her 6-month-old grandson is having trouble breathing and has turned blue.
Wow, that's got to be every parent's worst nightmare.
It is.
What goes through a paramedic's mind when they get a call like that?
Well, first you have to remember that cyanosis,
Right.
that bluish discoloration of the skin,
Yeah.
it's a major red flag in infants. Typically means there's not enough oxygen in the blood.
Okay.
So the paramedics rush to the scene
Yeah.
and they see this baby who's conscious but clearly distressed.
Oh, man.
So what do they do first?
What do they do first? Yeah.
Well, the textbook emphasizes the ABCs:
Okay.
airway, breathing, and circulation.
Got it.
So they check the baby's airway, make sure it's clear,
Okay.
and then they assess his breathing.
Okay.
They find that he's breathing rapidly but with difficulty.
Oh, okay.
They also feel for a pulse and find that his brachial pulse is strong.
Okay. So that's a good sign, right?
Yeah,
A strong pulse means his heart's still beating effectively.
It is a good sign. It's just one piece of the puzzle, though.
Okay.
The paramedics also find signs of a possible ear infection
Okay.
and learn that this breathing difficulty came on very suddenly.
You mentioned the puzzle earlier, and I'm guessing these are all like clues
They are?
that help the paramedics kind of figure out what's going on.
Absolutely.
Okay.
We're like detectives
Right.
piecing together the
I
evidence.
like it.
And in this case, the sudden onset of the breathing problems combined with the cyanosis.
Yeah.
That's a major concern.
Okay.
So they take the baby's vital signs,
Okay.
and things get even more concerning.
Oh.
His pulse is racing at 130 beats per minute.
Wow.
His respirations are 50 breaths per minute.
That's a lot.
His blood pressure is 80/60,
Oh, wow.
and his oxygen saturation is down to 88%.
Those are some scary numbers. It sounds like his body is really struggling to get enough oxygen.
You're right.
So what do they do?
So their immediate action is to administer oxygen
Okay.
via a non-rebreather mask. This is standard procedure to try to get those oxygen levels back up.
Right, but they still need to figure out the underlying cause.
Exactly.
Yeah.
And based on the symptoms and the rapid onset,
Yeah.
they suspect a congenital heart defect called tetralogy of Fallot.
Tetralogy of Fallot. Now, why does that diagnosis come to mind?
Well, it's because tetralogy of Fallot prevents enough oxygen-rich blood from circulating throughout the body,
Right.
which can lead to these sudden episodes of cyanosis
Oh, wow.
and difficulty breathing.
It all connects.
Yes.
But that's a serious condition. What can paramedics do in a situation like that?
Well, in the field, their main focus is to stabilize the baby's breathing and oxygen levels.
Right.
But they know they need to get this baby to a hospital and fast.
Yeah.
This is where rapid transport becomes absolutely crucial.
Yeah, because he needs specialized care from a pediatric cardiologist.
Exactly.
That's beyond what paramedics can handle on scene.
Exactly. And this case really highlights the importance of recognizing those subtle clues. The sudden onset, the cyanosis, the vital signs, all of that.
Yep.
That might point to a more serious underlying condition.
It's not always as simple as it seems.
No, it's not.
It's a great takeaway for our listeners.
Yeah.
Sometimes what looks like a simple breathing problem could be a sign of something much more complex.
Absolutely.
Right.
It's all about connecting the dots and knowing when to call for backup.
And speaking of backup,
Oh, yes.
let's move on to our next case where the backup arrives a little too late.
A little too late.
Oh, I'm intrigued.
This case is called premature arrival.
Yep.
It involves a 32-year-old woman who goes into labor 8 weeks early.
8 weeks? Oh my gosh.
Now, you know, premature births always present a higher level of risk.
Of course, because the baby's organs might not be fully developed.
Exactly. And in this case, it's the woman's first successful pregnancy
Oh, wow.
after a history of miscarriages.
So the stakes are incredibly high.
They are.
What happens when the paramedics arrive?
Well, they find the mother conscious and alert, which is good. But she's having contractions,
Okay.
there's bleeding,
Uh-oh.
and the baby is already visible.
So it's a precipitous labor.
You got it.
Things are moving very quickly.
Very quickly.
What are the top priorities when dealing with a premature baby?
Well, the first priority is always the airway.
Okay.
Premature infants often have difficulty taking those first breaths.
Right.
So the paramedics need to assess the airway immediately.
So they're checking to see if the baby's airway's clear.
Yeah,
And if they need help breathing.
exactly.
Okay.
And because this baby was born so early, they also have to be on the lookout for meconium.
Meconium, that's the baby's first stool, right? Why is
Yeah.
that a concern?
Well, if the baby inhales meconium during labor or delivery,
Okay.
it can cause serious respiratory problems.
Oh, no.
It can block their tiny airways,
Wow.
irritate their lungs.
So suctioning is key in those situations.
Quick suctioning by paramedics
Yeah.
can often prevent life-threatening complications.
I never realized how many things paramedics have to consider in these situations.
It's a lot.
Yeah.
And we're just scratching the surface.
Really?
In addition to the airway, they also have to think about the baby's temperature.
Oh, right, because premature babies can lose heat very quickly.
Exactly. They call it cold stress.
Right.
And it can be really dangerous for a newborn.
What happened?
It can lead to low blood sugar, make them more susceptible to infections.
So the paramedics have to work quickly.
Quickly.
Dry the baby off, wrap them in warm blankets.
Yes.
Just to make sure they're protected from the cold.
During transport.
It's amazing how even small details, like temperature control, can make such a big difference.
Huge difference.
This case really highlights the unique challenges of prematurity
It does.
and the specialized care that these babies need.
Absolutely.
So we've got a baby struggling to breathe because of a heart defect.
Right.
We've got a premature baby facing multiple challenges.
Yes.
What other kinds of emergencies might paramedics encounter?
Well, sometimes they get called to scenes where there's not much they can do.
Uh-oh. I have a feeling this next one's going to be a tough one.
It is. This one's called the silent emergency.
Oh, what?
And it's every parent's worst nightmare.
Oh, gosh.
Imagine you wake up one morning and your 1-month-old baby is unresponsive and not breathing.
Oh, my goodness.
Just a horrific thought.
So what happens when the paramedics arrive in a situation like that?
Well, they find the baby unconscious, not breathing at all, no pulse.
Gosh.
It's a full-blown cardiac arrest.
So it's a life or death situation, and every second counts.
Every second counts.
Yeah.
They immediately start CPR,
Okay.
trying to get that heart beating again.
Right.
And while they're doing CPR, they're also looking for any clues that might explain what happened,
Okay.
checking for signs of trauma, infection,
Yeah.
anything out of the ordinary.
But in this case, they don't find any obvious explanations.
No.
And that's when the possibility of SIDS comes into play.
Sudden infant death syndrome.
SIDS, I've heard of it. I don't really understand what it is.
So SITs is the sudden and unexplained death
Right.
of an infant under 1 year old.
Wow.
It's the leading cause of death in this age group.
Oh, my gosh.
It's one of the most devastating things a family can go through.
So basically, a seemingly healthy baby just dies in their sleep.
Yes, and despite decades of research,
Right.
we still don't fully understand what causes it.
There's a lot we don't know.
There is.
So if we don't know what causes it, how can we prevent it?
That's the million-dollar question.
Yeah.
And while we can't eliminate the risk entirely,
Right.
there are things parents and caregivers can do to reduce the risks significantly.
Okay. Like what?
So the most important is to follow safe sleep practices.
Okay.
Things like placing the baby on their back to sleep
Okay.
on a firm surface
Okay.
without any loose bedding or toys in the crib.
Got it.
Avoiding smoking around the baby is also critical,
Right.
as is making sure the baby doesn't overheat.
So simple steps can make a big difference.
Big difference.
But even with those precautions,
yeah.
it sounds like SIDS is still a very real and scary possibility.
It is, but there's good news.
Okay.
Paramedics are highly trained to respond quickly and do everything possible
Yeah.
to try to revive an infant in these situations.
It must be incredibly tough for them to deal with these cases, both emotionally and medically.
Definitely is.
And that brings us to another important point.
Yes.
The emotional toll of neonatal emergencies.
Absolutely.
Yeah, we haven't really talked about that yet.
No.
These aren't just medical events.
No.
They're deeply personal and emotionally charged experiences
Absolutely.
for everyone involved.
For everyone.
Can you imagine being the parent who finds their baby unresponsive?
It's just heartbreaking.
Or the paramedic who has to deliver the devastating news that the baby couldn't be saved?
I can't even imagine.
That must be incredibly difficult.
It is.
And that's why it's so important for paramedics to be able to provide support and empathy
Absolutely.
to the families involved. They need to communicate clearly,
Clearly.
compassionately, answer questions honestly,
Honestly.
and be sensitive to the emotional state of everyone involved.
Everyone.
It's about recognizing the human element in all of this.
Human element.
And sometimes just being there, listening,
Yes.
offering a kind word can make a world of difference.
Difference.
Well, we've covered a lot of ground in this first part of our deep dive.
We have.
We've seen how paramedics use their knowledge,
Yes.
skills,
Absolutely.
and compassion to tackle some of the most challenging emergencies imaginable.
Absolutely.
So we just finished talking about some really intense situations.
Really intense.
And I have to say, it's starting to make me realize just how much pressure paramedics are under
A lot of pressure.
when they respond to these neonatal emergencies.
They have to be ready for anything.
It's true. So let's circle back for a second
Yeah.
to something you mentioned earlier, SIDO,
Right.
sudden infant death syndrome.
It's a tough one.
It's such a heartbreaking topic, but it's also something that I think a lot of parents and caregivers worry about.
Absolutely. And I think it's worth emphasizing those safe sleep practices again
Yeah.
because they really can make a difference.
I agree. It's easy to forget about the little things, but those little things can have a big impact when it comes to infant safety. So just to recap, what are the key things parents should keep in mind?
Well, first and foremost, always place the baby on their back to sleep.
Okay.
That's the safest position for them.
Back to sleep.
Back to sleep.
Got it.
And make sure their sleep surface is firm.
Okay.
No soft mattresses, pillows, or blankets.
Right. They can create a suffocation hazard.
Exactly.
And what about toys in the crib?
It's best to avoid them altogether.
Okay.
They're not necessary for sleep.
Right.
And they can also pose a risk of suffocation or entanglement.
So back to sleep, firm surface, no toys. What else?
Make sure the baby doesn't overheat.
Okay.
Keep the room at a comfortable temperature and dress them in light, breathable clothing.
Okay. You don't want them to get too bundled up.
Right. And of course, smoking around the baby is a big no-no.
Absolutely. Secondhand smoke is a major risk factor for size.
Right.
And it can also cause a whole host of other respiratory problems.
So parents and caregivers listening, those safe sleep practices are essential.
Essential.
Every little bit of prevention counts.
Absolutely.
Okay, now moving beyond size.
Yeah.
Let's dive back into some of the other key themes that emerge
Yes.
from those case studies and the paramedic textbook.
Okay.
So what are the most important things our listeners should remember about neonatal emergencies?
Well, I think the case studies really highlighted the importance of rapid assessment.
Okay.
Paramedics need to be able to quickly evaluate the situation,
Right.
determine the severity of the infant's condition.
So they're looking for those telltale signs. Like
Yes.
difficulty breathing, changes in skin color, or lethargy.
Exact.
That might indicate a serious problem.
Yeah, and then based on their assessment.
They need to initiate the appropriate interventions.
Right.
Sometimes that means administering oxygen,
Or-
starting an IV,
Yeah.
or even performing CPR.
Right. It's all about taking those life-saving actions in those critical moments.
It is.
And another recurring theme was the importance of clear communication,
Oh, absolutely.
both within the EMS team and with the family members.
It's critical.
Why is communication so crucial in these situations?
Well, imagine the chaos of a neonatal emergency. You've
Right.
got paramedics, firefighters, maybe even police officers on scene.
Yeah.
Everyone's trying to do their job.
Of course.
Clear communication ensures that everyone is on the same page
Right.
and that the baby is getting the best possible care.
Right. You don't want any miscommunication or confusion
No.
when you're dealing with a life or death situation.
Exactly. And then there's the communication with the family.
Right.
Those parents or caregivers are going through an incredibly stressful experience.
Of course.
They need someone to explain what's happening, answer their questions honestly
Yeah.
and compassionately.
It's about providing reassurance and support during a very difficult time.
It is.
And sometimes that emotional support can be just as important as the medical interventions.
Absolutely.
So is there anything in the paramedic textbook
Yes.
that surprised you or that you found particularly interesting?
Well, there's a whole section on meconium that I found fascinating.
Meconium. Okay, let's unpack that.
Okay.
I remember you mentioned it's the baby's first stool and that it can cause problems if it's inhaled during birth.
Right. And what's interesting is that the textbook actually outlines a very specific protocol
Oh, wow.
for meconium aspiration.
Okay.
The first step is suctioning.
Okay.
If they see meconium in the baby's mouth or nose,
Yeah.
they'll use a bulb syringe or a suction catheter to clear it out.
Right. Get rid of it before the baby can inhale it.
Exactly. But here's the tricky part.
Okay.
They have to do this before stimulating the baby to breathe.
Oh, so they don't want the baby to gasp and inhale it.
Exactly. Because if they stimulate the baby first,
Yeah.
the baby might gasp
Right.
and inhale the meconium deeper into their lungs.
Oh, wow. So it's a balance
The balance.
between clearing the airway and avoiding further aspiration.
You got it. And if the meconium aspiration is severe,
Yeah.
the baby might need more advanced respiratory support,
Like what?
like intubation
Okay.
and mechanical ventilation.
Wow.
Yeah.
I'm starting to see why paramedics need such specialized training.
Yes, they're dealing with some pretty complex procedures.
It's a lot.
And another thing that stood out to me in the textbook was the emphasis on temperature control.
Okay.
We talked about cold stress earlier,
Yeah.
but it's such a critical issue for newborns, especially premature infants.
I can imagine their little bodies are so vulnerable to those temperature changes.
Exactly. And the textbook explains that when a baby gets too cold,
Yeah.
their metabolic rate increases.
Oh, wow.
And they start to burn through their energy stores very quickly.
So it's not just about being uncomfortable. It's about their body working overtime to stay warm.
Precisely. And that can lead to hypoglycemia,
Okay.
which is low blood sugar, which
Right.
can be dangerous for the brain.
Wow.
And it also weakens their immune system,
Okay.
making them more susceptible to infections.
Gosh. So what steps can paramedics take to prevent cold stress in these emergencies?
The key is to keep the baby warm and dry.
Okay.
They'll immediately dry the baby off after birth
Okay.
and wrap them in warm blankets.
Yeah.
They might also use a radiant warmer.
Okay.
which is a special device that provides heat from above.
I see. And I imagine they have to be careful about the temperature in the ambulance during transport.
Absolutely. Maintaining a warm environment throughout that transport process is crucial. They'll
Okay.
adjust the temperature in the ambulance,
Right.
make sure the baby's well protected from drafts.
It's amazing how much goes into caring for a newborn in these situations.
It is.
It's not just about treating the medical condition.
Sure.
It's about creating a supportive and nurturing environment.
Absolutely. And that brings us to another important aspect of neonatal care that's often overlooked,
Okay.
the emotional side of things.
Yes, we touched on this earlier,
We did.
but I think it deserves a little more attention.
Absolutely.
These emergencies are not just medical events.
No,
They're incredibly emotional experiences for everyone involved.
for everyone.
Imagine being a parent who has just witnessed their newborn go into cardiac arrest,
I know.
or a paramedic who has to deliver devastating news to a grieving family.
It's so difficult.
These are not easy situations to deal with.
They are not.
So how does the paramedic textbook address this emotional aspect?
Well, it emphasizes the importance of providing support and empathy
Okay,
to the families involved.
right.
It reminds paramedics to communicate clearly and compassionately, answer questions honestly,
Yeah.
and be sensitive to the emotional state of the parents and caregivers.
Right, so it's about recognizing that these families are going through this unimaginable ordeal
Yeah.
and providing them with a sense of understanding and support, even in the midst of all this chaos and uncertainty.
It is.
And this aspect of care, it goes beyond just the immediate emergency,
It does.
right? It extends to the follow-up care
Yes,
and the long-term emotional well-being of the families.
absolutely.
It's a lot to consider.
It is.
Well, I think we've covered a lot of ground in this second part of our deep dive.
We've gone from the nitty-gritty of meconium aspiration.
It's pretty nitty-gritty
It is.
to the importance of emotional support.
Yes.
We've really gotten a sense of the complexities and challenges of neonatal emergencies. So what awaits us in this final part of our deep dive? We've spent the last two parts really exploring these neonatal emergencies.
Fascinating stuff.
It is. And I have to say, it's really given me a whole new appreciation for the work that paramedics do.
They're truly remarkable.
They are dealing with some of the most vulnerable patients imaginable.
Absolutely.
And, it's not just about having the medical knowledge and skills. It's also about having the compassion
The empathy.
to support the families that are going through these incredibly stressful experiences.
Yeah, you've hit the nail on the head.
So as we wrap up this deep dive, let's distill everything we've learned
Yeah, okay.
into some key takeaways for our listeners.
Right.
What are the most important things that they should remember about neonatal emergencies?
Well, I think the first takeaway is that newborns are not just tiny adults.
Okay.
They have unique physiological needs
Right?
and vulnerabilities
Right.
that demand a specialized approach to care.
Right. Their airways are smaller, their immune systems are still developing,
Right.
and they're much more sensitive to temperature changes.
Absolutely. And that understanding should inform everything from how we handle them to how we assess and treat them
Right.
in these emergency situations.
So takeaway number one, respect the unique physiology of newborns.
Absolutely.
What else should our listeners keep in mind?
Takeaway number 2, be prepared.
Okay.
Neonatal emergencies can happen anywhere,
Right.
anytime. So it's essential to have some basic knowledge and skills.
Like knowing infant CPR and understanding safe sleep practices.
Exactly. Those are simple things that anyone can learn,
Right.
and they can make a world of difference in those critical moments before professional help arrives.
So know the basics and be ready to act.
Yes.
That's great advice.
What else?
What else? What?
Takeaway number 3,
Okay.
don't hesitate to call for help.
Oh, that's a good one.
If you're ever unsure about an infant's well-being, trust your instincts and call 911.
Right. It's always better to err on the side of caution.
Absolutely. Paramedics are trained to assess the situation
Yeah.
and provide the appropriate level of care, even if it turns out to be a false alarm.
I like it. And finally, takeaway number 4.
Remember the human element.
Yes. These emergencies are not just medical events. They're deeply personal and emotionally charged experiences for the families involved.
For everyone involved.
So it's important to approach these situations with compassion,
Empathy.
understanding. I think those takeaways really capture the essence of what we've explored in this deep dive.
We've gained a deeper understanding of the challenges and rewards of responding to neonatal emergencies.
And hopefully,
Oh,
we've equipped our listeners with some valuable knowledge and insights
Tools for their toolbox.
that they can carry with them.
Absolutely.
So as we conclude this episode, I want to leave our listeners with a final thought-provoking question.
Okay.
Knowing what you know now about the fragility of newborns and the complexities of these neonatal emergencies,
Yeah.
what steps can you take to be a more informed and proactive advocate for infant safety in your own community?
It's a great question. Perhaps it's taking an infant CPR class,
Oh, yeah.
volunteering at a local hospital's neonatal unit,
Right.
or simply spreading awareness about safe sleep practices.
Yeah.
Every action, no matter how small,
Right.
can contribute to a safer
Absolutely.
and healthier environment
Well said.
for these little ones.
Thank you for joining us on this deep dive into the world of neonatal emergencies.
It's been a pleasure.
We hope you found it informative
Empowering.
and empowering. Until next time, stay curious, stay informed,
Compassionate.
and stay compassionate. Welcome back, everyone, to The Deep Dive. Today, we're taking a look at a topic that's, well, a bit intense. Emergency response to chemical incidents.
Definitely a high-stakes area.
Absolutely. And to guide us through this, we've got, as always, some pretty interesting source material.
Always love seeing what you dig up.
Well, this time, we've got a chapter from a paramedic textbook. Pretty detailed stuff.
Ah, so we're getting into the nitty-gritty.
We are. And to add to that, a real-life case study.
Ooh, those are always fascinating. You really get to see the theory put into practice.
Exactly. So let's dive in, shall we?
Let's do it.
The textbook kind of sets the stage with this quote. Post 9/11, the world has become a different environment. Emergency preparedness is the most important element available to paramedics in such situations. Pretty sobering thought, right?
It really is. And while 9/11 obviously brought airport security to the forefront, it also just really heightened awareness about, well, all kinds of potential threats, including chemical attacks.
And that preparedness aspect, it's got to be top of mind for any first responder.
Absolutely crucial.
All right, so let's jump into this case study. It starts off with a student demonstration. Things get a little out of hand. Possible explosion.
Oh, that's never good.
No, it's not. And we end up with a young man, some burns, and he's having real trouble breathing.
So already a pretty serious situation.
Yeah, and it gets even more complicated because they find canisters of chlorine nearby, like chlorine gas.
Chlorine, yeah. Now that's a whole different ballgame. I mean, most people, when they hear chlorine, they think, swimming pools, keeping things clean.
Right, exactly.
But chlorine in its pure gaseous form, that's highly reactive. It can be really dangerous.
So in this case study, they talk about the burns on his hands, first degree, about 5% of his BSA. Now, how do paramedics even figure that out on the fly? What's BSA anyway?
So BSA stands for body surface area. It's essentially a quick way to assess how much of the body is affected by burns, to gauge the severity. And that BSA number, it's crucial for figuring out treatment and spotting potential complications. Out in the field, paramedics use what they call the rule of nines.
The rule of nines.
Yeah, it's a system where they assign percentages to different body parts, and it all adds up to, 99. Like, the head and each arm are 9%, front and back of the torso, each 18%, each leg 18%. There's a modified version for kids because, their proportions are different.
Okay, makes sense. So in our case study, 5% BSA with the burns on his hands. Even though it might seem like a small area, that could really mess with his ability to use them, right?
Absolutely. Hands are, pretty essential.
Understatement of the year.
Okay.
So we've got burns, we've got chlorine gas. What exactly happens when someone breathes that stuff in?
So chlorine gas, it's a powerful irritant. I mean, think about your respiratory system, all those delicate tissues. Chlorine just attacks them, basically. Yeah, so it can cause this burning sensation, coughing, makes it hard to breathe. And how bad it gets really depends on, how much chlorine there was and how long they were breathing it in.
The case study mentions this treatment, nebulized sodium bicarbonate.
Yeah.
They considered it, but it sounds kind of controversial. What's the deal with that?
Yeah, so nebulized sodium bicarbonate, it's basically this fine mist that you inhale, and the idea is to, neutralize the acid effects of the chlorine in the lungs. But it's not a standard treatment. There's some back and forth about how effective it actually is.
I see.
And there are concerns about potential side effects, things like fluid buildup in the lungs, especially if it's not done just right. So, it's a judgment call.
So our paramedics here, they're really in a tough spot, weighing the potential good against the potential bad. What else would they be thinking about when making a decision like that?
Well, you got to remember, they're out there in the field. It's a dynamic environment. Things are changing. They have limited information. They have to consider the patient's condition, what resources they have available, whether they can get them to a hospital quickly. It's all about making the best call with the information they have at that moment.
Really highlights the complexity of this whole world, right?
Yes, every situation is unique.
And speaking of complexity, the textbook mentions that there can be long-term effects from chlorine exposure, too. What are some of those?
Right. So while many people do recover completely, some end up dealing with lingering issues. Like one condition that can develop is called reactive airways dysfunction syndrome.
Okay, RADS.
Yeah, RAD. And basically, it's a lung disorder that can pop up after breathing in irritants like chlorine gas. It causes symptoms that are, well, kind of similar to asthma. Wheezing, coughing, shortness of breath, that feeling of tightness in the chest. Imagine having a persistent cough or, feeling like you can't quite catch your breath, even weeks or months after the exposure. That's the reality for some folks who develop RADS.
Man, that's rough. Really makes you think about the bigger picture here.
It definitely does.
We've touched on some of the immediate dangers of chlorine, but there's this whole other layer of complexity with the long-term effects.
Yeah, it's not just about the here and now.
Exactly. And I'm really curious to explore that further.
Well, let's do it.
So we were just talking about those long-term effects of chlorine exposure, and it really makes you think about the bigger picture here.
It does, doesn't it?
And that textbook really emphasizes how 911 was this major turning point for emergency responders. Like it forced them to think about things in a whole new way.
Oh, absolutely. 911 really brought about this shift in mindset. I mean, first responders now have to consider a much wider range of potential threats, including these chemical attacks. And that's had this ripple effect on everything, from their training to the protocols they follow, even the equipment they use.
So what are some of the biggest changes that have come about?
Well, for one, there's a much heavier emphasis on hazardous materials training now.
Hazmat training.
Yeah. Paramedics really need to be able to identify like a whole slew of different chemicals, understand their properties and know how to handle them safely. It's like adding this whole new layer of complexity to an already demanding job.
Sounds intense.
It is. And then there's the whole issue of on-scene safety.
Right. Because you don't want to become a casualty yourself.
Exactly. They've got to be hyper aware of their surroundings, assess the potential hazards, and take the right precautions.
Like what?
Well, it could be anything from approaching the scene from upwind to making sure they're wearing the correct personal protective equipment.
The PPE.
Yep, that PPE. And speaking of PPE, the textbook mentions that the paramedics in our case study donned level B protection.
Level B, what does that even mean?
So levels of protection, they refer to the different types of gear that paramedics wear based on, what kind of hazards are present. And level B, that provides a high level of respiratory protection, but a little less skin protection.
So serious stuff.
Definitely.
Okay, so back to our patient in the case study. They found his pulse was rapid, but his blood pressure seemed normal. What does that tell us?
Well, a rapid pulse, that's a classic sign of distress. It means the body's trying to compensate for something.
Which in this case would be?
The effects of the chlorine gas, right. It's trying to get more oxygen to the tissues and organs that need it.
Makes sense. So what about the blood pressure then?
Blood pressure can be a little trickier. It can be influenced by so many things, like the severity of the exposure, the person's age, any underlying health conditions they might have, even just their emotional state.
So it's not always a clear-cut indicator.
Right. And that's why it's so important to monitor those vital signs continuously in these situations. We need to see how the patient is responding over time, not just get one reading and call it a day.
The textbook also mentions the possibility of long-term effects from chlorine exposure. What are some things people should be aware of, even after that initial incident is over?
Yeah, so even though many people do recover completely, some experience some lingering effects. Like there's this condition called reactive airways dysfunction syndrome, or RAS. Yeah. And essentially, it's a lung condition that can develop after someone inhales irritants like chlorine gas. And it causes symptoms that are, well, they kind of mimic asthma.
Okay, so what kind of symptoms are we talking about?
Things like wheezing, coughing, shortness of breath, that feeling of tightness in the chest. Imagine having a persistent cough or, just feeling like you can't quite catch your breath, even weeks or months after the exposure.
Wow.
That's the reality for some people who develop RADS.
That sounds really debilitating. It really makes you realize that these chemical incidents aren't just about the immediate danger, there's this whole other layer of potential long-term consequence.
Exactly.
And it really underscores the importance of, well, prevention, preparedness, and prompt medical attention.
Couldn't agree more.
Before we move on, I want to touch on something else from the case study. It mentions that the patient was actually participating in this demonstration to earn some extra money.
Oh, wow.
And it just struck me because, it makes you think about the risks people might take without fully understanding the potential consequences.
Yeah, it's a really important point. I mean, we often associate chemical incidents with these large-scale industrial accidents or, acts of terrorism. But the reality is they can happen in everyday settings too.
Right.
And sometimes the people who are most at risk are the ones who are, well, maybe unaware of the potential hazards, or they feel pressured to participate in things that, could put them in harm's way.
It really highlights the importance of awareness. Knowledge, not just for the first responders, but for everyone.
Absolutely. The more we know about the chemicals in our environment and the risks that come with them, the better equipped we are to make, informed decisions and protect ourselves.
Speaking of knowledge, I think it's time to shift gears a bit and explore that aspect a little further. What do you say?
Let's dive in.
So we were just talking about the importance of knowledge and awareness when it comes to these chemical incidents. Where's a good place to start for the average person who wants to be more prepared?
Well, I think a good starting point is just understanding the chemicals you might encounter in your everyday life. Take a look around your house. Cleaning products, pesticides, even some pretty common household items, they can all pose a risk if they're not handled properly.
So read those labels, follow the instructions.
Exactly. Know how to store them safely, dispose of them properly. And if you work with chemicals, at your job, make sure you're familiar with all those workplace safety procedures. And of course, make sure you have access to the right protective equipment.
The PPE.
Right, the PPE.
So that's at home, at work. What about community preparedness? Are there resources out there to help people learn about these chemical hazards and how to respond if there's, an emergency?
Absolutely. A lot of communities have these emergency management agencies or public health departments, and they offer all kinds of information and training programs.
That's great.
Yeah, they can give you guidance on things like evacuation routes, what to do if you need to shelter in place, what to do if there's a chemical release.
So it's worth reaching out to those local resources.
Definitely. And don't forget about, just basic first aid. Knowing how to rotation, all that can make a huge difference, in those first few minutes before professional help arrives.
Those simple steps can really, really make a difference. We've explored the science, the immediate and long-term dangers, the treatments, and of course that critical importance of preparedness. This has been, well, a true deep dive.
It has. It's been fascinating to, really break down this complex topic with you.
And to our listeners, we hope this deep dive equips you to better understand and prepare for these situations should they ever arise. Stay curious, stay informed, and as always, stay safe. Until next time, happy diving.
All right, so today we're diving headfirst into emergency medicine.
Oh, yeah.
Specifically, we're focusing on gynecological emergencies.
Right.
Those really urgent and complex cases
Yeah.
affecting women of childbearing age.
Yeah.
You sent over some case studies, and honestly, just skimming them, my pulse was racing.
Well, they really highlight the importance of a rapid and accurate diagnosis in these scenarios.
Yeah.
They can be very high stakes.
Absolutely. We're going to be looking at two cases.
Okay.
The first one is a 27-year-old woman
Okay.
who's in a hotel room,
Right.
hit with severe abdominal pain, and then we'll move on to a train station in Manitoba.
Okay.
And this is another woman who is dealing with really intense lower abdominal pain, discharge, and chills.
Okay.
So let's jump right in. This first case, this one's a real nail-biter.
Well, good.
Our patient is 27 in a hotel room, doubled over in pain. Her vitals show that she's conscious, strong radial pulse, but her skin is pale and clammy. She's also breathing shallowly, which I think is an immediate red flag.
Right. Shallow breathing can indicate a lot of things.
Right.
But in this context, could suggest the body is trying to compensate for something.
Exactly,
And-
yeah. The pain is sharp. It's localized in her lower right abdomen. And here's where things get really interesting. So she mentions having back pain for about 2 weeks and took some medication for it, but earlier today the pain became more generalized. Now it's localized and way more intense. And she also notes she had her period a few days ago.
I have to admit, my mind went straight to possible pregnancy complications.
No, it's a natural leap, especially when you consider her age and the localized pain.
Right.
But what's interesting here is that the source material really emphasizes
Yeah.
how crucial a thorough sexual history is
Yeah.
in these situations.
Yeah.
It even goes so far as to say that, missing this piece of the puzzle
Wow.
can be the difference between life and death. Wow, that's a powerful statement. Makes you realize how even seemingly unrelated details can be so important in these cases.
Absolutely. And, in this case, the combination of her age, the localized pain, her recent period, it all points to the need to rule out
Yeah.
pregnancy-related complications as quickly as possible.
Of course. And so the medical team jumps into action: oxygen, IV fluids, pain management, all the initial steps to stabilize her.
Right.
But then she becomes lethargic. She starts bleeding vaginally. Not good.
Definitely not.
Right.
Lethargy and vaginal bleeding.
Yeah.
In this context,
Yeah.
could indicate internal bleeding.
Yeah.
And the situation
Yeah.
has escalated quite dramatically.
All right, so I think it's time to address the elephant in the room, or, well, the fallopian tube, perhaps. The source material poses a key question. What are the predisposing factors for ectopic pregnancy?
Okay.
Could you break that down, why that's such a dangerous possibility?
Sure. So in a nutshell, an ectopic pregnancy happens when a fertilized egg implants outside the uterus,
Right.
most commonly in the fallopian tube.
Yeah.
The problem is, as the embryo grows, it can rupture the fallopian tube,
Wow.
causing massive internal bleeding. It's a life-threatening condition,
Yeah.
requiring immediate surgery.
So you have this ticking time bomb situation going on. I'm on the edge of my seat. They transport her to the hospital ASAP. But I have to ask, what makes diagnosing ectopic pregnancy so tricky? Because wouldn't an ultrasound confirm it right away?
You'd think so.
Yeah.
But it's not always that straightforward.
Okay.
Early on, an ectopic pregnancy might not be visible on an ultrasound,
Okay.
especially if the embryo is very small.
Okay.
Plus, the symptoms can mimic other conditions
Right.
like appendicitis
Right.
or a ruptured ovarian cyst.
So you're dealing with a lot of unknowns. It's like solving a medical puzzle with incredibly high stakes.
Yeah.
I imagine it's this dance between ruling out the most dangerous possibilities,
Yeah.
but also, managing the patient's pain and anxiety.
Absolutely. And this is where, a physician's experience
Right.
and judgment
Yeah.
really, really come into play.
Wow. Yeah. I can only imagine the pressure.
Yeah, they have to weigh
Yeah.
the risks and the benefits of different diagnostic tests and treatments, all while making sure that the patient feels heard and supported.
I can only imagine. So let's say you're the doctor in this scenario.
Okay.
You have this patient with excruciating pain, possible internal bleeding,
Yeah.
and the specter of ectopic pregnancy looming.
Right.
What kind of, diagnostic tools would be most helpful at this stage?
Well, a pelvic exam would be essential,
Yeah.
but it wouldn't necessarily provide a definitive diagnosis
Okay.
of ectopic pregnancy.
Okay.
We'd also need blood tests
Right.
to check your HCG levels,
Right.
which is the hormone produced during pregnancy.
Okay.
And then transvaginal ultrasound
Yeah.
would be the gold standard for visualization.
Okay, so it's a multi-pronged approach, but what if the ultrasound is inconclusive or the HCG levels aren't clear-cut?
Right.
What happens then?
That's where things get really interesting.
Okay.
Sometimes we have to rely on what's called a diagnostic laparoscopy.
Okay.
It's a minimally invasive surgical procedure
Okay.
where a tiny camera is inserted through a small incision in the abdomen.
Yeah.
And it allows us to directly visualize the fallopian tubes
Okay.
and other pelvic organs.
So it's almost like a detective going undercover to get a closer look at the crime scene.
Exactly.
Yeah.
It's our way of getting definitive answers
Yeah.
when other diagnostic tools
Yeah.
have reached their limits.
Yep. Wow. So much can happen behind the scenes in these situations, and to think this all started with a woman in a hotel room just trying to manage her pain. All right, so we've unpacked this first case, explored the complexities of ectopic pregnancy, and even touched on the ethical considerations involved in managing these emergencies. Now let's shift gears to our second case,
Okay.
which unfolds at a train station. We have another female patient,
Okay.
but this time she's battling lower abdominal pain, vaginal discharge, and chills.
Okay.
This case presents a very different set of challenges,
Yeah.
but it's just as urgent. I
Good.
mean, the location itself, I think, adds another layer of complexity.
Right.
Because the medical team might have limited resources
Right.
and equipment at their disposal.
Yeah, it's a whole different ballgame
Yeah, totally.
when you're not
Yeah.
in a hospital setting.
Right. So let's break down what we know about this patient. She's experiencing sharp pain, no radiation, started 2 days ago, and it's progressively gotten worse, especially with movement. She describes the pain as quite severe. But here's the kicker. She's been self-medicating with the birth control pills and penicillin.
That detail immediately
Yeah.
piques my interest.
Okay, why is that?
Self-medication, especially with antibiotics, can sometimes mask
Oh, okay.
or complicate the underlying issue.
Okay.
It's a reminder that we always need to get a complete picture of the patient's history, including any medications they've been taking.
Right, right. It's like trying to solve a puzzle when someone's rearranged some of the pieces. What I find really interesting is that she mentions the pain intensified right before the call for help. What's the significance of that, especially in the context of her other symptoms?
Well, that sudden intensification of pain,
Yeah.
coupled with the vaginal discharge and chills, could point towards an acute infection. And considering her age and the fact that she's self-medicating with penicillin,
Right.
one possibility that jumps to mind is pelvic inflammatory disease.
Okay. PID.
PID, okay.
Okay.
Now, for our listener who might not be familiar with this condition, can you explain what it is and what causes it?
Absolutely. PID is an infection
Okay,
of the female reproductive organs,
okay,
and typically it's caused by bacteria,
okay.
often the same bacteria that cause sexually transmitted infections,
Got it.
like chlamydia and gonorrhea.
Okay.
And it can lead to some pretty serious complications if left untreated.
Like what?
Yeah.
What kind of complications? Because I'm getting the sense this is more than just your run-of-the-mill infection.
You're right. It's not something to take lightly.
Okay.
PID can lead to chronic pelvic pain,
Oh, wow.
infertility, and even increase the risk of ectopic pregnancy. Wow, so the stakes are high here too. And this poor woman is at a train station trying to manage this pain on her own. I'm guessing the medical team didn't waste any time getting her to the hospital.
Absolutely not.
Yeah.
Given the potential severity of PID,
Yeah,
rapid transport and treatment are crucial.
okay.
In the meantime, they would have focused on stabilizing her vital signs,
Right.
providing pain relief, and gathering as much information as possible.
Right. So again, we see that importance of that initial assessment and intervention. It's all about buying time while they figure out the best course of action.
Exactly.
Now, the source material has a bunch of questions about PID.
Okay.
Things like, what are the typical signs and symptoms? And why is the knees to chest position beneficial during transport?
Okay.
I'm hoping you can shed some light on those.
Sure, sure. The classic signs and symptoms of PID include lower abdominal pain,
Okay.
fever, chills,
Yeah.
vaginal discharge,
Yeah.
and painful urination.
Okay.
Now, the knees to chest position might seem a bit odd,
Yeah.
but it actually serves a very practical purpose.
Okay.
It helps to relax the abdominal muscles and reduce pressure on the pelvic organs,
Makes sense.
which can be incredibly tender
Yeah.
and inflamed
Yeah.
with PID.
So it's not just about comfort. It's actually about minimizing the pain and potential complications.
It is.
I love that they even considered that detail.
It highlights the importance of considering
Yeah.
the patient's overall well-being
Yeah.
throughout the entire process,
Yeah.
from initial assessment
Right.
to transport
Yeah.
and treatment.
It's like a holistic approach
It is.
to emergency care. I love that. Okay, so we have these two very different cases here,
Yeah.
but I think they share a common thread.
Okay.
Sudden, severe abdominal pain in women.
Right.
And as we've seen, both situations have the potential to become very serious very quickly.
Exactly.
Yeah.
And that's why it's so important for us to understand these conditions, to
Mm.
be aware of the red flags,
Yeah.
and to know when to seek
Yes,
medical attention without delay.
absolutely. Knowledge is power. And I think this is a perfect segue into the next part of our deep dive, where we're going to delve deeper into the diagnostic process, explore those tricky questions from the source material, and unpack what makes these situations so unique and challenging.
I'm looking forward to it.
Me too.
Yeah.
These cases really highlight, I think, the incredible skill and dedication of those working in emergency medicine.
Yeah, they really do.
It's amazing. All right, stay tuned, folks. We're just getting started. Welcome back to the deep dive. We're really getting into the weeds here with these gynecological emergencies, exploring these situations where minutes can really make all the difference. As we've been discussing these cases. One thing that keeps striking me
Yeah.
is the sheer amount of information the medical team has to process
Right.
in such a short amount of time.
It's true. It's true. These cases are like
Yeah.
fast-paced puzzles where you're
Yeah.
you're constantly gathering clues, trying to piece together the bigger picture. All the clock is ticking.
Exactly. And to make things even more challenging,
Right.
the source material highlights that a lot of these conditions
Mm-hmm.
can mimic each other
Yeah.
in the early stages.
Right.
So you might have two patients presenting with very similar symptoms, but the underlying causes could be totally different.
Right.
How do they even begin to narrow it down?
Well, that's where the art and science of medicine
Yeah.
really come together.
Okay.
It starts with a thorough patient history, listening carefully to their description of the pain,
Right.
its location, intensity, duration, and any associated symptoms.
Right.
And then, of course, a physical exam is crucial,
Okay.
focusing on the abdomen and pelvic area.
Okay. That makes sense. But let's talk about some of those tricky questions from the source material. So in both cases, the medical team initiated those essential first steps.
Right.
Oxygen, IV fluids, pain management.
Right.
But then when it comes to the actual diagnosis, things get a bit more complex.
Uh-huh.
In the first case, with the suspected ectopic pregnancy, we touched on ultrasound, blood tests, but what about PID? How do they confirm that diagnosis?
Well, with PID, a pelvic exam
Yeah.
can be very revealing.
Okay.
It allows the physician to assess for tenderness, masses, or any abnormal discharge.
Okay.
But to solidify the diagnosis, we often rely on laboratory tests.
Such as, give us the inside scoop.
Sure, sure. We typically order a complete blood count to look for signs of infection, like an elevated white blood cell count.
Okay.
We might also do a urinalysis to rule out a urinary tract infection,
Okay.
as those can sometimes present with similar symptoms.
Right.
So you're essentially trying to rule out
Yeah.
other possibilities
Mm.
while gathering evidence to support the PID diagnosis.
Yeah.
It's like building a case piece by piece.
Exactly. Yeah. It's like a medical whodunit.
It is. It is.
Now, in some cases, you might even perform a laparoscopy,
Right.
similar to what we discussed with the ectopic pregnancy.
Correct.
It allows you to directly visualize the fallopian tubes, ovaries, and surrounding tissues to look for signs of inflammation or infection.
Yes, and sometimes laparoscopy
Yeah.
can even be therapeutic.
Okay.
For example, if there's a pelvic abscess, which is a collection of pus,
Yeah.
the surgeon can drain it during the procedure.
Okay, so we have these diagnostic tools at our disposal, but the source material also raises a really interesting question about PID.
Okay.
It asks, why is the knees to chest position so beneficial during transport?
Okay.
We touched on this briefly before, but I'd love to kind of dive a little deeper into the reasoning behind it.
Sure. It might seem
Yeah,
like a small detail,
yeah.
but patient positioning can actually make a big difference in these situations. The knees to chest position helps to relax the abdominal muscles and decrease pressure on the pelvic organs, which can be incredibly tender and inflamed with PID.
So it's not just about comfort, it's actually about minimizing pain and potential complications. That's brilliant.
It is. And it highlights
Yeah.
the importance of considering the patient's overall well-being
Yeah.
throughout the entire process.
Yeah.
From initial assessment to transport and treatment.
Yeah, it's like a holistic approach. I love that. Okay, so we've delved into the diagnostic process, but now I want to shift gears a bit and talk about the psychological impact of these experiences,
Sure.
because I imagine it must be incredibly frightening to be in that much pain,
Right.
unsure of what's happening to your body.
Absolutely. These situations can be incredibly stressful and anxiety-provoking for patients. They might be worried about their fertility,
Yeah.
the potential for surgery,
Yeah.
or even the possibility of a life-threatening condition.
Yeah.
And on top of that, they might be feeling embarrassed or ashamed, especially if their symptoms are related to their sexual health.
That's such an important point. We often talk about the physical aspects
Yeah.
of these emergencies,
Right.
but the emotional and psychological components are just as significant.
Absolutely. Yeah.
How can medical professionals address those concerns and provide support in such a high-pressure environment?
Well, first and foremost, it's about creating a safe
Yeah,
and non-judgmental space for the patient
right.
to share their concerns.
Right.
Active listening,
Yeah.
clear communication,
Yeah.
and empathy
Yeah.
can go a long way in easing anxiety and building trust.
That makes sense. It's about treating the whole person, not just the symptoms. But I'm also curious about the role of patient advocacy in these situations.
Sure.
Because let's face it, when you're in excruciating pain,
Yeah.
it can be really hard to think clearly
Yeah.
and advocate for yourself.
You're absolutely right. And that's where friends, family members,
Yeah.
or even patient advocates
Right.
can play a vital role. They can help to ensure that the patient's voice is heard,
Yeah.
that their questions are answered, and that they feel supported throughout the process.
So it's a team effort with everyone working together to provide the best possible care.
It is.
Now, I want to circle back to something we mentioned earlier.
Okay.
The fact that many of these conditions can mimic each other
Right.
in those early stages.
Yeah.
This leads me to a question that's been swirling in my mind.
Okay.
What are some of the red flags that should prompt immediate medical attention, even if you're not sure what's going on?
That's a great question.
Yeah.
And I think it's important to emphasize that you should never hesitate to seek medical attention if you're experiencing severe abdominal pain,
Okay.
especially if it's accompanied by other symptoms like fever, chills, vaginal bleeding, or a change in your vaginal discharge.
So it's better to err on the side of caution.
It is.
Yeah. Yeah.
It's always better to be safe than sorry.
I love that advice.
Yeah.
And, as we've been discussing these cases,
Mm-hmm.
I've been thinking a lot about the importance of self-awareness and knowing your own body.
Right.
Because sometimes those subtle changes or nagging symptoms
Right.
can be early warning signs
Yes.
that something's not quite right.
Absolutely. Paying attention to those signals
Yeah.
and being proactive about your health
Yeah.
can make a world of difference.
Totally.
And it's especially important for women to be aware of the potential risks and complications
Yes.
associated with the gynecological conditions.
I couldn't agree more. Okay, so we've covered a lot of ground
We have.
in this deep dive.
Yes.
We've explored these two incredibly complex cases, delved into the diagnostic process, and even touched on the psychological and emotional aspects of these emergencies. But before we wrap up, I just want to take a moment to acknowledge the incredible skill and dedication of the medical professionals who handle these situations every day.
I couldn't agree more.
Yeah.
They're true heroes,
Yeah.
working tirelessly behind the scenes to save lives and alleviate suffering.
It's so inspiring to see their expertise, their compassion, and their unwavering commitment to patient care. Now, I know we've thrown a lot of information at you, so let's just take a moment to distill some key takeaways. What are the most important things our listeners should remember from this deep dive?
Well, I think the biggest takeaway is the importance of recognizing
Yeah.
the potential severity of gynecological emergencies.
Right.
Severe abdominal pain,
Yeah.
especially when accompanied by other concerning symptoms,
Yeah.
should never be ignored.
Absolutely. And we can't stress enough the importance of seeking medical attention promptly, even if you're unsure of what's happening. It's
Yeah.
always better to err on the side of caution.
Absolutely.
Okay.
Another key takeaway, I think, is the power of communication. Being open and honest with your healthcare provider about your symptoms, concerns, and any relevant medical history is crucial for accurate diagnosis and effective treatment.
Yes, and don't forget the importance of patient advocacy.
Yes.
If you or someone you know is experiencing a medical emergency, having someone there to advocate for your needs and ensure that your voice is heard can make a world of difference.
You've hit the nail on the head. Knowledge is power.
Yeah.
And feeling empowered to advocate for yourself
Right.
or for someone you care about
Yeah.
can be incredibly valuable in these situations.
Exactly. Okay, we're coming up on the end of our time for this deep dive, but before we sign off, I want to leave our listener with a final thought. These cases have highlighted the incredible complexity of women's health and the importance of being proactive and informed. But they've also showcased the remarkable resilience of the human spirit and the power of medical expertise to make a real difference in people's lives.
Beautifully said.
Yeah.
And I think that's a perfect note to end on.
I don't know about you, but after going through those cases, I'm in awe of the medical professionals who deal with this stuff every day.
Yeah, it's really amazing. That combination of knowledge and quick thinking and compassion they have to have is really remarkable.
It's like they're medical detectives.
It is.
Piecing together these clues from the patient's history and their symptoms and the test results to try to arrive at the right diagnosis, and all under this immense pressure,
Right.
knowing that a patient's life could hang in the balance.
Exactly. And let's not forget the importance of communication.
Right.
They need to explain these complex medical concepts
Yeah.
to patients who are likely in pain and feeling anxious, and all making sure that the patient feels heard and understood.
Yeah, it's a delicate balance.
It is.
And speaking of communication, one thing that stood out to me from the source material was the emphasis on obtaining a thorough sexual history.
Right.
And I imagine that can be a delicate conversation to navigate, especially in an emergency setting.
Absolutely. It's a sensitive topic, and it requires a great deal of tact and empathy on the part of the medical professional, but it's essential information for accurate diagnosis and treatment, particularly in cases of suspected PID or ectopic pregnancy.
Right, because those conditions are often linked to sexually transmitted infections.
Right.
And so understanding the patient's sexual history can really help guide those treatment decisions.
Exactly. And it's important to remember that medical professionals are trained to approach these conversations with sensitivity and confidentiality.
Right.
Their goal is to gather the information they need to provide the best possible care
Yeah.
without making the patient feel judged or uncomfortable.
That's really reassuring to hear.
Yeah.
And I think it highlights the importance of building that trust between the patient and their healthcare providers.
Absolutely. Trust is the foundation
Yeah.
of any strong doctor-patient relationship.
Right.
And in these high-stakes situations, it's more important than ever.
So we've talked about the importance of seeking medical attention promptly when experiencing severe abdominal pain, but let's say you're not the one experiencing the symptoms. What if it's, a friend or a family member or even a stranger who's in distress?
Right.
What can we do to be good allies in those situations?
That's a great question. Sometimes just being present and offering support can make a world of difference.
Yeah.
Encourage them to seek medical attention. Offer to accompany them to the hospital. Help them communicate their symptoms to the medical team.
Yeah. It's about being an advocate
It is.
for someone who might be, feeling overwhelmed or unable to advocate for themselves.
Exactly. And remember, even if you're not a medical professional,
Yeah.
you can still provide valuable support.
Right.
Listen attentively, offer comfort, and help them navigate the often confusing world of emergency medical care.
Those are great tips. And I think it speaks to this broader theme of community and supporting each other,
It does.
especially in times of need.
Absolutely.
Well, I think as we wrap up this deep dive into these gynecological emergencies, I'm left with a sense of awe, I think, for the resilience of the human body
Yeah.
and these incredible advancements in medical science that allow us to diagnose and treat these really complex conditions.
I agree. I hope our listeners have gained a deeper understanding of these emergencies and the importance of seeking timely medical care
Yes.
and the power of being informed and empowered advocates for their own health
Yeah.
and the health of those around them.
I think that's a perfect way to sum it up. Remember, knowledge is power, and taking the time to learn about these important health issues can make a real difference in your life and the lives of those that you care about. Stay curious, stay informed, and stay well.
Hey, everyone. Welcome to our deep dive. Today, we're going to be looking at something pretty incredible.
Yeah, childbirth.
Oh, yeah, right. Childbirth from the EMT's perspective,
Exactly.
using their training manual
Yeah.
is our source material today. So are you ready to see what it takes to bring new life into the world?
I think it's going to be fascinating to see what these EMTs encounter on a daily basis and, the kinds of skills they need to handle these really intense situations.
Well, let's jump right into it then. One thing that really struck me when I was looking through this textbook was just how much emphasis they place on effective communication. Why is that so important in the context of childbirth?
Well, think about it. You've got a patient who's in pain, probably anxious, and, on top of that, there's a whole new human about to enter the world.
Right.
So clear communication helps the EMTs build trust with the mother, get those vital pieces of information, and, even coordinate with other medical personnel who might be arriving on the scene. It's all about creating a calm environment amidst, what can be a really chaotic situation.
Okay, so let's put that into practice, shall we? Let's meet our first mom-to-be. Natasha, a 22-year-old woman experiencing her second pregnancy.
Okay.
She's in rapid labor, and things are progressing quickly.
Got it. So the textbook points out that Natasha's heart rate is elevated 168 beats per minute. That's not unusual during labor, but it is something that EMTs monitor closely.
Right.
And here's where it gets interesting. The baby's head is already visible.
Oh, wow.
This delivery is happening N-now-W.
Talk about a home birth with a sense of urgency.
Mm-hmm.
What steps do the EMTs need to take when a delivery is imminent like this? They don't have much time.
No, they have to act quickly. The textbook really emphasizes the importance of supporting the baby's head, making sure the umbilical cord isn't wrapped around the neck. And, they might need to suction the baby's airway if necessary. Constantly monitoring both the mother and baby for any signs of distress.
Wow, that's incredible. Okay, let's shift gears a little bit. Our next case involves a bit of a curveball. It's a breech birth. This time we've got a baby girl named Ashley who's decided to make her entrance feet first.
Wow. Okay, so breech births definitely add a layer of complexity. The textbook actually provides a really helpful visual here.
Oh, does it?
It does. It shows the baby's feet protruding first instead of the head. Really drives home the point that, EMTs need to be prepared for anything.
And I was thinking, I can imagine that this changes their entire approach to the delivery.
Oh, absolutely.
Yeah.
Instead of, focusing on supporting the head, they need to carefully guide the baby out, make sure that the umbilical cord isn't compressed.
Right.
And they might even need to reposition the mother, which is so crucial for safe delivery.
Oh, wow. Yeah.
But you can imagine that that's pretty tricky in a situation like this.
Yeah, for sure. And the textbook also mentions increased anxiety in the mother during a breech birth. Understandably so, right?
Absolutely. Think about it. You're expecting a certain kind of delivery, and then suddenly things are completely different. It's got to be terrifying.
For sure. It sounds like emotional support in a situation like this is just as important as, the actual physical actions that they're taking.
Oh, 100%.
Yeah.
The EMTs really need to project a sense of calm and confidence, even if they might be feeling a little bit of pressure themselves.
Yeah, okay, so for our final case today, things take a much more serious turn. We meet Marie-Louise, a 35-year-old woman who's experiencing sharp abdominal pain, vaginal bleeding, and low blood pressure.
Oh, that's concerning. Those are all classic signs of abruptio placentae, a condition where the placenta separates from the uterine wall prematurely.
Wow. Okay, and how serious is that?
It's life-threatening. Imagine this. The placenta is the lifeline between the mother and baby.
Right.
And it's being severed. So this is a true medical emergency.
So every second counts.
Absolutely. The textbook really emphasizes the need for rapid transport to a hospital. And the EMTs need to be very vigilant in monitoring those vital signs throughout transport.
Wow. Okay, so I'm curious. The textbook briefly mentions these mnemonics, Gravida and Para, that EMTs use.
Oh, yeah.
What are those all about?
They're really useful tools that help EMTs quickly gather and assess a pregnant woman's history, which is crucial in understanding, potential risks and complications.
Oh, okay. So it's like a shortcut to crucial information.
Exactly.
Okay, so break it down for us. How do they actually work?
Okay, so gravida refers to the number of times a woman has been pregnant,
Okay.
regardless of the outcome. So if a woman has been pregnant 3 times, she's considered gravida 3, whether those pregnancies resulted in live births, miscarriages, or abortions.
Okay, so Gravida gives us like a broad view
Yes.
of her entire pregnancy history.
Exactly. And that's where Paravia comes in. This one provides more specifics about the outcomes of those pregnancies.
Okay.
It stands for the number of births a woman has had. It's further broken down into full-term births, premature births, abortions, and living children.
Wow. It's like a mini history of her births.
It is. It's a very concise way of communicating all that information.
Wow, that's incredible.
Yeah.
Okay, so let's recap for a second. We've got 3 very different cases here. We've got a seemingly routine delivery that became urgent, a breech birth that required some special techniques, and then a really life-threatening situation with the abruptio placentae.
It's a really good snapshot of the diverse challenges that EMTs face in the field of obstetrics. Each situation demands quick thinking and decisive action.
Yeah, it really makes you appreciate the depth of knowledge and skill they need to have.
Absolutely.
Just reading through those test your knowledge sections in the textbook.
Yeah,
It's a lot to take in.
it is.
But before we move on to those key takeaways, is there anything that stood out to you so far? Anything that's really surprised you?
What's interesting to me is that while these cases highlight all these potential complications, Most births are actually joyful and natural events.
Right.
So I think this knowledge shouldn't create fear, but rather empower us
Right.
to understand those complexities and be prepared to act if needed.
Yeah, knowledge is power.
Right.
Okay, well, speaking of knowledge, let's unpack some more of those key takeaways in the next part of our deep dive.
Welcome back to our deep dive into the world of obstetrics.
I was thinking about that question you posed at the end of the last part, and it's really sticking with me. It's one thing to read about these emergencies, but it's quite another to imagine ourselves actually facing them.
It really puts things into perspective, doesn't it?
It does. But before we jump back into the thick of things, what were some of those key takeaways from the cases we discussed in the last part that really resonated with you?
Well, for me, it's got to be the importance of rapid assessment. In each scenario, the EMTs had to make those split-second decisions.
Yeah.
Gather crucial information about the mother, the stage of labor, any potential complications, and it all had to happen so quickly.
And based on that assessment, they have to figure out the next steps.
Exactly.
Right.
Do they need to transport her immediately? Can they deliver the baby safely right there?
Yeah.
It's a lot of pressure.
It is, and I think that's where those mnemonics we talked about come in handy, right?
Oh, absolutely. Gravida and Para, they provide that concise snapshot of the patient's history, which can be crucial in those first few moments.
Okay, so let's revisit those then. Remind us again how Gravida works.
Sure. So Gravida tells us the total number of pregnancies a woman has had,
Right.
regardless of the outcome. So whether it's a live birth, a miscarriage, or even an abortion, each pregnancy counts towards that number.
Okay, so if a woman has been pregnant 4 times, she'd be considered Gravida 4, even if only one of those pregnancies resulted in a live birth.
Exactly. It gives us that full picture of her pregnancy history. And then we have Para,
Right. Para?
which is all about the out things of those pregnancies.
Okay.
So it stands for the number of births, and it's broken down even further. We've got full-term births, premature births, abortions, and living children.
Wow, so it's like a mini medical history.
It is. It's like a secret code that unlocks all this important information.
So if a woman has had 2 full-term births, 1 premature birth, and 1 abortion, her PRA would be 2113, with the 3 representing her 3 living children.
Exactly. You got it.
Okay, that's fascinating. I'm starting to see how valuable these acronyms can be in a high-pressure situation.
Oh, they're essential. They help EMTs assess risk factors and
Yeah.
potential complications more effectively.
Yeah, that makes sense. So we've talked about rapid assessment, those handy mnemonics. What about the APGAR score? The textbook mentioned it briefly.
Oh, yeah, the APGAR score. That's a fantastic tool for quickly assessing a newborn's health right after they're born.
Okay, but refresh my memory on how it actually works.
Sure. So it's based on 5 key categories: appearance, pulse, grimace, activity, and respiration. Hence the acronym APGR.
Oh, right. I get it now.
Each category is scored from 0 to 2, with 2 being the best possible score.
So the higher the score, the better the baby is doing.
Exactly. A perfect APGAR score is a 10. But anything above a 7 is generally considered healthy.
Okay, but what if the score is low? What does that mean?
Well, a low score, especially in those first few minutes after birth, can indicate that the baby needs some extra help.
Oh.
Maybe they need oxygen or suctioning. It's a crucial piece of information that guides their immediate care.
So it's like a quick snapshot of the newborn's health.
It is. It's incredible how much those 5 simple observations can tell us.
So we've got rapid assessment, mnemonics, the APGAR score.
Yeah.
What other challenges do you think EMTs face out there in the field when responding to these obstetric emergencies?
Well, one of the biggest challenges is the environment. They're rarely working in a sterile, controlled hospital setting.
Right.
They might be in a patient's home, on the side of a road, even in the back of a moving ambulance.
Oh, wow. Yeah, that adds a whole other layer of difficulty.
It does, and they often have limited resources and personnel available.
So they really have to think on their feet.
Oh, absolutely. They need to be resourceful, quick thinking, and adaptable.
It's like being a medical MacGyver.
Right. But let's not forget about the emotional side of things. These EMTs are dealing with patients who are going through one of the most intense, life-changing events imaginable.
And sometimes those events don't go according to plan.
Exactly. So
Yeah.
they're encountering a lot of fear, anxiety, sometimes even panic.
It sounds like they need to have strong emotional intelligence as well as medical expertise.
Oh, for sure. They need to be able to provide reassurance and support,
Right.
maintain clear communication, and, stay focused on the medical tasks at hand, all while managing their own emotions and stress.
Yeah, that takes a special kind of person. And the textbook mentions that continuous learning is so crucial in this field.
Yo, it's essential. Obstetrics is constantly evolving, new research, new techniques.
Right.
EMTs need to stay updated on the latest best practices and protocols if they're going to provide the best possible care.
So they're lifelong learners then.
Absolutely, they're always striving to improve their skills and knowledge.
It's inspiring to see that level of dedication. It really underscores their commitment to the well-being of both mothers and babies.
For sure.
We've covered a lot of ground here, but I want to make sure we highlight that one key takeaway for our listeners. What's the one thing you really want them to remember from this deep dive?
While we've discussed all these potential complications that can arise during childbirth, it's really important to remember that most births are joyful and natural events.
Right.
But having this knowledge, understanding those complexities, knowing there are skilled professionals who are trained to respond, it's empowering. It allows us to appreciate the miracle of birth even more.
Yeah, and recognize those incredible individuals who dedicate their lives to making sure it happens safely.
Exactly.
So before we wrap things up, what's been the most surprising or intriguing thing for you throughout this exploration of obstetrics?
What really struck me is just how much EMTs need to know and how quickly they need to apply that knowledge in those high-pressure situations. They're truly on the front lines of healthcare. They're making life or death decisions in the blink of an eye.
It's remarkable, isn't it?
It is. And I think it speaks to their skill, their dedication, and their resilience.
I agree. Well, we have time for one final thought before we conclude this part of our deep dive.
Okay.
What's something you want our listeners to ponder as they move forward with this new knowledge?
Okay. I want you to imagine yourself in the shoes of an EMT. You get a call about an obstetric emergency. The adrenaline's pumping. You arrive at the scene. Maybe it's a home birth. Maybe it's a car on the side of the road.
Right.
You assess the situation. You gather information. And you realize it's a breech birth. Or there are signs of abruptio placenta.
Oh, wow.
How would you react in that moment?
That's a powerful question. It makes you realize that knowledge is one thing, but applying it under pressure like that, well, that's a whole different ballgame.
Absolutely. It's about trusting your training, relying on your instincts, and staying calm amidst all the chaos.
It's about taking everything you've learned
Yeah,
and putting it into action when it matters most.
exactly. And hopefully remembering those mnemonics.
Right. Gravida, para.
Exactly. Well, this deep dive has certainly given us a lot to think about, hasn't it?
It has.
Yeah.
It's given me a whole new appreciation for the challenges and rewards of working as an EMT in the field of obstetrics.
Yeah. And on that note, we'll sign off for now, leaving you with that thought-provoking question to ponder.
Yeah, that's a question that really makes you think.
Yeah.
It's one thing to talk about it,
Yeah.
but to actually imagine yourself in that moment.
Yeah. And I think, it brings up a really important point. Even if we never actually find ourselves, in those shoes,
Right.
having that knowledge, that understanding,
Right.
it gives you a deeper appreciation
Yeah.
for the whole process and the people who are trained to handle it.
Absolutely. This deep dive has been incredible. We've tackled routine deliveries, breech births, the urgency of abruptio placentae. We even learned how to decode those mnemonics, gravida and para, which, to be honest, sounded a bit like a secret code at first.
Yeah, I think it's safe to say we're both fluent in gravida and para now.
Right. And the AFGAR score. Such a simple yet effective system for, quickly assessing a newborn's health.
It really is. It's amazing how much information those 5 categories can tell us.
Yeah. So as we wrap up today, what's one key takeaway you'd like our listeners to remember from this exploration?
Throughout this deep dive, we've focused on the technical aspects, right? The procedures, the complications.
Yeah.
But I think it's important to remember the human element.
Yeah.
Childbirth is such a profound experience. It's filled with joy, anticipation, and sometimes fear.
Right. And, we talked about the mother's anxiety during a breech birth, but can you imagine the emotions that the EMTs are encountering in these situations?
Oh, absolutely. I mean, they're dealing with expectant parents who are excited, nervous, terrified.
Yeah.
And all the while they have to remain calm, reassuring.
Yeah, it's a lot to handle.
It is. They're not just medical professionals, They're also caregivers. They're witnesses to this miracle of birth, but they also see the potential for things to go wrong.
It's true. It makes you realize that their work goes beyond the textbook.
It does.
It requires empathy, compassion, and a deep understanding of, that human experience.
And that's something we can all learn from, you know?
Yeah.
Whether we're witnessing the birth of a child, supporting a friend or family member through pregnancy, or simply encountering a pregnant woman, remembering that human connection. It makes all the difference.
It really does. Well, we've gained so much from this deep dive, knowledge, insights, and I think a newfound appreciation for just how complex childbirth can be.
Yeah.
And for the amazing people who work so hard to ensure safe deliveries.
Yeah, and for the strength and resilience of mothers.
Absolutely. So as we sign off today, we want to encourage you to stay curious and keep exploring. Remember, knowledge is power. And, even an event as seemingly routine as childbirth, well, it's full of wonder and challenges and the potential for extraordinary human connection.
And who knows, maybe this deep dive has sparked an interest in learning more about obstetrics. Or maybe you'll just look at childbirth with a newfound sense of awe and respect.
Right. Until next time, thanks for joining us. All right, get ready, because today we're diving deep into some pretty intense medical cases.
Oh, I'm ready.
These are all about pulmonary emergencies, stuff paramedics deal with every day.
You got it. Real-life scenarios, every second counts.
We've got a whole stack of case studies that you, the listeners, have sent in.
Yeah.
And we're going to break them down, figure out what's going on, see how paramedics approach these situations.
Awesome.
So by the end, you'll have a much better understanding of how to recognize respiratory distress.
Mm-hmm. And what to do about it.
Exactly. So, you ready to get started?
Absolutely. Let's dive in.
Okay. Our first case takes us to a home in Sudbury, Ontario.
All right.
22-year-old woman, let's call her Sarah,
Okay.
having trouble breathing for the past 4 days. Paramedics get there, find her in what they call tripod position,
Oh, yeah.
leaning forward, hands on her knees, gasping for air.
Classic sign of respiratory distress. You see that tripod position, you know it's serious.
Really, that's a big red flag.
Absolutely. It means her body's working overtime just to breathe, She's using every muscle she can to try and pull air in.
So the case study says Sarah has a history of asthma and was recently prescribed a new medication. Could that be playing a role here?
Oh, for sure. Asthma, airways narrow. It's like breathing through a straw, and a new medication, especially if not taken correctly, yeah, it could definitely make things worse.
So paramedics are thinking asthma. What do they do next?
Well, they'd listen to her lungs, right? And they're going to hear things like shallow breathing, decreased breath sounds, especially at the base of her lungs. And they're going to hear wheezing when she exhales.
Okay, yeah.
It's that whistling sound, like a balloon that's losing air.
I get it. And what about her vitals?
Heart's racing, oxygen levels are low, and her fingertips, they're probably turning blue.
That's not good.
No, it means her body's not getting enough oxygen, and it's starting to affect her circulation.
So this is serious.
Yeah, it is. Paramedics got to act fast. First, oxygen.
Almost like that emergency lifeline, that medications, maybe
Salbutamol.
Yeah, it's a bronchodilator, opens up the airway.
Oh, so that's the go-to for asthma attacks.
Usually. But in severe cases, they might need epinephrine.
Epinephrine.
It's like a supercharge,
Yeah.
Gets things moving.
Yeah.
Buys them time to get her to the hospital.
Wow. I'm already getting stressed just hearing about this.
Yeah, it's high pressure.
Okay, let's move on to our next case. A 25-year-old male, let's call him David.
All right, David.
He's just finished a basketball game, suddenly has this sharp chest pain, difficulty breathing.
Ooh, sudden chest pain. That's always tricky.
Yeah.
Could be a lot of things. But given his age, the activity, sharp pain, gotta think about a collapsed lung.
You mean a pneumothorax?
That's the one, yeah. Like, imagine your lung is a balloon in your chest, right?
Okay.
And it gets a tear. Air leaks out, lung collapses.
You can collapse a lung just from playing basketball.
It happens, especially in tall, thin people.
Huh, interesting.
So how would they know if it's actually a pneumothorax?
They'd check his breathing. They'll hear decreased breath sounds on one side, that collapsed lung, not much air moving. And his vitals, heart rate, breathing, skin color, all clues.
So what do they do? Like, can they fix it right there?
Not reinflate the lung on the spot, no. But they can give him oxygen, monitor him closely, get him to the hospital fast.
Okay, got it. Next up, we've got a 65-year-old male. Let's name him John.
John, okay.
Woke up with trouble breathing, history of asthma, and he's a smoker.
Ah, smoker. That adds other layer of complexity.
How so?
Years of smoking, it really damages the lungs,
Right.
makes them less efficient, like trying to breathe through a sponge.
Yikes.
Yeah, not good. So on top of asthma, you've got this underlying lung damage.
The case mentions supraclavicular indrawing.
Yeah, that's when the tissue above the collarbone sinks in when he breathes in.
Really?
It means he's using all these extra muscles, like in his neck and shoulders,
Wow.
to help him breathe.
So his body's really struggling.
Big time. It's like sending out an SOS, you know?
Okay, moving on. We've got an 80-year-old woman, Mary.
Mary.
She collapses at a museum.
Sudden collapse, especially at that age, gotta be worried.
Yeah, sounds scary.
First thing, paramedics assess.
Yeah.
Conscious, breathing, pulse,
Right.
bystanders. They can be really helpful here, you know?
How so?
They might know if she have any medical conditions, if there were any warning signs before she collapsed.
Okay, that makes sense.
Oh.
So she's confused, having trouble breathing, weak and irregular pulse, and there's swelling in her lower left leg. Is that important?
Swollen leg,
Yeah.
especially in someone her age, could be a deep vein thrombosis.
Deep vein thrombosis.
DVT, blood clot in her leg. And that can be a big problem.
How so?
It can travel to the lungs, pulmonary embolism.
Very dangerous.
So blood clot in the leg can, like, move to the lungs.
Yep, blocks blood flow. Life-threatening situation.
Vitals aren't good either.
Yeah, high blood pressure, rapid pulse, labored breathing. She's in trouble. Okay, so what can they do?
Oxygen. Monitor her heart. Get her to the hospital fast.
Wow, it's like every second counts in these situations.
Do bet.
Okay, last case in this set.
Yeah.
51-year-old construction worker. Let's call him Bill.
Construction worker, Bill.
Difficulty breathing, productive cough.
Productive cough, huh? Means he's coughing up phlegm. So something's irritating those airways.
Yeah, the case study says he's got a weak and irregular pulse, labored breathing, and his extremities are cool.
Okay, so his circulation might be compromised. What else do we know about him?
Well, he's a construction worker, so I'm guessing his job might be relevant.
Oh, yeah, absolutely. Dust, fumes, all that stuff. It can really mess with your lungs.
So what are we thinking here? Like, what could be causing all this?
Pneumonia, bronchitis, could be a respiratory infection, could even be something like COPD or heart failure. Gotta consider everything.
His vitals. Elevated heart rate, irregular pulse, low oxygen saturation.
Okay, so definitely needs oxygen, IV access for fluids and meds, close monitoring all the way to the hospital.
Wow. So we've gone from asthma attacks to potential collapsed lungs to possible blood clots.
Yeah.
It's clear that paramedics need to be ready for anything.
Absolutely. Quick thinking, thorough assessments, staying calm under pressure. It's amazing what they do.
It really is.
It is.
You know, these cases are just scratching the surface of pulmonary emergency.
Yeah, there's so much more.
But before we get too deep into the weeds, let's take a step back and highlight some of the key things we've learned so far.
Sounds good. What stands out to you? For me, it's the assessment piece. It's crucial. They have to be like detectives, you know, gathering all the clues,
Yeah.
symptoms, history, vitals.
That's like a medical puzzle, but with like a time limit.
Exactly. And the pressure's on. I mean, even talking about these cases gets my heart racing.
Oh, tell me about it. I'm getting anxious just listening.
Right. But that's their job every day. And what's crazy is how different each case can be.
That's true.
Yeah.
We've seen sudden onset, like with David and his chest pain, and then gradual worsening, like Sarah's asthma.
Exactly. So many ways respiratory distress can present.
Makes you wonder how they even prepare for all that.
Well, you can't anticipate everything, right? But solid training, a systematic approach, that's key.
Yeah.
But one thing's for sure. No matter the cause, oxygen and medications are vital.
It's like their go-to toolkit.
First line of defense, stabilize the patient, get him to the hospital.
Makes you appreciate what they can do in the back of an ambulance.
No kidding.
Speaking of those interventions, let's go back to Sarah for a second. Salbutamol and epinephrine.
Right.
What's the difference? When would they use one over the other?
Good question. So salbutamol, it's a bronchodilator, short-acting. It relaxes the muscles around the airways, helps them open up, you know, airflows better, like widening a road to ease traffic.
Makes sense.
It's usually the first choice for asthma attacks.
Okay.
Now, epinephrine, that's the big guns. It acts on the airways, but also the heart, the blood vessels.
Oh, wow.
Increases heart rate, blood pressure. You need that in those super severe cases.
Yeah. So it's about matching the treatment to the severity.
Exactly.
Now, with David, his collapsed lung, you said it's more common than people think.
Yep.
What else, besides those decreased breath sounds, would tip him off to a pneumothorax?
Good question. They'd check for tracheal deviation. That's when the windpipe shifts away from the collapsed lung.
Great.
Like a balloon deflating on one side pulls everything towards it.
Huh. Never thought about it that way.
And they check for subcutaneous emphysema.
Subcutaneous emphysema.
It's when air gets trapped under the skin. Feels crackly when you touch it.
Wow. So many things to look for.
It's all about the details. Now, John, the smoker with asthma, his case, it really highlights the damage smoking does.
Yeah, for sure. That supraclavicular indrawing you mentioned, that was a new one for me.
Oh, yeah. That's a sign he's working really hard to breathe.
Right.
Those muscles above the collarbones, they sink in when he inhales.
Wow.
Means he's using his neck and shoulder muscles to help pull air in.
Like his body's calling for
Yeah.
backup.
Exactly. The main respiratory muscles are exhausted.
Okay, so back to Mary, the woman who collapsed at the museum. That blood clot, that was scary.
Pulmonary embolism, yeah. Very serious.
What are some things that increase your risk of getting DVT?
Well, sitting for long periods, like on a plane or after surgery, that's a big one.
Right, so those airplane exercises are actually important.
They are. You got to keep the blood moving. Other risks, medications, smoking, obesity, family history.
Oh, wow, so many things.
It all slows down circulation, makes those clots more likely to form.
Got it. And last, Bill, the construction worker. His case really shows how our jobs can impact our lungs.
Yeah, environment plays a huge role. For those in similar professions, protection's key.
Like wearing a mask, things like that.
Exactly. Masks, respirators, anything to minimize exposure to dust, fumes, all that stuff.
Makes sense.
And regular checkups. Catch things early.
Prevention is key, right?
Always.
Okay, so much to unpack here. These cases, they're complex. And paramedics, they're incredible.
Truly are. On the front lines, making life-saving decisions every day.
But there's another side to this we haven't really talked about.
Oh, what's that?
We've talked about, the medical stuff.
Mm-hmm.
But what about the paramedics themselves?
Oh, yeah. That's important.
I mean, they see a lot of trauma, a lot of suffering.
It takes a toll, that's for sure.
What kind of impact does that have on them, emotionally?
Well, these are, real people dealing with intense situations day in and day out.
Yeah.
The emotional burden, it can be heavy.
Right, because it's not like they can just, switch it off at the end of their shift.
Exactly. It stays with you. You see someone fighting for every breath. It's hard not to take that home.
But what are we doing to support them?
Well, that's a good question. But we got to start talking about it, right?
For sure.
Compassion fatigue, burnout, these are huge issues in this field. They're giving so much all the time.
It's like they're the ones who need rescuing sometime.
It's true. We got to make sure they have access to mental health resources, Debriefing sessions after tough calls, a supportive work environment, it all matters.
It's true. We need to take care of those who take care of us.
Absolutely. It's about recognizing them, not just for their skills, but for their resilience.
These cases, they really highlight that.
Yeah.
Paramedics, they're heroes.
No doubt about it. Putting themselves out there every day.
This whole deep dive has been eye-opening. I feel like I understand pulmonary emergencies so much better now.
Me too. And it makes you appreciate those on the front lines even more.
For sure. It's not just about knowing the right treatments. It's about quick thinking, compassion.
Mm-hmm.
And I think, if our listeners take away one thing from this,
Yeah.
it's that even a little bit of knowledge about respiratory distress can make a difference.
Absolutely. Recognizing the signs, knowing when to call for help, it can be life-saving.
Okay, I think it's time to wrap up this deep dive.
Yeah, we've covered a lot.
It's been intense, informative, and, inspiring.
I agree. A real privilege to share these stories.
So, to everyone listening, thank you for joining us. Keep learning. Keep asking questions.
Keep those brains engaged.
And remember, if you or someone you know is experiencing respiratory distress, don't wait. Call for help.
Couldn't have said it better myself.
Until next time, stay curious, stay informed, and thank you for being part of the deep dive.
It's been a pleasure. See you all next time.
Welcome to our deep dive into the world of spinal trauma. It's one of those things you hear about, but maybe you haven't really thought deeply about until today. We're going to be dissecting a chapter from a trauma emergencies textbook. And trust me, it's full of real-life twists and turns that'll leave you with a whole new perspective on spinal injuries.
What's fascinating here is that it's not as straightforward as a broken bone. We're talking potential damage to the spinal cord, which can impact the entire body in ways you might not expect.
Or it's like a domino effect.
Yeah.
Speaking of unexpected, imagine yourself as a first responder arriving at a scene. A motocross accident in a remote national park. You find an 18-year-old named Dan lying face down after a nasty crash.
The hikers who found him said he's conscious and talking. His pulse is strong, but there's a catch. He's incontinent, both urine and feces, and although he says he can't move, he's not in any pain.
Wait, no pain? That seems odd given the situation. Isn't that a red flag?
It absolutely is. It could be a sign of spinal shock where the body's pain signaling is disrupted. Now, you might be thinking, how is that even possible? Well, the spinal cord is like a superhighway for information, and when there's trauma, those signals can get scrambled.
So it's not just the injury itself, but the body's response to it.
Yeah.
And get this, the textbook also mentions Dan having an erection. Now, I know this might sound a little out there, but
It's actually a possible symptom of spinal shock. The disruption of nerve signals can lead to what's called priapism.
wow, okay. That's definitely not something you typically associate with a spinal injury. Let's move on to Dan's vitals. His blood pressure and breathing are stable, and his skin is normal. But his EKG shows sinus tachycardia. What exactly does that mean?
Sinus tachycardia simply means his heart rate is elevated, which is a normal response to trauma. Think of it as his body going into overdrive trying to compensate for the stress.
So his body's kind of freaking out, which makes sense given the circumstances. So what happens next? What are the priorities for Dan's care?
The first priority is always airway management, making sure he can breathe properly. Then they'd immobilize his C-spine, basically stabilizing his neck, and whisk him off to a trauma center.
And why C-spine specifically?
Well, based on the initial assessment, the textbook suspects a possible C6 fracture. Now, you may be wondering, what's so special about C6? To understand that, you need to picture the spinal cord like a roadmap with different exits controlling various parts of the body. C6 happens to be a critical junction for arm and hand movements.
So a fracture there could have serious implications for his ability to use his hands. That's a scary thought.
It really highlights the delicate nature of the spinal cord and the potential for long-term consequences. Now, while we have Dan's case fresh in our minds, let's shift gears a bit and talk about Carly.
Okay, so Carly's story takes place at a party. She fell into a shallow pool, and now she can't move, complaining of severe back pain. Quite a different scene than Dan's motocross crash, right?
Yes, indeed. The mechanisms of injury are vastly different, and this underscores the point that spinal trauma can happen in unexpected ways.
And here's a key difference from Dan. Carly is feeling the pain, right?
Exactly. And that pain tells us the nerves responsible for pain signals are still working, which could suggest a different type of spinal injury than Dan's.
Interesting. So even the presence or absence of pain can provide valuable clues. Her vitals are stable, and her EKG is normal. What happens next in her case?
Given the potential for spinal injury, they'd carefully remove her from the pool, immobilize her spine, and transport her to the hospital for further evaluation. It's always better to err on the side of caution.
Okay, so both Dan and Carly have potential spinal injuries, but their presentations are completely different. What's the takeaway here for someone like me or, anyone listening?
What's fascinating is that these cases illustrate how diverse spinal injuries can be. Dan with no pain but signs of spinal shock, and Carly with localized pain and numbness. It highlights the crucial role of a thorough assessment looking beyond the obvious.
Right. It's like detective work piecing together the clues to figure out what's really going on. So it's not just about asking, do you feel pain? It's about considering everything. How the injury happened, vital signs, checking reflexes and sensation, getting the patient's history.
Absolutely. It's a holistic approach. Every detail adds to the bigger picture, and that's what guides treatment decisions and ultimately influences recovery.
Okay, so we've established that early intervention is key. But before we move on to treatment, I'm curious about something. You mentioned earlier that spinal cord injuries can have effects beyond what we typically think of. Can you elaborate on that?
Of course. Aside from the obvious physical impact, we need to consider the potential for spinal shock and neurogenic shock, both of which can disrupt the body's internal balance in profound ways.
Let's unpack those, starting with spinal shock. What exactly is going on there?
Think of spinal shock as the body hitting the pause button on the nervous system below the injury. It's a temporary loss of reflexes, sensation, and even movement.
So it's like the spinal cord is in shock, literally. And how long does this pause last?
That's the tricky part. It varies. It could be hours, days, even weeks. And here's something you might find surprising. Spinal shock doesn't always mean permanent damage. It's the body's way of protecting itself while it figures out what's going on.
Okay, so it's not necessarily a worst-case scenario. But what about neurogenic shock? That sounds a lot more intense.
Neurogenic shock is a whole different ballgame. It's not the spinal cord itself in shock, but rather the disruption of the autonomic nervous system, the control center for things like heart rate, blood pressure, and even temperature. Imagine the thermostat in your house going haywire because the wiring got messed up.
Okay, so it's a system-wide malfunction. And how does that play out in someone like Dan or Carly?
Well, imagine Dan with his suspected C6 injury. Remember how C6 is high up in the neck? Injuries above the T6 vertebra, about midway down your back, are particularly prone to causing neurogenic shock. This is because the nerves controlling those essential functions branch out from the spinal cord in that area.
So a higher injury means a greater risk of this system-wide chaos.
Exactly. And that's why recognizing the signs early on is crucial. Instead of the typical fight or flight response where your heart races and your blood pressure goes up, neurogenic shock presents a bit differently.
How so? What should we be looking for?
Think opposite. A slow heart rate, called bradycardia, a drop in blood pressure, hypotension, and even warm, flushed skin because the blood vessels aren't constricting like they normally would.
So it's not always the dramatic Hollywood-style presentation we might expect. It's almost like the body is shutting down.
In a way, yes. It's a loss of that sympathetic nervous system drive. And that's why prompt medical attention is critical. Treatment might involve fluids to boost blood pressure, medications to stabilize heart rate, and constant monitoring.
Wow, this is getting really intricate. So we've talked about the initial assessment, the potential for complications like spinal and neurogenic shock. But what happens next? Let's walk through the steps of managing a spinal cord injury.
Well, let's go back to the scene of the accident for a moment. You're the first responder. You see Dan lying there. What's your absolute top priority?
From what we've discussed, I'd say immobilization is key, right? Don't move him unless absolutely necessary.
Spot on. The golden rule is do no harm. Any unnecessary movement could worsen the injury. So you'd stabilize his neck with a cervical collar, get him on a backboard to support the entire spine, and make sure his head and neck are in a neutral position. No dramatic tilting back of the head like you see in the movies.
Okay, got it. Safety first. But what about his airway? We need to make sure he's breathing.
Absolutely. Airway management is vital, but it has to be done with extreme caution. There are specific techniques like the jaw thrust maneuver that allow you to open the airway without moving the neck.
I'm starting to see just how specialized this field is. Every move has to be calculated.
Exactly. And it's not just about what you do, but how you communicate. The paramedics on scene need to relay every detail: how the accident happened, Dan's condition, what they've done so far to the hospital team. It's a relay race against time.
So that the trauma team is prepped and ready to go when he arrives.
Precisely. And once at the hospital, things shift to a more in-depth assessment and stabilization phase.
What does that involve?
A comprehensive neurological exam is a must. It's like taking inventory of the nervous system, checking Dan's strength, sensation, reflexes, all the things controlled by the spinal cord. They'll also do imaging studies, probably a CT scan or MRI, to actually see the damage to the spine.
It's like putting together a puzzle, isn't it? Using all the pieces of information to understand the extent of the injury.
That's a great analogy. And based on that picture, the treatment plan is formed. It could range from conservative management with bracing and immobilization to surgery if things are more severe.
Let's talk about surgery for a moment. When would that be necessary in a spinal cord injury?
Surgery is usually reserved for cases where there's significant instability in the spine, compression of the spinal cord itself, or when those initial conservative approaches haven't worked. The goal is to stabilize the spine, prevent further damage, and hopefully improve neurological function.
So it's not a first resort, but a crucial option when needed. And what about recovery after surgery? What can patients expect?
Well, it's a long road, and I won't sugarcoat it. It can be tough. Rehabilitation is key. Physical therapy to regain strength and movement, occupational therapy to relearn daily tasks, maybe even speech therapy if communication has been affected.
It sounds like a multidisciplinary approach with different specialists working together.
Exactly. It's all about tailoring the program to the individual's needs and goals. And remember, it's a marathon, not a sprint. Patience and perseverance are key.
And support systems play a huge role, right? Family, friends, therapists.
Absolutely. That support network is vital for emotional well-being, for practical help, and for navigating the challenges that inevitably arise. It's a team effort.
Okay, so we've covered the basics of management, but I want to bring it back to Dan and Carly. How might all of this apply to their specific situations?
Let's start with Dan. Given his potential C6 fracture and signs of spinal shock, immediate immobilization, careful airway management, and close monitoring of his vitals would have been crucial during transport. At the hospital, imaging studies would have confirmed the diagnosis and shown the severity of the injury.
And because his potential injury is so high up, would surgery be more likely?
It's definitely possible. If the fracture is unstable or pressing on his spinal cord, surgery could be necessary to stabilize things and prevent further damage.
And what about his recovery? What might that look like?
Well, a C6 injury means his rehabilitation would focus on regaining as much function in his arms and hands as possible. He might need adaptive equipment to help him with daily tasks.
It sounds like he's got a tough road ahead. What about Carly? How would her management differ considering her potential L2 injury and those heel fractures?
First things first, those calcaneus fractures, the broken heel bones, would need to be addressed. Depending on the severity, surgery might be needed to repair them.
Ouch, that sounds painful.
It definitely can be. And those fractures would add another layer of complexity to her recovery. As for the potential L2 spinal cord injury, imaging studies would have been done to confirm the diagnosis and check for any damage.
Would surgery be on the table for her as well?
It's less likely with an L2 injury, especially if there's no pressure on the spinal cord, but if it's unstable, surgery might be needed to stabilize her spine.
And what about her rehabilitation? What would be the focus there?
Regaining strength and mobility in her legs would be a top priority. She might need to learn how to walk again, potentially with some help from assistive devices.
So both Dan and Carly would have long roads to recovery, but with different challenges. It's clear that spinal cord injuries, regardless of location, require a tailored approach.
Absolutely. It's not a one-size-fits-all situation.
Hmm.
And while we've focused heavily on the physical aspects, we can't overlook the emotional and social impact of these injuries.
You're right. Recovering from a spinal cord injury goes beyond regaining physical function. It's about adapting to a new way of life, and that can be incredibly challenging.
Imagine the emotional roller coaster. The shock of the injury, the fear of the unknown, the realization that life might be permanently different. It's a lot to process.
And then there are the practical hurdles, navigating a world that isn't always accessible, dealing with limitations, and potentially relying on others for help with things you used to take for granted.
Exactly. It's a huge adjustment, and it's easy to feel overwhelmed, frustrated, even isolated.
So what can be done to help people navigate those emotional and social challenges?
Yeah, that's where support systems become absolutely vital. Family, friends, support groups, therapists, they all play a crucial role.
How so? Can you give some specific examples?
Welcome back to our deep dive into spinal trauma. We've explored the medical side of things, the initial response, the complexities of treatment, and the long road to recovery. But now let's shift our focus to something equally important, the human side of spinal cord injuries. Yeah, it's crucial to remember that behind the medical terms and diagnoses are real people navigating life-altering experiences. They're facing challenges that many of us can't even imagine.
It's easy to get caught up in the technical aspects, but we can't forget the emotional and social ripple effects of these injuries.
Imagine the emotional turmoil someone goes through after a spinal cord injury. The initial shock, the fear of the unknown, the realization that life may never be the same. It's a profound and often overwhelming experience.
And those feelings are compounded by the practical challenges of navigating a world that isn't always designed for accessibility.
Think about it. Simple tasks like getting around, using the restroom, cooking a meal can become daunting obstacles. And that can lead to frustration, helplessness, and even social isolation.
It's a stark reminder that recovery isn't just about physical healing. It's about adapting to a new way of life, both emotionally and practically.
And that's where support systems come in. Family, friends, support groups, therapists, they all play a vital role in helping individuals navigate this uncharted territory.
It's about creating a safety net, a network of support that empowers individuals to rebuild their lives and find meaning and purpose in the face of adversity.
Loved ones provide emotional support, practical assistance, a shoulder to cry on. Support groups offer a sense of community, a space to connect with others who truly understand. And therapists provide coping mechanisms and tools for processing the emotional roller coaster that often comes with a spinal cord injury.
It's about fostering a sense of hope, helping individuals see that while life may be different, their dreams and aspirations are still within reach.
Exactly. We often see individuals with spinal cord injuries achieving amazing things, becoming advocates, athletes, artists, entrepreneurs. They challenge perceptions and redefine what's possible.
It's a testament to the resilience of the human spirit to overcome adversity and find strength in unexpected places.
It's a reminder that while spinal cord injuries present unique challenges, they don't have to define a person's life.
So as we wrap up this deep dive into spinal trauma, what key takeaways do you want to leave our listeners with today?
Remember, spinal cord injuries are complex with far-reaching consequences that extend beyond the physical. Early intervention is key, and that means proper immobilization and prompt medical attention.
We also can't forget the importance of rehabilitation, addressing not only physical function, but emotional and psychological well-being as well.
And above all, remember the importance of hope, resilience, and the incredible capacity of the human spirit to adapt and thrive in the face of adversity.
Well said. We've explored the science, the challenges, and the triumphs. As we conclude this episode, I encourage you to reflect on the questions we've raised. How can we as individuals and as a society create a more inclusive and supportive world for those affected by spinal cord injuries?
Let this be a starting point for ongoing dialogue and action. Let's advocate for accessibility, support research efforts, and foster a culture of empathy and understanding that values and embraces diversity in all its forms.
On that note, we'll leave you to contemplate these important questions and encourage you to continue exploring this fascinating and impactful field. Thanks for joining us on this deep dive. All right, welcome to another deep dive. Today we'll be looking at some intense scenarios from, a paramedic textbook, kind of like real-life cases. We're going to see what makes treating children so different from treating adults.
Absolutely.
We're going to try and put you, the listener, right into the action. That's right. We'll go beyond the textbook and really get into the nitty-gritty of what it's like to be a paramedic, facing these challenges.
Okay, so first scenario, picture this. Perfect sunny day, you're on shift, and you're just kind of thinking about what you'll have for dinner later.
And suddenly your pager goes off.
Oh yeah, and the call comes in. You're dispatched to a home where there's a 4-year-old child, unresponsive.
Right away, there's a sense of urgency to this. The child is found near a bunch of pill bottles scattered on the floor, and the medications are metoprolol, glyburide, also oxycodone, aspirin, and Vasotec.
Wow, that's a lot of different medications.
Yeah.
And for a child that young, that's a red flag. What are the potential dangers of that kind of mix? It's a dangerous cocktail, to say the least. You got metoprolol, that's a beta blocker, slows the heart rate. Then there's glyburine, that's for diabetes, and can cause dangerously low blood sugar. Oxycodone, as you know, is a powerful opioid painkiller, can suppress breathing. Aspirin, even in small doses, can be toxic to children. And then Vasotec is an ACE inhibitor, another type of blood pressure medication. The combined effect of these could be life-threatening for a child.
And to make matters even worse, the textbook says that the child's pulse is weak, at 60 beats per minute. Their breathing is shallow, noisy, and there's cyanosis around the lips. That means the blood isn't carrying enough oxygen. What are your immediate priorities as a paramedic?
First thing, secure the airway. Make sure that child can breathe. We'll start providing ventilations, assisting the breathing to get oxygen into their system. At the same time, we're assessing for any other injuries, and we want to establish IV access for fluids and medications.
So it's all about those quick life-saving interventions. But you mentioned earlier that treating children is different than treating adults. How does that play out in this kind of situation?
A child's body responds to medications and trauma differently than an adult's. Their airways are smaller, more easily obstructed. Their metabolisms are faster. Their organs are still developing. So we have to adjust our approach. For example, the dosage of medications. We have to carefully calculate it based on the child's weight.
Yeah, that makes sense. And I imagine the equipment you use has to be adapted for smaller bodies as well.
Exactly. We use specialized equipment designed just for pediatric patients. Smaller breathing tubes, IV catheters, things like that.
Okay, so you've got the child stabilized. Now imagine that the child starts seizing.
Okay.
What do you do?
A seizure in a child that has potentially overdosed on multiple medications is a critical situation. We need to protect them from injury during the seizure. So gently position them, make sure their surroundings are safe. Continue to manage the airway, provide oxygen, and we may administer a medication like diazepam to try and stop the seizure.
So even with everything else going on, you have to be prepared for those new complications.
That's the nature of emergency medicine, especially when it comes to children. They can deteriorate quickly. We have to be vigilant, adapt our treatment plan as needed.
It sounds intense. Really highlights that specialized knowledge and skills to care for these pediatric patients.
Speaking of challenging airways, now imagine you're called out on a frigid winter morning.
Yeah. You arrive at a home and before you even step inside, you hear it.
Hear what? Don't leave me hanging. A harsh, barking cough coming from inside the house.
Wow, I can only imagine. That must be concerning coming from a child. What could be causing that?
Well, that distinctive cough is a classic sign of croup, a common respiratory infection in young children. It's caused by a virus that inflames the upper airway, specifically the larynx and the trachea.
So when we talk about a child's airway being smaller and more easily obstructed, This is a prime example.
Mhm.
What are you looking for when you assess a child with suspected croup?
So in this case, the call is for a 7-month-old infant. And when we arrive, we see that the infant is pale and struggling to breathe. Their skin is warm to the touch. And again, you see that cyanosis around the lips, indicating those low oxygen levels.
This little one's in distress. How do you approach treating croup?
The first step is to provide humidified oxygen,
Okay,
almost like creating a mini sauna for their airway. The moisture helps to reduce inflammation and make breathing easier.
that makes sense. So why wouldn't regular oxygen be enough? Why humidified?
Well, with croup, the inflammation is specifically in the upper airway, and the humidified oxygen targets that area more effectively. Remember, a child's airway is much smaller than an adult, so even a little bit of swelling can significantly restrict their breathing.
So you're trying to soothe and open up those tiny airways as quickly as possible. But what if that's not enough? What other options are there?
In severe cases of croup, we might administer epinephrine. It's a medication that acts quickly to reduce swelling in the airway. It's a powerful drug, but it can be a lifesaver in these situations.
I see. So you're constantly assessing the severity and adjusting your treatment plan. Sounds like a delicate balance between providing relief and managing the risks.
Exactly. And that's something we'll see again and again as we explore more of these cases. The decisions we make as paramedics can have a profound impact on these young patients. So we have to be knowledgeable, adaptable, and always focused on their well-being.
Well said. And unfortunately, our shift isn't over yet. This next call is one that every paramedic dreads. You're dispatched to a highway accident involving a truck and a car carrying two young brothers, ages 7 and 10.
It's chaotic. First responders everywhere, and the wreckage is significant.
Is every paramedic's nightmare. What's the situation when you arrive?
Tragically, the 7-year-old is deceased. The 10-year-old, he's conscious, but he's disoriented. And that's a serious concern in itself.
Oh, that's heartbreaking. Can you imagine what that must be like for everyone? The surviving brother, the parents, even the first responders?
It's one of the toughest parts of this job, dealing with the loss of a child. We have to try to compartmentalize to focus on the surviving brother.
You're in a situation where every second counts. What kind of injuries does he have?
He's got multiple traumas, abrasions and cuts all over his body. His abdomen appears distended, and his pulses are weak.
So you're immediately thinking internal bleeding, shock. What are your top priorities in treating him?
In trauma situations like this, we talk about the golden hour. It's that first hour after a traumatic injury when getting the patient to definitive care, surgery, blood transfusions has the greatest impact on survival. We need to control any bleeding, stabilize his vital signs, and get him to a trauma center fast.
I've heard of the golden hour before. Why is it so critical, especially for a child?
Children can compensate for blood loss for a while, but they can crash very quickly. Their bodies just don't have the same reserves as adults. So that rapid transport to a trauma center equipped to handle pediatric trauma is essential.
That makes sense. But there's another layer of complexity here, right? The emotional impact of this accident. He just witnessed something horrific.
You're absolutely right. We're dealing with a child who is likely in shock, both physically and emotionally. So clear communication, compassion, reassurance. Those are crucial, even as we're performing these life-saving procedures.
I can only imagine how challenging that must be. To balance those urgent medical needs with the emotional needs of a child in that situation. It speaks to that incredible skill set required of paramedics, to be both highly trained medical professionals and compassionate human beings.
You hit the nail on the head. It's not just about the technical skills. It's about connecting with the patient on a human level, especially a child.
Okay, let's move on to a different type of emergency, one that can escalate very quickly. Imagine you get a call for a 6-year-old boy, sore throat that's rapidly gotten worse over the past few hours. He's drooling and struggling to breathe.
This raises immediate concern for epiglottitis. It's a serious infection that causes swelling of the epiglottis. That's the flap of tissue that covers the windpipe.
Epiglottitis. That sounds scary. What makes it so dangerous?
The danger is in the speed and severity of the swelling. It can happen so fast. And that swelling can completely block the airway, cut off airflow to the lungs. It can be fatal, especially in children.
So the symptoms you described, the drooling, difficulty swallowing, and noisy breathing, that's all because the airway is being obstructed.
Exactly. The drooling is because it's too painful to swallow. And that noisy breathing, it's also known as stridor. It's the sound of air struggling to get past the swollen epiglottis.
I'm guessing that when you arrive on scene like this, it's all about speed and knowing what to do. What's the approach to a potential epiglottitis case?
Our top priority is to keep the child calm. Any agitation can worsen that swelling and make things more critical. We provide humidified oxygen to try and reduce the swelling and transport them to the hospital quickly and safely as possible.
It sounds counterintuitive, but the textbook really emphasizes avoiding any invasive procedures like intubation, unless absolutely necessary. Why is that?
Because in epiglottitis, inserting a breathing tube could actually worsen the swelling and completely obstruct the airway. It's a delicate situation that requires a lot of judgment and a steady hand.
So you're racing against time, but you also have to be incredibly careful not to make things worse. It's amazing how much knowledge and experience goes into every decision a paramedic makes.
You're right. It's a constant process of assessment, reassessment, adaptation. No two cases are exactly alike, and that's especially true with children.
Okay, let's move on to our final case for this deep dive. Get ready, this one is tough. Imagine you arrive at a scene where an 8-year-old boy has been accidentally scalded with boiling water.
It's a scene that nobody wants to see. The child has blistering burns over his entire chest and abdomen, his scrotum, and parts of his legs.
Just hearing you describe it is difficult. Is he conscious?
Yes, thankfully he's alert and conscious, but he's in excruciating pain.
So you've got a child in agony with extensive burns. How do you even begin to assess and treat something like this?
Our approach to any emergency starts with the ABCs: airway, breathing, and circulation. In this case, we need to check if he's having any difficulty breathing due to potential airway burns or swelling. Then we focus on pain management. With burns this severe, pain relief is crucial.
I can imagine. Seems like with burns, it's so much more to consider than just the immediate pain. What else is important when you're dealing with burns, especially in a child?
Burn severity is determined by two factors: total body surface area, or TBSA, affected, and the depth of the burn. In this case, with burns covering such a large area of the child's body, we're dealing with a potentially life-threatening situation.
Why is TBSA such a big deal, especially when it comes to kids?
Because children have a much higher body surface area to body mass ratio compared to adults, this means that a burn that might seem relatively small in an adult can be much more serious in a child. It can lead to greater fluid loss, difficulty regulating their body temperature, and a higher risk of complications.
I see. So even though the burns might not look as extensive, the impact on a child's body can be much greater.
Precisely. That's why we use a specialized chart, the Lund and Browder chart, to estimate that percentage of TBSA affected in children. The proportions are different from the chart used for adults, reflecting the unique proportions of a child's body.
That's fascinating. Really highlights how much we have to adjust our thinking when we're dealing with these pediatric patients. So given the extent of this boy's burns, what are some of the complications you're watching for?
Infection is a major concern with burns, especially when they cover a large area. We're also concerned about hypovolemia. That's a decrease in blood volume due to fluid loss from the burn. And this can lead to shock. And depending on the location of the burns, respiratory distress can also occur if the airway is affected by the burn or by swelling.
It sounds like you're managing so many different things at once, all while trying to keep this little boy as comfortable as possible. What's the next step in his care?
He needs to be transported to a hospital, one with a burn unit. These units are specifically equipped to handle the complex care required for severe burns, especially in children. They have specialized teams of doctors, nurses, therapists who can provide the best possible care.
This deep dive has been incredibly eye-opening. We've covered a lot of ground from overdoses and seizures to croup, trauma, and severe burns. It's clear that pediatric care demands a unique set of skills and knowledge. What are some of the key takeaways you want our listener to remember?
The most important takeaway is that children are absolutely not just small adults. Their physiology, their anatomy, their emotional needs, all of it's unique, and it requires a specialized approach.
And we've seen that play out in every single case we discussed. The way you manage child's airway, determine medication dosages, even the way you communicate, it's all different.
Exactly. And I think it's important to highlight that emotional toll these cases can take on paramedics. We're dealing with children in vulnerable and often traumatic situations. Compassion, empathy, and clear communication are just as vital as any medical intervention.
Well said. As we wrap up this deep dive, I want to pose a question to our listener. What stood out to you most from these cases? What sparked your curiosity? We've only scratched the surface of pediatric care, and there's always more to learn.
And that's the beauty of knowledge, isn't it? It's an ongoing journey of exploration and discovery.
Couldn't agree more. We'll be back soon with more deep dives into other fascinating areas of emergency medicine. Until then, keep learning, keep asking questions, and remember, every patient, every call is a chance to make a difference. As we wrap up this deep dive into pediatric care, I keep thinking about all those subtle differences between treating children and adults. It's like a whole other level of expertise.
It is, it really is. And sometimes those subtle differences can make all the difference in the outcome. Let's revisit that first case. The 4-year-old, unresponsive, all those different medications.
Right, the metoprolol, glyburide, oxycodone, aspirin, and Vasotec. It was like a pharmacology quiz, just listing them all.
It was a complex mix, and it really highlights how critical it is for paramedics to understand those potential interactions between different drug classes,
Yeah.
especially in children.
So walk me through it. What kind of effects could that combination of drugs have on a child's body?
Well, you have to consider how each drug affects those different systems. Metoprolol, the beta blocker, can slow the heart rate and lower blood pressure. Glyburide for diabetes can cause dangerously low blood sugar, which can then lead to seizures and coma. Oxycodone, the opioid, suppresses the respiratory system, slows breathing. Aspirin can be toxic to children even in small doses and can cause bleeding problems. And then Vesotec, the ACE inhibitor, also lowers blood pressure.
So you've got multiple medications affecting the heart, blood sugar, breathing, blood clotting, all at the same time.
Exactly. And in a child whose organs are still developing and who may metabolize these drugs differently than adults, these effects can be amplified.
It's like a domino effect.
Yeah.
One problem triggering another. It really underscores the importance of gathering as much information as possible on scene.
Absolutely. Talking to caregivers, looking for those medication bottles, any clues that can help us understand what the child might have ingested is essential.
It's like detective work on top of providing medical care.
You could say that.
Let's shift gears back to that croup case with the 7-month-old infant. We talked about how epinephrine can be a lifesaver in those severe cases, but it's a powerful drug. Are there any risks involved in using it on, such a young child?
Well, epinephrine is a powerful drug, and like any medication, it has potential side effects. It can cause a rapid heart rate, anxiety, tremors. But in a situation where a child's airway is closing off due to the croup, the benefits of quickly opening that airway, they far outweigh the risks.
So it's a calculated risk, but one that you're trained to assess and manage.
That's right. We carefully calculate that dosage based on the child's weight, and we monitor them very closely for any adverse reactions.
Now, that highway accident with the two brothers, where one child tragically died and the other was seriously injured, it's a scenario that brings up so many questions. What if you're in a rural area, far from a specialized trauma center? How do you make those critical decisions about where to take a seriously injured child?
That's a tough situation, and it's one that paramedics in those rural areas face all too often. We have to weigh a lot of factors: the severity of the injuries, the capabilities of the nearest hospitals, the time it would take to transport that child to a trauma center.
So it's a judgment call based on experience and the specific circumstances.
Exactly. We have protocols and guidelines to help us make those decisions, but ultimately it comes down to using our knowledge and training to determine the best course of action. Sometimes that means stabilizing the child as best as we can and transporting them to the closest hospital, even if it's not a trauma center. Other times it means calling for air transport to get that child to a trauma center faster.
It sounds incredibly stressful.
It can be. But we train for these situations. We have a network of resources to support us. We also rely on each other, sharing knowledge and experience to make the best decisions for our patients.
And that brings us back to that burn case, the 8-year-old boy scalded with boiling water. We talked about how children have a different body surface area to body mass ratio than adults. Can you explain how that affects, how you assess and treat burns in children?
Sure. So we use the Lund and Browder chart to estimate that percentage of TBSA, total body surface area, affected by a burn. The proportions assigned to different body parts on that chart are adjusted for children. For example, a child's head and neck make up a larger percentage of their total body surface area than an adult's.
So a burn that might look relatively small on a child could actually represent a larger percentage of their TBSA, making it more serious than it might appear.
That's right. And that difference is critical in determining the severity of that burn and the appropriate treatment. Fluid resuscitation, for example, is crucial in burn patients to prevent shock, and it's calculated based on that TBSA. We also consider the depth of the burn, first degree, second degree, or third degree, because that affects healing and the potential for complications.
It's amazing how much goes into assessing and treating burns. It's so much more than just putting on some ointment.
Absolutely. It's a complex process that requires specialized knowledge and skills.
Well, I think we've covered just about every aspect of pediatric care in this deep dive. We've explored some really intense scenarios and learned a lot about the unique challenges of treating children in these emergency situations.
It's been a great discussion. I hope it's given our listener a better understanding of the dedication and expertise of paramedics who care for children in their most vulnerable moments.
I agree. And for our listener out there, we encourage you to keep learning, keep asking questions. The world of emergency medicine is vast and constantly evolving. There's always something new to discover. Until next time, stay curious, stay informed, and stay safe.
Have you ever heard of a condition where, like, a seemingly minor injury is actually masking something way more serious?
Oh, yeah.
Today, we're going to dive into compartment syndrome.
Ooh.
And trust me, this is a bit of a medical mystery. We've got two cases from the field that really highlight how tricky this condition can be.
Yeah, these cases are fascinating because they demonstrate that compartment syndrome can develop from a variety of injuries, and the external signs can be very deceptive.
Exactly. So in the first case, we have a road worker who's been injured in a blasting cap explosion.
Oh, wow.
Pretty intense, right?
Yeah.
His left hand took the brunt of it, but it's his right hand that's raising red flags.
Interesting.
And then in case 4.2, we've got a climber who is trapped under a collapsed wall with crush injuries to his legs.
Ooh.
So our mission today is to really understand compartment syndrome.
Okay.
What is it? What causes it? How can we recognize it quickly?
Right.
Because as we'll see, time is of the essence with this condition.
Early recognition is absolutely critical when it comes to compartment syndrome.
Okay, so let's start unpacking this with our first case, the road worker. He was conscious and alert when help arrived, but obviously had been through quite an ordeal.
But his vitals were stable, though. Blood pressure was 130/88, pulse 76, respirations 20. Looking at those numbers, you might think he's going to be all right.
Okay, so outwardly, things seem somewhat stable.
Right.
But here's where it gets interesting. Even though his left hand was the one directly hit in the blast, it was his right hand that was significantly more swollen, even though there was minimal visible trauma.
Interesting.
What's going on there?
So that's one of the hallmarks of compartment syndrome. You see, our muscles are surrounded by a tough, fibrous layer called fascia. Think of it as the casing that holds everything together, much like the skin on a sausage. And this fascia creates compartments within our limbs.
Okay, so that's where the term compartment syndrome comes from.
Exactly. Now, when there's bleeding or swelling within one of these compartments, the pressure starts to build up. And because fascia doesn't stretch easily, that pressure has nowhere to go.
So it's like trying to cram too much stuff into a suitcase that won't zip closed.
That's a good analogy.
Yeah.
And the real danger here is that this increased pressure begins to restrict blood flow to the muscles and nerves within that compartment.
So even though the road worker's right hand didn't suffer direct trauma, the blast likely caused internal bleeding and swelling within that hand's muscle compartments, leading to compartment syndrome?
Precisely. And without adequate blood flow, the muscles and nerves don't get the oxygen and nutrients they need. They essentially begin to suffocate.
Oh, that's terrifying. What can be done in a situation like this?
Well, the immediate focus is on rapid transport to a hospital. They'll need to manage his pain and potentially perform a surgical procedure called a fasciotomy.
A fasciotomy, what does that involve?
It's a procedure where they make incisions in the fascia to relieve the pressure within the compartment. Think of it as a pressure release valve. This allows blood flow to return to the affected muscles and nerves.
So it sounds like time is really critical here.
Absolutely. The longer the pressure continues, the greater the risk of permanent damage to the muscles and nerves. In severe cases, it can even lead to amputation.
Wow, that's a sobering thought. Let's move on to our second case, the climber who was trapped under that collapsed wall. 25 minutes is a long time to be pinned down like that.
It is, and the fact that he was experiencing some mild confusion when rescuers reached him is a red flag.
Oh, why is that?
Confusion can be a sign that the crush injury is having systemic effects. It could indicate that his body is struggling to cope with the trauma.
He wasn't in any pain, though. Isn't that a good sign?
Not necessarily. The absence of pain in crush injuries can actually be a warning sign. It could mean that there's nerve damage or that compartment syndrome is already setting in.
So how exactly does a crush injury, like in the climber's case, lead to compartment syndrome?
Imagine that wall pressing down on his legs for an extended period. That prolonged pressure causes significant damage to the muscle tissue, leading to swelling and inflammation.
Okay.
And as we discussed, When that swelling occurs within the fascial compartments, the pressure builds up and restricts blood flow.
That makes sense. So it's essentially the same mechanism as the blast injury, just a different cause.
Exactly. The takeaway here is that compartment syndrome can arise from a variety of traumatic events, and the external presentation can be deceiving.
So we can't just rely on outward appearances. We need to consider the mechanism of the injury and be aware of other signs and symptoms. But before we dive into those, I think it's time to take a quick break. We'll be back in a moment to explore the signs and symptoms of compartment syndrome and why recognizing them early is so crucial.
You know what's really interesting about compartment syndrome?
Hmm.
It's that the initial presentation can be so subtle. People might just think they have a bad sprain or a bruise.
Right, and I imagine that's what makes it so dangerous, right? Because you might just brush it off as a minor injury, and then by the time you realize it's something more serious,
Yes.
it could be too late.
That's exactly right. And to make things even more complicated, the affected area may not even look that bad externally. Think back to our road worker.
Right,
Minimal visible trauma to the right hand,
right.
but inside a very different story.
So we really can't rely on appearances alone. We need to pay close attention to those other signs and symptoms you mentioned earlier. What should we be looking out for?
One of the most telling signs of compartment syndrome is pain that seems out of proportion to the injury.
Okay.
If someone's experiencing excruciating pain after what seems like a minor bump or fall, that should raise a red flag.
Okay, so intense pain, even if the injury itself doesn't look that bad, could be a sign of compartment syndrome. What else?
You'll likely also see swelling, tightness, and tenderness in the affected area. And as the pressure builds, you might start to notice numbness or tingling as the nerves get compressed.
And since the muscles aren't getting enough blood flow, could weakness or difficulty moving the limb also be a sign?
Absolutely. Think of it like this. Your body is essentially sending you an SOS signal saying, hey, something's really wrong here.
So if we connect this to the bigger picture, what other situations besides blast injuries and crush injuries
Right.
could put someone at risk for compartment syndrome?
Well, it's not just limited to major trauma. Burns, snake bites, even intense exercise
Oh, wow.
can sometimes trigger compartment syndrome. Anytime you have that increased pressure within a muscle compartment,
Okay.
it's a possibility.
So even athletes pushing their limits could be at risk.
Yes, especially
But-
those participating in high-intensity activities like marathon running or weightlifting.
Right.
They need to be aware of the signs and symptoms as well.
This raises an interesting question. What can we do to prevent compartment syndrome? Is it even preventable in all cases?
That's a great question. And honestly, it's a complex one.
Yeah.
While we can't always prevent the initial injury, prompt and appropriate medical care is essential
Right.
to minimize the risk of compartment syndrome developing.
Okay.
For instance, if someone has a fracture, proper immobilization and elevation of the limb can help to control swelling.
And we've already talked about how crucial rapid extrication is in cases of crush injuries.
Exactly. Time really is of the essence with compartment syndrome.
Right.
The longer the pressure continues, the greater the potential for damage.
Okay, so we've covered what compartment syndrome is, what causes it, and how to recognize it. Let's shift gears a bit and talk about treatment.
Okay.
What can be done to address this condition once it's diagnosed?
Well, as we touched upon earlier, a fasciotomy is often the go-to surgical intervention.
Right.
It's essentially a pressure release valve for those affected compartments. By making incisions in the fascia,
Okay.
surgeons relieve the pressure and restore blood flow to the muscles and nerves.
That sounds pretty intense. Is a fasciotomy always necessary?
Not always.
Okay.
But if compartment syndrome is suspected, it's crucial to seek medical attention immediately. Early diagnosis is key.
Yeah.
Doctors will assess the severity of the condition, monitor the pressure within the compartment, and then determine the best course of action.
Okay.
Sometimes conservative measures like pain management and elevation might be enough. But in many cases, a fasciotomy is necessary to prevent permanent damage.
It sounds like a delicate balance between monitoring the situation and acting decisively when needed.
You're absolutely right. And it's a decision best left to medical professionals.
So if someone does undergo a fasciotomy, what's the recovery process like?
Well, it can be a bit of a journey. The wound is typically left open initially to allow for continued decompression,
Okay.
and then it's closed later on.
Okay.
Physical therapy is often involved to help regain strength and range of motion in the affected limb. It can be a long road, but with proper care and rehabilitation, most people make a good recovery.
That's reassuring to hear. But let's be honest, even with the best medical care, there's always a risk of complications, right?
Right.
What are some of the potential long-term consequences of compartment syndrome if it's not treated quickly and effectively?
You're right, there are potential risks.
Yeah,
Delays in treatment or misdiagnoses can sometimes lead to devastating outcomes.
right.
One possible complication is muscle contracture, where the muscle becomes permanently shortened and tight.
And I imagine nerve damage is a big concern as well.
Unfortunately, yes.
Yeah,
Nerve damage can lead to chronic pain, numbness, and weakness.
right.
And in the most severe cases, it could even result in amputation.
Wow. Those are some serious consequences. It really underscores the importance of early recognition and swift medical intervention. We've covered a lot of ground today exploring the complexities of compartment syndrome, from its various causes to the importance of timely treatment. Is there anything that stands out to you as the most critical takeaway for our listener?
For me, it's the deceptively subtle nature of this condition. Compartment syndrome can be lurking beneath seemingly minor injuries.
Hmm.
So it's absolutely crucial to be aware of those red flags. The pain that's out of proportion to the injury, the swelling, the numbness, the weakness. These are not signs to be ignored.
I couldn't agree more. It's a powerful reminder that we need to trust our instincts and seek medical attention if something doesn't feel right. We can't afford to downplay those signals our bodies are sending us.
Absolutely. And it's not just about being aware of our own bodies.
Right.
It's about being informed bystanders as well.
Yeah.
If you see someone who's been injured, don't hesitate to ask if they're experiencing any of the symptoms we've discussed. You might just save a limb or even a life.
That's such an important point. Sometimes we hesitate to get involved, but when it comes to potential medical emergencies, speaking up could make all the difference. You never know, you might be the one who helps someone get the care they desperately need.
Absolutely. We all have a responsibility to look out for one another, especially in situations where someone might be injured.
Right.
This deep dive has been incredibly eye-opening.
Yeah, it has.
It's amazing how such a seemingly straightforward injury can actually mask something far more complex and dangerous.
It really highlights the intricate workings of the human body, doesn't it?
Yeah,
There's so much going on beneath the surface
right?
that we often take for granted.
I think that's a great takeaway for our listener. This deep dive into compartment syndrome isn't just about learning the facts. It's about fostering a deeper appreciation for the incredible complexity and resilience of our own bodies.
I couldn't agree more. And with that understanding comes a sense of responsibility. We need to pay attention to the signals our bodies send us and advocate for ourselves when something feels off. Absolutely. We can't just assume that a seemingly minor injury will resolve on its own.
Right.
We need to be aware of the potential for complications like compartment syndrome and seek medical attention when necessary.
Knowledge is power. And in this case, it could be the key to preventing long-term damage or even saving a limb.
Well said. Before we wrap up, I want to leave our listener with a final thought, something to ponder as they continue exploring this topic.
Okay.
Considering the two cases we've discussed, how might the initial presentation of compartment syndrome differ depending on the location of the injury? Could it be more difficult to detect in certain areas of the body? It's a question worth considering.
That's an excellent point to consider. Compartment syndrome can be more subtle and challenging to diagnose in certain areas of the body, like the forearm or the foot, where the compartments are smaller and the signs might not be as obvious. It's a reminder to always stay vigilant and seek medical attention if you have any concerns, regardless of the location or apparent severity of an injury.
This has been a truly enlightening deep dive into the world of compartment syndrome. We've explored the causes, symptoms, treatment options, and most importantly, the critical need for early recognition and prompt medical attention. We encourage our listener to continue their exploration of this topic, delving deeper into the nuances and complexities of this often overlooked condition.
And remember, knowledge is power. The more you understand about your body and the potential risks it faces, the better equipped you are to stay healthy and safe.
Until next time, stay curious, stay informed, and stay well. All right, ready to dive deep. Today, it's trauma emergencies. Intense stuff, right?
Yeah, high stakes. We're focusing on hemorrhage and shock today. What happens when someone's losing a lot of blood?
Exactly. We've got some gripping medical textbook cases to unpack.
Real-life scenarios ripped from the pages of medical textbooks. Should be pretty fascinating.
We'll be looking at excerpts on how the body responds to that kind of trauma, plus 2 specific cases. The goal.
To help you guys recognize the signs of shock, understand the different stages.
Yeah, it's about seeing those subtle clues that can be easy to miss, but could make all difference.
We want you to walk away from this deep dive feeling more confident, like you can spot those critical situations.
All right, let's jump into the first scenario. Picture a crowded bar in Montreal, late at night. Things are getting a little rowdy,
It's case 3.1 from the textbook, the bar fight.
and it definitely lives up to its name. We've got a young guy who, well, he punches a glass door.
Not the best decision,
Hmm.
especially with tempered glass.
No kidding. Shatters into those nasty shards.
Yeah, recipe for disaster. So the paramedics arrive and find him conscious, but he's confused, disoriented.
His pulse is weak, barely there at the wrist. And there's blood. A lot of blood.
His vitals paint a pretty clear picture. Blood pressure is 80/60, heart rate is through the roof at 150,
Yeah.
skin's pale and clammy. Classic shock. His body's in full-on crisis mode.
Textbook calls this compensated shock, right? What does that even mean?
Think of it as damage control. His heart is racing, trying to pump what little blood he has left as fast as possible.
To try and maintain blood pressure.
Exactly. Even though he's losing volume fast, it's like trying to keep a sinking ship afloat.
Buying time.
Yeah, but that can't last forever. It's like running a marathon at a sprint. You're going to hit a wall. Hard.
Which brings us to the stages of shock.
Right. 4 of them. Initial, compensatory, decompensated, and irreversible.
And based on his symptoms.
Our bar fight friend is definitely in the compensatory stage. Still fighting, but without intervention, things are going to go south quickly.
So what needs to happen, like, right away?
The textbook highlights 2 immediate actions. First, direct pressure to stop that bleeding. And second, 4 fluids, stat.
Replace that lost volume.
Support those failing systems. Give his body a fighting chance.
The textbook also mentions his ECG. It shows something called sinus tachycardia. Should we be worried?
Sinus tachycardia just means his heart rhythm is fast, originating from the heart's natural pacemaker. Another sign his body is in distress.
Working overtime.
Exactly.
Uh-huh.
And based on what we see here, it's likely he's lost a significant amount of blood, somewhere between 25 and 35%.
That's a lot.
Yeah, it is. And it just goes to show that even injuries that might seem minor on the surface can have serious consequences.
All right, so we've got a handle on the bar fight, ready for a change of scenery.
Hit me.
Okay, picture this. A quiet Sunday night, June. A lone driver on a back road, suddenly out of nowhere.
A moose.
This is case 3.2, the moose collision.
Direct hit. The kind of impact that makes you wonder how anyone survives.
And to make things even more complicated, the driver. Oh, wow. Okay, that definitely adds another layer of concern.
Absolutely. Pregnancy can actually make it trickier to spot the typical signs of shock. That increased blood volume acts like a buffer, delays the drop in blood pressure.
So she might seem less injured than she actually is.
Exactly. Plus, we have to consider the baby. Fetal distress is a huge worry in these situations.
So paramedics arrive and find her a little confused, weak pulses at the wrist, some bleeding from a cut on her forehead. But what really stands out is how pale she is.
Vasoconstriction. Like her body's trying to pinch off a leaky hose, devote blood to those vital organs.
But her vitals might not scream critical right away.
You're right, they might not. But something tells me this is more serious than it looks.
The textbook mentions leg trauma, too. Makes me think about tourniquets. Stop the bleeding, right?
Yeah, but they're a last resort. Like a nuclear option. Can be life-saving, but there are risks.
How so?
They cut off blood flow completely, and when you release them, all those toxins that have been building up in that limb can flood back into the bloodstream. Not good.
A tough call, then. Weighing those benefits against the potential harm.
Exactly. It's a judgment call that requires a deep understanding of the situation and the potential consequences.
So much to think about in these scenarios.
That's why we're doing this deep dive, to help you make sense of it all.
Okay, we've covered a lot of ground with these first 2 cases, but there's still more to unpack. Stick with us as we keep digging into the details.
These cases really make you think about the bigger picture. Like, it's not just about knowing the medical terms, it's about connecting the dots, seeing the whole story.
Absolutely. I remember in that bar fight case, the textbook asked us to estimate how much blood he lost before the paramedics got there.
A good question, right?
Yeah.
Because it helps you understand how serious the situation really is. Remember, he had those classic signs of compensated shock. Blood pressure 80/60, heart rate 150.
Pale, sweaty.
Right, all pointing to significant blood loss. And when you put it all together, the textbook estimates he probably lost between 25% and 35% of his total blood volume.
Wow, that's a lot. There was another question about those stages of shock, too. Like, what happens as the body's trying to compensate for that blood loss?
Right, those 4 stages. Initial, compensatory, decompensated, and then irreversible. And in this case,
The bar fight guy.
clearly in the compensatory stage. His body's still trying to keep things running. Maintain that blood pressure, keep the vital organs going.
Throwing everything it's got at the problem.
Exactly. But if they don't stop the bleeding, if they don't get that blood volume back up, he moves into that decompensated stage. And that's when things get really bad.
Like, what happens then?
The body just can't keep up anymore. Blood pressure plummets, the heart weakens, organs start shutting down.
Because they're not getting enough oxygen.
Right. And that can lead to that final stage, irreversible shock. At that point, even if they do everything right, it might be too late.
Makes you realize how critical it is to act fast in these situations.
Every second counts. The textbook also asked about how much blood a typical person has, like a 70-kilogram person.
Seems kind of random.
But it's important, right? Because if you know a 70-kilogram person has about 5 liters of blood, then you can start to understand what losing even a small amount really means.
So if you lose 1 liter, that's 20% of your total blood volume.
Exactly. Helps put things into perspective. Then there's the whole clotting process, too.
Right, the body trying to plug the leak.
Yeah, it's complicated. But basically, the blood vessels constrict, platelets rush to the injury to form a plug, and then you get that fibrin clot to seal it all up.
Like a multi-layered defense system.
Pretty amazing, right?
Yeah.
Then there was that question about the ECG again, that sinus tachycardia.
Yeah, I'm still not totally clear on what that means for this guy.
Remember, it just means his heart is beating really fast.
Yeah.
And it's coming from that natural pacemaker in the heart. So basically, it's like his heart is trying to rev the engine, to compensate for that blood loss and keep his blood pressure up.
Makes sense. Oh, and there was that question about his medication too, right? The Ativan?
Yeah, important to know what meds someone's on because it can affect how you treat them.
Yeah.
Ativan, it's a benzodiazepine used for anxiety, seizures, that kind of thing.
So the paramedics would need to keep that in mind.
Absolutely.
Yeah.
And then that last question about the tourniquet, why it's a last resort for stopping bleeding.
Right, we talked about that, but why are they so risky?
Well, because you're completely cutting off the blood supply to that limb. So yeah, it can stop the bleeding, but it can also damage the tissue. And all those toxins build up in that area where there's no blood flow.
Yeah.
So when you finally release the tourniquet, they can flood back into the body. It can cause all sorts of problems.
So it's really a balancing act, huh? Weighing the risks and the benefits.
A tough call. All right, let's switch gears back to that moose collision. The pregnant driver.
Okay, yeah, that one was interesting.
Definitely adds another layer of complexity, right?
Mm.
The textbook asked about what the paramedics would be thinking about based on the mechanism of the injury. Like, how would the impact itself suggest she's already in shock?
I mean, hitting a moose at speed, that's a lot of force.
Exactly, and that force can cause all sorts of internal injuries that you might not see right away.
So even if her external injuries seem minor, she could be bleeding internally.
And remember, she was pale, sweating. Those are signs her body was already trying to compensate.
Right, right. The next question was about how much blood she might have lost based on what they saw.
Taking everything into account, the bleeding, the leg trauma, those weak pulses, the textbook estimates she lost somewhere between 1,500 and 2,000 milliliters of blood.
That's a lot.
It is, especially considering pregnant women have more blood volume to begin with. So even though she might not be showing those typical signs of shock.
Her body's definitely stressed.
Definitely. Oh, and the textbook mentioned a possible ankle fracture, too.
Right, right.
Important because fractures, especially pelvic fractures, can cause a lot of internal bleeding. Then there was the question about why those signs of shock might be delayed in a pregnant patient.
We talked about that a little, right? Something about the extra blood volume.
Right. It's like a safety margin, but it also makes it harder to tell how bad things really are. The textbook says a pregnant woman can lose up to 30–35% of her blood volume before you see those classic signs of shock.
Wow, that's a big difference.
Big difference. So you have to be extra careful with pregnant trauma patients. Can't just rely on the usual signs. There was also that point about how 10–20% of the blood flow gets shunted away from the uterus.
To help compensate, right. But what does that mean for the baby?
It means the mom's body is going to prioritize her own survival, even if it means taking blood away from the baby. A protective mechanism, but yeah, it can put the fetus at risk.
So they're both in danger.
It's a tough situation. The textbook also asked about the vasoconstriction. Remember that?
Vaguely. Remind me what that is again?
It's when the blood vessels narrow. It's actually a good thing at first. Helps shunt blood to the vital organs. But if it goes on too long, it can actually make things worse.
How so?
Well, it cuts off blood flow to the extremities. And in this case, it's probably because of those fight-or-flight hormones, the catecholamines.
Adrenaline.
Exactly. Essential in a crisis. But that prolonged vasoconstriction, it can cause problems. Tissues don't get the oxygen and nutrients they need.
Like clamping down on a hose. Stops the leak, but nothing gets through.
Perfect analogy. There was also that question about medications that are contraindicated during pregnancy.
Meaning they're not safe to use.
Right. Always important to consider a patient's medical history and medications, especially when they're pregnant. The textbook specifically mentioned folic acid and vitamin B complex as safe options.
So if she was on other meds, the paramedics would have to be really careful.
Absolutely. Got to weigh those risks and benefits. Then there was a question about her vital signs.
All right, what were those telling us?
Those weak pulses, the confusion, the paleness. All signs of shock. And finally, they asked about the specific type of shock she was experiencing.
Oh, right. There are different kinds, aren't there?
Yet based on how much blood loss there is and how the body's responding. In this case, with that estimated blood loss of 30–35%, the textbook suggests she's in class 3, maybe even bordering on a class 4 shock.
Okay, so remind me, what do those classes mean again?
Class 3 means significant blood loss, rapid heart rate, changes in mental state. Class 4, that's even worse. Dangerously low blood pressure, real threat to life.
She's in a bad spot.
Yeah, she is. That's why they need to act fast. Get her stabilized. Stop that bleeding.
These cases really highlight how much is going on beneath the surface. You know, it's easy to focus on the obvious injuries, but there's so much more happening inside the body.
And that's what we're trying to do here, right? Peel back those layers, understand how the body responds in these extreme situations.
It's all about connecting those dots.
Exactly. Now let's turn things over to you, the listener. Imagine you're the first responder at one of these scenes. What would you do first?
What would you be looking for to figure out how serious it is?
Think about what we've talked about today. Those signs and symptoms of shock, the different stages, how important it is to act quickly.
Makes you think, right. All those things to consider. It can feel overwhelming.
Yeah, but I think the big takeaway here is awareness.
Yeah.
You know, recognizing those signs, understanding the stages, that's what matters.
And knowing what to do. It's about being prepared, not panicking.
Right. And this deep dive, this is just the beginning.
There are so many resources out there. First aid courses, online stuff.
Even just reading more about trauma.
Exactly. Knowledge is power in these situations.
And sometimes it really is the little things that make a difference, like just stopping the bleeding, keeping the person warm, making sure they know they're not alone. Those things can buy precious time.
So as we wrap up this deep dive into trauma emergencies, we want to leave you with this. Be curious, you know? Don't shy away from these topics.
The more you know, the more prepared you'll be to handle whatever comes your way.
And you never know. Maybe someday that knowledge will help you save a life.
Maybe you'll be that calm voice someone needs in a crisis.
Until next time, stay curious and stay safe. All right, diving in, you guys have given us a really interesting set of materials to work with here.
Yeah, definitely.
Medical texts, case studies, and a lot of it seems to be centered around,
Chronic and terminal illness.
yeah, heavy stuff.
Absolutely.
But, I mean, that's why we do these deep dives, right?
Yeah.
So whether you are here because this is related to your work or for personal reasons, maybe you're just curious, we're going to try to help you make sense of all of it.
Yeah. We'll break down some of the jargon.
Yeah.
Definitely explore some ethical questions. Hopefully give you some new insights along the way.
Okay, perfect. So we're starting off with this excerpt. It's on chronic patients. And I think the big takeaway here is that paramedics really have to kind of be chameleons, right?
Right.
They've got to adapt to each patient's specific needs.
Exactly. And that's especially true with chronic conditions. You can't treat everyone the same.
No, absolutely not. Which brings us to case 29.1. This one throws us right into the, I guess you could say the deep end, right?
Yeah.
So we are in a suburban home. Family is frantic because their mother, who has cancer, is having a really hard time breathing.
Right away, you see this extra layer of complexity because she has a DNR order in place.
Right.
Do not resuscitate, which we'll get into a little bit later.
Yeah, definitely need to unpack that. But she's also under palliative care, which means that they're really focusing on comfort, quality of life. It's not always so black and white. You know?
Exactly. The paramedics get there and find her conscious, but she's confused, her breathing's shallow. But thankfully, she's got strong pulses.
Okay.
Vitals are a bit all over the place. Blood pressure 110/70, but it's irregular. Respirations are at 22, pupils are dilated. 4 + 4 = 8 millimeters, which tells the paramedics her brain might not be getting enough oxygen.
So they go a little bit deeper, notice some wheezing, her abdomen is distended, but no tracheal tugging. For those who aren't familiar, tracheal tugging is when the muscles around the neck pull in with each breath, it's a sign of a serious airway obstruction. So the fact that it's not there, that gives them some clues, but it's still a tricky situation.
Right.
They administer salbutamol, and this is kind of interesting. Her breathing actually improves enough that they're able to transport her to the hospital.
Yeah.
Okay, hold on. Back up a second. Why is that interesting? What does that tell us about what was going on with her?
It suggests that maybe the breathing difficulty wasn't only due to the cancer itself.
Okay.
The salbutamol, that's a bronchodilator, it opens up the airways. So the fact that it worked hints that there might have been something else happening, maybe a bronchospasm, which is like a sudden tightening of the muscles in the airways.
Ah, so even though she had a DNR, this intervention was appropriate because it wasn't about restarting her heart. It was about addressing a breathing issue that could potentially be treated. Okay, so that makes sense. This whole scenario, though, does bring up a big question, like how do paramedics balance a patient's wishes, especially when there's a DNR in place, against the concerns of a really frantic family? I mean, those are tough calls, especially in the heat of the moment.
Yeah, they really are.
And I think that leads us perfectly into these test your knowledge questions that come after this case. It really delves into the legality, the ethics surrounding these DNR orders. And something that you mentioned really stuck with me, which is that respecting the patient's wishes is paramount, even if the family disagrees.
Yeah, absolutely. And it's so important that there's clear communication here, right?
Yeah.
DNR does not mean do not treat.
Right.
It simply means do not resuscitate if their heart stops.
There's a big difference. I think a lot of people get that confused. And in a stressful situation like this, those nuances can get lost. So it really highlights the importance of having these honest conversations about end-of-life wishes long before you reach a crisis point.
Definitely. And it takes sensitivity to have those conversations too.
Right.
Yeah, you have to acknowledge the family's grief, understand that they're going through so many emotions at once.
Absolutely. Okay, so we've got this really complex ethical landscape around DNRs. And then we get case 29.2. And this one takes us in a slightly different direction. We're introduced to a man, he's struggling to breathe, and this time he's battling ALS.
Right. And this one adds another layer of difficulty because communication is limited by the progression of this disease.
Yeah, it's debilitating. His son's there, you can tell he's distressed, trying to help the paramedics understand what his dad's going through. The initial assessment, they find that he's conscious, breathing is labored, but again, he's got strong radial pulses. Vitals show blood pressure is 130/80. Respirations are 22, and his pupils are a bit constricted this time. 3 plus 3, totaling 6 millimeters.
Right.
They find out he's got a history of ALS, also hypertension. They assess him further. They find shallow respirations, and there's consolidation in the left lower lobe of his lung. What does that mean?
So that means that there's something filling up the air sacs in that part of his lung. Could be fluid, could be pus, even tissue. It's basically a sign that something abnormal is happening there,
Okay.
which could be a complication of ALS or an infection or something else altogether.
Got it. Thanks. So they've got this patient with ALS, difficulty breathing, and this lung issue. What's the plan?
So the focus is going to be on managing his airway, providing oxygen, and then just keeping a close eye on those vitals, make sure everything stays stable.
Okay, this case really made me want to understand ALS better. I thought those test your knowledge questions were actually super helpful for that. Can you kind of give us the rundown? What is ALS?
Yeah, so ALS, also known as Lou Gehrig's disease, it's a progressive neurodegenerative disease. So that means it gets worse over time.
Okay.
And what makes it so devastating is it specifically targets motor neurons, which are the nerve cells that control muscle movement.
And here's the thing, we still don't totally understand what causes it.
Right, the exact cause is still unknown. We know it involves this deterioration of upper and lower motor neurons, which are essential for all kinds of things, walking, talking, swallowing, even breathing.
Okay. And that's where something like a BiPAP machine comes in, right? I
Exactly.
remember seeing that in the materials.
Yeah. A BiPAP machine helps with breathing, especially at night. So it can really improve a patient's quality of life by giving their respiratory muscles a break, letting them sleep better.
But sadly, there's no cure for ALS. So it's all about managing symptoms and, like you said, just making the patient as comfortable as possible.
Right.
Which brings us back to these ethical considerations we were talking about earlier. How do we ensure that patients have a say in their care, especially as their condition progresses? How do we balance prolonging life versus maintaining quality of life? Tough questions. And it
Yeah.
seems like communication is key here.
It really is.
But before we get too deep into that, let's take a look at the medications that are mentioned in these materials. We're seeing a mix of drugs here that are commonly used for chronic conditions.
Like the ones we've been discussing.
Like, for example, there's Lasix, which is furosemide, a loop diuretic. So it basically helps the body get rid of excess fluid, which can be a problem for patients with heart failure, kidney disease.
Okay. Then there's Slow K, which is a potassium supplement. Why is that important?
Well, that's important because certain medications, like diuretics, they can deplete potassium levels in the body,
Oh, okay.
which can lead to other health problems.
Got it.
Then we have Pulmicort, brand name for budesonide. It's an inhaled steroid that's used to reduce inflammation in the airways. You'll often see it prescribed for things like asthma and COPD.
Makes sense. And of course, there's Salbutamol, better known as Ventolin.
Yeah.
We saw that in action earlier with the first case.
Yeah.
It's a bronchodilator, so it quickly opens up the airways, gives some relief when someone is struggling to breathe.
Right. And finally, there are two narcotics that are mentioned here. Diloted, which is hydromorphone, and MS-Contin, which is a morphine-based medication. And both of these are used for pain management, which is obviously a crucial part of palliative care.
Absolutely.
So we're seeing this whole mix of medications that are really aimed at managing symptoms, improving quality of life, and addressing that very real issue of pain. I'm already feeling like my brain is doing gymnastics trying to keep up with all this information.
Yeah. It is a lot.
Yeah.
But what really stands out to me is this theme of communication. Whether it's about respecting a DNR, explaining these complex medical terms, helping a family understand the realities of ALS, it all kind of boils down to clear, compassionate communication.
It really does. And for you listening, what's resonating with you so far? What questions are popping up in your mind? Hold on to those thoughts because we're going to keep exploring all of this as we continue our deep dive. You know, we've covered DNRs and ALS and all sorts of medications and just the weight of the decisions that, healthcare professionals and families have to grapple with in these situations. But there's something else in these materials that I think connects to all of this, and that's the stages of grief.
Well, that's a good point. Yeah.
They come up in the test your knowledge section. And, we tend to think of them, I think, in relation to death and dying.
Right.
But I think they have much broader implications, don't they?
Absolutely.
It's really about any kind of loss, isn't it?
Yeah.
Loss of health, loss of independence.
Yeah, loss of the life that you thought you would have.
Exactly.
And all of those things trigger that grieving process.
And it's not a linear thing, is it?
No, not at all.
It's not like you just kind of climb the stages,
Right. Those stages, the denial, anger, bargaining, depression, acceptance, it's not a staircase. It's messy. It's cyclical. You can bounce between them.
Absolutely. And it's not just the patient going through it. It's their family and loved ones too, right?
Exactly. It's like this ripple effect.
Yeah. And I think just recognizing those stages in yourself and others, that's where the real power is, isn't it?
Absolutely. It allows you to validate those emotions, offer support, meet people where they are.
Without judgment.
Right.
I keep thinking about that son in case 29.2 trying to advocate for his dad with ALS. You can just imagine the mix of emotions he must have been going through.
Oh, for sure. Fear, frustration, maybe even some guilt or anger. And understanding the stages of grief, it kind of gives us this framework for navigating those emotions, right? Both as individuals and as caregivers.
Yeah. And there's no right or wrong way to grieve, right?
Right. It's such a personal experience.
It is. And there's no timeline for healing either. Some people need more time. Some people need different kinds of support. Which kind of brings us back to the medical side of things. We saw a whole list of different medications, each one targeting specific symptoms. But, it strikes me that medication is really just one piece of the puzzle, right? Especially when we're talking about chronic and terminal illness.
You're absolutely right. True healing, particularly in these cases, goes so far beyond treating just the physical body.
It's about acknowledging the emotional, the spiritual, even the social needs of the patient. It's about making them feel heard and respected and empowered.
Exactly. And that's where those tough conversations, we were talking about them before, become even more important. What really matters most to this person? What are their hopes and fears? How can we support them on this journey?
It might be managing pain or offering emotional support, even just being present. There's so many ways to contribute to a patient's well-being.
Right. And even those little acts of kindness, they can have such a huge impact, not only on the patient, but their family and loved ones too.
It's about creating this circle of care where everyone feels supported and connected. I'm thinking back to those paramedics we talked about earlier, they walk into these really intense situations, and it's not just about medical procedures, it's about stepping into people's lives at their most vulnerable moments.
Right, and that takes such strength and compassion.
Absolutely. And looking at these cases, it's easy to get kind of bogged down by the weight of it all, but there's also this glimmer of hope there too, isn't there?
I think so. The way healthcare professionals and families try to navigate these challenges,
Hmm.
you know, with grace, with empathy, it's this beautiful reminder that even when you're facing suffering, that human connection can still shine through.
Absolutely. It really is a powerful testament to, I don't know, to the resilience of the human spirit.
It is.
We face these incredibly difficult situations. We wrestle with loss and uncertainty, but we find these ways to support each other, to find meaning, to find purpose.
It's amazing.
And on that note, I think it's a perfect time to pause and hear from you. What's sticking with you? What questions are swirling around in your mind? This is your space to process, to reflect, to really make these issues your own. Okay, so we've really explored the human side of things. The tough choices, the ethical dilemmas, the emotions. But there's another layer that we need to peel back here. And it's one that a lot of people might find intimidating. And that's the legal side.
Yeah, absolutely. I mean, we can't ignore the legal framework around all of this, right?
Yay.
DNR orders, advanced directives, even just the right to refuse treatment. It's not just about medical knowledge. It's about understanding the laws that govern these situations.
And I imagine those laws can get pretty tangled, especially when we're talking about something like, end-of-life care.
Right, yeah, and it gets even more complicated because those laws can vary depending on where you are.
Oh, that makes sense.
So something that's legally sound in one province might not be in another. So both healthcare professionals and patients really need to be aware of the specific laws in their region.
Okay, so it's not just about knowing the law, it's about knowing the right law.
Exactly. And, it's not about memorizing every single legal detail, but having a general awareness of those principles and then knowing where to go to find the right information when you need it.
And I think our source material actually touches on this a little bit. It talks about how crucial it is for paramedics to understand their legal duties and ethical responsibilities when they're responding to these kinds of calls.
Yeah, it is. Yeah, I mean, think about it. They're walking into these very intense situations. Maybe a patient's wishes are clashing with what their family wants, or there's confusion about a DNR. They need to know how to handle that both legally and ethically.
It's a huge responsibility. And again, it highlights how important clear communication and documentation are in these cases.
Oh, absolutely. Yeah, every decision, every action, it all needs to be documented. And it's not just for legal protection, it's so that everyone involved in the patient's care is on the same page.
Yeah, it really is a team effort. Like we were saying before, paramedics rely on information from doctors and nurses, social workers, and everyone needs to be sharing that information in a way that makes sense, that's timely.
Especially when time is so critical. I mean, clear communication can literally save lives.
Absolutely. Wow, we have covered so much ground in this deep dive. I'm a little overwhelmed, honestly. What about you? Are there any key takeaways that are really sticking with you?
Yeah. For me, it's this, I guess it's a reminder that healthcare isn't just about the physical stuff.
Right.
It's about respecting a patient's autonomy, their right to make decisions about their own body, and providing care with compassion, and just recognizing that there are all these layers, these medical layers, ethical layers, legal layers, emotional layers, and they're all intertwined.
Yeah, you can't separate them. It's about seeing the whole person, not just a diagnosis or, a set of symptoms.
Exactly. And remembering that each person's experience, their journey, it's unique. There's no one-size-fits-all approach to any of this.
I feel like these cases, these discussions, they've really challenged me to think differently about healthcare, both from a professional perspective and a personal one. I imagine it's been the same for you listening out there.
Yeah, I hope so. And I hope this deep dive has given you, some food for thought, maybe some new insights, some things to think about. But remember, this is just the start.
Yeah.
Keep asking questions, keep learning, and keep having those important conversations.
Because ultimately, it's about living a life that aligns with your values, making choices that feel right for you, and advocating for yourself and the people you love.
Couldn't have said it better myself. And on that note, we'll leave you with one final thought to kind of ponder. If you were the one in charge of training paramedics to navigate all of these really complex ethical and legal situations, what would you make sure they knew? What would be at the top of your list? Think about it, maybe talk about it with someone, and yeah, let's keep the conversation going. Thanks for joining us for this deep dive.
Welcome to the deep dive. Today we're diving into the world of toxicology and substance abuse,
Okay.
but not like in a lecture hall kind of way.
Right.
We're going to be using real case studies from a paramedic textbook to kind of understand how those folks think on their feet when every second counts.
Yeah, that's right. We're essentially going to be training you
Right.
to approach these situations like a first responder would.
Exactly. Now, you might be thinking, why would I need that? But have you ever been in a situation where someone was having like a bad reaction to something?
Oh, yeah.
Maybe too much caffeine or even just mixing medications?
Sure.
Understanding the basics of toxicology can help you stay calm and know what to do,
Absolutely.
which can literally be life-saving.
And what's interesting is that toxicological emergencies aren't always about illegal drugs or anything like that.
Right.
It could be something as simple as accidentally taking too much of a common over-the-counter medication.
Yeah. Okay, let's dive into our first case. Imagine this. You're at the gym, and you see someone collapse near the weights.
Oh, jeez.
That's Zhongyi in our first scenario. He's a middle-aged guy, conscious but confused, and his skin is flushed.
Okay.
We learn he has a history of fainting spells while lifting weights.
Yeah,
Already a few red flags, right?
definitely. And then you check his vitals.
Oh boy.
Blood pressure is sky-high, heart's racing like crazy.
Oh, wow.
Next to them are a couple of empty energy drink cans,
Oh.
which immediately raises a question for me.
Right, like how much caffeine did this guy have?
Exactly.
But there's another twist. Zhongyi admits to taking some energy pills before his workout.
Interesting.
Now, I know those supplements are popular,
Yeah.
but are they really safe?
That's where things get tricky. You see, some of these supplements contain ingredients like ephedra,
Okay.
which can have serious side effects on their own. But when you combine them with the caffeine from energy drinks,
You're in trouble.
you're essentially putting your cardiovascular system into overdrive.
Mm-hmm.
That explains Zhongyi's high blood pressure and rapid heart rate.
So it's not just about the individual substances, but also how they interact.
Exactly.
It's kind of like a dangerous cocktail.
Exactly. And what's really concerning is how common this combination is.
Yeah.
People often don't realize the potential risks they're taking by mixing these substances.
It's a good reminder to always read labels and be aware of what you're putting into your body.
Absolutely.
And to think we're only on our first case.
Yeah.
Okay, let's shift gears a bit and talk about Tammy.
Right.
This case highlights a different kind of toxicological emergency, one that's driven by emotional distress.
Okay.
We find Tammy on a couch, distraught and confused. She's been crying, feeling weak, and admits to taking a bunch of pills after a bad breakup.
Wow.
The empty pill bottle nearby is labeled orthotricycline low,
Okay.
which are birth control pills. Now, while a large amount of birth control pills isn't usually fatal,
Right.
it can still lead to serious complications. We might see nausea, vomiting, and even blood clots.
Yeah, that's right.
It's heartbreaking to think that someone would feel so desperate to take that kind of risk with their health.
Yeah.
It makes you realize that emotional well-being plays a huge role in these situations.
It's a crucial reminder that mental health and substance use are often intertwined.
Right.
Sometimes the substance is a way of coping with emotional pain,
Yeah.
but it can lead to even bigger problems down the road.
It's a vicious cycle.
Mhm.
And speaking of cycles, our next case brings us to Jeremy,
Okay.
who's experiencing a completely different kind of toxicological crisis. This one's less about emotional distress and more about well pain.
All right.
Jeremy is found clutching his stomach, pale and sweating.
Yeah.
He's complaining of intense stomach pain, and alarmingly, he's vomiting blood.
Oh, geez.
Yikes!
That doesn't sound good.
What caused this?
He reveals he took a large amount of aspirin, a common over-the-counter pain reliever.
Wait, aspirin?
Mm.
But that's in everyone's medicine cabinet. How can that be dangerous?
It's all about dosage. Aspirin, when taken in excess, can cause internal bleeding, which explains the blood in Jeremy's vomit. We also see his pulse is rapid and irregular, and his blood pressure is dropping.
Uh-oh.
Not good signs.
So what we're seeing here is that even seemingly harmless everyday substances can turn dangerous if misused or taken in excess.
Exactly.
Yeah.
It's all about understanding the potential risks and respecting the power of these substances. Now, before we move on, are you noticing any similarities between these cases so far?
Well, they all involve substances that seem pretty common. Energy drinks, birth control pills, aspirin.
Right.
You wouldn't necessarily think of those as dangerous.
And that's a great observation.
Yeah.
And that's exactly why toxicological emergencies can be so tricky.
Okay.
It's not always about illegal drugs or obvious poisons.
Right.
Yep.
It's a good reminder that anything can be harmful if not used responsibly.
Absolutely.
But how does this all connect to how our bodies actually react to these substances?
That's where things get really fascinating. Let's take a closer look at some of the major systems in the body and how they're affected. Think of your body like a complex machine with different systems all working together.
Okay.
When a substance enters the picture, it can disrupt those systems in various ways.
Okay, so let's break it down. Where should we start?
Um, let's start with the central nervous system, the command center of your body.
Okay.
This includes your brain and spinal cord.
The brain, the control center for pretty much everything we do.
Exactly. Substances can interfere with the way the brain sends and receives signals, affecting everything from mood and behavior to basic bodily functions like breathing.
So like in Tammy's case, the emotional distress she was feeling could have been amplified by the overdose.
That's a great connection. And remember Zhongai's confusion after mixing energy drinks and supplements.
Right.
That's another example of the central nervous system being affected.
It's amazing how one system can have such a widespread impact. What about the cardiovascular system? That's the heart and blood vessels, right?
Right. And this system is often a target for substances, especially stimulants.
Okay.
Think back to Zhongai's racing heart and high blood pressure.
Summer.
Those are classic signs of a stimulated cardiovascular system.
Makes sense. His heart was working overtime trying to keep up with all that extra energy.
Exactly. And on the flip side, some substances can depress the cardiovascular system, leading to a dangerously slow heart rate and low blood pressure.
Okay, so we've got the brain and the heart.
Right.
What's the third system we should be thinking about?
The respiratory system responsible for breathing.
Right.
Substances can affect this system in a number of ways,
Okay.
either by speeding up breathing or slowing it down.
Okay.
Remember Tammy's shallow breathing?
Yes.
That could have been a result of the overdose affecting her respiratory system.
And Jeremy's rapid breathing, too.
Exactly.
So basically, when someone is experiencing a toxicological emergency, it's like a domino effect.
Yeah,
One system gets hit and it can trigger problems throughout the body.
you've got it. And that's why understanding these systems is so important for paramedics in the field.
Right.
They need to be able to quickly assess the situation and figure out which systems are being affected.
It sounds like they're playing a high-stakes game of medical detective. How do they even begin to approach these emergencies? I mean, there are so many potential substances out there.
It's all about observation information gathering and connecting the dots. Paramedics are trained to be incredibly observant, taking in everything from the patient's appearance and behavior to the surrounding environment.
So they're not just looking at the patient, but also at the bigger picture?
Yeah.
Kind of like Sherlock Holmes searching for clues?
Exactly.
Huh.
They'll look for things like medication bottles, drug paraphernalia, or even chemical spills.
Yeah.
They'll also talk to bystanders, family members, or anyone who might be able to provide information about what happened.
And then there are the vital signs, which we've already talked about.
Mhm.
Those seem to be crucial in these situations.
Absolutely. Vital signs like heart rate, blood pressure, respiratory rate, and even pupil size can tell us a lot about what's going on inside the body.
It's amazing how much information paramedics can glean from those simple measurements.
It's all about recognizing patterns and deviations from the norm. A rapid heart rate could indicate stimulant use,
Okay.
while constricted pupils might suggest opioid involvement.
Interesting.
Paramedics use this information, along with their knowledge of toxicology, to guide their treatment decisions.
Okay, so let's talk about treatment. What can paramedics actually do in the field for these emergencies?
That's a great question. The treatment really depends on the specific substance involved and the severity of the situation. Sometimes the most important thing is to provide supportive care.
Supportive care, what does that mean?
It means ensuring the patient has a clear airway, providing supplemental oxygen if needed, and closely monitoring their vital signs.
So basically keeping them stable until they can get to the hospital.
Exactly. But in more serious cases, paramedics might need to administer specific antidotes.
Antidotes, like an antidote for a snake bite.
Yes, exactly. For example, naloxone is a powerful antidote for opioid overdoses.
Okay.
It can rapidly reverse the effects of opioids like heroin or fentanyl.
Naloxone, that's one we hear about a lot in the news,
Yeah.
especially with the opioid crisis.
That's right. It's becoming increasingly important as a harm reduction tool and can truly be a lifesaver in those situations. But it's crucial to remember that not every overdose has a specific antidote.
So what happens in those cases?
Paramedics focus on managing the symptoms and supporting the body's natural detoxification processes. They might administer fluids intravenously to help flush the substance from the system, or medications to control seizures or vomiting.
Wow, it sounds like paramedics have to be incredibly adaptable and resourceful in these situations.
They absolutely do. They're essentially mobile intensive care units equipped to handle a wide range of medical emergencies.
It makes you appreciate the critical role they play in our healthcare system. They're often the first on the scene, and their quick thinking and expertise can make all the difference.
They are truly unsung heroes. Their work is often challenging and high pressure, but they're dedicated to saving lives.
Okay, I have to ask, what's one of the most memorable or unusual toxicological emergencies you've encountered in your career?
Oh.
There must be some wild stories.
Well, the one case that sticks with me involved a young man who was found unconscious in a park.
Okay.
His symptoms were unusual. Extremely high body temperature, dilated pupils, and he was acting very agitated.
Sounds like a scene straight out of a movie.
It did feel a bit surreal.
Right.
We suspected an overdose, but we couldn't figure out the substance. We started with basic life support, making sure he was breathing and getting oxygen.
Okay.
Then while transporting him, we noticed a small surgical scar on his abdomen.
Wait, a surgical scar?
Yeah.
How did that help?
It was a clue. He'd recently had his appendix removed.
Oh.
We realized he might be reacting badly to one of his prescribed medications.
So the scar was like a hidden message pointing you in the right direction?
Exactly.
Yeah.
And it highlights just how important observation is in these cases.
It's like solving a medical mystery. Did the patient recover?
He did.
Oh.
Once we relayed this information to the hospital, they were able to provide targeted treatment. It was a great reminder of how vital communication is between paramedics and hospital staff.
It's amazing how these seemingly small details can make such a big difference. Okay, so we've talked about the science, the assessments, and the treatments, but I think we need to address the elephant in the room,
Yeah,
the opioid crisis.
you're absolutely right. It's a major public health crisis, and it's something we can't ignore.
Exactly. So let's talk about fentanyl. It seems to be at the center of many of the headlines these days. Why is this particular opioid so dangerous?
Well, for starters, fentanyl is incredibly potent. We're talking 50 to 100 times more potent than morphine.
Whoa, that's scary powerful.
It is. And what makes it even more dangerous is that it's often laced into other drugs,
Oh, wow.
sometimes without the user's knowledge. Someone might think they're taking heroin or a prescription painkiller, but they're actually getting a dose of fentanyl that's potentially lethal.
That's terrifying. It's like playing Russian roulette with your life.
It's a huge problem. Let's go through a scenario involving fentanyl. A young man is found unconscious in his apartment. His friend calls 911 and he's barely breathing.
Sounds like a classic opioid overdose. What did the paramedics do?
They immediately suspected an opioid overdose. They saw the telltale signs, shallow breathing, pinpoint pupils, slow heart rate. They administered naloxone.
Oh, wait.
But here's the thing. It took multiple doses to revive him.
Multiple doses. Why was that?
Because fentanyl is so potent, it can take a much higher dose of naloxone to counteract its effects.
Oh, wow.
That's why it's crucial to have naloxone readily available and to administer it quickly in suspected fentanyl overdoses.
This is all pretty intense. It's clear that fentanyl is a game changer in the world of toxicological emergencies.
Absolutely. And it highlights the need for greater awareness,
Yeah.
harm reduction strategies, and readily available access to naloxone.
I think you just transitioned us perfectly into the next part of our deep dive.
Okay.
Let's talk more about harm reduction and what it means in the context of substance use.
All right. So harm reduction,
Yeah.
what does that look like in action?
Yeah, it feels like a bit of a controversial topic.
Yeah.
But clearly something needs to change, especially with this fentanyl crisis.
Yeah, harm reduction is really about practicality over judgment. We know substance use exists, and the goal is to minimize the negative consequences that come with it.
Okay.
And it's important to remember harm reduction isn't one size fits all.
Right.
It's about finding the right strategies for different individuals and communities.
So walk me through some examples. What kind of strategies are we talking about?
Well, one that's been around for a while is needle exchange programs.
Okay.
They provide sterile needles to people who inject drugs,
Right.
which directly reduces the risk of transmitting diseases like HIV and hepatitis C.
That makes sense.
Hmm.
It's a simple way to prevent a much bigger problem.
Exactly. Another harm reduction strategy that's gained traction is safe consumption sites, sometimes called supervised injection facilities.
I've heard about those. Aren't they kind of controversial?
They can be,
Yeah.
yes,
Sure.
but the idea is to provide a safe, hygienic environment for people to use drugs under medical supervision.
Right.
If someone overdoses, there's help immediately available.
So it's kind of like having a safety net there just in case things go wrong.
That's a good way to put it. And it's not just about preventing overdoses. Safe consumption sites also offer an opportunity to connect people with health and social services like addiction treatment or housing support.
So it really is a wraparound type of support system.
Exactly.
It sounds like harm reduction is about meeting people where they are and offering support without judgment.
That's the heart of it.
Mm.
It's about recognizing the humanity of people who use drugs and offering them a pathway to a healthier life.
This all makes sense to me, but I'm sure there are still people who are hesitant about harm reduction. What are some of the common misconceptions or challenges?
The biggest hurdle is often stigma.
Okay,
Some people believe that harm reduction enable or encourages drug use.
but that's not the goal at all, right? It's about minimizing harm, not promoting drug use.
Exactly. It's about shifting the focus from judgment to compassion and recognizing that addiction is a complex health issue, not a moral failing.
I think sometimes we forget that people who use drugs are just that people, they have their own stories, their own struggles, and they deserve support and understanding.
Absolutely. We need to have more open and honest conversations about substance use in our society. We need to move beyond fear and prejudice and embrace evidence-based approaches that prioritize health and well-being.
Well, I think we've covered an incredible amount of ground in this deep dive.
We have.
We've explored the science behind toxicological emergencies, we've examined real-life scenarios, and we've even delved into the complexities of the opioid crisis and harm reduction.
And how paramedics and medical professionals respond, and how important it is to have a multifaceted approach to addressing substance use in our communities.
Listeners, as we wrap up this episode, I want to leave you with this thought. Substance use and abuse are complex challenges, and there are no easy solutions. But by fostering understanding, embracing compassion, and supporting harm reduction initiatives, we can create a safer and more supportive environment for everyone.
Thank you for joining us on this deep dive. Stay curious, stay informed, and most importantly, stay compassionate.
So we're talking harm reduction. What does that look like in action? It feels like a bit of a controversial topic,
Yeah.
but clearly something needs to change, especially with this fentanyl crisis.
Yeah, harm reduction is really about practicality over judgment.
Okay.
We know substance use exists, and the goal is to minimize the negative consequences that come with it.
Right.
And it's important to remember, harm reduction isn't one size fits all. It's about finding the right strategies for different individuals and communities.
So walk me through some examples. What kind of strategies are we talking about?
Well, one that's been around for a while is needle exchange programs.
Okay.
They provide sterile needles to people who inject drugs,
Right.
which directly reduces the risk of transmitting diseases like HIV and hepatitis C.
That makes sense. It's a simple way to prevent a much bigger problem.
Exactly. Another harm reduction strategy that's gained traction is safe consumption sites, sometimes called supervised injection facilities.
I've heard about those. Aren't they kind of controversial?
They can be, yes. But the idea is to provide a safe, hygienic environment for people to use drugs under medical supervision.
Right.
If someone overdoses, there's help immediately available.
So it's kind of like having a safety net there just in case things go wrong.
That's a good way to put it. And it's not just about preventing overdoses. Safe consumption sites also offer an opportunity to connect people with health and social services, like addiction treatment or housing support.
So it really is a wraparound type of support system.
Exactly.
It sounds like harm reduction is about meeting people where they are and offering support without judgment.
That's the heart of it. It's about recognizing the humanity of people who use drugs and offering them a pathway to a healthier life.
This all makes sense to me, but I'm sure there are still people who are hesitant about harm reduction. What are some of the common misconceptions or challenges?
The biggest hurdle is often stigma.
Okay,
Some people believe that harm reduction enables or encourages drug use.
but that's not the goal at all, right? It's about minimizing harm, not promoting drug use.
Exactly. It's about shifting the focus from judgment to compassion and recognizing that addiction is a complex health issue, not a moral failing.
I think sometimes we forget that people who use drugs are just that people.
I
They have
think-
their own stories, their own struggles, and they deserve support and understanding.
Absolutely. We need to have more open and honest conversations about substance use in our society. We need to move beyond fear and prejudice and embrace evidence-based approaches that prioritize health and well-being.
Well, I think we've covered an incredible amount of ground in this deep dive. We've explored the science behind toxicological emergencies, we've examined real-life scenarios, and we've even delved into the complexities of the opioid crisis and harm reduction.
Yeah, it's been quite a journey.
Thanks for walking us through all of this. It's so important for people to have this knowledge and to feel empowered to act if they ever encounter a situation like one of the ones we discussed.
Absolutely. Knowledge is power. And remember, folks, if you or someone you know is struggling with substance use, there are resources available. Don't hesitate to reach out for help.
That's right. There's no shame in seeking support. And to our listeners, thank you for joining us on this deep dive into the world of toxicology and substance abuse. We'll see you next time.
Stay safe, everyone. All right, everyone. Get ready for a deep dive you asked for. We're going deep into thoracic trauma.
Oh, buckle up.
You sent over medical textbooks, case studies. So we're not messing around. We're going beyond the basics here.
Absolutely.
And you know what's really got my attention? Thoracic trauma. It's on the rise.
It is.
And not just for the reasons you might think.
Yeah.
Of course, car accidents always a factor, but we're also seeing an increase because of rising crime rates.
That's right.
Which means in these situations, those first few minutes, absolutely crucial.
Yeah, quick, accurate assessment, really key for paramedics. Got to figure out what's really going on and then prioritize.
Life-saving treatment.
Absolutely, life-saving treatment.
So before we jump into the drama of the cases you sent, let's make sure we're all starting from the same place.
Okay.
Thoracic trauma, when we say that, what are we really talking about?
So thoracic trauma is any injury to the chest cavity,
Okay.
the space that holds, well, some of our most vital organs.
Right.
Your heart, lungs, major blood vessels. And you can imagine when those structures get injured, things can get serious pretty fast.
Yeah, no kidding. So any injury to that area, whether it's like a heart impact or something penetrating the chest,
Exactly.
makes sense why this is such a critical area to understand.
Yeah.
Now, you sent over 2 case studies.
Yes.
Let's jump right into the first one.
Okay.
This one involves a 28-year-old female skier.
Okay.
She had a pretty rough fall while trying to ride the rail at Drayton Valley Ski Hill.
Ouch. Riding the rail, those wipeouts can be brutal.
Yeah.
So what did the initial assessment show when the paramedics got to her?
Well, first of all, conscious and alert, always a good sign.
Yeah, for sure.
But she was definitely in a lot of pain.
Okay.
And because of that, breathing shallowly.
Right.
They got a strong radial pulse, no external bleeding, but they suspected some fractured ribs.
So far, so good. But shallow breathing after a fall like that definitely raises some concerns.
Right. Her pain assessment said it was sharp, sudden onset, located in her left lateral ribs, 5, 6, and 7.
Okay.
And had been going on for about 25 minutes.
Yeah.
Her vitals, mostly stable. Blood pressure was good. Heart rate, a bit elevated. Respiration's normal, considering, she's in pain. And oxygen saturation was 99%.
Okay, so on the surface might seem okay, but that elevated heart rate could be from more than just pain or anxiety. It could
Right.
be a sign of internal bleeding. Might not be obvious right away.
So even though her breathing seems okay now, you're saying that could still become a problem later.
Exactly. Think about it. She's got potential rib fractures, breathing shallowly because of pain. So what happens if those fractures start affecting her lung function?
Okay.
That's why they would be watching her very carefully, even if things seem stable at first.
Right, right. So what kind of treatment did they start at the scene?
Standard C-spine support, protect her spine, just in case. Gave her pain medication, some oxygen, started an IV. And the report also mentions that they were monitoring for something called paradoxical movement of the chest.
Paradoxical movement.
Yeah.
That sounds ominous.
Yeah, so paradoxical movement, that's a telltale sign of a flail chest.
Okay.
And that is a serious condition that can happen with rib fractures.
Right.
Imagine this. 3 or more ribs next to each other, each broken in at least 2 places. Basically, a section of the chest wall detaches. And it starts moving in the opposite direction from the rest of the chest when the person breathes.
Wait, so as they inhale, that section sucks inward, and then as they exhale, it bulges out.
You got it.
That sounds like it would make breathing incredibly difficult.
It does. That's why paradoxical movement is such a red flag. It can lead to major problems with breathing and oxygen getting to the lungs. And here's the tricky part. Sometimes it doesn't show up right away.
Why wouldn't it be obvious immediately? You'd think a detached section of the chest wall, that'd be pretty noticeable.
You'd think so, but those intercostal muscles, the ones between the ribs, they can initially act like a splint, holding things together, so it kind of masks the problem.
So it's like a hidden danger.
Yeah.
You might not realize how serious it is until later.
Precisely.
Right.
It's one of the reasons why thoracic trauma cases require such close monitoring, even if things seem okay initially.
Okay.
Now, this case study didn't give us details on her hospital treatment, but they would definitely continue to monitor her breathing closely, manage her pain, and probably do imaging to confirm the rib fractures and check for any other injuries.
Okay, so skier number 1, definitely in a precarious situation. And it's interesting, the second case study you sent highlights how different these presentations can be. This time, it's a 36-year-old woman named Natalie, and she's experiencing worsening chest pain several days after a car accident.
Delayed presentation's always a bit tricky. It's easy to brush off lingering pain after an accident, but sometimes it's the body's way of saying, hey, something's not right here.
Right. Exactly. So what was going on with Natalie when the paramedics arrived?
She was conscious and alert, breathing a bit shallowly like the skier.
Okay.
Good radial pulses, no external bleeding. But here's a key difference. She was complaining of substernal pressure.
Substernal pressure. Doesn't that usually point to a heart problem? I mean, isn't that one of the classic signs?
You're absolutely right. While rib fractures can definitely cause chest pain, that feeling of tightness or squeezing under the breastbone, that's a huge red flag for potential cardiac issues.
So we've got this delayed onset of chest pain.
Uh-huh.
And it's not just any chest pain, it's substernal pressure.
Hmm.
What else did they find out about her pain?
Well, it had been a constant ache throughout the morning, an 8 out of 10 on the pain scale,
Ooh.
which is pretty significant. And here's another concerning detail. She had been taking Tylenol, #2, which has a mild narcotic, and Toradol, an NSAID, but neither was providing any relief.
That's definitely not a good sign.
No.
It's like her body's screaming that something is wrong, but the usual pain relievers aren't touching it.
Right.
So what does that tell us?
It suggests the pain might be more than just musculoskeletal soreness from the accident. It could be coming from the rib fractures themselves, or, and this is the worrisome part, it could be related to a cardiac issue.
Especially with that substernal pressure.
Exactly. That's why they wouldn't just chalk it up to sore muscles. They would need to dig deeper and rule out any heart involvement.
And that's where those test your knowledge questions from the textbook come in, right?
Yes.
The ones about differentiating cardiac contusion from commotio cordis.
Exactly. Those questions are perfect for this scenario. They really make you think about the subtleties of these conditions. So let's break them down.
Yeah.
First up, cardiac contusion.
If I remember correctly, a cardiac contusion is basically a bruise to the heart muscle, right?
You nailed it. It's often caused by a blunt force to the chest, like in a car accident. And just like a bruise anywhere else, it can cause pain and swelling. But when it's the heart, it can mess with the electrical signals that control your heartbeat.
Right.
We're talking potentially dangerous arrhythmias.
Okay, so that's cardiac contusion. And then there's commotio cordis, which, if I'm not mistaken, is sudden cardiac arrest triggered by a blow to the chest at a very specific moment in the heart's electrical cycle.
Wow, you really did your homework.
Well,
It's less common than contusion, but often more deadly.
okay.
Especially in younger athletes.
Right.
Where a seemingly harmless hit can have devastating consequences.
And how do they figure out which one it is? They both seem like they'd cause serious heart problems.
That's where an EKG comes in.
Okay.
A cardiac contusion might show up as abnormalities in the heart's electrical activity on the EKG,
Okay.
whereas commotio cordis might not, at least not initially. It's a really nuanced diagnosis.
Wow. Okay, so with Natalie, we've got delayed chest pain, substernal pressure, and pain that's not responding to medication. Then you add in the possibility of a cardiac issue like a contusion, or even worse, commotio cordis. Suddenly those test your knowledge questions aren't just theoretical anymore.
You're catching on quickly, and this is just the beginning of Natalie's story. There's so much more to unpack in her case, and I can't wait to dive into it further and see what the paramedics uncovered.
We left off with Natalie in this really unsettling picture. Delayed chest pain, substernal pressure, and the pain meds, not even touching it.
Right.
I'm on the edge of my seat here. What happened next?
Well, given the red flags, they rushed her to the hospital.
Okay.
But first, the paramedics, they gathered as much information as they could. They found her blood pressure was slightly elevated, but her heart rate was normal, which seems a little odd considering the amount of pain she was in.
Right. You'd think with an 8 out of 10 pain level, her heart rate would be through the roof. Does that mean we can rule out a heart problem?
Not so fast. Remember, this is a delayed presentation.
Right.
Her body's initial stress response might have calmed down, but that doesn't mean the underlying problem has gone away.
Okay.
And we can't ignore that substernal pressure.
Right.
Plus, her respirations were a bit shallow, 18 breaths per minute, and although her oxygen saturation was holding steady at 99%, the shallow breathing's still a concern.
So lots of things pointing to something more serious going on.
Yeah.
What happened once you got to the hospital?
Okay, at the hospital, they would run a battery of tests
Right.
to get a clearer picture. An EKG would be top priority to check for any irregular heart rhythms, and they'd likely order a chest x-ray to assess the rib fractures, look for any other issues.
Like fluid in the chest cavity.
Exactly, like fluid or air in the chest cavity.
The textbook actually mentions pulmonary contusion as a possible complication with rib fractures. especially after a big impact. Basically, it's a bruise to the lung tissue itself.
You're absolutely right. And that's why getting a quick diagnosis and treatment is so important with these kinds of injuries.
Right.
A pulmonary contusion can make it hard for the lungs to do their job, getting oxygen in and carbon dioxide out. Plus, it can increase the risk of infections.
Definitely not something you want to mess around with. Okay, so we've got these two cases, both involving potential rib fractures, but with such different presentations and potential complications. What are some of the key takeaways we can glean from this so far?
I think the biggest takeaway is that with thoracic trauma, prompt and thorough assessment is absolutely critical.
Okay.
That means checking the ABCs, airway, breathing, and circulation, monitoring those vital signs like a hawk, and doing a really thorough physical exam to catch any obvious injuries or signs of internal bleeding.
And we've also seen how the type of injury, blunt force versus penetrating, can lead to very different types of injuries.
Exactly. But there are commonalities too.
Yeah.
Remember the pain assessment, not just where it hurts and how much, but also the type of pain.
Right.
Sharp, stabbing, aching, and whether it's constant or comes and goes, that can give clues about what's causing the pain.
And those test your knowledge questions really brought home the point that these injuries can be far more complex than they seem on the surface.
Absolutely.
Like with the flail chest, you might not see the paradoxical movement right away.
Right.
And those cardiac conditions can be difficult to diagnose without careful EKG interpretation.
Absolutely. It's not just about memorizing facts. It's about connecting the dots, thinking critically, and being aware of the subtleties.
Okay, I have a question that's been bugging me. In both of these cases, the patients were conscious and alert when the paramedics got there.
Right.
But what happens if someone with thoracic trauma is unconscious? Does that change the approach entirely?
That's a great question, and it definitely raises the stakes.
Yeah,
An unconscious patient can't tell us what they're feeling or where it hurts.
right.
So we have to rely even more on our assessment skills and look for clues.
So things like checking their pupils, looking for signs of trauma, and of course, constantly monitoring those vital signs.
You got it. And time is of the essence in those situations.
Yeah.
We need to stabilize the patient, make sure their airway is clear, support their breathing, and control any bleeding while trying to figure out what's happening internally.
That sounds incredibly intense. It really highlights the importance of quick thinking and expertise in those first responders.
Absolutely. They're often making life or death decisions based on limited information. And it's amazing how they can piece together the puzzle under such pressure. Now, while we're talking about procedures, the textbook mentioned chest tubes.
Okay.
I know they're used in thoracic trauma, but I'm not entirely sure why.
I'm with you. Chest tubes always sounded kind of scary to me.
They might sound scary, but trust me, in the right situation, a chest tube can be a real lifesaver. It's basically a hollow tube inserted into the pleural space. That's the area between the lung and the chest wall.
Okay, and what does that accomplish?
It allows any fluid or air that's built up in that space to drain out. This can happen for a bunch of reasons.
Right.
For example, if someone has a collapsed lung, also known as a pneumothorax, air can get trapped and put pressure on the lung, preventing it from expanding properly.
So the chest tube acts like a release valve, letting the air escape and allowing the lung to reinflate.
Exactly. Chest tubes can also be used to drain blood or other fluids that might be collecting in the pleural space, like after surgery or in cases of internal bleeding.
Makes sense. But how do they decide if someone needs a chest tube? Is it based on the type of injury, their symptoms, or something else?
It's usually a combination of things. The type of injury, the patient's symptoms, their vital signs, and what they see on the physical exam and imaging studies.
Okay.
For example, someone with a penetrating chest wound is much more likely to need a chest tube than someone with a simple rib fracture.
So it's not just a standard procedure. They really have to assess the situation and determine if a chest tube is the best course of action.
You got it. And just like any medical procedure, there are risks and benefits to consider.
Right.
But in the right circumstances, a chest tube can truly be a life-saving intervention.
Wow. This deep dive has really opened my eyes to the complexities of thoracic trauma.
Yeah.
I feel like I could ace that test your knowledge quiz now.
I think you could. But the world of medicine is constantly evolving, and there's always something new to learn. Even the most experienced professionals are constantly learning and refining their skills.
That's what makes it so fascinating, right?
Yeah.
There's always more to discover. But for now, I think we've given our listener a really solid foundation in thoracic trauma, and hopefully we've sparked a curiosity to learn even more.
Absolutely. And speaking of learning more, there's one aspect of thoracic trauma we haven't touched on yet, the psychological impact.
Oh, right.
It's often overlooked, but it can be just as significant as the physical injuries.
You're right, I hadn't thought about that. But it makes perfect sense. Going through something as traumatic as a car accident or a violent assault, that can leave some serious emotional scars.
Exactly. And when you combine that with the pain, fear, and uncertainty that often accompany thoracic trauma, it's no surprise that these patients are at a higher risk for developing mental health issues.
So things like anxiety, depression, PTSD, those can all be part of the picture too.
Absolutely. It's not uncommon for survivors of thoracic trauma to experience flashbacks, nightmares, difficulty sleeping, and this heightened sense of danger that can make it hard to relax or feel safe.
Makes sense. If your body has been through that kind of trauma, it's understandable that your mind would be affected too.
Exactly. And here's the thing. Those psychological effects can actually hinder the physical healing process.
You're kidding. So not only do you have to deal with the physical injuries, but the emotional stress can make it even harder for your body to recover.
That's right. Stress and anxiety can increase inflammation, slow down tissue repair, and weaken the immune system, making the body more susceptible to infections and other complications.
Yeah.
It's like a vicious cycle.
So it's not enough just to treat the physical injuries. You have to address the psychological impact as well.
Precisely. That's why a holistic approach to care is so important. It's
Well,
about treating the whole person, body and mind, and recognizing that healing goes beyond just stitching up wounds or setting broken bones.
that's such an important point. So if someone is dealing with the aftermath of thoracic trauma, what are some of the things they can do to support their mental health?
There are a lot of great resources available, connecting with support groups, talking to a therapist, learning relaxation techniques, and in some cases, even medication can be helpful in managing anxiety or depression.
Okay.
It's about finding what works best for each individual.
It sounds like open communication with your healthcare team is key here.
Absolutely.
They can help you navigate those resources and come up with a plan that addresses both the physical and emotional aspects of recovery.
Exactly. And remember, asking for help is a sign of strength, not weakness. Healing takes time, and it's okay to reach out for support along the way.
That's a really powerful message. We've covered a lot of ground today, from the mechanics of breathing to the nuances of cardiac assessment, and now the psychological impact of these injuries. It's been an incredible journey.
It really has, and I hope our listener is walking away feeling more informed and empowered.
Wow, we've really been on quite a journey today, exploring the world of thoracic trauma.
It has been quite the deep dive.
Yeah, we've talked about flail chests, EKGs, chest tubes, and even those hidden psychological wounds that can linger long after the physical injuries have healed.
Absolutely.
Eye-opening, to say the least.
Yeah, it really highlights the complexity of the human body and how interconnected our physical and mental well-being truly are.
Exactly. And, it's made me think about something. We've been talking a lot about the assessments paramedics do at the scene,
Right.
checking vital signs, looking for external injuries. But what about those internal injuries?
Yeah.
The ones that might not be so obvious? How do they figure out what's going on inside the chest cavity?
Well, that's where those imaging studies we mentioned earlier come in.
Right.
Things like chest x-rays, CT scans, and ultrasounds. Those can give us a peek inside and help us pinpoint the location and extent of internal injuries.
Okay, so a chest x-ray, probably the first line of defense, quick, relatively inexpensive, and can show things like rib fractures, a collapsed lung, or fluid buildup.
Right, but sometimes we need a more detailed look, and that's where a CT scan comes in.
Okay.
Uses x-rays to create cross-sectional images of the chest, so it gives us this 3D view that can reveal even subtle injuries.
So if they suspect something like a pulmonary contusion, that bruising of the lung tissue, or damage to the heart or major blood vessels, they'd likely go for a CT scan.
Exactly. And in some cases, they might also use ultrasound,
Uh-huh.
especially if they're concerned about bleeding around the heart or in the abdomen. Ultrasound uses sound waves to create images, and it's particularly good at detecting fluid.
So it's like having a toolkit of different imaging techniques they can use depending on the specific situation.
Yeah,
They might start with a chest x-ray and then move on to more advanced imaging if needed.
that's a great way to put it. And the beauty of these imaging studies is they can help us make faster, more informed decisions about treatment.
Right.
For example, if a CT scan shows a large pneumothorax, that collapsed lung we talked about,
Yeah.
they can insert a chest tube right away to reinflate the lung.
It's incredible how technology has advanced to the point where we can literally see inside the body and pinpoint these injuries. Really takes the guesswork out of diagnosis and treatment.
It does. But it's important to remember that technology is only part of the equation.
Right.
It's the skill and expertise of the medical professionals interpreting those images and making treatment decisions that truly make the difference.
Such a good point. It's not just about the machines. It's about the human element, too.
Absolutely.
And speaking of the human element, I can't help but think back to that discussion about the psychological impact of thoracic trauma.
Yeah.
It really stuck with me.
I know, it's something that's often overlooked, but it's so crucial to address.
Yeah.
Those emotional wounds can be just as debilitating as the physical ones,
Right.
and they can have a huge impact on a person's recovery.
And you know, it's interesting. The textbook had a section on pre-hospital care for thoracic trauma.
Yeah.
And it talked about the importance of providing psychological support, even in those early stages.
That's so important. Those first few minutes and hours after a traumatic event can be incredibly overwhelming and disorienting. Just having someone there who can offer reassurance, a listening ear, and some basic emotional support, it can make a world of difference.
And it's not just about comforting words, right? It's about practical things, too, like making sure the patient feels safe and secure, explaining what's happening in a way they can understand, and involving them in decision-making as much as possible.
You've hit the nail on the head.
Yeah.
It's about empowering the patient, giving them a sense of control in a situation where they likely feel very powerless.
And I imagine that kind of early intervention can have a ripple effect, making it more likely that the patient will seek ongoing support and resources as they continue to heal.
Absolutely. It sets the stage for a more holistic approach to recovery,
Right.
where the focus is not just on fixing the physical injuries, but also on addressing the emotional and psychological needs of the patient.
So if we could sum up everything we've learned today in one concise takeaway for our listener, what would it be?
I think the biggest takeaway is that thoracic trauma is far more complex than it might seem at first glance.
Yeah.
It's not just about broken ribs and collapsed lungs. It's about understanding the intricate workings of the human body, recognizing the interconnectedness of physical and emotional well-being, and appreciating the incredible skill and dedication of the medical professionals who care for these patients.
I couldn't agree more. We've delved deep into the science, explored the latest technologies, and even touched on those often overlooked psychological aspects of these injuries. It's been a truly fascinating journey.
And as always, we encourage our listener to continue exploring.
Right.
The world of medicine is constantly evolving, and there's always something new to discover.
That's the beauty of learning, right? It's a never-ending adventure.
It is.
So, to our listener, thank you for joining us on this deep dive into thoracic trauma. We hope you found it informative, engaging, and maybe even a little bit inspiring.
And remember, knowledge is power. The more you understand about your own body and the potential challenges it might face, the better equipped you'll be to navigate those challenges and advocate for your own health and well-being.
Couldn't have said it better myself. Until next time, stay curious, keep learning, and take care of yourselves, body and mind.
All right. Let's dive in. Looks like we're tackling urology and nephrology today. We've got medical textbooks, some case studies, even some quizzes from what looks like a paramedic handbook.
Should be interesting. The kidneys are pretty amazing, you know. People don't think about them much, but they're always working hard behind the scenes.
Definitely vital organs. Let's see. One of the sources, this urology.pdf, it talks about two big urological emergencies: renal colic and renal failure. Renal colic? That sounds pretty intense.
It can be. Imagine like this sudden gripping pain like in your side, and it shoots down towards your groin.
Oof.
That's renal colic. Often, it's a kidney stone that's blocking things up.
Oh, so it's like a blockage. Makes sense.
Yeah, and the pain gets so bad that people, they can't even sit still. You know, they're just constantly moving, trying to find any position that gives them a little bit of relief.
I can see why that would be an emergency.
Oh, yeah, definitely. Now, renal failure, that's a whole other story. It can be acute, which means like a sudden loss of function, or it can be chronic, where the kidneys slowly lose their ability to, well, to filter waste and balance fluids.
Right, and this source really stresses how serious acute renal failure can be. What makes it so critical?
Well, think about it. Your kidneys, they're filtering your blood nonstop, removing toxins, keeping your electrolytes balanced, even having managed your blood pressure. When they just suddenly quit, it's life-threatening, really.
Yeah, that makes sense.
Waste products start building up in the blood, and that can mess with everything, like brain function, even your heart rhythm.
And that's where dialysis comes in, right?
Exactly.
In fact, we have this case study from the paramedic handbook, case 17.1. It's about this 63-year-old man, Maurice. Seems his kidneys aren't doing so hot.
Let's see. Maurice is confused, incontinent, hasn't had dialysis in a week.
Mhm.
His son mentioned he's been wearing the same clothes for days, like his mental state has been declining.
And missing those dialysis appointments, that's a bad sign.
Definitely a red flag.
So can you walk us through what happens when someone like Maurice skips dialysis?
Sure, dialysis, it's like a life support system,
Yeah.
for people whose kidneys have failed.
Okay.
There are two main types: hemodialysis, which filters the blood using a machine, and then there's peritoneal dialysis, which uses this special fluid that's put into the abdominal cavity to draw out waste.
Oh, interesting.
But without regular dialysis, the toxins build up, fluids get all out of whack, and things can go downhill really fast.
Speaking of imbalances, there's this test your knowledge question that asks about the effect of missed dialysis on the acid-base balance. What does that even mean?
Well, it's about maintaining the pH of your blood. When the kidneys aren't working right, acids can build up, and that throws off the balance. And even a tiny shift in pH that can affect your whole body, heart, nerves, muscles, everything. They all rely on that balance.
So it's not just filtering waste, it's about keeping this precise chemical environment inside the body.
Precisely. Dialysis helps to do that, It mimics the kidneys, keeps everything in check.
So it's literally keeping someone like Maurice alive.
It is.
Wow. This is really giving me a new appreciation for my kidneys right now.
They're pretty amazing.
Now, before we jump to another case study, I'm curious. The answer section mentioned different types of dialysis. So what determines which type is best for someone?
That's a good question. It depends really on the individual, their lifestyle, their health, even personal preference comes into it. Some folks, they find peritoneal dialysis easier because it can be done at home.
Oh, I see.
Yeah. Others, they prefer the structure of hemodialysis, going to a clinic a few times a week, having that medical supervision.
Makes sense. So it's really tailored to each person.
It is.
That's fascinating. Okay, ready to tackle another case study?
Hit me with it.
All right, case 17.2. This one's about Laura. She's 40 and dealing with some serious flank pain.
Oh, flank pain. That often points to the kidneys. What else do we know?
Well, it says the pain's so bad it woke her up in the middle of the night she can't get comfortable. Oh, and she mentioned she was on a trip recently and that this kind of pain is totally new for her.
This is starting to sound like classic renal colic. Maybe a kidney stone?
Oh, right.
You ever heard anyone describe kidney stone pain?
Oh, yeah. Not fun. People say it's one of the worst pains imaginable.
It can be brutal. It's that intense, often radiating pain. The source describes it as coming on suddenly, and it just keeps getting worse and worse. Sometimes it even leads to nausea and vomiting.
Sounds awful.
And just like Laura's experiencing, people with renal colic, they often feel restless, agitated, always moving, trying to find some way to ease the pain.
Makes sense. The source mentions the pain can radiate down to the groin. Is that common?
Very common, yeah, because the way the nerves are all connected in that area.
Oh,
The source also mentions it can come in waves. So periods of really intense pain,
yeah.
then moments where it kind of calms down a bit. Remember those muscle spasms we talked about earlier?
Uh-huh.
Those can make the pain even worse. As the ureter, that's the tube carrying urine from the kidney to the bladder, it tries to, squeeze that stone out.
It's amazing how much is going on inside when we feel pain.
It really is.
Speaking of which, there's another test your knowledge question about typical signs and symptoms of renal colic.
Well, aside from that intense radiating pain, you might see blood in the urine, nausea, vomiting, even a constant urge to pee, even if barely anything comes out.
So lots of potential red flags.
Yeah. And it's important to remember renal colic, it's a symptom of a blockage. It's not a disease in itself.
Oh, right.
So the treatment depends on what's causing that blockage.
I see.
Sometimes medication can help the stone pass naturally. Other times you might need a procedure to remove it or break it up.
So the medical team has to do some detective work.
Exactly. Figure out the best course of action for each patient.
Makes sense. It seems like it'd be crucial to see a doctor if you have any sudden severe pain in your side or back, especially if it comes with any of those other symptoms we talked about.
Absolutely. Don't wait on that one. It's pretty wild, how these two cases, Maurice and Laura, they kind of show the range of these urological emergencies. Chronic condition needing constant management on one side, and then, bam, sudden acute event needing attention, like right now, on the other.
really highlights how diverse this whole field of medicine is. And speaking of diverse, Maurice's case mentions a bunch of medications. One of the test your knowledge questions is about classifying them, and it just made me realize how tricky it must be managing multiple health issues like that.
Oh, absolutely. It's a juggling act for sure. Let's see. Maurice is on Altes. That's an ACE inhibitor, pretty common for high blood pressure, heart failure. Then there's glyburide. That's for type 2 diabetes.
Mhm.
And HCT, a diuretic, helps get rid of excess fluid. It's not unusual to see this, especially with chronic kidney disease.
Makes you wonder how all those meds interact, right?
That's where having a good healthcare team is key. They can keep an eye on things. Watch for potential interactions, adjust dosages if needed, make sure each medication is doing its job without causing, like, a whole other set of problems.
Right, like a balancing act.
It is, very much so.
So we've talked about kidney failure, renal colic, but what about the link between kidney health and blood pressure? It keeps coming up in these materials.
Oh, yeah. That relationship, it's a fascinating one. It's a two-way street. High blood pressure, it can damage the blood vessels in your kidneys, those tiny, delicate vessels.
Ah.
And when those get damaged, it makes it harder for the kidneys to filter waste properly.
So it's not just about the heart then. High blood pressure impacts the kidneys directly.
It does, yeah. And here's the kicker. Kidney problems can also lead to high blood pressure. It's like this vicious cycle.
How so?
Well, when your kidneys aren't filtering right, fluid builds up. That increases your blood volume, and that pushes your blood pressure up.
So damaged kidneys, higher blood pressure, more damage to the kidneys.
Exactly. It's all connected. Shows how intertwined these bodily systems are.
That makes me think, what can you do to protect your kidneys, especially if you already have high blood pressure?
Well, managing that blood pressure is huge. Lifestyle changes are often the first step, like diet and exercise,
Right.
and sometimes medication.
Yes.
It's all about, like, giving your kidneys a break,
Yeah.
easing the stress on those little blood vessels.
So those healthy habits we always hear about, they really do make a difference for our kidneys too.
They do. A diet low in sodium, less processed food that helps reduce fluid retention, lowers blood pressure, takes some of the load off your kidneys, and exercise, that's a winner too. Helps control blood pressure, improves circulation, good for your whole cardiovascular system.
So good for the heart, good for the kidneys.
Bingo.
It's all connected.
It is. And don't forget about staying hydrated. Water, lots of it, helps flush out toxins, keeps your kidneys humming along, like giving your internal filter a good rinse.
This is making me want to chug a whole bottle of water right now.
Always a good idea.
Now, before we wrap up our kidney adventure, there's one more common issue that keeps popping up in the source material. UTIs.
Ah, yes, UTIs. Super common, especially for women. They can be just a minor annoyance, or they can get pretty serious if you ignore them.
I've definitely heard of them. What causes them and how bad can they actually get?
Well, UTIs happen when bacteria get into the urinary tract, usually through the urethra. The source material mentions dysuria.
Dysuria.
Yeah, it just means painful urination. That's a common symptom, along with, like, feeling like you have to pee all the time. Sometimes you might even see blood in your urine.
So those are all signs that something's not right.
Exactly.
Yeah.
Body's trying to tell you something. Most UTIs are pretty simple, thankfully, and a round of antibiotics usually clears them right up. But if you leave them untreated, they can travel up to the kidneys, and that's when you get a much more serious infection called pyelonephritis.
So definitely not something to ignore.
Nope. Best to see a doctor if you think you might have a UTI.
Mm.
Get it treated quickly, avoid those complications.
This whole deep dive has been eye-opening, really. We've gone over how the kidneys work, the seriousness of things like renal failure and renal colic, the connection between kidneys and blood pressure, even common stuff like UTIs.
It's amazing what you can learn when you really dig into a topic.
Yeah.
And we've only just scratched the surface, really.
Right. Makes you realize how important these often overlooked organs are.
They really are the unsung heroes of the body.
For sure. But before we get too sentimental about kidneys, I have one last question that's been bugging me.
Let's hear it. What's got you curious?
Well, we've talked about how these conditions are diagnosed and treated, but what about preventing them in the first place? What can we do to keep our kidneys healthy and maybe avoid these emergencies altogether?
Ah, a great question, and the perfect note to end our deep dive on, I think. It really comes down to making healthy choices, day in and day out. Those small things that make a big difference over time.
I'm all for simple but effective strategies. Tell me more.
So, prevention. When it comes to your kidneys, a lot of it boils down to a few key things. And honestly, staying hydrated is probably the biggest one. Think of water as like your kidney's best friend.
Okay.
It helps flush out all that waste, keeps things moving, and helps prevent those minerals from clumping together and forming kidney stones.
So 8 glasses a day, they're serious about that.
They are. And, if you're exercising, hot weather, things like that, you'll need even more. Listen to your body.
Right, right. Makes sense. So water's key. What else can we do to keep our kidneys happy?
Well, a healthy diet is huge. Lots of fresh fruits and veggies, lean protein, whole grains, those are your winners. Cut back on processed foods, sugary drinks, and too much salt. That'll do wonders for your blood pressure, which we know is good for your kidneys.
It's funny, we always think of healthy eating as being for our hearts or our weight,
Yeah.
but it's clear the kidneys are a big part of the picture too.
Oh, absolutely. And don't forget exercise. Regular physical activity, it's like a tune-up for your whole body. Helps manage blood pressure, gets the blood flowing, all good things for your kidneys.
So all those healthy habits we hear about all the time, they're not just fads. They really can help keep our kidneys healthy.
They do. And here's one more thing to keep in mind. Be careful with those over-the-counter pain relievers.
Oh, like ibuprofen?
Yeah, ibuprofen, naproxen, that kind of thing. In the short term, they're fine. But if you use them a lot, long term, they can actually damage your kidneys.
Interesting. So everything in moderation, and probably a good idea to check with your doctor about any medications you're taking regularly, especially if you already have kidney issues.
Couldn't agree more. Knowledge is power when it comes to your health, right?
Mm.
The more you know about your body, the better choices you can make.
Absolutely. Well, this deep dive has been amazing. We've learned so much about how the kidneys work, how serious these urological emergencies can be, and even some simple things we can do to protect our kidney health.
It's been a fascinating journey for sure. I hope our listeners have come away with a newfound respect for these incredible organs.
I know I have. So to everyone listening, thanks for joining us on this deep dive into the world of urology and nephrology. We hope you've learned something new and feel empowered to take care of your amazing kidneys.
Keep learning, keep exploring, and take good care of those kidneys.
And that's a wrap for this episode of The Deep Dive. Until next time, stay curious.
All right, buckle up for this deep dive because we're jumping right into the action.
Oh, going right in?
Right into it. You are an EMT
Okay.
responding to a remote accident in northern Quebec.
Uh-oh.
And we're talking remote, like hospital is a distant prayer,
Yeah.
and the terrain itself is like an obstacle course.
Sounds challenging.
Challenging is an understatement.
Okay.
So imagine this. You arrive on scene, frantic, 35-year-old guy waving you down.
All right.
It's his dad. His dad was driving their truck when it rolled down a hill.
Oh, no.
Now, the dad is trapped inside this wreckage.
Okay.
You get to the overturned vehicle and find the patient, a 66-year-old male,
Okay.
lying a good 10 feet away from the truck.
Oh, wow.
Seems he was ejected during the rollover.
Wow.
He's on his back, still wearing his helmet, conscious, but definitely not looking good.
So when you say ejected, does that mean he wasn't wearing a seatbelt?
We don't have that information from the report, so we can't assume either way.
Fair enough.
But just the fact that he was thrown that far from the vehicle.
Yeah, that's a lot of force.
Exactly. Where do you even begin with a situation like this?
Well, the fact that he was ejected from the vehicle is a major red flag right off the bat. You have to think about the forces involved in a rollover.
Oh, yeah?
So we need to be prepared for some serious blunt force trauma, possible spinal injuries,
Right.
and honestly, a whole host of other potential problems. That initial scene assessment is absolutely critical here.
So you start your initial assessment, and things seem pretty serious right away.
Okay.
The patient is lethargic and a little confused, which not a good sign.
No, not at all.
Breathing, thankfully,
Right.
which is a plus.
Good.
And it seems regular, strong,
Right.
but his pulse, weak and slow. You can feel radial pulses, so there's some circulation, but something's definitely off.
Yeah.
He's also complaining of pain in his abdomen and groin.
Okay.
And you notice he's incontinent of urine.
Oh, that adds another layer of concern.
It really does. What's going through your mind at this point?
Honestly, that altered mental status combined with the weak and slow pulse, that is incredibly worrying.
Yeah.
This could indicate shock, potentially from internal bleeding,
Right.
something we always have to consider in a trauma like this. And the incontinence
Yeah.
that points towards possible pelvic injuries, adding to the urgency of the situation.
As you're working on the patient, his son tells you that his father takes a daily aspirin,
Okay.
ASA, as it's sometimes called,
Right.
along with morphine for pain
Okay.
and tenormin, a beta blocker for high blood pressure.
Okay.
He also mentions his dad has a history of hypertension,
Okay.
had a heart attack 6 years ago, and experiences angina, which is basically chest pain caused by reduced blood flow to the heart.
Right.
On top of all that, he has diet-controlled diabetes.
Oh, wow.
He did have breakfast this morning, but the son doesn't know of any other medications his dad might have taken.
Okay.
How does all of this medical history change your approach?
Well, it's like adding pieces to a puzzle, right?
Yeah.
And suddenly the picture becomes much more complicated.
Right.
These pre-existing conditions just add another layer of challenges to his care. For example, the diabetes can delay healing
Right.
and make him more susceptible to infections.
Oh, wow.
And his heart history.
Yeah.
That definitely raises concerns about his cardiovascular system's ability to cope with the stress of this trauma.
So you move on to a more detailed physical examination, trying to get a clearer picture of his injuries.
Okay.
His airway seems clear, and his breathing is good,
Good.
but he's got some pain in his lower ribs, and you notice some bruising there too.
All right.
Then you check his abdomen, find it's distended and tender to the touch.
Okay.
You also notice that his pelvis feels unstable,
Uh-oh.
which makes you really worried about potential fractures.
A distended and tender abdomen, coupled with an unstable pelvis, definitely screams internal bleeding and possible fractures.
Oh, wow.
At this point, spinal immobilization becomes paramount.
Right. We need to minimize any movement that could worsen a potential spinal cord injury.
His vitals paint a pretty grim picture.
Right.
His blood pressure is 80/60, his pulse is still weak, and his respirations are shallow.
Okay.
His skin is pale and clammy. It definitely seems like shock is setting in.
Those vital signs are like flashing red alert.
Yeah.
We need to establish IV access immediately.
Okay.
And start fluid resuscitation.
And for those who don't know, fluid resuscitation means.
Oh, good point. So that usually involves using normal saline or lactated ringers,
Right.
which are basically solutions that help restore fluid volume in his bloodstream
Right.
and boost his blood pressure. It's like jump-starting his circulatory system.
Now, I want you to put yourself in the EMT's shoes here.
Right.
We've got this patient,
Okay.
66-year-old male,
Okay.
history of heart problems and diabetes.
Yeah.
Clearly been through a traumatic event. Given everything you've seen and heard so far, what other injuries or complications are on your radar? Well, given the mechanism of the accident, we absolutely have to consider a fractured pelvis
Yeah.
and a fractured arm.
Okay.
Given his abdominal pain and distension, injuries to his spleen or liver are major concerns.
Right.
Both are highly vascular organs, meaning they have a rich blood supply,
Right.
and damage to either could cause life-threatening bleeding. And considering his altered mental status, we can't rule out a possible spinal fracture or dislocation either.
But amidst all this bad news, there's one detail in the patient's chart that kind of stands out.
Okay.
His EKG shows a normal sinus rhythm. What does that tell us?
That's actually a bit of good news.
Yeah.
It means his heart, despite all the trauma and his existing heart conditions, is currently beating with a regular rhythm.
Oh, okay.
This helps rule out some immediate cardiac complications, which is a relief considering everything else we're dealing with.
Okay, so we're dealing with a critically injured patient, complex medical history,
Yes.
miles from the nearest hospital, and time is of the essence.
It is.
What happens next?
Well, that's where things get even more interesting and challenging.
We're back, and the situation is pretty intense.
It is.
We have our patient, 66 years old,
Okay.
history of heart problems and diabetes,
Right.
lying here after being ejected from a truck that rolled down a hill.
Yeah.
He's showing signs of shock,
Right.
likely due to internal bleeding, and we're still miles from the nearest hospital.
Miles.
So let's talk about how you, as the EMT, would stabilize and prepare this patient for transport, knowing that you have limited resources.
You're right. This is where the rubber meets the road.
Yeah,
And your skills as an EMT are really put to the test.
for sure.
First things first.
Yeah.
Given the potential for spinal injuries,
Right.
careful spinal immobilization is absolutely crucial.
Okay.
That means applying a cervical collar to stabilize his neck
Okay.
and securing him to a backboard to prevent any further movement of his spine. We have to minimize the risk of making a spinal injury worse, especially since we're dealing with a possible fracture or dislocation here.
Makes sense. What about his airway? Should we be concerned about that?
Well,
Even though he seems to be breathing okay right now?
While his airway seems clear at the moment, we can't afford to be complacent.
Right.
His level of consciousness is fluctuating,
Yeah.
and with trauma patients, there's always a risk that his airway could become compromised.
Oh, okay.
So supplemental oxygen is a must. We want to make sure his blood oxygen levels stay up.
Okay, so oxygen is on, and we know he's hypotensive,
Right.
which you mentioned earlier is a major concern.
Yes.
What do we do to address that dangerously low blood pressure?
We need to get fluids into him,
Okay,
and fast.
right.
2 large bore 5V lines are crucial.
Okay.
This allows us to deliver fluids quickly and efficiently.
Right.
We'll start aggressive fluid resuscitation with either normal saline or lactated Ringer solution.
Right, and you might be wondering what those are. Well, they're basically solutions that help restore the fluid volume in his bloodstream and boost his blood pressure. It's like jump-starting his circulatory system.
Exactly.
And while we're doing all this, how do we approach pain management?
Hmm.
I can't imagine how much pain he must be in.
Pain management in trauma is always a balancing act.
Right.
We want to alleviate his suffering, but we don't want to mask any symptoms that might be crucial for assessing his condition.
Right.
Remember, his son mentioned he takes morphine regularly for pain.
Yeah.
That means we have to consider his tolerance to opioids.
So do we give him more morphine, or is that too risky given his current state?
It's a judgment call, and in this situation, we'd want to consult with medical control for guidance.
Okay.
They can help us weigh the risks and benefits of administering pain relief, considering his existing medications and his vital signs.
Right.
We need to make sure we're giving him the right dosage and that it won't interfere with other treatments.
This whole situation feels incredibly urgent.
It is.
Every decision, every minute seems critical.
You're absolutely right. It's a race against time.
Yeah.
While we're stabilizing him, we need to constantly reassess his vital signs,
Okay.
his blood pressure, pulse, and respirations.
Right.
We're looking for trends,
Okay.
any changes that might indicate his condition is improving or, more importantly, deteriorating.
And I keep thinking about all those potential internal injuries we talked about.
Yes.
His pelvis feels unstable. He's got that abdominal pain and distension.
Right.
It's hard not to jump to conclusions, but what are the most likely injuries we're dealing with here?
Well, based on the mechanism of his injury,
Right.
being ejected from a rolling vehicle,
Right.
a pelvic fracture is very high on the list.
Okay.
Pelvic fractures can be incredibly serious because the pelvis has a rich blood supply.
Yeah.
So there's a risk of major internal bleeding.
And what about that abdominal pain and distension? What's the most likely explanation for that?
That's definitely worrisome because it raises the possibility of injuries to his spleen or liver.
Right.
Both of these organs are also very vascular,
Okay.
and damage to either one could cause life-threatening bleeding. We have to be very cautious and monitor him closely for signs of internal hemorrhage.
So we've got the pelvis, the abdomen.
Hmm.
Anything else we should be particularly worried about internally?
Mm-hmm.
His age and medical history make me wonder if there could be other complications.
You're thinking like a seasoned EMT.
Oh, I try.
His age and his history of heart problems make us consider a possible cardiac contusion.
Right.
That's basically bruising of the heart muscle.
Right.
It can occur with blunt force trauma to the chest, which is very likely considering he was ejected from the truck.
Right.
And don't forget, he was complaining of rib pain and had some bruising in that area.
So many things to think about. It's
Right.
like trying to solve a puzzle with the clock ticking relentlessly in the background. And speaking of the clock, how do we tailor his transport to the hospital, given his potential for internal bleeding and his heart conditions? Do we just go as fast as we can?
Speed is important, of course.
Right.
But it's not just about getting him to the hospital as quickly as possible.
Right.
We need to aim for a smooth and rapid transport, minimizing any bumps or jarring movements that could worsen his injuries
Okay.
or make his heart work harder than it already is.
So I'm the EMT. I've got my patient stabilized as best as I can.
Right.
We're en route to the hospital, sirens blaring. What are the key things I need to be monitoring during transport?
Okay.
What are the red flags that tell me his condition is getting worse?
His level of consciousness is absolutely critical. Any decrease in responsiveness could signal a problem with blood flow to his brain,
Right.
which is a very bad sign.
Yeah.
We also need to keep a very close eye on his vital signs,
Okay.
his blood pressure, pulse rate, and respiratory rate.
Okay.
And I don't just mean checking them once in a while. We're talking continuous monitoring and looking for trends. Is his blood pressure continuing to drop despite the fluids we're giving him? Is his breathing becoming faster or more labored?
Okay.
These are all signs that his condition might be deteriorating.
What about his pain? Should we be asking him about his pain level regularly, or is that something we should just address if he complains about it?
You're right to be concerned about his pain.
Yeah.
Changes in his pain level, either an increase or a decrease, could indicate that his injuries are getting worse
Okay.
or that new complications are developing. And don't forget about monitoring for any signs of external bleeding.
Okay.
We also want to keep an eye on his urine output
Right.
or the lack thereof,
Okay.
because that can give us a clue about how well his kidneys are functioning.
It sounds like transport isn't just about driving fast. It's also about constant vigilance, careful observation, and being ready to adjust our treatment based on how the patient is doing. It's like you're running a marathon while simultaneously playing a game of medical chess.
That's a great analogy. Yeah.
It really highlights the complex and dynamic nature of trauma care, especially in a remote setting like this.
Yeah.
And there's another layer of complexity that we need to discuss, something that often gets overlooked in the heat of the moment.
You okay?
Are you ready to explore that?
Absolutely. Let's dive into that. We're back. And as we navigate this really challenging scenario, there's another layer we need to consider.
Okay.
We've focused on stabilizing our patient, addressing those potential injuries, getting him to the hospital. But let's not forget,
Right.
this is a 66-year-old man
Yeah.
with a history of heart problems, diabetes.
Right.
And he's on several medications.
Lots to consider.
How do those factors impact our overall treatment strategy?
Well, his age and pre-existing conditions definitely make this a much more delicate situation.
Right.
For example, his diabetes can affect his body's ability to heal
Right.
and increases his risk of developing infections. That means we need to be extra vigilant about monitoring his blood sugar levels.
And making sure any wounds are properly cleaned and dressed.
And his heart condition. Does that change how we approach fluid resuscitation? Earlier, we talked about getting fluids into him quickly to combat shock.
Right.
But now I'm wondering if that could put too much stress on his heart.
That's a great question, and it highlights the importance of personalized care.
Yeah.
While we want to aggressively address his low blood pressure,
Right.
we need to be careful not to overload his heart with too much fluid.
Okay.
His heart might not be strong enough to handle a sudden increase in volume.
Right.
We need to find that sweet spot where we're providing enough fluids to maintain his blood pressure without overtaxing his heart.
So it really is this constant balancing act.
It is. It is.
It seems like communication with the receiving hospital is going to be crucial in this case.
Oh, absolutely.
They need to be ready for him when we arrive.
Clear and concise communication is absolutely essential in trauma care, especially when dealing with a patient as complex as this one. We need to provide the receiving hospital with a detailed report of his condition, the mechanism of his injuries,
Right.
the interventions we've performed, and any changes we've observed during transport.
Okay.
This gives them a heads up and allows them to be fully prepared to take over his care as soon as we arrive. A smooth handoff can make a world of difference.
Thinking back to his medications, the son mentioned that he takes Tenormin,
Yeah.
a beta blocker for his high blood pressure.
Right.
How might that affect his response to this trauma?
Here's where things get tricky.
Yeah.
Beta blockers can mask some of the typical signs of shock,
Right.
like an elevated heart rate.
Oh, okay.
So we have to rely on other indicators like his blood pressure,
Okay.
mental status,
Okay.
and how well his skin is perfused to assess how serious his condition really is.
It's like trying to read a map with some of the landmarks missing.
Exactly.
We have to rely on our training and experience to kind of fill in the gaps.
You got it.
So we've covered the immediate life-threatening injuries,
Mm.
his medical history, his medications. Is there anything else we need to be mindful of as we care for this patient? It feels like we've thought of everything, but I always wonder if there's something we might be missing.
There's one aspect of trauma care that often gets overlooked,
Oh,
and that's the psychological impact of these events.
right.
This man has just been through a terrifying experience.
Yeah.
His son witnessed the entire accident,
Of course.
and he's undoubtedly worried sick.
Right. Of course.
How do we address that human side of this situation?
That's a really important point.
Hmm.
We tend to focus so much on the physical injuries, the broken bones, the internal bleeding,
Right.
but the emotional trauma can be just as significant.
Absolutely.
How do we even begin to offer support in the midst of all this chaos?
Well, you don't need fancy techniques or a psychology degree to provide comfort.
Right.
Sometimes the simplest things make the biggest difference.
Yeah.
Clear communication, reassurance, acknowledging their fear and anxiety.
Mhm.
These are powerful tools. Just letting the patient and his son know that we're doing everything we can,
Right.
that we're going to take good care of him, can go a long way in easing their distress.
As we wrap up this deep dive,
Yeah.
What are the key takeaways you want our listener, the EMT in this scenario, to walk away with?
Okay.
What are the most important lessons we've learned today?
I think the biggest takeaway is the importance of a systematic approach to trauma care.
Okay.
From the moment you arrive on scene to the initial assessment
Right.
to the ongoing monitoring during transport, having a structured approach helps ensure that you don't miss anything critical. It's like having a mental checklist that guides your actions and helps you prioritize care.
And what about the challenges of dealing with a patient with such a complex medical history, like this one?
Yeah,
It feels like every decision has ripple effects.
absolutely. In these situations, you have to be a detective.
Yeah.
Every piece of information matters.
Right.
His age, his medications, his past medical conditions. All of these factors can influence your treatment decisions. You have to think critically and be ready to adapt your plan as you gather more information.
And I can't stress enough the power of clear communication,
Yes,
both with the patient and the receiving hospital.
it really is key.
It's the thread that holds everything together.
Definitely.
This deep dive has been a whirlwind of information,
It has.
a real roller coaster ride through the world of trauma care.
For sure.
We've tackled a challenging scenario, explored the intricacies of assessment and treatment, and hopefully you, our listener, feel a little more prepared to face a similar situation in the real world.
And remember, the learning never stops.
That's right.
Trauma care is a constantly evolving field,
Yeah,
and there's always more to learn.
absolutely.
So stay curious, keep asking questions, and never stop seeking to improve your skills.
Thanks for joining us on this deep dive. Until next time, stay safe out there.